And we are live and worldwide here on News Now. Thank you, everyone, for joining us here as we always bring you the top stories and headlines from across the country. And obviously, we do know what the big story is, as always. Stock market today, sell off right now, 2,300 points down. The market plunge with the coronavirus concerns. You are watching News Now. We do appreciate you joining us here worldwide as we will be giving you updates throughout the day right here as we bring them to you. Live look right now at, well, it's not a live look, it's a frozen shot, but here's a live look at the White House. We're expecting a coronavirus task force news conference coming up at 3:30 Eastern. It was supposed to be happening in about 30 minutes, but that was pushed back. We'll provide you with the very latest as we get them right here on News Now, and we'll give you top numbers in just a little bit. There's the latest total cases around the world, 169,000. We have 6,500 deaths around the world. 77,000 people have recovered already. We're going to go out to a live briefing from Kentucky right now on the latest the coronavirus fears and concerns out there.
Search requirements while the state of emergency is in effect. We know that the steps we're taking are going to cause people to lose their job. We want you to be able to qualify for unemployment, and we don't want to create impediments that keep you from being able to get through this, which we are going to make sure that we get through it together. All right, beginning tomorrow morning, we are going to close the state capitol to non-essential personnel. That, again, is a big step. And I am a person who ran on these doors being open for everyone all the time. We're dealing with something that we could have never anticipated, and at the end, my obligation is to keep people safe as we move forward. This is a step where we are modeling what we're asking other people to be modeling. So we'll have more details on that, but again, we are taking the steps that are necessary. Also want to announce that we have 2 state government officials in self-isolation, our Transportation Cabinet Secretary Jim Gray and Edith Hallbleib, who heads the industrial, can you help me out? The industrial infrastructure. She's over connected to DLG. We will get that title. Both are feeling just fine. It is out of an abundance of caution. And again, we are trying to model as best we can the behavior we need from everybody else. Folks, we're going to continue to take these steps. What we need you to do is to remain calm and to handle this disruption and this anxiety as it comes. We are going to get through this. We are taking aggressive action to protect you and the people around you. What I'm asking you to do starting today, though many of you have done this, is to consider it your duty as a Kentuckian and as an American to follow the guidance that we are putting up. The more you internalize that, the more you do it, the better neighbor you are and the better protected we will be as a state. So I know that was a very long resuscitation. We'll open it up to some questions.
Governor,
Tom.
With the closing of the Capitol tomorrow, what does that mean for the legislative session?
I believe that we will see the leadership talk about steps that they are going to take as far as the third floor and the annex. It would certainly be my guidance to them to get us a budget as quickly as we can. And we'll see what that budget includes. You know, I was very proud to put forth a budget where for the first time in 12 years we were making real investments. we're to the point where we're going to have to get through this coronavirus and see what investments we can make at that point. But we are in a different time, and what's most important is that they get us a budget, and then we can come back if we have to at a later date. And my hope is to have more dollars to put into important places.
Can you talk a little bit, so you're going to be issuing an order today to close all bars and restaurants to in-person traffic statewide?
Yes.
How?
Let me repeat the question.
Yeah.
It was confirming that we're going to be closing all bars and restaurants to in-person traffic statewide today. Yes, we will be putting out that order.
When will that take effect, and can you talk a little bit more about the impact that you're expecting on workers?
Well, my goal is that the order will take effect as of about 5 p.m. today. That's my goal. We're working fast, and we want to make sure that we are not operating 2 weeks too late like Philadelphia did in that model that we put up. It's going to have a major impact on workers. One of the reasons that we're changing unemployment, waiving the days that it takes, it's going to have a major impact on a lot of people out there. And I want them to know that we understand, but we will get through this. We will all bounce back. We will rebuild what has to be rebuilt. We are a resilient people. We've proven it time and time again. We're going to prove it here too.
And how will that work with takeout? Because it sounds like they're allowed
yes,
to do that.
There are going to be exceptions for drive-throughs, for takeout, that we need to look at exactly how that's done, and for delivery. And let me ask, again, as part of our duty, we need folks that are out there to be ordering takeout now, to be ordering delivery. You know, my family's going to commit to do it for at least 3 meals a week. There are 4 of us. We need everybody else to do that too. These are important businesses. They employ people throughout our community. I know it's a little strange to think about patriotic duty in ordering takeout. It is important.
Governor, I would think the challenge will be for large crowds of lines to be gathered outside some of these restaurants.
And we can't allow that, so we have to. The question was, what about large lines or crowds outside of restaurants? That's something that we can't allow to happen. So we'll make sure in our order, whether if it's curbside, it's going to need to be brought to you. If it is drive-through, that ought to work. But we'll put out guidance on that. Again, if you are a restaurant that is going to switch to this model or is already in this model, you have to think about how you lessen those contacts. It is all of our responsibility. And to those that had already stepped up after my comments yesterday, thank you. Thank you for setting the example. Had a number of groups. Country Boy Brewing sent me a personal text. I want to thank them for their example and so many others out there.
Governor, could you give us some new information out of Bourbon County one more time?
The new information out of Bourbon County is that unfortunately we have lost the patient there that had tested positive. We are thinking about him and his family. While the coronavirus wasn't the only cause, it was a contributing factor, and it just reminds us that while we got to remain calm and we're going to get through this, it is serious and it truly impacts people. So think about the ramifications as an individual if you're not following this guidance. It's probably somebody else's loved one that might end up in harm's way. Let me read a couple questions. With the new CDC guidance to cancel or postpone in-person events that consist of 50 people or more for the next 8 weeks, what is your recommendation for events such as Thunder over Louisville and the Kentucky Derby? My belief is that we are going to hear shortly about that. I don't want to get ahead of any of those announcements. Another individual, is the time coming to close down state government for a few weeks except for essential services? We are going to be taking steps to stop any in-person service that is needed from state government. We're going to do whatever it takes to make sure that we can provide those services remotely, and we'll be changing regulations for the short term to do that. Let me say we're also going to put out an order later today that extends people's driver's license if they would otherwise be expiring for the next 90 days. We don't want you to have to come in person to get that license reissued. And we have so much that we do that requires person to person right now. We're going to take each one as they come. I got a question of what is the per day testing capacity of U of L and LabCorp. I don't have that information. LabCorp is obviously a national lab, and we'd have to reach out to see that. We all want the day where the major private labs can provide a test to everyone who needs it, and we are preparing for that scenario. We just got to be ready for it to be sometime further out in the future. How soon does LabCorp expect to set up drive-through testing in Kentucky? We don't have a date for that. We will deal with our situation on the ground until it is available. And my pledge to you is the moment that it's available, we will be up, we will be running. We will do everything we can to get it to everyone. We are planning and replanning for it every day. Did I meet with Robert Stivers or David Osborne on Sunday to discuss what to do with the General Assembly? I talked individually with them by phone, and then we'll allow them to make any additional announcements. We have, would it be possible to let us know how many people in eastern Kentucky have been tested for the coronavirus and the breakdown of counties and hospitals where the test took place and the results? We are working on being able to post counties that have had tests or even negative tests, but folks, we expect to have a case of the coronavirus in every area of the state, and we should not be thinking that just because there hasn't been one in our county that we should not be following this guidance. Absolutely critical that everybody out there follow these practices, whether there has been one reported in your region or not. Questions on unemployment, I think I addressed. Well, this is a personal one. As the father of two, how do you calm fears, and what advice, resources do you have for parents? I'm working through this every day, just like you all are. My kids show the anxiety, and it's my job as a parent to reassure them, to spend time with them, to get them outside, to make sure they have exercise, to make sure they have intellectual stimulation. We're going to try tomorrow to have somebody here right at the beginning for an age-appropriate discussion for kids. So if you want to tune in, we'll do it tomorrow at 4 with your children. We'll start with that, and then we'll move into the normal one that I give. I hope that is one where we can speak directly to children and also to parents. But it's again going to be very different for kids. So keep them on their schedule as much as they can. This isn't a time for letting people sleep in. Keep the bedtime, keep the wake up time. If there is non-traditional instruction your kids are doing, schedule it during times when they would otherwise be doing it in school, and make sure they are healthy. You know, one thing that we can learn coming out of this is not just practicing good hygiene, but let's get as healthy as we can as a state. One of the reasons that we're being so aggressive is that we have so many folks that are at risk because of heart, lung, or kidney disease. And everything that we can do in this to model good physical, mental, and emotional health is going to be helpful as we move into the future. With the rapid increase of calls to the coronavirus hotline, is the state looking into ways to absorb the increase in calls? Yes, that is run through Norton Healthcare. They are hiring more people, and it's asked if the state has more funding to help. We are in a state of emergency, so we'll tap into all of the funding that is at our disposal. Do we believe that there are more cases of the coronavirus in Kentucky than what are reported due to lack of available testing? We believe that there are more cases out there than are being reported, but that's not just due to a lack of testing. If we had the widespread testing that we hope to have in the future, yes, we would discover that there are many more positive cases, and we expect to see that. But the main reason that we know that there are more cases out there is for 80% folks, you're going to be just fine. You might not show any symptoms, or you will show mild symptoms. And so that's part of that duty to reduce our contacts, that you might have this coronavirus and not even know it. So your patriotic duty is to make sure you're protecting yourself and others throughout the course of this. So folks, we're going to continue to move forward. Again, we are going to make it through. I need everybody to remain calm, for you, for your neighbors. But I need you to follow this advice. Let's protect the most vulnerable out there. Yes, let's take two more.
There was a report that the Federal Health and Human Services Department had a cyber attack over the weekend, and I was just wondering what, if anything, the state's doing to try to prepare, if you're worried about that being an issue for you guys.
We do need to make sure that at this time that others across the world don't try to take advantage of us. We need to be prepared for that. And so we have a Department of Homeland Security that's here that works with others to make sure that we are protecting ourselves the best we can. All right. So again, let me end by saying that we got the greatest people here in Kentucky of anywhere in the world. And what always drives us is our sense of home, our sense of belonging, our sense of how special Kentucky is. I need everybody to step up and to live that, not just to feel it, but to live it. Now, as we go through these next couple of weeks or even months, the steps that you take to be a good neighbor, protect the people around you. Again, social distancing is not isolation. You can be 6 feet away from somebody and have a good conversation, and you need to continue to have personal interaction. Use all the tools that you have, if you have FaceTime or if you have others, to communicate with loved ones that you can't see, and take care of yourself. And people are going to be more at home moving forward than maybe they have been in their entire lives. So just take care of yourself. It's okay to take time. You certainly should shut off the news at different times. Don't do this 24 hours a day, 7 days a week. I know what that's like. Please, those around you need your reassurance, and they need to reassure you. But we're going to make it. We're going to come out the other side. We're going to be stronger for it. We're just going to take the steps along the way to protect all of those Kentuckians who are most vulnerable. It is us against the coronavirus, all of us together. No more divisions, no more things that we argue that keep us apart. Just us together getting through this. Thank you all very much. search requirements while the state of emergency is in effect. We know that the steps we're taking are going to cause people to lose their job. We want you to be able to qualify for unemployment, and we don't want to create impediments that keep you from being able to get through this, which we're going to make sure that we get through it together. All right, beginning tomorrow morning, we are going to close the state capitol to non-essential personnel. That, again, is a big step. And I am a person who ran on these doors being open for everyone all the time. We're dealing with something that we could have never anticipated, and at the end, my obligation is to keep people safe as we move forward. This is a step where we are modeling what we're asking other people to be modeling. So we'll have more details on that, but again, we are taking the steps that are necessary. Also want to announce that we have 2 state government officials in self-isolation, our Transportation Cabinet Secretary Jim Gray and Edith Hallbleib, who heads the industrial, can you help me out? The industrial infrastructure. She's over connected to DLG. We will get that title. Both are feeling just fine. It is out of an abundance of caution. And again, we are trying to model as best we can the behavior we need from everybody else. Folks, we're going to continue to take these steps. What we need you to do is to remain calm and to handle this disruption and this anxiety as it comes. We are going to get through this. We are taking aggressive action to protect you and the people around you. What I'm asking you to do starting today, though many of you have done this, is to consider it your duty as a Kentuckian and as an American to follow the guidance that we are putting up. The more you internalize that, the more you do it, the better neighbor you are and the better protected we will be as a state. So I know that was a very long resuscitation. We'll open it up to some questions.
Governor,
Tom.
With the closing of the Capitol tomorrow, what does that mean for the legislative session?
I believe that we will see the leadership talk about steps that they are going to take as far as the third floor and the annex. It would certainly be my guidance to them to get us a budget as quickly as we can. And we'll see what that budget includes. You know, I was very proud to put forth a budget where for the first time in 12 years we were making real investments. We're to the point where we're going to have to get through this coronavirus and see what investments we can make at that point. But we are in a different time, and what's most important is that they get us a budget, and then we can come back if we have to at a later date. And my hope is to have more dollars to put into important places.
Can you talk a little bit, so you're going to be issuing an order today to close all bars and restaurants to in-person traffic statewide?
Yes.
How?
Let me repeat the question.
Yeah.
It was confirming that we're going to be closing all bars and restaurants to in-person traffic statewide today. Yes, we will be putting out that order.
When will that take effect, and can you talk a little bit more about the impact that you're expecting on workers?
Well, my goal is that the order will take effect as of about 5 p.m. today. That's my goal. We're working fast, and we want to make sure that we are not operating 2 weeks too late like Philadelphia did in that model that we put up. It's going to have a major impact on workers. One of the reasons that we're changing unemployment, waiving the days that it takes, it's going to have a major impact on a lot of people out there. And I want them to know that we understand, but we will get through this. We will all bounce back. We will rebuild what has to be rebuilt. We are a resilient people. We've proven it time and time again. We're going to prove it here too.
And how will that work with takeout? Because it sounds like they're allowed
yes,
to do that.
There are going to be exceptions for drive-throughs, for takeout, that we need to look at exactly how that's done, and for delivery. And let me ask, again, as part of our duty, we need folks that are out there to be ordering. takeout now, to be ordering delivery. You know, my family's going to commit to do it for at least 3 meals a week. There are 4 of us. We need everybody else to do that too. These are important businesses. They employ people throughout our community. I know it's a little strange to think about patriotic duty in ordering takeout. It is important.
Governor, I would think the challenge will be for large crowds of lines to be gathered outside some of these restaurants
And we can't allow that, so we have to. The question was, what about large lines or crowds outside of restaurants? That's something that we can't allow to happen. So we'll make sure in our order, whether it is, if it's curbside, it's going to need to be brought to you. If it is drive-through, that ought to work, but we'll put out guidance on that. Again, if you are a restaurant that is going to switch to this model or is already in this model, you have to think about how you lessen those contacts. It is all of our responsibility. And to those that had already stepped up after my comments yesterday, thank you. Thank you for setting the example. Had a number of groups. Country Boy Brewing sent me a personal text. I want to thank them for their example and so many others out there.
Governor, could you give us some new information out of Bourbon County one more time?
The new information out of Bourbon County is that unfortunately we have lost the patient there that had tested positive. We are thinking about him and his family. While the coronavirus wasn't the only cause, it was a contributing factor, and it just reminds us that while we got to remain calm and we're going to get through this, it is serious and it truly impacts people. So think about the ramifications as an individual if you're not following this guidance. It's probably somebody else's loved one that might end up in harm's way. Let me read a couple questions. With the new CDC guidance to cancel or postpone in-person events that consist of 50 people or more for the next 8 weeks, what is your recommendation for events such as Thunder over Louisville and the Kentucky Derby? My belief is that we are going to hear shortly about that. I don't want to get ahead of any of those announcements. From another individual, is the time coming to close down state government for a few weeks except for essential services? We are going to be taking steps to stop any in-person service that is needed from state government. We're going to do whatever it takes to make sure that we can provide those services remotely, and we'll be changing regulations for the short term to do that. Let me say we're also going to put out an order later today that extends people's driver's license if they would otherwise be expiring for the next 90 days. We don't want you to have to come in person to get that license reissued. And we have so much that we do that requires person to person right now. We're going to take each one as they come. I got a question of what is the per day testing capacity of U of L and LabCorp. I don't have that information. LabCorp is obviously a national lab, and we'd have to reach out to see that. We all want the day where the major private labs can provide a test to everyone who needs it, and we are preparing for that scenario. We just got to be ready for it to be sometime further out in the future. How soon does LabCorp expect to set up drive-through testing in Kentucky? We don't have a date for that. We will deal with our situation on the ground until it is available. And my pledge to you is the moment that it's available, we will be up, we will be running. We will do everything we can to get it to everyone. We are planning and replanning for it every day. Did I meet with Robert Stivers or David Osborne on Sunday to discuss what to do with the General Assembly? I talked individually with them by phone, and then we'll allow them to make any additional announcements. We have, would it be possible to let us know how many people in eastern Kentucky have been tested for the coronavirus and the breakdown of counties and hospitals where the test took place and the results? We are working on being able to post counties that have had tests or even negative tests, but folks, we expect to have a case of the coronavirus in every area of the state, and we should not be be thinking that just because there hasn't been one in our county that we should not be following this guidance. Absolutely critical that everybody out there follow these practices, whether there has been one reported in your region or not. Questions on unemployment, I think I addressed. Well, this is a personal one. As the father of two, how do you calm fears, and what advice, resources do you have for parents? I'm working through this every day, just like you all are. My kids show the anxiety, and it's my job as a parent to reassure them, to spend time with them, to get them outside, to make sure they have exercise, to make sure they have intellectual stimulation. We're going to try tomorrow to have somebody here right at the beginning for an age-appropriate discussion for kids. So if you want to tune in, we'll do it tomorrow at 4 with your children. We'll start with that, and then we'll move into the normal one that I give. I hope that is one where we can speak directly to children and also to parents. But it's again going to be very different for kids. So keep them on their schedule as much as they can. This isn't a time for letting people sleep in. Keep the bedtime, keep the wake up time. If there is non-traditional instruction your kids are doing, schedule it during times when they would otherwise be doing it in school, and make sure they are healthy. You know, one thing that we can learn coming out of this is not just practicing good hygiene, but let's get as healthy as we can as a state. One of the reasons that we're being so aggressive is that we have so many folks that are at risk because of heart, lung, or kidney disease. And everything that we can do in this to model good physical, mental, and emotional help is going to be helpful as we move into the future. With the rapid increase of calls to the coronavirus hotline, is the state looking into ways to absorb the increase in calls? Yes, that is run through Norton Healthcare. They are hiring more people, and it's asked if the state has more funding to help. We are in a state of emergency, so we'll tap into all of the funding that is at our disposal. Do we believe that there are more cases of the coronavirus in Kentucky than what are reported due to lack of available testing? We believe that there are more cases out there than are being reported, but that's not just due to a lack of testing. If we had the widespread testing that we hope to have in the future, yes, we would discover that there are many more positive cases, and we expect to see that. But the main reason that we know that there are more cases out there is for 80% of folks, you're going to be just fine. You might not show any symptoms, or you will show mild symptoms. And so that's part of that duty to reduce our contacts, that you might have this coronavirus and not even know it. So your patriotic duty is to make sure you're protecting yourself and others throughout the course of this. So folks, we're going to continue to move forward. Again, we are going to make it through. I need everybody to remain calm, for you, for your neighbors. But I need you to follow this advice. Let's protect the most vulnerable out there. Yes, let's take 2 more.
There was a report that the Federal Health and Human Services Department had a cyber attack over the weekend, and I was just wondering what, if anything, the state's doing to try to prepare, if you're worried about that being an issue for you guys.
We do need to make sure that at this time that others across the world don't try to take advantage of us. We need to be prepared for that. And so we have a Department of Homeland Security that's here that works with others to make sure that we are protecting ourselves the best we can. All right. So again, let me end by saying that we got the greatest people here in Kentucky of anywhere in the world. And what always drives us is our sense of home, our sense of belonging, our sense of how special Kentucky is. I need everybody to step up and to live that, not just to feel it, but to live it. You know, as we go through these next couple of weeks or even months, the steps that you take to be a good neighbor, protect the people around you. Again, social distancing is not isolation. You can be 6 feet away from somebody and have a good conversation, and you need to continue to have personal interaction. Use all the tools that you have, if you have FaceTime or if you have others, to communicate with loved ones that you can't see, and take care of yourself. And people are going to be more at home moving forward than maybe they have been in their entire lives. So just take care of yourself. It's okay to take time. You certainly should shut off the news at different times. Don't do this 24 hours a day, 7 days a week. I know what that's like. Please, those around you need your reassurance, and they need to reassure you. But we're going to make it. We're going to come out the other side. We're going to be stronger for it. We're just going to take the steps along the way to protect all of those Kentuckians who are most vulnerable. It is us against the coronavirus, all of us together. No more divisions, no more things that we argue that keep us apart. Just us together getting through this. Thank you all very much.
And we are going to continue to bring you the very latest on the coronavirus. This is a live look right now of coverage in California as people are continuing to line up at grocery stores and get what they can. Let's continue to bring you news briefings from around the country.
The State House, folks who need to show up at a field office to get cash payments or food benefits and food stamps. We have another press conference this afternoon. I'll be issuing additional guidance then. For now, what I'm saying is avoid gatherings of 25 people or more, avoid all non-essential meetings and human contact, and we'll be back out today, later this afternoon, with more specific guidance. With that, I'm going to turn it over to Dr. Nicole Alexander-Scott and then Mayor Elorza, and then we'll answer all of your questions.
Good morning. Thank you all for being here. Thank you, Governor, for your tireless leadership and effort. Thank you, microphone, for behaving properly. Thank you also, Mayor Elorza, for your partnership and leadership with this. So I want to echo what the governor has said. It is critical right now that people not be a part of gatherings or crowds where there are 25 people or more. We also have to make sure that people stay home, stay local, refrain from engaging in non-essential activities, particularly where there are crowds. We need everyone to understand the importance of this. We need everyone to understand the importance of this timing right now. I particularly want to speak to the teenagers that are out there. We are talking to you as well. The point of all students being home is not to then go congregate someplace else at the mall or in other places. I will continue to share the way this virus spreads is when groups of people get together and folks have symptoms of illness. That's all the virus needs. We are looking to stop the spread of illness, and that can only work with everyone participating. That's our teenagers, our students, and our adults setting the example. We have to act now to keep people healthy and safe and to limit the spread of COVID-19 in Rhode Island. Everyone has to play their part. Everyone does. So that's why we are now expanding to restaurants, to bars, cafes, any place where you go and you see a crowd of people, 25 or more. You can use a smaller number if you'd like. Avoid that crowd. Go someplace else, stay home, use a different time frame to go back out. Understand that crowds are what the virus uses to spread illness. That's why we are putting these directives before you. The governor announced about dine-in service at restaurants, bars, and cafes. We have been working to get additional guidance to people in the food industry. everyone who works in the food industry or delivers food must stay home and not prepare or handle food for others if they have symptoms. That is critical. That is something everyone within food establishments know very well, and it's something that we have to be crystal clear about now. To cut down on the amount of face-to-face contact that people have, orders should be paid for online or by phone, by credit card, anytime that it is possible. There's also the opportunity to work with restaurants to be creative about having drop-off service or pickup service where you can come to the window. The goal here is to limit contact with multiple people again and again. The more we can do that, the better off we can be as a state. Food establishments have also been reminded of how critical it is that people practice appropriate hygiene and sanitation measures, especially at this time. So as mentioned, the Rhode Island Department of Health will be issuing guidance later today, particularly for food delivery service options and takeout protocols. I want to again thank restaurant owners, restaurant workers, Dale and the Hospitality Association. This is something that we will do together. And we very much appreciate the leadership of those in the restaurant and food industry who understand the importance, are taking the sacrifice together, and we need all members of Rhode Island to work with us. Regarding gatherings, as the governor has said, we're going to continue to repeat, we are restricting gatherings larger than 25 people. These are numbers that we're establishing really to reiterate the point. If you see a crowd, that's the best place for viruses to spread. That's what needs to be avoided. We should not be seeing teenagers out, group of 50 people huddling together. So we need everyone to heed this and to understand how critical this is. All you have to do, particularly while you're home now, is look online and check internationally what happens in countries where they have not been able to do this effectively. That's what we are looking to avoid. And we can do it if everyone heeds the guidance that's been put forth. We are being very aggressive because this window of opportunity is only open to us once. If we work effectively now, we can decrease how long this goes on for. In terms of data and our case count, I want to share what the updates are. Since the last time we communicated with you, we have had one additional case. This person is a woman in her 40s. She is currently hospitalized and is in isolation, but she is in stable condition. The Rhode Island Department of Health is currently investigating the source of her illness. This brings our total case count to 21. I also want to make an important statement about what we're seeing. Community spread occurs when you cannot immediately identify the source of illness. We have started to see cases where we have not been able to immediately identify the source of illness. To err on the side of caution and to help us stay 2 steps ahead of this, we are saying that Rhode Island has community spread. All the more important for everyone to heed the messages that we're saying. Virus spreads most easily in crowds. We need everyone to stay home and only go out for essential needs, please. Before stepping away, I want to reiterate our critical personal prevention measures. If you've traveled anywhere internationally in the last 14 days, self-quarantine for 14 days, that means stay at home, and monitor for symptoms of illness, fever, cough, shortness of breath. For everyone, whenever possible, avoid close personal contact with multiple people in public. When greeting people, avoid handshakes and hugs. Let's keep the elbow and fist pumps going. People who think they have COVID-19 should call their healthcare provider. We are working closely with healthcare providers to handle how to provide recommendations to you. I want to reiterate, if you have symptoms of illness, cough, fever, respiratory symptoms, shortness of breath, if you are able to stay home and recover, that is the best thing. Testing will be important for people who have severe illness and need to go to the hospital. Whether it's COVID-19 or the flu, the treatment is the same. If you can recover at home, please do that. That's the way to keep illness from spreading. People with general, non-medical questions about COVID-19 can call our COVID-19 hotline. That phone number is 401-222-8022. Again, it's not too late to get your flu shot. That's critical. We've spoken today about preserving our healthcare system for the people that need it. A flu shot is one of the many preventive measures that can be done to keep people out of the hospital. Wash your hands often through the day. Use good cough etiquette, cough or sneeze into your elbow. Avoid touching your eyes, nose, or mouth. That's how germs spread. All of these measures I have discussed and that the governor has mentioned and what you'll hear from the mayor all have an impact. We also really want to protect our older adults and people with underlying medical conditions. Those who are vulnerable are the ones that we need to monitor for. Finally, I want to acknowledge that there are a lot of questions out there. Teachers and parents want to know what's happening with school next week. You've already heard from the governor. We're going to continue to work with you. I want to also give that message to our primary care providers who have been on the front lines and doing the best they can. We appreciate you. We'll be talking to you later this afternoon as well. And I want to turn it over to Mayor Elorza. Thank you.
Thank you, Doctor. Good morning, everyone. I want to thank everyone for joining us and to the media. Thank you for helping us get this important information out on a timely basis and a recurring basis to all of our residents in the city and in the state. I want to especially thank the governor and her team for her leadership in this moment. The federal guidelines for communicating during a public health crisis say be first, be right, be credible, show respect, and promote action. And Governor, you and your team have done this throughout, and we appreciate the partnership. I also want to recognize Council President Sabina Matos, who's been a valuable thought partner for me and has been with us every step of the way. So thank you for your leadership on this as well, Council President Matos. And finally, I also want to recognize the hospitality industry. We know how deep of a hit this has been and likely will continue to be, but we appreciate your partnership in recognizing that this is important for all of us. As you know, and as we continue to hear from our health professionals, we are at a crucial and critical point in mitigating the impacts of COVID-19 within our city and state. We've continued to call on our residents, our business owners, our community partners, everyone to do their best in keeping our families, neighbors, and city safe from the spread of the virus. And I want to take a moment to thank everyone for their cooperation. I especially want to recognize our first responders, our clinicians, our public health officials, all of them who are working tirelessly and around the clock to keep our community safe. We're grateful to all of our public employees for their dedication. We thank everyone throughout these trying times. As more and more tests become accessible locally and nationally, we are now beginning to see the full extent to which this virus is impacting our community. We find ourselves still in this moment of what is called exponential spread or exponential growth. Based on the experience of other countries, we know that this time typically takes, on the shorter end, 5 to 6 weeks, and on the longer end, 8 weeks and counting. And the extent or the length of that exponential growth is entirely dependent on the social actions and the steps that we take to limit social interactions and hence the spread of this virus. In other words, as you've heard throughout, we need to do everything we can to maintain social distancing, and through that, we will flatten the curve. It's amazing how fast things are changing. Just last week, I announced that the City of Providence was taking emergency measures. What seemed bold just a few days ago now seem quite quaint. And as this virus continues to spread, it's important for us to take additional measures to continue to support and protect our community. I know that these changes are hard on so many of us, but so many of our businesses have already risen to the occasion. We've continued to monitor compliance to these restrictions, and we hold the public health and safety of our city as the #1 priority under these circumstances. Effective immediately, I will be ordering my police department and our public safety officials to ensure that we ramp up monitoring according to the guidance and the directives given by the governor to make sure that there is compliance, that restaurants, bars remain shut, and that gatherings are maintained to less than 25 people. We want to truly ensure that we're being safe and encouraging practices that will help us mitigate the spread. And with guidance from our public safety and public health officials, I'm prepared to use our forces, use our resources to, in fact, stop all on-premises food and alcohol consumption at restaurants in the City of Providence per the governor's guidance and directive. We also believe that limiting gatherings of people to 25 and less for the next couple of weeks will help us in this effort that we have as a community. Though it will be difficult for many of us, it's necessary in our efforts to contain the virus. In addition to the restrictions which you've just heard, beginning tomorrow, Tuesday, March 17th, I'm also requiring that Providence Place Mall close until further notice. We want to eliminate the highest risk areas within our state, and frankly, we also want everyone to take this seriously. This week, as kids are out of school, and perhaps some families are out of work, we do not want them to congregate in these public spaces and create the circumstances that are ripe for transmission. We need everyone to take this serious and do not leave your house unless it's for an essential reason. We have been in communication with leaders of our business community, and we understand the strain that these circumstances have had on their businesses. And while most people have complied, this past week we were forced to shut down 2 businesses that were not complying. And anyone who does not comply going into the future, your actions are irresponsible. You need to take responsibility, and if you don't, we will shut you down accordingly. As the capital city, this has already taken a palpable toll on the way we do things in our city. I'm not saying that residents and visitors should stop supporting our businesses, but we should do it responsibly in accordance with the governor's guidelines and directives. As we watch this crisis develop and spread in communities similar to ours, we can't stress enough to anyone who isn't yet taking this seriously, or to any young or able-bodied person who thinks they could just ride this out even if they get the virus, this is not about you. You all have a responsibility to your entire community, and you have to do everything you can to prevent yourself from getting it so that you are not unnecessarily spreading it to others who might be more vulnerable. Remember, we all have parents, we all have grandparents, we all know someone with underlying health conditions that might not be able to survive and might not be able to withstand having the virus. As a thriving and densely populated city, we need to take every precaution that's necessary to contain this virus in our community and in our state. My team and I will continue to be in close communication with the governor, her team, and all the public health officials. And we'd also like to take this opportunity to remind you to limit all non-essential travel and to self-quarantine should you be returning from an international flight per the governor's direction. You can find accurate and timely information on all COVID-19 efforts by going to our website in the city, pvdcovid19.com, or reaching out through our PVD 311 system. Anywhere in the city, just dial 311 and you'll be connected with my office. The Mayor's Office for Constituent Services will remain open from 8 a.m. to 8 p.m., now 7 days a week, through March 30th, to help residents with any questions or concerns that they may have. And last, should you feel sick, please call your primary care provider first, or the Department of Health, where you can be evaluated and tested if necessary. We ask everyone to take this seriously. It is a global pandemic, and whether or not this continues to spread is in the hands of all of us as Rhode Islanders and throughout our city. We ask everyone to please continue to cooperate. We'll take any questions at this time.
Governor, what will the state do about supermarkets? They've obviously been seeing above average business, so what about the advice to avoid crowds of more than 25?
Yeah. So I would say it's the same advice, right? Going out for dinner is not essential. Eating is essential. So folks should still go to the grocery store, the pharmacy, the bank, doctor's appointments.
And we were listening live to the Rhode Island officials there talking about the coronavirus concerns here. Here is a look and update of the illnesses in the U.S. Right now, there's 3,700 cases across the country. 68 deaths have been reported. Washington State has 769 cases, in New York with 749. Now we're going to go out live to the governor of New York, Andrew Cuomo, talking about the crisis there in New York.
Guidelines on businesses, here are the guidelines on travel, rather than having a scramble of every local government, state government, trying to figure it out on its own. It makes no sense. It is also counterproductive, because then what it does, it allows what I call state shopping. In other words, you don't like the rules in New York? Well, then you go to Pennsylvania. You don't like what California is doing? Then you can come to New York. That's the last thing you want. That is the last thing you want. But when you allow this pattern of disparate policies, that's exactly what you're driving. And look, I manage the state of New York. All the local governments in the state of New York must have the same policy. Why? Otherwise, we would be creating the same problem that the federal government is creating. You can't have Albany with one set of rules, but Schenectady with a different set of rules, and Rensselaer with another set of rules. People will be confused. And again, if you don't like the rule, you get in your car, you drive 15 minutes, you're in a different jurisdiction subject to a different set of rules. So in New York, you cannot shop New York City versus Westchester versus Nassau versus Albany versus Schenectady. It's one set of rules for the entire state. And it should be one set of rules for the entire nation. And that is the role of the federal government and national leadership. And it is lacking. The federal government should put one position in place and coordinate it with the states. If the federal government isn't going to do what it should do, then the states have to try their best, right? And the best way is for me not only to have a uniform policy within the state of New York, But to the extent you can, cooperate with surrounding states so you all have a common set of practices, right? I don't want to close down bars in New York, but Connecticut leaves the bars open. Why? Because then many people will get in their car and they'll drive to Connecticut to go to a bar, which is the last thing we want. Now we have people who are drinking and driving. It makes no sense. I don't want to have one set of rules here and a different set of rules in New Jersey, because then I close down the bars, you'll get in the car, you'll drive to New Jersey. It makes no sense. Well, then get the states to coordinate themselves. Yes, very hard to do. Luckily, we have set a template where our regional states work together. Many of you came to our regional meeting on marijuana laws. And I have a good relationship that I've developed with the surrounding governors. So we have actually deployed that here. And I just did a call with Governor Phil Murphy of New Jersey and Governor Ned Lamont of Connecticut, and we are adopting the same policies. So there is no benefit to try to shop New York versus Connecticut versus New Jersey. There will be no more gatherings of 50-plus people. So if you were hoping to plan a graduation party, you can't do it in the state of New York, you can't go do it in the state of New Jersey, and you can't do it in the state of Connecticut. Casinos, we all have casinos. If I close my casinos, but New Jersey keeps their casinos open, we're going to have the same problem. All casinos will be closed effective 8 p.m. tonight, and they will stay closed until further notice. On all these closings, they are all until further notice, and hopefully I can coordinate with the other governors so we can have the same opening period, just the way we had the same closing period. Gyms are closed effective 8 p.m. tonight. I know that's a specific hardship for the people in this room because I can all see you are in masterful shape, buff even. There are other ways to exercise. Theaters closing at 8 o'clock tonight until further notice. Any bar or restaurant closes at 8 o'clock tonight. However, there is a silver lining for these establishments because we're also very aware of the economic consequences for these establishments. So the State Liquor Authority is going to change its rules. They'll have guidance up by 5 p.m. this evening that will allow bars, restaurants, distilleries to sell their products off premises. So whatever you could order in the bar or restaurant or distillery or winery, you can purchase through takeout. And we hope that goes a long way towards alleviating any economic hardship. Stay home and order from your favorite restaurant, order from your favorite bar, order from your favorite winery, order from whatever establishment that you were thinking of patronizing. Just order it and stay at home. And again, the State Liquor Authority will change their rules to allow that. It's not currently allowed. We will only allow it during this period of closure, but I think it will help those businesses. As you know, we've done a lot of work with the wineries and distilleries to grow that industry in New York, and I want to make sure we protect them. Now everybody is at home, and they're at home with their kids. My kids are a little older, but I remember the old days when you're in the house with a number of young kids. The house can get very small very quickly. The kids can get very rambunctious very quickly. We're going to waive all park fees in all state parks, local parks, county parks. So you want to get out of the house? Great. Go to the park. The weather's changing. Take a walk. Enjoy your family, and do it in an environment that is not a dense environment, which is exactly what the parks provide. Other actions, all local governments must reduce their workforce by 50% minimum. I'm directing all local governments to allow their non-essential personnel to stay home, work from home, with a 50% minimum. A local government can go higher than 50%, but it must be a 50% minimum. Work from home, which is the same thing I'm asking private businesses. If we can ask private businesses to do that, government, I think, leads by example. So not just for New York State government, which will do this also, all local governments, non-essential people work from home, and a minimum of 50% of the workforce must stay at home. Second, I'm directing local governments to make sure that all their local police departments and emergency management services are supplied with masks, surgical masks. You have police officers who are encountering people in all different circumstances, EMS workers who traditionally wear masks, police officers who traditionally do not. But I was at the New Rochelle drive-through testing center the other day. And, you know, if you're a police officer, you're walking up to a car, you're stopping a driver, they roll down the window. By definition, you're within more than 6 feet. You don't know who you're talking to. People are positive who don't even know that they're positive. I want all the police officers who are showing, all first responders, are showing great coverage, great courage, getting up and going out and doing their job every day. I want them to know that we understand the situation they're putting themselves in, and we're providing the necessary precautions. So every local government must provide their local police department, EMS workers with masks. New York City, Nassau, Suffolk, Westchester, and Rockland must have child care, educational services, and meal programs in place by midnight. We said that those schools will be closing, but we need to take care of the negative, the downside of closing a school. This is not an easy decision. There are negatives when you close a school. Most notably, you don't have child care for essential personnel. You don't have child care for healthcare workers. Remember, please, the greatest challenge and the greatest damage is going to be done by an overwhelmed healthcare system. Nurses, healthcare workers, 1199 members don't have alternatives to child care. Public education is also this state's child care system. It's this nation's child care system. And it's not that easy to say, well, let them get a babysitter. They can't afford it, it's hard to find, and we would have created a true negative situation if we lost healthcare workers or first responders because we closed schools and they had to stay home with their children. This is solved easily enough. You're closing schools. Don't close all the schools. Leave a couple of schools open or parts of schools open to provide child care for the essential personnel. We also have to have meal programs and meal services in place and educational services in place. On that condition, I ordered the schools closed. But it's on that condition. And I want those plans, and I want them in place by midnight, and they have to be approved. We strongly advise that only services and businesses that are essential stay open after 8 p.m. Grocery stores, gas stations, pharmacies, medical facilities. We want people home. We want less density. We strongly advise this. This is not mandatory, but it is strongly advised. And it's not mandatory at this time. And it may be in the future, but it is strongly advised at this time. Testing, we have had a phenomenal increase in testing. We've been able to use our laboratories. Our emergency management team has done a very good job of reaching out to our state labs, getting them on track, getting them coordinated. Our testing numbers are way up, as you'll see. Next week, by the end of this week, we think we're going to be up to about 7,000 tests per day, which is an exponential increase of what we have done. I made the suggestion to the Vice President. I made it to the President. I often tell you when I am unhappy with the federal response to this state. The fairness dictates that kudos where kudos are due, and here the Vice President and the President responded very quickly. So I want to thank them for that. We started a drive-through testing facility in New Rochelle, Westchester, where we have one of the highest clusters. It's one of the first in the United States. I believe actually the first on the eastern seaboard. It has worked very well. It's safe for everyone. You drive up in your car, you never get out of your car, you're tested in your vehicle. They take the test kits back. The time that it takes to take the test is actually faster than we thought. Doesn't normally happen in government. We allotted 15 minutes per car. It's actually running ahead of that schedule. We want to replicate that because it's just smart. The worst thing is a person walking into an emergency room. If you are positive, you infect other people. If you're negative, you may get infected by walking into the emergency room. So this is the best way to test someone. We said we were going to open one on Long Island after the positive New Rochelle experience. We're also going to open one on Staten Island. Staten Island does not have an abundance of hospitals. Staten Island is a community where people drive, and Staten Island, I believe, is an appropriate location for this. I also think that Staten Island feels that they have not gotten the level of attention of health services that they need. And I've spoken to Max Rose, I spoke to Senator Andrew Lanza, and I believe this is going to make a difference. We're also open one in Rockland County on the same theory. We're going to a new phase in this entire process. We talked about early detection, we've talked about testing, we talked about containment. You see those numbers are going up. That means you're moving towards a mitigation phase, and you're moving to a phase where you must expect a significant inflow into the hospital health care system. Now again, this is the great curve they talk about, plus or minus. Flatten the curve, flatten the curve, flatten the curve. That's what all you hear, that's what you hear every day on TV. You see this curve, we must flatten the curve. The concept is right. Flatten the curve, slow the spread so the healthcare system can handle it. When they say this, I don't think of a curve, I think of a wave. And the wave is going to break, and the wave is going to break on the hospital system. We're doing everything we can to flatten the curve. I believe we've taken more dramatic actions than any state in the United States. I believe we've had the most effective response of any state in the United States. I don't believe we're going to be able to flatten the curve enough to meet the capacity of the healthcare system. So in this business, plan ahead, plan forward, anticipate what's coming down the road and get ready for it. Expanding the capacity of the healthcare system for a state is virtually impossible. Building a hospital is a very elaborate, extensive, expensive undertaking. Again, we need the federal government to play its role. The federal government has tremendous capacity. I was in the federal government. I was a cabinet secretary. I worked with the military. I worked with the Army Corps of Engineers. They have tremendous capacity. This is what they do. This is what they do. They build airports. They build bridges. They build hospitals. This is exactly what they do. Deploy the Army Corps of Engineers to come work with states to build temporary medical facilities. Get us backup beds. So when the hospital is overwhelmed, we can have some of the people who are in the hospital beds go to a backup medical facility. It makes all the sense in the world. And if you don't do it, you know what is going to happen. You're going to overwhelm the hospitals. You only have 53,000 hospital beds. You only have 3,000 ICU beds. Why? Because our health system is basically a private system. They don't build capacity that they don't need. They don't build extra ICU beds just in case. An intensive care bed is very expensive. They don't build a wing of ICU beds that sit vacant for 10 years on the off chance that there's going to be a public health emergency and you'll need the beds. They don't. It's not economic. It's not their business model. So we don't have them. We have the capacity that people use day in and day out. And that's not just New York, that's every state in the United States. You now have this influx, you can't handle it. You overwhelm the hospitals. You have people on gurneys in hallways. That is what is going to happen now if we do nothing. That is what is going to happen now if we do nothing. And that, my friends, will be a tragedy. We know what lies ahead. Look at the numbers from China, South Korea, and Italy. You don't have to guess. You just have to project. The numbers are on a chart. Our numbers are on a chart. Just extend the current trajectory. Just go dot, 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 and you'll see the numbers rise, and you compare those numbers to our hospital capacity, and it's still math at the end of the day. And it doesn't work. The federal government must do this. Assume the federal government doesn't do what the federal government is supposed to do, which would not be a wild assumption, as it hasn't happened to date. Well, then, as a fallback, the states have to do whatever they have to do. And the state has to mobilize to create backup medical facilities. And that is what we are going to do. We're going to organize the National Guard, work with the building unions, and work with private developers to find existing facilities, that could most easily be adapted to medical facilities. Meaning what? Meaning dormitories, meaning former nursing homes, facilities that have that basic configuration that could be retrofit. Even that is not easy because you have the construction element and you also have the equipment element. It is very, very hard to get medical equipment now because everybody on the globe is trying to buy the same medical equipment. Everybody wants to buy a ventilator. Everybody wants to buy oxygen. Everybody is trying to buy the same equipment, and it's terribly scarce. That's why I go back again to the capacity of the federal government, which operates and maintains a medical emergency stock where they have stocked medical equipment for domestic issues or for wartime, right? When you go to war and they set up a wartime hospital, they have equipment. They have it stockpiled. That's why they're uniquely suited to do this. But in any event, we're going to do the best we can. I need, first and foremost, to find available facilities that can be converted. And I'm asking local governments, especially in the most dense area, to immediately identify a number of beds in facilities that are available. Frankly, I hope they're surplus because we don't have, this is very expensive, and I don't want to pay money for acquisition of property and real estate. But we need the communities that are most effective to begin finding available beds. New York City, we estimate conservatively, we, at this point, should identify 5,000 additional beds, Nassau 1,000 additional beds, Suffolk 1,000 additional beds, Westchester 2,000 additional beds. Why more for Westchester? Westchester has the New Rochelle cluster, which, as you know, has a significant number of people who tested positive. We will do everything we can, but we need federal assets and we need federal assistance. I am very proud of this state government and what it can do. And we have done things that no state government has done before. We built bridges, we built airports, we've responded to emergencies. But know what you can't do. We don't have the billions of dollars that you would need to implement an immediate emergency hospital construction program. This state can't do it. No state can do it. To increase hospital capacity of the existing hospitals in the meantime, DOH is going to be suspending its regulations to allow existing hospitals to increase their space and capacity. DOH has regulations about how many beds per room, how much space between beds, et cetera, how wide a hallway has to be. Those are going to be suspended so hospitals can actually use their physical space with more efficiency. We're leaving it up to the hospitals for their discretion and prudence in making these decisions. But we do have to get very aggressive about them better using their existing space. I want the private hospitals to be on notice that we may soon be canceling elective surgery. We are not doing it now. Elective surgery is between 25 and 35% of the beds. Some of the elective surgery is critical. Some is not critical. The non-critical elective surgery may be canceled on a mandatory basis. I'm asking them now, as a precaution, to start to plan to cancel elective surgery that is not necessary. We will need that capacity in the hospitals when those numbers peak. Michael Dowling, who was the former health commissioner for the state of New York, a phenomenal fellow. He worked with my father and was in my father's administration. He was health commissioner, he was deputy secretary. He's just a jewel of a human being. And he's one of the best healthcare professionals in the United States of America. He runs Northwell now, which is a magnificent organization. But Michael and Ken Rasky runs Greater New York Hospital Association. They coordinate all the hospitals. I asked them to convene all the hospitals and now start developing the maximum surge capacity. So if a hospital's capacity is 500, okay, what if we bring in more beds? How many more beds can you hold? What if we brought in more staff, et cetera? We also have a number of efforts going on finding more staff, more doctors, et cetera, not just for the surge capacity, but also for the additional facilities we may open. These are the new number of tests. We're up to 7,000 tests, so it's a dramatic increase, 1,600 new tests. What happens when the testing capacity increases? The number of positives increase by definition. So the number of new cases has gone up 221 to 950 cases. And you can see New York City is increasing. Westchester is still disproportionate to the population of Westchester. That still represents the New Rochelle cluster. Nassau, 109. Suffolk 63, Rockland 16, Albany 12, Orange 11, Dutchess 10, Monroe 9, Ulster 7. Number of new cases, New York City and Westchester. Some in Nassau, some in Suffolk. But you'll see the cases rise in the most dense areas because that's where people are transferring the virus among themselves. Counties with new cases today, Allegheny, Onondaga, Ontario, and Wyoming. So you see the spread continues. Most impacted states in the United States, we are now 950, number one in the country, 676 for Washington State. Again, these cases are more an example of how many tests you're doing and who you're testing rather than a raw number of cases in that area. Our deaths have increased to 7. Washington is the next highest at 42. Total deaths in the United States, 67. Hospitalizations, 158 out of 950. That's 17% of the cases. When we talk about hospital capacity, just take that 17%, and it's always, if you notice, 14%, 15%, 16%, 17%. Run that 17% against whatever you think the total infected population will be, and then compare that to our hospital capacity. And that will keep you up at nights. Hence, the situation that Dr. Zucker and myself and my colleagues are in. Again, perspective, perspective, perspective. I went through the numbers in Italy. I went through the numbers in South Korea and China last night. You look at all these numbers, they're the same story. You look at the deaths in New York, it's the same story. People who had underlying illnesses, if they got the flu in a normal season, they would be in grave trouble. Instead, they got the coronavirus, and they had existing illnesses, and they passed away. Remember, before any of this, somebody would pass away in a hospital, an older person, and you would say, how did they die? And they would say, pneumonia. You'd say, pneumonia? Well, how'd they catch pneumonia? Well, it wasn't really pneumonia, it was they had heart disease, they had emphysema, they were struggling with cancer. And then the pneumonia becomes the accelerant to a bad situation. And that's what's happening here. Any of my colleagues, additional points? Why don't you make them? Melissa?
No.
Robert? Questions?
You said that gyms will be closed. Can you elaborate on that? And also, did you confer with City Hall or Mayor de Blasio on this? Because he was at the gym this morning, and just wondering if he knew about the fact that you're going to close down gyms.
He can be in the gym this morning. You can be in the gym this afternoon. You can be in the gym this evening. You just can't be in the gym after 8 o'clock.
Should he have been using the gym already as is with social distancing?
Yeah, yeah, you can use the gym.
Have you been using the gym?
Are you asking me if I go to a public gym?
Yeah, do you? Or gym in general?
Yeah, I have my own workout routine that I have developed over a number of years that I do alone. So I don't do it in the gymnasium.
Governor, have you heard,
Go ahead.
I'm sorry, Governor, have you heard back from the White House about the matter of deploying the Army Corps of Engineers?
We're having ongoing conversations, and none have been conclusive.
What's the overall prediction or projection for the number of people who could potentially get this in New York? And what's the overall projection for the need for hospital beds? I mean, I know we've got like a cap of like 50,000 or so beds, but what's the need looking like at this point?
Yeah, that's an unfair question for Commissioner Zucker because it's anyone's guess, but I'll recommend this to you. Google that question, and you will get a range from 40% to 80% of the population. Merkel said what, 70%? 60% of her population. 40% to 60%. So take 40% or 60% of 18 million, take a hospitalization rate of our sample of about 17%, and then compare that to 50,000 hospital beds. You will then break out in a sweat, maybe hives. You will feel great anxiety, panic attack, and you'll be right.
How does the state work for it? What are the plans in place? I know you have restrictions downstate, but I drove in today. The Empire State Plaza seems to be full. And as you're telling local governments get to 50%, what about state workers here in Albany?
Yeah, that was yesterday's policy. Today's policy is non-essential workers, a minimum of 50% of the workforce for our state government and every local government in the state.
Governor, are you requesting that the federal government shut schools, shut businesses, shut bars, restaurants? It seems like that's where you're headed.
I want federal guidance, Jesse. You can't have one state taking actions that are different than other states. There are ways to do it. You could say, if your state has a density index of over X, if you have more than this many cases, then this. But when you leave it, this is like the reverse federalism. This is a national pandemic, and there are no national rules. So literally, the national news broadcasts today would cause somebody to panic. Everybody on their own with all these hodgepodge, just say, you don't even have to make it mandatory. Just let the federal government say, here's what we think you should do, so I know what Connecticut is going to do and Massachusetts is going to do and Pennsylvania is going to do, or they're likely to do, so I do the same thing. Look how much damage you can do. I close down my bars. Jersey doesn't close down their bars. Everybody drives to Jersey to drink. Everybody drives home. It makes no sense.
By extension, though, did you try to include Massachusetts, Vermont, Pennsylvania, other regional states in this compact?
I did not get there here. You know, we are the tri-state area. We have the most interaction. Obviously, part of New York abuts Massachusetts, and Allen Chartock goes back and forth. Part of it goes, we have contiguous with Pennsylvania also. We did convene them for the marijuana regional discussion. We started here. We will be expanding. But this was quite an elaborate undertaking because you had to align 3 states' policies. So this is not just consultative. We actually all adopted the same policies, Jesse. I don't ever remember this happening, period.
So presumably, does this preempt what Mayor de Blasio announced last night in terms of closings of?
This preempts what any mayor anywhere or county executive anywhere in the state said. The same point I make about the national government is even more true on the state level. You can't close bars in Manhattan, but leave them open in Nassau, because now everybody drives to Nassau for the bar. You have to have one set of rules that are uniform. And that's why in an emergency situation, there's actually a protocol that makes sense. Local governments can set rules, the state can override those rules, and the federal government can override state rules. Because it's not a situation where you can allow all these disparate policies. They are actually counter not only to common sense, but they're counter to public safety and they're counter to public health.
Why not do the same thing with schools then in New York? Why not you just have a blanket policy, they're all closed, you know, like the city, going to be closed
We
April
will.
20th? What do you mean, will? I mean, you will.
We will.
When is that going to happen?
People that
You
have
wanna
tested
do
positive.
that
Yeah, I
now?
can. So about 86% of the schools are closed already statewide. We have talked to SED this morning. We are closing the remaining 14%. That will go into effect by Wednesday.
So then, is there a date specific as to when they would reopen?
We're starting with 2 weeks, and then we'll adjust as it makes sense moving forward.
So just so I'm clear, by the end of the day, this afternoon, you'll be closing all schools for 2 weeks?
Yes.
Well, yeah, and we'll have an announcement this afternoon on the specifics of that, because people want to know exactly how and when and what hour, et cetera.
Why just the 2-week period? Obviously, New York City's closed for, you know, a month or so. Why just start at 2 weeks and then reevaluate it? Is that kind of?
Reevaluate, that's all it is.
It's a
And look,
calibration.
if in 2 weeks, miraculously, everything is fine, I'll reopen every school in New York in 2 weeks. So,
So 2 weeks, all schools in the state closed for 2 weeks at least.
yeah, I haven't communicated with SED yet, Jesse, so that's what we're planning. We will have specific guidelines that we announced this afternoon.
Governor, the 950 people who have tested positive for coronavirus, have any of them self-resolved or gotten better at this point?
Sure.
Sure, we've actually had patients discharged from the hospital. 16 have been discharged from the hospital. And I am sure there are many people out there that we have not tested who have gotten coronavirus and have gotten better that are out there in the community. And as
Track of like how many people have tested positive and how many people are now like.
we're tracking all of that information, yes.
Excuse me, just look at these numbers, please. Where are they for you? Since it started, 169,000 cases, 77,000 recovered on the 169 since it started. 85,000 are pending, which means they're still ill. 6,000 passed away. I'm sorry.
What about
Just to go back to Jesse for a second. Jesse, I want a uniform policy on the schools also, because, you know, you have 2-parent families who have children in schools. businesses that are operating that have employees with children in different school districts. So we want to get a uniform school closing policy also, and that's what we're working with SED about. So hold on the details of the school closing policy, but we will be closing all schools. That is true, and I then want to have a uniform policy so we have a semblance of normalcy.
Is that sort of similar to what you're doing downstate? You want to ensure that there's childcare, there's
Yes, sir.
meals?
Yes, sir. And I want to make sure every school district is in a position to do that, and they know it's coming, and they're preparing for it.
Do gyms need to suspend their billing practices while they're closed? Asking
Did
for
gyms?
one who hasn't been to the gym in a while?
My gym did. But I don't have a gym.
Governor,
But I don't know what the other gym's policy is going to be.
Governor, what's going to happen with the budget at this point? And should there be money set aside, like a rainy day fund set aside for when we're still dealing with this several months down the road?
There should be a rainy day fund set aside. There should be a snowstorm fund set aside. There should be a fog fund set aside. Yeah, all those set aside should be done. Obviously, I'm kidding. The budget, I asked the controller to give me his re-estimate of the revenues. Let's just take a second on this because it's important that you understand. The essential element in the budget is the projection of revenues. And that's why there's always a disagreement on the revenue projection, and we have this whole elaborate process to come up with a consensus revenue forecast. We did a revenue forecast. Since we did a revenue forecast, the world has changed 180 degrees 3 times, okay? I asked the controller for a revenue forecast. He's doing it. You turn on the television, you look at the stock market, you tell me what the revenue forecast is. My best guess is our revenue forecast was outrageously high compared to what is going on. How high, who knows? Rob Mujica, who can be an optimist for very brief intervals of time, says that there's a theory that the market is a V. It dropped quickly, and it's going to come up quickly. That's a theory. What is the effect of these businesses that are closing down? How much revenue did they lose? And how much less tax revenue will we get? How many people will be laid off and not earning income? And how much tax revenue will we lose? There is no doubt that the revenues are going to be way down. So, rainy day fund, that was my attempt at humor, have a rainy day fund, a number of reserve funds. That is very true. On top of that, you have the Medicaid redesign team coming back, which is trying to close what was already a $2.5 billion hole. We now have a new complication that could only happen in a world of total chaos. The federal government is passed the first coronavirus bill, which I have lamented, $8 billion. New York State only gets $35 million. They're now passing a new coronavirus bill. In that coronavirus bill, New York State gets the lowest level of reimbursement. They do it based off the Medicaid funds. New York State gets 50% of their Medicaid funds reimbursed. Some states get 75%. No state gets less than 50%. In raw dollars, we do very well, but that's only because we spend more than anybody else. But in that bill, they tucked in a provision that said you can make no changes whatsoever to your Medicaid program, which means, if you want to take the literal approach, the MRT, which is recommending changes in the Medicaid program, cannot be accepted because of that federal bill. Why the federal government would have passed the written in language that says you can't make any changes to your Medicaid program, why our New York delegation allowed it when they knew in January we had an MRT, Mike Dowling, Dennis Rivera were heading it. The second time we did it to find improvements, I have no idea.
I read those provisions. My read was that there's one that basically says you can't cut benefits for people, which I don't think you were hoping to do anyway. And the other one says you can't do what you tried to do, which is to shift more of the share of costs on the counties. So counties and the city of New York are delighted that you've lost on the second
I
provision.
understand your position. Would you like to make a wager, my friend, that you are incorrect?
But I read the bill and I talked to the Senator Schumer's
I know,
office.
we went through this. Oh, okay, so you want to make a wager that you are wrong.
Casinos, I don't think you can.
I will wager you that you are wrong, that you misread the bill, that the bill says you can't make any changes to the Medicaid program which would preempt the MRT changes. I have no doubt that they did it as political protection. You're half right. They did it for political protection so the counties wouldn't have to pay anything more, which is ironic, by the way, since we voluntarily now pay all the excess from the counties, which we did on our own. The federal government never said you should pay all the increased costs, but they now want to tell us you can't raise it. It also said, do you have the language here? Yes. Wait, don't read it yet. How much are we wagering?
I'll bet you beer.
Okay. Read the language.
Yeah, it says you can't change any eligibility standards or methodologies. It also says you can't make any changes to any of the enrollment standards going forward. It talks about making changes to any premiums.
I'll take the beer right now, as a matter of fact, because you're not going to be able to give it to me after 8 o'clock.
And it also refers to any kind of income checks or any qualifying checks. So it goes on and on. But it basically limits substantially the ability of the MRT to do what the MRT was intended to do.
And here's the problem, Jimmy. Without the MRT, you can't balance the budget. So I spoke to Senator Schumer. They tried to say, oh no, all we did was protect the local governments in New York City. This provision goes well beyond that, says no MRT. You can't do a budget without the MRT. Now we can't do a budget until they fix that anyway. I spoke to Senator Schumer. I spoke to Congresswoman Lowy. I'm calling Congresswoman Speaker Pelosi. But it was a terrible blunder by the federal government. And it makes it impossible to do the budget, and they have to fix it, and they have to change it.
Last question. Speaking of that, the Senate and Assembly just canceled session for the day, postponed until at least Wednesday. I know you had some bills that you wanted them to do this week. Does that put a crimp in your plans?
No, Wednesday's fine. April 1 is the budget.
But didn't you have things like this week with the petition gathering numbers and paid sick leave?
No, I did the petition by executive order. That's done. Well, what they don't pass is the paid sick leave, which also gave people pay for their quarantine period. So I'm sure the people who are in quarantine and wanted to get paid wish that they voted for the bill so they could get paid.
Governor, you waived the 7-day waiting period on unemployment benefits. We're hearing reports that...
On what, I'm sorry?
On the unemployment benefits.
Yes, sir.
It seems like people going to the website can get it on the website, but then they're told to call a number, and they're saying that the wait could be several days before they hear back from DOL. So Can you kind of address that? Is there anything being done to fix that?
I have not heard that, obviously, but I will check forthwith. Shouldn't be, shouldn't be.
Just to go back to Medicaid, because I've got a beer on the line here.
Yeah. No, you lost the beer.
We've applied for waivers in the past successfully. What makes you think you couldn't come up with a way to do this that would also be eligible for a waiver?
Okay, you want to go double or nothing on that question?
Yes.
On what theory could you apply for a waiver for a law that is not changed and be granted the waiver in time to do a budget for April 1?
You come up with the plan, you bake it in, you do a contingent on a waiver, much like the budget you
I
proposed
do a
earlier this year.
budget contingent on a waiver?
Proposed the budget earlier this year contingent on a waiver.
2.5 billion? Maybe we'll get it, maybe we won't.
Earlier this year.
Never.
You did it earlier this year.
I never had a $2.5 billion contingency. You couldn't get it rated.
Does the closing of casinos affect the racino's too, as well as Batavia Downs and Cherokee casinos?
Who knows that?
Governor?
Rob?
Does the closing of the casinos affect the closing of racinos as well, such as Batavia Downs or the Saratoga Casino?
I believe it does.
Yes.
I believe it does.
2 beers, Jimmy, 2 beers.
Have you done modeling on this thus far, and can we anticipate how many cases, or can you share how many cases we can anticipate?
We actually are working with some of the associations on a modeling to try to figure out exactly where on that spectrum this will fall, both in New York as well as on the national level.
But Jesse, if you take your story in the, you didn't write it, your time story on projections, it answers that question. See, the range is so broad. If you go from 40% of the population to 70% of the population, it is so broad. And the hospitalization rates tend to be somewhat predictable. China will tell you their hospitalization rate, South Korea will tell you, Italy will tell you. The overall universe, they can't tell you the 40 to 70. But if you start with, if you go to 40%, if you go to any projection, you are, it's an avalanche on the healthcare system. Any projection. I mean, it's like hundreds of thousands.
How many deaths do we have recorded?
7.
7. Whereabouts are they?
There-
How many in the city?
There are 5 in New York City, 1 in Rockland, 1 in Suffolk.
Also, with the bars and restaurants closure, how does that impact the cities?
So you cannot ask 3 questions about bar and restaurant
I'm gonna
closures.
try.
I'm just saying, it's, go ahead.
I'm Irish. Anyway, so how
You
does
said
that
it.
impact the city's executive order that de Blasio announced last night, supposed to go into effect tomorrow?
This is a statewide executive order. Different governments may have different executive orders. This one overrides all executive orders.
Also, is your gym at home, or where is that?
I'm going to take you to my gym one day.
Plans to close the subways.
I'm sorry.
Governor, given the uncertainty around the budget, and all this talk about Medicaid, are you still pushing for a bond act this year?
Yes.
Similar question for marijuana.
Yes.
Do you anticipate that bail and marijuana
Yes.
will both be in the budget?
Yes, we're here, we're doing our job like everybody else, especially like government employees. Like the police are out doing their job, and the correction officers are doing their job, and the nurses are doing their job, and the transit worker unions are doing their job. Public service, we're here in public service, and that's what we're doing at a time when you desperately need public service. You join the military, you know when they need you? When there's a war, that's when they need you. And this is a war against coronavirus. So we're here, we're working.
So even with all of the moves that the state is making at the state level, you still want to see bail, some changes to bail reform and marijuana legalization within the budget?
Yes, I want to see as much as we can get done. Only caveat, I want to do things right. I know the legislature, sometimes they're overly anxious to pass a bill, and then you pass a bill, and then it turns out it was a mistake, and then you have to come back and fix it. I want to do as much as we can do. Only caveat, if it has not been thought through, that's a different story. I want to do what we can do as long as we can do it right. Thank you.
All right, so we were taking a listen there live at the news conference in New York as, well, pretty much every business in New York will be shutting down at 8 p.m. tonight. We're talking about bars, restaurants, gyms, really only the essential of essential places going to be open there. All right, folks, we are continuing always to bring you the top stories and headlines from across the country on coronavirusnow.com. We do appreciate you joining us here worldwide on News Now. Let's continue this coverage going. Take you out now to Rhode Island for an update there.
I know this is brutal. Tomorrow's St. Patrick's Day. For many of you pub owners, it's the biggest day of the year.
Be open there.
Figure out a
All
way
right,
to
folks,
make it up to you.
Always to bring you the
Doing
top
the
stories
right
and headlines.
thing. Islanders safe, and so thank you to Dale and to all of your members. Thank you so much. Know that you're doing the right thing, and we appreciate you. A few more things that I'd like to mention. Our unemployment insurance claims are starting to skyrocket. The same with our TDI claims. That's what we expected, and it's happening. So I'll make a few comments. Today, I will be submitting to the Federal Small Business Administration for an economic injury disaster declaration. What does that mean? That I'm trying to make it so that we are eligible to receive low-interest federal disaster loans designed to allow Rhode Island small businesses to apply for working capital loans to pay fixed operating costs through this period until we can return to some sense of normalcy. And I'd like to thank Mark Hayward, who is with us today in the back of the room. Thank you, Mark. Mark is the SBA District Director. He's been fantastic. He's here in Rhode Island and working very closely with us. I think Rhode Island is the first, or one of the first, to apply for this sort of disaster funding. We're going to work as hard as we can to get this money on the street as quickly as we can. But we're hearing from a lot of businesses, actually a lot of restaurateurs, who say, we hope to be returning to normal at some point in the near future, and we want to give you some liquidity so that you're able to keep the business open and help with paying for the fixed costs. So I've applied today. We're going to be working very closely. By the way, we're working very closely with our federal delegation in order to make sure Rhode Island is the very first state that has this sort of low-interest loans available to our small businesses. With respect to unemployment insurance, the best thing I can suggest is that you go online. If you call, the first thing that the person on the other end of the phone is going to say is to tell you to fill out an application. So we have, as of this morning, made it so that there's excess capacity. Go online. If you need to file for unemployment insurance, or for that matter for TDI, go online to the Department of Labor and Training's website, go ahead and apply, check that this is a COVID-related claim, and those claims will be expedited. And in this regard, I'd like to give a big thank you to the state's IT team, as well as Director Scott Jensen of DLT, who've been working throughout the weekend to make it so that as of today, we have excess capacity online, and we'll do everything we can to get the unemployment insurance checks out to you as quickly as possible. A few other thoughts. I've been hearing from a lot of teachers and principals and superintendents. They want to know what's happening to school next week and then the next week. I would just ask you to hang on a day or two. We know what's happening this week. This week, there's no school in the state of Rhode Island. It's closed, and we've asked teachers and principals and superintendents to begin finalizing their distance learning plans. By the way, I know you're all working on it, and I'd like to say thank you. I'm asking for a day or two, and we'll be coming out with an announcement very soon around what we think is best and safest for school in the coming couple of weeks. Similarly, there are many questions around what we're doing here at the state as it relates to lobbies, the DMV, the State House, folks who need to show up at a field office to get cash payments or food benefits and food stamps. We have another press conference this afternoon. I'll be issuing additional guidance then. For now, what I'm saying is avoid gatherings of 25 people or more. Avoid all non-essential meetings and human contact, and we'll be back out today, later this afternoon, with more specific guidance. With that, I'm going to turn it over to Dr. Nicole Alexander-Scott, and then Mayor Elorza, and then we'll answer all of your questions.
Doctor, would you just pull the microphone and speak?
Good morning. Thank you all for being here. Thank you, Governor, for your tireless leadership and effort. Thank you, microphone, for behaving properly. Thank you also, Mayor Elorza, for your partnership and leadership with this. So I want to echo what the governor has said. It is critical right now that people not be a part of gatherings or crowds where there are 25 people or more. We also have to make sure that people stay home, stay local, refrain from engaging in non-essential activities, particularly where there are crowds. We need everyone to understand the importance of this. We need everyone to understand the importance of this timing right now. I particularly want to speak to the teenagers that are out there. We are talking to you as well. The point of all students being home is not to then go congregate someplace else at the mall or in other places. I will continue to share the way this virus spreads is when groups of people get together and folks have symptoms of illness. That's all the virus needs. We are looking to stop the spread of illness, and that can only work with everyone participating. That's our teenagers, our students, and our adults setting the example. We have to act now to keep people healthy and safe and to limit the spread of COVID-19 in Rhode Island. Everyone has to play their part. Everyone does. So that's why we are now expanding to restaurants, to bars, cafes, any place where you go and you see a crowd of people, 25 or more. You can use a smaller number if you'd like. Avoid that crowd. Go someplace else, stay home, use a different time frame to go back out. Understand that crowds are what the virus uses to spread illness. That's why we are putting these directives before you. The governor announced about dine-in service at restaurants, bars, and cafes. We have been working to get additional guidance to people in the food industry. Everyone who works in the food industry or delivers food must stay home and not prepare or handle food for others if they have symptoms. That is critical. That is something everyone within food establishments know very well, and it's something that we have to be crystal clear about now. To cut down on the amount of face-to-face contact that people have, orders should be paid for online or by phone, by credit card, anytime that it is possible. There's also the opportunity to work with restaurants to be creative about having drop-off service or pickup service where you can come to the window. The goal here is to limit contact with multiple people again and again. The more we can do that, the better off we can be as a state. Food establishments have also been reminded of how critical it is that people practice appropriate hygiene and sanitation measures, especially at this time. So as mentioned, the Rhode Island Department of Health will be issuing guidance later today, particularly for food delivery service options and takeout protocols. I want to again thank restaurant owners, restaurant workers, Dale and the Hospitality Association. This is something that we will do together. And we very much appreciate the leadership of those in the restaurant and food industry who understand the importance, are taking the sacrifice together, and we need all members of Rhode Island to work with us. Regarding gatherings, as the governor has said, we're going to continue to repeat, we are restricting gatherings larger than 25 people. These are numbers that we're establishing really to reiterate the point. If you see a crowd, that's the best place for viruses to spread. That's what needs to be avoided. We should not be seeing teenagers out, group of 50 people huddling together. So we need everyone to heed this and to understand how critical this is. All you have to do, particularly while you're home now, is look online and check internationally what happens in countries where they have not been able to do this effectively. That's what we are looking to avoid. And we can do it if everyone heeds the guidance that's been put forth. We are being very aggressive because this window of opportunity is only open to us once. If we work effectively now, we can decrease how long this goes on for. In terms of data and our case count, I want to share what the updates are. Since the last time we communicated with you, we have had one additional case. This person is a woman in her 40s. She is currently hospitalized and is in isolation, but she is in stable condition. The Rhode Island Department of Health is currently investigating the source of her illness. This brings our total case count to 21. I also want to make an important statement about what we're seeing. Community spread occurs when you cannot immediately identify the source of illness. We have started to see cases where we have not been able to immediately identify the source of illness. To err on the side of caution and to help us stay 2 steps ahead of this, we are saying that Rhode Island has community spread. All the more important for everyone to heed the messages that we're saying. Virus spreads most easily in crowds. We need everyone to stay home and only go out for essential needs, please. Before stepping away, I want to reiterate our critical personal prevention measures. If you've traveled anywhere internationally in the last 14 days, self-quarantine for 14 days, that means stay at home, and monitor for symptoms of illness, fever, cough, shortness of breath. For everyone, whenever possible, avoid close personal contact with multiple people in public. When greeting people, avoid handshakes and hugs. Let's keep the elbow and fist pumps going. People who think they have COVID-19 should call their healthcare provider. We are working closely with healthcare providers to handle how to provide recommendations to you. I want to reiterate, if you have symptoms of illness, cough, fever, respiratory symptoms, shortness of breath, if you are able to stay home and recover, that is the best thing. Testing will be important for people who have severe illness and need to go to the hospital. Whether it's COVID-19 or the flu, the treatment is the same. If you can recover at home, please do that. That's the way to keep illness from spreading. People with general non-medical questions about COVID-19 can call our COVID-19 hotline. That phone number is 401-222-8022. Again, it's not too late to get your flu shot. That's critical. We've spoken today about preserving our healthcare system for the people that need it. A flu shot is one of the many preventive measures that can be done to keep people out of the hospital. Wash your hands often through the day. Use good cough etiquette. Cough or sneeze into your elbow. Avoid touching your eyes, nose, or mouth. That's how germs spread. All of these measures I have discussed and that the governor has mentioned and what you'll hear from the mayor all have an impact. We also really want to protect our older adults and people with underlying medical conditions. Those who are vulnerable are the ones that we need to monitor for. Finally, I want to acknowledge that there are a lot of questions out there. Teachers and parents want to know what's happening with school next week. You've already heard from the governor. We're going to continue to work with you. I want to also give that message to our primary care providers who have been on the front lines and doing the best they can. We appreciate you. We'll be talking to you later this afternoon as well. And I want to turn it over to Mayor Elorza. Thank you.
Thank you, Doctor. Good morning, everyone. I want to thank everyone for joining us and to the media. Thank you for helping us get this important information out on a timely basis and a recurring basis to all of our residents in the city and in the state. I want to especially thank the governor and her team for her leadership in this moment. The federal guidelines for communicating during a public health crisis say be first, be right, be credible, show respect, and promote action. And Governor, you and your team have done this throughout, and we appreciate the partnership. I also want to recognize Council President Sabina Matos, who's been a valuable thought partner for me and has been with us every step of the way. So thank you for your leadership on this as well, Council President Matos. And finally, I also want to recognize the hospitality industry. We know how deep of a hit this has been and likely will continue to be, but we appreciate your partnership in recognizing that this is important for all of us. As you know, and as we continue to hear from our health professionals, we are at a crucial and critical point in mitigating the impacts of COVID-19 within our city and state. We've continued to call on our residents, our business owners, our community partners, everyone to do their best in keeping our families, neighbors, and city safe from the spread of the virus. And I want to take a moment to thank everyone for their cooperation. I especially want to recognize our first responders, our clinicians, our public health officials, all of them who are working tirelessly and around the clock to keep our community safe. We're grateful to all of our public employees for their dedication. We thank everyone throughout these trying times. As more and more tests become accessible locally and nationally, we are now beginning to see the full extent to which this virus is impacting our community. We find ourselves still in this moment of what is called exponential spread or exponential growth. Based on the experience of other countries, we know that this time typically takes, on the shorter end, 5 to 6 weeks, and on the longer end, 8 weeks and counting. And the extent or the length of that exponential growth is entirely dependent on the social actions and the steps that we take to limit social interactions and hence the spread of this virus. In other words, as you've heard throughout, we need to do everything we can to maintain social distancing, and through that, we will flatten the curve. It's amazing how fast things are changing. And just last week, I announced that the City of Providence was taking emergency measures. What seemed bold just a few days ago now seem quite quaint. And as this virus continues to spread, it's important for us to take additional measures to continue to support and protect our community. I know that these changes are hard on so many of us, but so many of our businesses have already risen to the occasion. We've continued to monitor compliance to these restrictions, and we hold the public health and safety of our city as the #1 priority under these circumstances. Effective immediately, I will be ordering my police department and our public safety officials to ensure that we ramp up monitoring according to the guidance and the directives given by the governor to make sure that there is compliance, that restaurants, bars remain shut, and that gatherings are maintained to less than 25 people. We want to truly ensure that we're being safe and encouraging practices that will help us mitigate the spread. And with guidance from our public safety and public health officials, I'm prepared to use our forces, use our resources to, in fact, stop all on-premises food and alcohol consumption at restaurants in the city of Providence per the governor's guidance and directive. We also believe that limiting gatherings of people to 25 and less for the next couple of weeks will help us in this effort that we have as a community. Though it will be difficult for many of us, it's necessary in our efforts to contain the virus. In addition to the restrictions which you've just heard, beginning tomorrow, Tuesday, March 17th, I'm also requiring that Providence Place Mall close until further notice. We want to eliminate the highest risk areas within our state, and frankly, we also want everyone to take this seriously. This week, as kids are out of school, and perhaps some families are out of work, we do not want them to congregate in these public spaces and create the circumstances that are ripe for transmission. We need everyone to take this serious and do not leave your house unless it's for an essential reason. We have been in communication with leaders of our business community, and we understand the strain that these circumstances have had on their businesses. And while most people have complied, this past week we were forced to shut down 2 businesses that were not complying. And anyone who does not comply going into the future, your actions are irresponsible. You need to take responsibility, and if you don't, we will shut you down accordingly. As the capital city, this has already taken a palpable toll on the way we do things in our city. I'm not saying that residents and visitors should stop supporting our businesses, but we should do it responsibly in accordance with the governor's guidelines and directives. As we watch this crisis develop and spread in communities similar to ours, we can't stress enough to anyone who isn't yet taking this seriously, or to any young or able-bodied person who thinks they could just ride this out even if they get the virus. This is not about you. You all have a responsibility to your entire community, and you have to do everything you can to prevent yourself from getting it so that you are not unnecessarily spreading it to others who might be more vulnerable. Remember, we all have parents, we all have grandparents, we all know someone with underlying health conditions that might not be able to survive and might not be able to withstand having the virus. As a thriving and densely populated city, we need to take every precaution that's necessary to contain this virus.
It'll close at 9 o'clock tonight. How long this order will be in effect, we don't frankly know. It will be in effect as long as it needs to. To clarify, carry-out food is still allowed and certainly encouraged. We have some great restaurants. We have some that deliver food, maybe more that will be delivering food now. And so those are still open. The restaurant can stay open. That can take place. We hope it does take place. Some of our great places to eat, I know, have carry-out. Maybe more will be encouraged to do this. This is not a decision. Well, let me just, again, clarify. If you can walk in and buy a donut, or buy coffee, walk in, buy coffee, and walk out, that's okay. What we can't have is people congregating and people who are seated. So carry out is fine. Delivery is fine. I have some understanding of what this order will do. And I think of all the places that I've eaten across the state of Ohio, many small business owners who this is going to hurt greatly. I'm also aware of the many fine people who work in these establishments, work in these restaurants, work in the bars, who will not have a job. I'm going to ask in a moment the Lieutenant Governor to talk about some of the things that we're going to do, and there will be more to try to mitigate this and mitigate the suffering. But I understand, have some idea of that suffering, and I can't tell you how sorry I am. Our goal is for everyone to get through this. What we wish is that next St. Patrick's Day, everyone will be there. And they'll have the opportunity to celebrate St. Patrick's Day, but not only that, they'll have the opportunity to live their life and live their American dream. But if people are not around, they can't do that. And so this is a very, very crucial time. Delay means more people will die. Literally every day we delay, the data clearly shows that more people will die. It is not just only a question about people dying from this pandemic, from the coronavirus. It is also a case that if we do not act and stop and break up these groups and get some distance people, if we do not do that, our healthcare system in the state of Ohio will not hold up. We have people who have strokes, who have heart attacks, who have all kinds of urgent needs for that healthcare system to attend to. So the loss will not only be those individuals who might be not be able to get a respirator, not be able to be treated because of the coronavirus. The danger is not only to them, it is to everyone else who does not get this, and everyone else who needs to be treated. And so all the actions we are taking for this very specific purpose in mind. I'm going to ask, and let me just say one thing about the small business men and women. It is the small businesses that in an order like this are hurt the most. I'm fully aware of that. My family was in a small seed company, part of it retail, for about 70 years, started by my grandparents. I know how tough it is in small businesses. There's also been many DeWines who have run restaurants and many DeWines who have run bars. And so I have some understanding of this. Let me ask Dr. Acton to come up, and then I'll ask the Lieutenant Governor. Dr. Acton can give you an update of really where we are and some of the rationale behind this decision. The Lieutenant Governor will talk about what we're getting ready to start, what we've already been doing, the phone calls that have been made in regard to unemployment and in regard to other things that we're going to be doing to mitigate the suffering that will be caused by this order. Amy?
Thank you, Governor. Good afternoon, everyone. As you know, we've been trying to tell you everything we know as we know it, and I've given a series of little science lectures, so to speak, to try my very best to translate this as a doctor to my patients, which is the 11.7 million people of Ohio. My team's putting together the past press conferences we've had and snippets from that because I can't start from the beginning and take us all there today. But I'm going to give you a few things that I want you to keep in mind, go over again why our healthcare system not being overwhelmed is so vitally important, and I'm going to talk a little bit about how every day and every one of us and what we do matters. and try to give a little bit of guidance for the folks, what you can do at home and what we need to do for the most vulnerable among us. So starting with what we know today, it is getting increasingly hard to give you numbers that are accurate because it's pouring in so quickly. We have data from our labs. We're still awaiting some of the private data, but I'll give you what we knew as of 2 p.m. We do know that we have 36 positive cases and at least 350 pending people under investigation, and that's just in our lab. The illness onset is from February 7th through March 13th. And I want to pause there for 1 second and say, this is absolutely important for everyone in this country to understand. I saw Dr. Fauci, Dr. Gottlieb on the news today trying to explain this to people. And I've said this before, cases can be very misleading to the public because it's a past historical event. Because of our lack of testing, cases are just the tip of the iceberg. And in reality, it's not the numbers of people you have, the numbers going around. We will not have an accurate picture of that. We'll never know accurately who all, but we'll get closer as we look back in history on this. But it's not, the cases are the tip of the iceberg. There are many cases out there that are undetected. And more importantly, there are many asymptomatic people. Each and every one of us must suspect that we could have it or be carrying it. But you can be asymptomatic and your symptoms will not show for at least 5 to 6 days, if not 14 days from now. It is, like I said about the starlight, we're seeing the light in history of light years, and that is what you are seeing cases. So we are looking at what the scientists know, what we're seeing happening in other countries, what the best data and studies are, and we're predicting based on that. But be assured, it's already amongst us. And in fact, the fact that one of our cases started in February 7th, having their first symptoms, means that they were infectious long before that, up to 14 days before February 7th, but certainly at least 5 to 6 before they started showing those symptoms. And then they probably thought, like most of us probably did back in February, that we had a cold or perhaps the flu and lived through it. And that's amongst all of us here in Ohio. You have to understand that by the time you're infected and you do not know it, it will be another 2 weeks, and this is Hopkins research, 2 weeks before you will actually be hospitalized from this. It's really from that first onset of infection when you didn't know you have it to you are in the ICU is 2.5 weeks. And deaths are going to occur 4 to 6 weeks after that. So that is why we have to just assume right now what is here, and our data is increasingly showing that. Our age ranges, 31 years of age to 86 years of age, with a median age, again, of 53 years. We have 13 females and 23 males, 11 hospitalized. Multiple counties, and our county data is going to lag our understanding. I'm getting a lot of reports from a lot of cities that have been told they have a case. But unfortunately, because most of our testing is sequestered in the hospital centers, often in the big 3 Cs here in Ohio, sometimes they're putting down where they tested and not the county a person lives in. But as of right now, we have 11 counties that we have accounted for: Belmont, Butler, Cuyahoga, Franklin, Lorain, Lucas, Medina, Stark, Summit, Trumbull, and Tuscarawas. And I know for a fact that some of that has not been included yet. So, timing is everything and every day matters. All of this is about the hospital surge that you're hearing about. It's about what I believe Newt Gingrich just wrote about today, what he's seeing on the ground in Italy, saying we have to act like this is a war. It's a war on a virus. And you're seeing unprecedented measures in places like France and Italy. Italy, the closing of churches, even for individual prayer, has never been done, even in the Black Plague. You're seeing stresses on systems that have modern healthcare systems taking the actions we're taking. The blessing we have is that every day we do more, we are going to blunt that curve. But we are in the surge. And as the governor said, you know, the places, Wuhan was one city under a surge. It was one point because it was where it originated. They didn't have time to put our non-pharmacologic interventions, these things that we're doing to enforce the social distancing that is so essential. So they saw that spike, and every day and everything we do in this country, and this is from, again, Dr. Fauci, Dr. Gottlieb, the folks that were out there in the news that are saying this, everything we're doing is trying to slow the spread that we know is coming and decrease that surge on our hospital system. It is a lot like a hurricane. I've said this before as well. You want to evacuate and make your moves, and if you're blessed enough to see this tidal wave coming, this tsunami coming, you make these moves now, and every day decreases that exponential 2 to 3 people spread that creates the surge. We are in the time of evacuating from a hurricane where it's starting to pour more and more heavily with each day. We don't want to be doing these moves in the heat of the storm. And I can tell you, Ohio is prepared, they're preparing, our hospitals are preparing, but I want to give you some of the data. We'll talk a lot more about the surge tomorrow. Just some statistics that we have as of now. And my staff will give you the sources of these. In a moderate COVID-19 outbreak, as it hits the United States, and I'll say one more point, we likely won't have one city. We'll have surges in cities first, but we're gonna have multiple Wuhans in this country because it had already spread in our country. It didn't start at that point of origin. So you'll see this in places all over the country. We know from the first estimates that 200,000 ICU beds will be needed in the US. 45,000 ICU beds are available, and many of them are already occupied at 60 to 80% occupancy. We know that we have approximately 160,000 ventilators available. I heard Dr. Gottlieb use words this morning. We have 60,000 of the full-service ventilators, another 100,000 ventilators that aren't this, they're more mechanical, old-school type ventilators. We have in stockpile, I've heard some numbers, Dr. Gottlieb said 8,900 of the full service. I've heard 10 to 20,000. If we don't make these measures, and remember, this is key because people keep taking these numbers, if we do these measures now, we will greatly decrease the need for these. That's why it's so important. So the actions we take now will have an effect in mitigating these kinds of numbers. But if we delayed mitigation, an original estimate of an influenza of 1918, like
Hey Google,
would be, you would need
navigate home.
740,000 ventilators. So that's why the things we do matter, because we're trying to keep within the scope of what we have. You're going to see unprecedented measures by hospitals set up here. They're going to be doing more of what we said. We're going to be stopping all elective surgeries. They're going to be sending people who aren't as acute home. But much more important, I think people at home don't understand. It's very easy to think, especially when you're healthy right now, especially when it's just trickling that rain, that, you know, I'm invincible, I'm not going to need this. But the fact is, not only do we need this, for our most vulnerable, so many people in our country have pre-existing conditions of heart disease, diabetes, all sorts of healthcare needs who are being treated for cancer and on immunocompromising drugs, including our children, who we know get sick as much of us, don't get as badly sick, but some of our kids will get sick and some of our kids will die. And the ones who have pre-existing conditions more so, but they most certainly are infected as much as we are. But this is it, when our hospital systems are overwhelmed, that means if you're having a birth that you are planning, if you are in a car accident and need your hospital, if you have a stroke or an MI, even if you never get coronavirus, people in this country could die from something other than coronavirus. It's so important. These actions we take individually are going to keep our nurses from getting sick. You're going to hear a lot about bed capacity. It's not about beds. Our national, our National Guard and others will be setting up tents and things with beds. We need nurses and doctors. We need firefighters and EMS and people to not be sick right now. And every one of us might be infecting our neighbor who is a nurse, who we need during this response. This is a civic duty to keep those folks safe too. We know already of a firefighter who is one of our cases. That means that firefighter was sick for asymptomatic 6 to 14 days. That means that entire house of firefighters has been exposed and might need to stay home for 14 days. Now we don't have a fire station up and going. We saw this in Washington already from those first responders. So all of these ripple effects matter. And these proven strategies, we have talked to the scientists who have invented these strategies. They were in the footnotes of the governor's curve on that 1918 data. What they are saying is, and what Dr. Fauci said today is, we need to do all of this, and every day and every one of us matters. Young people, I had my first night at home with my husband, and my daughter was home. She's 23 or 4. I'm miscalculating that today as I stand here. Maddie, sorry. She and her friends were talking about, do we go out tonight? We should not be going to restaurants. Now, no, we rely on restaurants. 50% of us get our food from them now, and that's why the carry-out and delivery is still so needed, because we need that, because there's so much pressure on our stores right now. But if it is not essential, you should not be doing it. And young people, you're part of this, absolutely part of what I'm talking about. And we'll have more communications on how you can help during this, because we're going to need your help as well. This is disproportionately going to hit the most vulnerable amongst us. There is no doubt of that. We've predicted this all along. All over this state, philanthropies and nonprofits are working tirelessly. We're going to work on the needs of the homeless population. We're going to work on all of this. And these policies will layer on day after day. We won't have them all in the big day, but the state of Ohio has moved all the big rocks, the most important breaks we can put on spread, and we'll keep layering those on day by day. And as the Lieutenant Governor will share with you, we will keep building supports. But please know, everyone, this is the real thing. This is not a drill. This is the once-in-a-lifetime pandemic, and everything each of us does matters.
Good afternoon. I would like to reiterate a couple of things that the governor and Dr. Acton talked about. First, though, I want to thank the Restaurant Association and the restaurants and bar owners who spent time with us today, helping us work through these policies to make them as impactful from the standpoint of health benefits, and also helped us work through how we can minimize the economic consequences of these decisions. As the governor reiterated, this was a very difficult decision. We know how difficult it is on business owners and their employees. I also want to emphasize that carry-out and delivery are available options. You will want to continue to use these institutions, these businesses, for that purpose. We don't want everybody to stop buying restaurant food and start going to the grocery store. That will create problems of its own. Continue to use your local restaurants for food and delivery services, carry-out food delivery services. But as we have discussed, this will have an impact. And so the governor is going to sign an executive order regarding unemployment compensation. This will assist Ohio workers directly impacted by the COVID-19 health emergency. He will be issuing this executive order that will make several changes to Ohio's unemployment law and state agency policy to enable workers who do not have paid leave benefits to access unemployment benefits during this period of emergency. We will be broadening the current state policy to clarify that individuals that are quarantined by a health professional or by their employer are considered to be unemployed and will not be subject to the requirements to actively seek work during the period of this emergency. This also applies to companies that determine it is necessary to temporarily shut down operations due to the current emergency. Ohio currently has a 1-week waiting period before an individual can receive unemployment benefits. In the order, it will expedite payments to impacted Ohioans, and we will be waiving that delay, that 1-week delay for eligible workers to receive their first week's unemployment payments and applications. Because we do not want to penalize individual employers for the impact of this outbreak by increasing their future unemployment taxes, the cost of these additional benefits will be mutualized. The Ohio Department of Job and Family Services will waive employer penalties for late reporting and payments for the next quarter to assist employers impacted by the lack of staff availability. More information on this is available at unemployment.ohio.gov or at the 800 number 877-644-6562. Now I would like to move to an issue to help these bar owners and restaurants who may have purchased liquor in preparation for whether it was March Madness or St. Patrick's Day. The administration has been working with Jobs Ohio and the Department of Commerce, along with the Restaurant Association and the Ohio business community and the Division of Liquor Control to identify ways the state may be able to provide
The right thing for the governor to do so that it takes the decision out of our hands and that our staff can go home and worry about their families at this point. The challenges that we have, paying the bills, utilities, mortgages, insurance, all these things we still have to pay. I don't know how long we're going to have to be closed, but we have to go home as owners and try to figure out exactly how this is going to work for us and what our options are going to be, whether it be an SBA assistance or an insurance claim of some sort, but those, I believe, are going to be out there for us. The Ferndale DDA is part of the Main Street program in Oakland County. The Ferndale DDA has been really good about getting out to the business owners, giving us links to the SBA, giving us information as to what's out there to help us, what we can do to try and mitigate the loss that we're going to have and what we can do moving forward to keep our businesses going. Right now we're kind of being forced into a situation where we're on vacation. Doing things like carry out and delivery, gift card sales are all good things. The places that do carry out and known for it, you should continue to support them. Same thing with businesses that do delivery. Support those folks. They're going to need it. People like us that really are not known for that, and my particular businesses, I think we'll keep our doors closed and let the people that handle those things as a specialty service handle it, but don't let that dissuade you from going to carry out to your favorite restaurant and help supporting them if they decide to open in this time. We're all in this together. We have a lot to think about. We have a lot of new challenges to face. This is unprecedented territory. Restaurant owners have never thought about this before. I can guarantee it. I've talked to many through Facebook and on the telephone, and there's a sense of relief that this is happening right now, and I think we'll get through it. You know, all we can do is all we can do. We want to make sure that our staff is safe and that our customers are safe. So wash your hands and let's get through this together. That's all I really have to say right now. This is again trying times for everybody. The restaurant industry works on really slim margins. We've got a challenge ahead of us, and hopefully we get through it.
Could you please pronounce and spell your name?
My name is Dean Bach, DEAN-BACH. You're welcome. And at this point, I really have not much else to say. I get the honor to introduce Congressman Andy Levin.
Yes, sir. Okay.
All right.
Thanks, Dean.
Thank you.
Dean, do you have gift cards?
We do have gift cards.
All right. I'm buying a $100 gift card, and in happier times, Mary and I are going to come back here, and we're going to celebrate your reopening, whenever that is. I want to start by thanking all the folks up here for the great work they're doing, and particularly Governor Whitmer and County Executive Coulter for being ahead of the curve on making the tough decisions required to keep us all safe and try to flatten out the curve of this pandemic. I also want to start just on a personal level. All of you who are hearing this, we up here and you, we're just all people trying to deal with something that's scary and that has a lot of uncertainty to it. I've got a dad who's 88, an uncle who's 85, my mother-in-law's 88. Two of our kids have Crohn's disease, so they are immunocompromised, and they're young adults out in the world, so how to try to reel them in and keep them safe. And then I've got a school-age daughter whose school is closed. Every one of you has situations like this. And so I just urge you to prioritize your own personal safety and your family's safety. If we all dial back and keep our social distance, wash our hands, sanitizers, clean all those surfaces, you're taking care of yourself, but you're also reducing the risk for all of your neighbors. Do go outside. But, parents, if you got little kids and the playground equipment is used by a lot of kids, that's probably not the greatest idea. Everybody can take a walk. Everybody can go out, in the woods or whatever, whatever space that's not crowded that you have access to. I want you to know that our office in D.C. and my district office here in Warren are moving to telework or have moved to telework. But we are 100% available to you. I want you to call us. I want you to email us. Go to our website. If you have any concerns, problems with the federal government, or frankly, if you just want to talk, we are there for you to talk to you, and our staff is 100% engaged. On the federal level, first of all, a couple weeks ago, we passed $8.3 billion of all new funding to basically support and turbocharge the public health response to this, directly the public health response. Research into a vaccine, cures, and testing. Direct support for for state and local public health departments, and so forth. And then on Saturday night at 12:30 in the morning, Saturday morning at 12:30 a.m., we passed the Families First Coronavirus Response Act. And that is all about helping people most affected by this crisis. So, a couple of the top line pieces of it. Number one, for anybody who needs to be tested, I'm not urging everybody who has a sniffle to run out and get tested. If you're exposed or you have real symptoms, you need to be tested without regard to worrying about.
All right, everybody, we will be taping a segment here. This is Ron Hoon, Mike Pace. We're taping a 2-minute segment for the news at 4.
Okay, here we go. In 3, 2,
Hey everybody, it's Ron and Mike with the fastest 2 minutes in TV news, and we've got all kinds of stories, Mike, that we continue to follow when it comes to the virus. And there's this example out of, well, it was a flight that was delayed for hours because of one, frankly, bozo on board. You are not going to believe this. There was a flight, it was supposed to go from DFW to Nashville. It took off 8 hours late. And it was delayed 3 times. It took over 8 hours. Let me start it up. Yep. All right. 3, 2. Hey, everybody. It's Ron and Mike with the fastest 2 minutes in TV news. Mike, the one thing that you cannot do if you're on a plane right now is to even joke about the coronavirus.
No, not at all. And we have one example why that's the case.
Yeah. So this came out of DFW. There was going to be a flight that was supposed to go from Dallas to Nashville. It took over 8 hours to take off. It got delayed 3 different times because apparently a guy on the flight joked about having the coronavirus. So this was over the weekend, flight 1076 to Nashville. So apparently the guy was, he wouldn't lift up his tray table, and then he claimed that he had the virus. So as you can imagine, one passenger said, look, people on the plane were freaked out. They brought hazmat crews on.
Can you imagine?
They got to take incidents like this seriously, you know, so you got to give American credit for that. But then it turned out apparently that some of the crew members did not want to continue on with the flight, so they had to do kind of some reworking just to get that plane in the air and on to Nashville. So that is a definite no-no. The guy, by the way, has been arrested for making that false claim.
Just shows you that one person can really screw things up for a lot of people there on the board. All right, now let's go out to Oregon, where a police department out there telling and reminding the citizens, don't call 911 if you don't have any toilet paper or can't find any at the store.
Mike, don't tell me somebody did that.
Yes, they did there. The Newport, Oregon Police Department going to social media and saying, please do not call 911 when there's no toilet paper.
Wow.
Yeah.
Well, we once had a mayor here in the Valley, this was probably 20 years ago, who got lost on the way to a public event and called 911 because she was lost.
Oh, look at that.
There are things that you should and should not do when it comes to those 911 phone calls, and toilet paper is not an emergency, even if it feels like it at your place.
Yes.
That's the fastest 2 minutes.
With public health emergencies. And he can call in the CEOs of testing companies, of the companies that make the gowns, of the companies that make the respirators, and to order them to make what we need right now. And I urge, within 90 minutes, I got 57 co-signers on that letter. That's all I had. It was the end of the day Friday. We would have gotten hundreds. So I'm urging the president to invoke the Defense Production Act, and I can talk to people who are interested in the details of that later. But for now, I just want to end by, again, commending all of our leaders, and I'm going to single out one other one because I get to introduce her. Really, our Attorney General has been so out front in protecting the citizens in this situation and so many others. So I thank her, and I call her to the microphone, our great Attorney General, Dana Nessel.
Thank you, Congressman Levin. I do want to say that this seems, Executive Coulter, thank you so much for inviting me, but it seems particularly cruel on the day that we're talking about the closure of bars to be so close to all these delicious beers that you have at your establishment here, Dean. But obviously this is for the greater good, and there's a very important reason that the governor issued that important order. I do want to dovetail on what Congressman Levin said, in that obviously the federal government is working very hard to try to allay the financial concerns that so many people have, and of course the health concerns. I will say just yesterday I spoke with Representatives Slotkin, Stevens, and Dingell, and there is a coordinated effort between the state and the federal government in terms of providing relief to Michigan residents. So we are working in lockstep together on that. In regard to the governor's order from this morning, closing so many different types of establishments, obviously we understand that this is a tremendous hardship for tens of thousands of businesses around this state, hundreds of thousands of employees and workers. And again, obviously, there is a concerted effort to provide relief to these workers, and I will say that just moments ago, I believe the governor issued a new executive order that extends unemployment benefits and also expands those who would be eligible for those unemployment benefits, and most of you probably just got that into your email boxes from the press release. But that being the case, we do have to make certain that we are enforcing the governor's many executive orders for the health and safety of the public. This does not work unless we all work together on it. And so what our office is doing is we're working together, we're coordinating with local, county, and state partners, as well as state regulatory agencies in the event that we see any violations of the governor's executive orders. And we do ask people to contact our office at the Department of Attorney General for that. We are very sympathetic to the many people who are affected by this, but we have to make sure that people are not congregating and that the businesses that have been ordered to close remain closed. But of course, we, as Dean indicated, we urge people to frequent these businesses to the extent they can. If you can afford it, get takeout, get delivery, make sure you tip your servers the same way you would if you were dining in. All of us really need to pull together to take on this challenge, but we are going to be aggressive in terms of enforcement as well. So contact us at the Department of Attorney General if you see any violations of the governor's orders. A few other things that I want to discuss. I just want to reiterate what we talked about at our press conference yesterday in Lansing regarding price gouging. Again, the new executive order that came down from the governor yesterday is that no one who has acquired any product from a retailer shall resell that product in this state for a price that is grossly in excess of the purchase price at which they bought that product. And no one shall offer for sale or sell any product in this state at a price that is more than 20% higher than what the person offered or charged for that product as of March 9th of 2020, unless that person can demonstrate that the price increase is attributable to an increase in the cost of bringing that product.
And welcome everyone here to News Now. We are seeing another big down day, a market sell-off here, down 2,000 points. We were seeing it all last week. Welcome everyone here to News Now. 2 hours of nonstop coverage for you right here on Fox 10 Extra. I'm your host, Mike Page, alongside Ron Hoon. And Ron, this has just been really, the last 72 hours has been really just strange, hasn't it?
Yeah, it has, Mike. And of course, one of the problems is we're not quite there yet when it comes to testing. I think we're going to have a much greater handle on it, say, about a week from now. Because it took the government a while to get set and ready to go. It looks like they're saying that over the course of this week, they will finally ramp up. We'll have a lot more tests. So here in Arizona, we jumped in one day from 12 cases yesterday to 18 today. Now that's a 50% increase. Is that something we should be worried about? Or is it more indicative of the fact that starting to see more people getting tests? Yeah, the numbers they're kind of frightening, and frankly, we got to all remember we're going to get through this.
Yes.
Somehow, eventually, we will get through this. But there's great concern. I mean, Mike, I've been watching you this morning, and he's been taking you from one event. This is on our live stream.
Right.
From one event to the other. When you had Andrew Cuomo, the governor of New York, coming out and saying, we have identified that we have a need to be on the cautious side for 5,000 more hospital beds in and around New York City. So he said we want to work with developers or whoever we have to identify places that can be quickly converted from whatever they are now to basically makeshift hospitals. We watched what China did, and it was effective.
Right.
I mean, they said, we're going to build a hospital in 10 days. It really was incredible, especially when you watch the time-lapse video. Just this morning over in the UK, their Prime Minister, Boris Johnson, said, we want to start to roll out a plan where we can convert hotel rooms into hospital rooms because basically they want to be ready. If in fact the system gets swamped, that's the big concern. A lot of hospitals are already, operating close to capacity,
Yeah, sure.
and that's the real concern. So that was one glimpse out of the state of New York, what they're doing. But boy, until the end of the week, and we have much bigger numbers, then I think we'll finally get a real sense for where we're at, how bad it is.
And didn't you feel that on Thursday it was really like the turning point, I would say, as far as where people were really taking it seriously? I mean, you had the NBA shutting down.
Yep.
All the major sports, no March Madness, that we're not going to have this
I know.
time. And think
Yeah.
about it, even in Las Vegas, casinos now shutting down, MGM and others.
Well, we had an airline executive from one of the European airlines give an interview where this morning he said, it's clear to me now that this is the worst crisis in the history of aviation. So you go all the way back to when the Wright brothers first flew that aircraft to today in 2020. They have never seen darker days than what we are dealing with right now. I mean, you have a number of airlines that are talking about cutting back flights anywhere from 70 to 90% because people just don't want to get on planes. But at the same time, you have governments saying, we're not going to allow travel from here to there.
Right.
Yeah, it really creates a lot of concern. I saw where I believe it was British Air was asking its employees to voluntarily take some unpaid leave. So you have airline after airline trying to figure out where we go from here. It wasn't that long ago, Mike, that the only, biggest problem in the airline biz was with the 737 MAX.
That's true.
And the question was, when is it going to get back up in the air?
Yes.
And how things have changed in 1 month.
Yeah, think about that. That's now we have 100, just looking at the latest numbers, 175,000 total confirmed cases around the world. And this is really something that started in November and is now sweeping the world.
Yeah. And Italy is the cautionary tale.
Yeah. Yes.
I mean, you look at what they are dealing with. As Mike shows you the numbers, we're just about at that 2,000 point down mark, which, by the way, as bad as that looks, down 1,966, we were down well over that, well into the 20,000. I think it was about 20,500 range shortly after the market opened this morning. So as ugly as 8.5% is, it was much worse earlier. But yeah, Italy has tried everything, but they tried it too late. And right now it's not showing any signs of letting up. And it's really heartbreaking. But it is a cautionary tale for countries around the world. I guess we're fortunate in a way that the president did put the China travel ban on fast.
Yep.
Eventually the European travel ban came on, and so as it has literally kind of swept its way around the world, it's now come here. But we have had at least a few weeks to know it was coming our way and to gear up. Some people say we didn't do enough, but I will say this, we're expecting another update in a little over 2 hours, correct?
Yes, we
From
are.
the White House, and we'll see what either further restrictions they announce. I know a lot of mayors and governors were pretty upset to see that people, like on Friday and Saturday night, were paying no attention to the warnings to not gather in large numbers. And the bars and the nightclubs were jammed with people that are like, time out, nobody gets it, so we will have to take more drastic measures. I believe you told me, because you were monitoring that Andrew Cuomo news conference, that they are going to begin the process of shutting down a lot of businesses in New York starting tonight.
Yeah, tonight at 8 p.m. Eastern, bars, restaurants being shut down, as well as gyms. A lot of people, there's different ways to work out other than a gym workout, but this is going to be something to see. I mean, it's going to be almost like if New York shut down.
Yeah, something we've really never seen before.
No.
I mean, we made it through the 2 world wars. 9/11, of course, was such a shock to the national system and to the city of New York. And we just watch what's happening, both in terms as the numbers grow, particularly in New York. It does seem like they're pretty hard hit, but it really does feel as though they've got some of the right people in place. The governor there Andrew Cuomo and his team holding these daily news conferences, and it does really look like they're trying to get ahead of the curve. Look, today he said, and you carried some of this on the stream, we need more coordination from the federal government. But here's where we are identifying the needs right now. And one of the biggest was to get more temporary hospital bed space up and running fast.
Yeah, that's so true. And all day today, we'll be taking you really around the country, showing you these updates from city officials and government officials. Let's go do that right now. Let's go out to Michigan, where we have some people there talking about the latest there in Michigan, and then we'll take you out to New Jersey as well.
Great.
Right here on News Now, everybody.
If in 2 weeks or 3 weeks they say, oh, you overreacted, I think everyone here would agree with me that that was the wise and prudent thing to do at this moment. As I started by saying, we now have the level of infections that Italy had 2 weeks ago. I don't think we can take this seriously enough. I think we are taking it very seriously. And I hope people think it's an overreaction 2 weeks ago, because that means we did a better job of flattening the curve. It's spiking now, and now is the time for action to save lives.
Dean, if you could, I know you don't speak for all small businesses, but when we're talking about those options for loans and things of that nature, how long are you able to currently pay your employees before you have to start going to that kind of situation?
Most of us in this industry don't have deep bank accounts. With small businesses, small reserves, and we run on very tight margins. So the answer is I don't know. It might not be passed today. Right now, I'm telling all the staff to stay home. I'll get with them tomorrow. We're going to have a meeting so I can give them some options, whether it's state assistance through unemployment or the SBA assistance. But right now, I got to imagine that most people in my position are wondering the same thing. How are we going to pay a staff that counts on a paycheck every week?
Congressman, may I ask you something?
Sure.
Trying to keep it apolitical and understanding people are looking forward, but when it comes to medical equipment and when it comes to what some still continue to say is disinformation from the president, not to tee you up to go after that, but I'm just curious about the concerns about the information we continue to receive or not receive, and in regard to whether we are still not doing everything we can to get supplies to people who need them.
Well, I don't want to sort of relitigate the past. There'll be plenty of time for that. We need to support this administration to succeed in this because, as the county executive said, flattening the curve now will save thousands, tens of thousands, hundreds of thousands of lives potentially. So we just have to all work together as best we can. I am just trying to do my best to contribute to the most robust response possible. That's, for example, why I called on the president to invoke the Defense Production Act. So we're all trying to contribute to the most effective response possible. And I think what we see in terms of conflicting accounts and different information coming from different places within the administration, it is what it is. It's not something new, and I think we all just need to work together with the health professionals, the public health professionals in the administration who do understand this and know what to do to try to have the most effective response possible, and that's what we're going to do.
Other questions?
Going back to the executive order, what sort of penalties would a small business who refuses to comply would we be looking at here?
Let's hand that one to you, or is that an AG question? Yeah.
So now, in terms of a regulated business that involves somebody who has a license from the state, obviously you're looking at the suspension of their license or a revocation of their license in the event that they violate the executive order. For unregulated businesses, it's a misdemeanor offense. So the proprietor of that business can be criminally charged with a misdemeanor offense.
So perhaps a bar that was refused to close could lose their liquor license?
That's correct. And the Liquor Control Commission is going to be paying close attention to this.
Other questions? All right, we appreciate your time today. Thanks so much.
Thank you.
And coming up here next on News Now, we'll take you out to New York, hear from the New York governor there, Andrew Cuomo, talking about the concern. Yep. And welcome back, everyone, here to News and Now. We're taking a look at the market here, down 1,800 points. That is not the session lows, though, as we had more than 2,000 points a little bit ago down as the market continues its massive sell-off. Hi, everyone. Mike Page here. Thanks so much for joining us here on News and Now. We're going to keep you up to date on the latest coronavirus concerns from around the country. Right now, we're going out to New York, where the New York Governor Andrew Cuomo talked to the media after he made a big announcement saying that at 8 p.m. Eastern today, a lot of the businesses would be having to shut down, including bars and restaurants, gyms, and others. Let's take a look.
And coordinate it with the states. If the federal government isn't going to do what it should do, then the states have to try their best, right? And the best way is for me not only to have a uniform policy within the state of New York, but to the extent you can, cooperate with surrounding states so you all have a common set of practices, right? I don't want to close down bars in New York, but Connecticut leaves the bars open. Why? Because then many people will get in their car and they'll drive to Connecticut to go to a bar, which is the last thing we want. Now we have people who are drinking and driving. It makes no sense. I don't want to have one set of rules here and a different set of rules in New Jersey, because then I close down the bars, you'll get in the car, you'll drive to New Jersey. It makes no sense. Well, then get the states to coordinate themselves. Yes, very hard to do. Luckily, we have set a template where our regional states work together. Many of you came to our regional meeting on marijuana laws. And I have a good relationship that I've developed with the surrounding governors. So we have actually deployed that here. And I just did a call with Governor Phil Murphy of New Jersey and Governor Ned Lamont of Connecticut, and we are adopting the same policies. So there is no benefit to try to shop New York versus Connecticut versus New Jersey. There will be no more gatherings of 50-plus people. So if you were hoping to plan a graduation party, you can't do it in the state of New York. You can't go do it in the state of New Jersey, and you can't do it in the state of Connecticut. Casinos, we all have casinos. If I close my casinos, but New Jersey keeps their casinos open, we're going to have the same problem. All casinos will be closed effective 8 p.m. tonight, and they will stay closed until further notice. On all these closings, they are all until further notice, and hopefully I can coordinate with the other governors so we can have the same opening period, just the way we had the same closing period. Gyms are closed effective 8 p.m. tonight. I know that's a specific hardship for the people in this room because I can all see you are in masterful shape, buff even. There are other ways to exercise. Theaters closing at 8 o'clock tonight until further notice. Any bar or restaurant closes at 8 o'clock tonight. However, there is a silver lining for these establishments because we're also very aware of the economic consequences for these establishments. So the State Liquor Authority is going to change its rules. They'll have guidance up by 5 p.m. this evening that will allow bars, restaurants, distilleries to sell their products off premises. So whatever you could order in the bar or restaurant or distillery or winery, you can purchase through takeout. And we hope that goes a long way towards alleviating any economic hardship. Stay home and order from your favorite restaurant, order from your favorite bar, order from your favorite winery, order from whatever establishment that you were thinking of patronizing. Just order it and stay at home. And again, the State Liquor Authority will change their rules to allow that. It's not currently allowed. We will only allow it during this period of closure, but I think it will help those businesses. As you know, we've done a lot of work with the wineries and distilleries to grow that industry in New York, and I want to make sure we protect them. Now everybody is at home, and they're at home with their kids. My kids are a little older, but I remember the old days when you're in the house with a number of young kids. The house can get very small very quickly. The kids can get very rambunctious very quickly. We're going to waive all park fees in all state parks, local parks, county parks. So you want to get out of the house? Great. Go to the park. The weather's changing. Take a walk. Enjoy your family. And do it in an environment that is not a dense environment, which is exactly what the parks provide. Other actions, all local governments must reduce their workforce by 50% minimum. I'm directing all local governments to allow their non-essential personnel to stay home, work from home, with a 50% minimum. A local government can go higher than 50%, but it must be a 50% minimum. Work from home, which is the same thing I'm asking private businesses. If we can ask private businesses to do that, government, I think, leads by example. So not just for New York State government, which will do this also, all local governments, non-essential people work from home, and a minimum of 50% of the workforce must stay at home. Second, I'm directing local governments to make sure that all their local police departments and emergency management services are supplied with masks, surgical masks. You have police officers who are encountering people in all different circumstances, EMS workers who traditionally wear masks, police officers who traditionally do not. But I was at the New Rochelle drive-through testing center the other day. And, you know, if you're a police officer, you're walking up to a car, you're stopping a driver, they roll down the window. By definition, you're within more than 6 feet. You don't know who you're talking to. People are positive who don't even know that they're positive. I want all the police officers who are showing, all first responders, are showing great coverage, great courage, getting up and going out and doing their job every day. I want them to know that we understand the situation they're putting themselves in, and we're providing the necessary precautions. So every local government must provide their local police department, EMS workers with masks. New York City, Nassau, Suffolk, Westchester, and Rockland must have child care, educational services, and meal programs in place by midnight. We said that those schools will be closing, but we need to take care of the negative, the downside of closing a school. This is not an easy decision. There are negatives when you close a school. Most notably, you don't have child care for essential personnel. You don't have child care for healthcare workers. Remember, please, the greatest challenge and the greatest damage is going to be done by an overwhelmed healthcare system. Nurses, healthcare workers, 1199 members don't have alternatives to child care. Public education is also this state's child care system. It's this nation's child care system. And it's not that easy to say, well, let them get a babysitter. They can't afford it, it's hard to find, and we would have created a true negative situation if we lost healthcare workers or first responders because we closed schools and they had to stay home with their children. This is solved easily enough. You're closing schools. Don't close all the schools. Leave a couple of schools open or parts of schools open to provide child care for the essential personnel. We also have to have meal programs and meal services in place and educational services in place. On that condition, I ordered the schools closed. But it's on that condition. And I want those plans and I want them in place by midnight, and they have to be approved. We strongly advise that only services and businesses that are essential stay open after 8 p.m. Grocery stores, gas stations, pharmacies, medical facilities. We want people home. We want less density. We strongly advise this. This is not mandatory, but it is strongly advised. And it's not mandatory at this time. And it may be in the future, but it is strongly advised at this time. Testing, we have had a phenomenal increase in testing. We've been able to use our laboratories. Our emergency management team has done a very good job of reaching out to our state labs, getting them on track, getting them coordinated. Our testing numbers are way up, as you'll see. Next week, by the end of this week, we think we're going to be up to about 7,000 tests per day, which is an exponential increase of what we have done. I made this suggestion to the Vice President. I made it to the President. I often tell you when I am unhappy with the federal response to the state. The fairness dictates that kudos where kudos are due, and here the Vice President and the President responded very quickly. So I want to thank them for that. We started a drive-through testing facility in New Rochelle, Westchester, where we have one of the highest clusters. It's one of the first in the United States. I believe actually the first on the eastern seaboard. It has worked very well. It's safe for everyone. You drive up in your car, you never get out of your car. You're tested in your vehicle. They take the test kits back. The time that it takes to take the test is actually faster than we thought. Doesn't normally happen in government. We allotted 15 minutes per car. It's actually running ahead of that schedule. We want to replicate that because it's just smart. The worst thing is a person walking into an emergency room. If you are positive, you infect other people. If you're negative, you may get infected by walking into the emergency room. So this is the best way to test someone. We said we were going to open one on Long Island after the positive New Rochelle experience. We're also going to open one on Staten Island. Staten Island does not have an abundance of hospitals. Staten Island is a community where people drive, and Staten Island, I believe, is an appropriate location for this. I also think that Staten Island feels that they have not gotten the level of attention of health services that they need. And I've spoken to Max Rose, I spoke to Senator Andrew Lanza, and I believe this is going to make a difference. We're also open one in Rockland County on the same theory. We're going to a new phase in this entire process. We talked about early detection, we've talked about testing, we talked about containment. You see those numbers are going up. That means you're moving towards a mitigation phase, and you're moving to a phase where you must expect a significant inflow into the hospital health care system. Now again, this is the great curve they talk about, plus or minus. Flatten the curve, flatten the curve, flatten the curve. That's what all you hear, that's what you hear every day on TV. You see this curve, we must flatten the curve. The concept is right. Flatten the curve, slow the spread so the healthcare system can handle it. When they say this, I don't think of a curve, I think of a wave. And the wave is going to break, and the wave is going to break on the hospital system. We're doing everything we can to flatten the curve. I believe we've taken more dramatic actions than any state in the United States. I believe we've had the most effective response of any state in the United States. I don't believe we're going to be able to flatten the curve enough to meet the capacity of the healthcare system. So in this business, plan ahead, plan forward, anticipate what's coming down the road and get ready for it. Expanding the capacity of the healthcare system for a state is virtually impossible. Building a hospital is a very elaborate, extensive, expensive undertaking. Again, we need the federal government to play its role. The federal government has tremendous capacity. I was in the federal government. I was a cabinet secretary. I worked with the military. I worked with the Army Corps of Engineers. They have tremendous capacity. This is what they do. This is what they do. They build airports. They build bridges. They build hospitals. This is exactly what they do. Deploy the Army Corps of Engineers to come work with states to build temporary medical facilities. Get us backup beds. So when the hospital is overwhelmed, we can have some of the people who are in the hospital beds go to a backup medical facility. It makes all the sense in the world. And if you don't do it, you know what is going to happen. You're going to overwhelm the hospitals. You only have 53,000 hospital beds. You only have 3,000 ICU beds. Why? Because our health system is basically a private system. They don't build capacity that they don't need. They don't build extra ICU beds just in case. An intensive care bed is very expensive. They don't build a wing of ICU beds that sit vacant for 10 years on the off chance that there's going to be a public health emergency and you'll need the beds. They don't. It's not economic. It's not their business model. So we don't have them. We have the capacity that people use day in and day out. And that's not just New York, that's every state in the United States. You now have this influx, you can't handle it. You overwhelm the hospitals. You have people on gurneys in hallways. That is what is going to happen now if we do nothing. That is what is going to happen now if we do nothing. And that, my friends, will be a tragedy. We know what lies ahead. Look at the numbers from China, South Korea, and Italy. You don't have to guess. You just have to project. The numbers are on a chart. Our numbers are on a chart. Just extend the current trajectory. Just go dot, 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 and you'll see the numbers rise, and you compare those numbers to our hospital capacity, and it's still math at the end of the day. And it doesn't work. The federal government must do this. Assume the federal government doesn't do what the federal government is supposed to do, which would not be a wild assumption, as it hasn't happened to date. Well, then, as a fallback, the states have to do whatever they have to do. And the state has to mobilize to create backup medical facilities. And that is what we are going to do. We're going to organize the National Guard, work with the building unions, and work with private developers to find existing facilities that could most easily be adapted to medical facilities. Meaning what? Meaning dormitories, meaning former nursing homes, facilities that have that basic configuration that could be retrofit. Even that is not easy because you have the construction element and you also have the equipment element. It is very, very hard to get medical equipment now because everybody on the globe is trying to buy the same medical equipment. Everybody wants to buy a ventilator. Everybody wants to buy oxygen. Everybody is trying to buy the same equipment, and it's terribly scarce. That's why I go back again to the capacity of the federal government, which operates and maintains a medical emergency stock where they have stocked medical equipment for domestic issues or for wartime, right? When you go to war and they set up a wartime hospital, they have equipment. They have it stockpiled. That's why they're uniquely suited to do this. But in any event, we're going to do the best we can. I need, first and foremost, to find available facilities that can be converted. And I'm asking local governments, especially in the most dense area, to immediately identify a number of beds in facilities that are available. Frankly, I hope they're surplus because we don't have, this is very expensive, and I don't want to pay money for acquisition of property and real estate. But we need the communities that are most effective to begin finding available beds. New York City, we estimate conservatively, we, at this point, should identify 5,000 additional beds. Nassau, 1,000 additional beds. Suffolk, 1,000 additional beds. Westchester, 2,000 additional beds. Why more for Westchester? Westchester has the New Rochelle cluster, which, as you know, has a significant number of people who tested positive. We will do everything we can, but we need federal assets and we need federal assistance. I am very proud of this state government and what it can do. And we have done things that no state government has done before. We built bridges, we built airports, we've responded to emergencies. But know what you can't do. We don't have the billions of dollars that you would need to implement an immediate emergency hospital construction program. This state can't do it. No state can do it. To increase hospital capacity of the existing hospitals in the meantime, DOH is going to be suspending its regulations to allow existing hospitals to increase their space and capacity. DOH has regulations about how many beds per room, how much space between beds, et cetera, how wide a hallway has to be. Those are going to be suspended so hospitals can actually use their physical space with more efficiency. We're leaving it up to the hospitals for their discretion and prudence in making these decisions, but we do have to get very aggressive about them better using their existing space. I want the private hospitals to be on notice that we may soon be canceling elective surgery. We are not doing it now. Elective surgery is between 25 and 35% of the beds. Some of the elective surgery is critical. Some is not critical. The non-critical elective surgery may be canceled on a mandatory basis. I'm asking them now, as a precaution, to start to plan to cancel elective surgery that is not necessary. We will need that capacity in the hospitals when those numbers peak. Michael Dowling, who was the former health commissioner for the state of New York, a phenomenal fellow. He worked with my father and was in my father's administration. He was health commissioner, he was deputy secretary. He's just a jewel of a human being, and he's one of the best healthcare professionals in the United States of America. He runs Northwell now, which is a magnificent organization. But Michael and Ken Rasky runs Greater New York Hospital Association. They coordinate all the hospitals. I asked them to convene all the hospitals and now start developing the maximum surge capacity. So if a hospital's capacity is 500, okay, what if we bring in more beds? How many more beds can you hold? What if we brought in more staff, et cetera? We also have a number of efforts going on finding more staff, more doctors, et cetera, not just for the surge capacity, but also for the additional facilities we may open. These are the new number of tests. We're up to 7,000 tests, so it's a dramatic increase, 1,600 new tests. What happens when the testing capacity increases? The number of positives increase by definition. So the number of new cases has gone up 221 to 950 cases. And you can see New York City is increasing. Westchester is still disproportionate to the population of Westchester. That still represents the New Rochelle cluster. Nassau, 109. Suffolk 63, Rockland 16, Albany 12, Orange 11, Dutchess 10, Monroe 9, Ulster 7. Number of new cases, New York City and Westchester. Some in Nassau, some in Suffolk. But you'll see the cases rise in the most dense areas because that's where people are transferring the virus among themselves. Counties with new cases today, Allegheny, Onondaga, Ontario, and Wyoming. So you see the spread continues. Most impacted states in the United States, we are now 950, number one in the country, 676 for Washington State. Again, these cases are more an example of how many tests you're doing and who you're testing, rather than a raw number of cases in that area. Our deaths have increased to 7. Washington is the next highest at 42. Total deaths in the United States, 67. Hospitalizations, 158 out of 950, that's 17% of the cases. When we talk about hospital capacity, just take that 17%, and it's always, if you notice, 14%, 15%, 16%, 17%. Run that 17% against whatever you think the total infected population will be, and then compare that to our hospital capacity. And that will keep you up at nights. Hence, the situation that Dr. Zucker and myself and my colleagues are in. Again, perspective, perspective, perspective. I went through the numbers in Italy. I went through the numbers in South Korea and China last night. You look at all these numbers, they're the same story. You look at the deaths in New York, it's the same story. People who had underlying illnesses, if they got the flu in a normal season, they would be in grave trouble. Instead, they got the coronavirus, and they had existing illnesses, and they passed away. Remember, before any of this, somebody would pass away in a hospital, an older person, and you would say, how did they die? And they would say, pneumonia. You'd say, pneumonia? Well, how'd they catch pneumonia? Well, it wasn't really pneumonia. It was they had heart disease. They had emphysema. They were struggling with cancer. And then the pneumonia becomes the accelerant to a bad situation. And that's what's happening here. Any of my colleagues, additional points? Why don't you make them? Melissa?
No.
Robert? Questions?
You said that gyms will be closed. Can you elaborate on that? And also, did you confer with City Hall or Mayor de Blasio on this? Because he was at the gym this morning, and just wondering if he knew about the fact that you're going to close down gyms.
He can be in the gym this morning. You can be in the gym this afternoon. You can be in the gym this evening. You just can't be in the gym after 8 o'clock.
Should he have been using the gym already as is with social distancing?
Yeah, you can use the gym.
Have you been using the gym?
Are you asking me if I go to a public gym?
Yeah, do you? Or gym in general?
Yeah, I have my own workout routine that I have developed over a number of years that I do alone. So I don't do it in the gymnasium.
Governor, have you
Go ahead.
I'm sorry, Governor, have you heard back from the White House about the matter of deploying the Army Corps of Engineers?
We're having ongoing conversations, none have been conclusive.
What's the overall prediction or projection for the number of people who could potentially get this in New York? And what's the overall projection for the need for hospital beds? I mean, I know we've got like a cap of like 50,000 or so beds, but what's the need looking like at this point?
Yeah, that's an unfair question for Commissioner Zucker because it's anyone's guess, but I'll recommend this to you. Google that question and you will get a range from 40% to 80% of the population. Merkel said what, 70%? 60% of her population. 40% to 60%. So take 40% or 60% of 18 million, take a hospitalization rate of our sample of about 17%, and then compare that to 50,000 hospital beds. You will then break out in a sweat, maybe hives. You will feel great anxiety, panic attack, and you'll be right.
How does the state work for it? What are the plans in place? I know you have restrictions downstate, but I drove in today. The Empire State Plaza seems to be full. And as you're telling local governments get to 50%, what about state workers here in Albany?
Yeah, that was yesterday's policy. Today's policy is non-essential workers, a minimum of 50% of the workforce for our state government and every local government in the state.
Governor, are you requesting that the federal government shut schools, shut businesses, shut bars, restaurants? It seems like that's where you're headed.
I want federal guidance, Jesse. You can't have one state taking actions that are different than other states. There are ways to do it. You could say, if your state has a density index of over X, if you have more than this many cases, then this. But when you leave it, you know, this is like the reverse federalism. This is a national pandemic, and there are no national rules. So literally, the national news broadcasts today would cause somebody to panic. Everybody on their own with all these hodgepodge, just say, you don't even have to make it mandatory. Just let the federal government say, here's what we think you should do, so I know what Connecticut is going to do and Massachusetts is going to do and Pennsylvania is going to do, or they're likely to do, so I do the same thing. Look how much damage you can do. I close down my bars. Jersey doesn't close down their bars. Everybody drives to Jersey to drink. Everybody drives home. It makes no sense.
By extension, though, did you try to include Massachusetts, Vermont, Pennsylvania, other regional states in this compact?
I did not get there here. You know, we are the tri-state area. We have the most interaction. Obviously, part of New York abuts Massachusetts, and Alan Chartock goes back and forth. Part of it goes, we have contiguous with Pennsylvania also. We did convene them for the marijuana regional discussion. We started here. We will be expanding. But this was quite an elaborate undertaking because you had to align 3 states' policies. So this is not just consultative. We actually all adopted the same policies, Jesse. I don't ever remember this happening, period.
So presumably, does this preempt what Mayor de Blasio announced last night in terms of closings of...
This preempts what any mayor anywhere or county executive anywhere in the state said. The same point I make about the national government is even more true on the state level. You can't close bars in Manhattan, but leave them open in Nassau, because now everybody drives to Nassau for the bar. you have to have one set of rules that are uniform. And that's why in an emergency situation, there's actually a protocol that makes sense. Local governments can set rules, the state can override those rules, and the federal government can override state rules. Because it's not a situation where you can allow all these disparate policies. They are actually counter not only to common sense, but they're counter to public safety and they're counter to public health.
Why not do the same thing with schools then in New York? Why not you just have a blanket policy, they're all closed, you know, like the city, going to be closed
We
April
will.
20th? What do you mean, will? I mean, you will.
We will.
When is that going to happen?
People that have tested positive. Yeah, I can. So about 86% of the schools are closed already statewide. We have talked to SED this morning. We are closing the remaining 14%. That will go into effect by Wednesday.
So then, is there a date specific as to when they would reopen?
We're starting with 2 weeks, and then we'll adjust as it makes sense moving forward.
So just so I'm clear, by the end of the day, this afternoon, you'll be closing all schools for 2 weeks?
Yes.
Well, yeah, and we'll have an announcement this afternoon on the specifics of that, because people want to know exactly how and when and what hour, et cetera.
Why just a 2 week period? Obviously, New York City's closed for, you know, a month or so. Why just start at 2 weeks and then reevaluate it? Is that kind of
Reevaluate, that's all it is. And look, if in 2 weeks, miraculously, everything is fine, I'll reopen every school in New York in 2 weeks. So
2 weeks, all schools will stay closed for 2 weeks at least.
yeah, I haven't communicated with SED yet, Jesse, so that's what we're planning. We will have specific guidelines that we announced this afternoon.
The 950 people who have tested positive for coronavirus, have any of them self-resolved or gotten better at this point?
Sure.
Sure, we've actually had patients discharged from the hospital. 16 have been discharged from the hospital. And I am sure there are many people out there that we have not tested who have gotten coronavirus and have gotten better that are out there in the community.
All right, we were taking a listen there as New York really going to start shutting down businesses starting at 8 p.m. tonight there. Let's go out live right now to the Pentagon. We got a live briefing from Department of Defense officials on the coronavirus.
Information about the changes happening in the department impacting our service members. I'll give a few updates and then Dr. Friedrichs and myself will take some of your questions. First, I want to start with the latest DoD coronavirus numbers. As of 0500 today, there have been 37 reported cases, 18 military, 13 dependents, 3 civilian, and 3 contractors. We are continuing to monitor the situation and will provide updates each day as we receive them. As you know, on Friday, the Deputy Secretary Norquist released additional guidance on domestic travel for service members and DoD personnel. Effective today through May 11th, all domestic travel for military personnel will be halted unless it meets one of a number of waiver criteria, including mission essential travel or humanitarian reasons. This will also restrict DoD civilian hiring on DoD installations to persons who live within the immediate commuting area of the facility. The Secretary continues to state his top priority during the outbreak is to protect service members and their families and maintain our ability to complete our essential missions. And we're going to continue to take all of those efforts. I wanted to give a couple additional updates. Today, the department has given authority to the local commissary store directors to impose restrictions on purchasing high-demand products. This will be done in coordination with base leadership. The department is working to make sure that service members and their families living on base understand these changes and have access to the goods that they need. Finally, I want to give you guys some updates on what we're doing here in the building. Starting today, the Secretary and the Deputy Secretary are remaining physically separated. So we are attempting to put for lack of a better term, a bubble around the two of them. That means that they and their staffs will only interact via teleconference. We're screening people that are entering the Secretary's suite and limiting the number of people who have access as well. Earlier today, the CMO team, I think some of you may have been on that, hosted a teletown hall for residents of the Pentagon Reservation to address the protective measures that we've put in place. They got a bunch of really good questions from people on the reservation, which includes this building as well as, I believe, 78 other buildings in the National Capital Region, talking about force protection, health protection measures. We're going to continue to do events like that here and around the country to keep our people informed. At this time, I want to just thank a number of people who have been working on this problem for many weeks now. So I believe we've had teams at a number of different bases working on coronavirus issues, providing HHS support to HHS at Dobbins, Miramar, Lackland, and Travis. Those teams have done an outstanding job in what has been a very demanding situation, and they've continued to do a great job, and everyone here at the department appreciates that. And then last, I want to thank the custodial staff at the Pentagon. They've been asked over the last few weeks to really step up what they've done to help limit the spread of any infectious disease here. And so I think, as you guys have seen, they're increasing their rounds, they're increasing the type of work they're doing, and that is to everybody's benefit here, and we appreciate that. So with that, I'll see if General, do you have anything
No,
else?
I would say let's go straight to questions, sir.
All right, Bob.
Jonathan, aside from what the National Guard is doing in many states, is the Defense Department considering making available to civilian agencies medical facilities, medical equipment, medical personnel? Is that under consideration?
So I think you guys are all familiar with how the requests for assistance come into the department. And so far we've received requests for assistance from HHS specific to the quarantining and housing of individuals who are either evacuated from Wuhan, Hubei province, or the Grand Princess and the Diamond Princess. And then additionally for the 11 feeder airports for individuals who flew back into the U.S. who need to be quarantined. So that's the one set of RFAs that we have fulfilled with regard to coronavirus. We've not received any other ones at this time that we have responded to and are doing. We are looking at a number of different options with regard to resources and what we can do. I would point out that the big benefit of the Department of Defense is logistics and planning support. Those are two things that we are able to provide a lot of assistance to. There are other things where we'll take a look at it as they come in, but at this time, those are the only RFAs that we've seen so far.
Okay, so aside from the request itself, which you've made clear you haven't had any of this type, but you're considering what you might do or might be able to do in the area of medical assistance?
So we've done a look at our abilities and our resources and what we can do. And where we think that we have capability to assist the civilian sector in this whole of government approach, while still ensuring that we have the resources that are necessary to A, take care of our personnel and their families, and B, to focus on our mission.
And welcome back, everyone, here to News Now. I'm your host, Mike Page. We have one more hour here on Fox 10 Extra, and we are continuing to take a listen at the Department of Defense, talking about the coronavirus strategies as well as concerns with the government officials there. I do want to take you out live right now, just show you the market lows right now. We are seeing session lows here down 2,200 points. Big market sell-off again today, and we will continue to follow that for you. I do got the latest numbers here. Total confirmed cases around the globe at 179,000. There has been 7 deaths around the world associated with the coronavirus, and we will continue to take a look at news briefings from around the country as they happen. Let's go back out to the Department of Defense.
Meet the requests that we get, and that's why I think this is really important that, you know, if we're asked to do something, we look at what we have available and how best to support that.
Yeah. Sorry, it's a little disconcerting. This is the closest I've been standing next to somebody in about a week, so it's throwing me off. So, okay.
Sure, if I could follow up, how much slack is there in sort of the military health system that you can actually provide to the civilian authorities? They're obviously not doctors just lying around who are waiting to go to work. They would presumably come from civilian hospitals. You know, how many respirators do you have sort of lying around? I mean, how much can you actually support if you're asked?
Yeah, so those are great questions, and those are the sorts of analyses that we're going through right now to identify what we can do. And I want to emphasize the point that people have come up and said, you know, what about this idea? What about that idea? We're trying to step through each of those questions that we receive and then say, here's what's within the realm of possible. If we do this, then here's the consequence. A great one that's come up is, why don't we mobilize the Guard and Reserve? I think that's what you're talking about right now. The challenge with that, as you alluded to, is if you mobilize the Guard and Reserve medical personnel from their civilian jobs, they're no longer in their civilian jobs, and that directly impacts the community where they worked. And that's the trade-off that, whether it's a natural disaster or the coronavirus or anything else, that's part of the trade-off that we look at as we offer options going forward.
Okay, David?
General, give us some idea of the capacity that is out there within the Department of Defense. How many hospital beds? How many doctors, if it comes to that?
So we have 36 hospitals in the United States, and from the standpoint of a domestic response, 36 hospitals within the United States. As many of you are aware, they are relatively small hospitals. They're not 1,000-bed hospitals, so they range in size. Many of them are configured to support, as you might imagine, our immediate military needs. So they take care of the active duty population and their families and some retirees. We have some large facilities, like here in the D.C. area up at Walter Reed, that have much more diverse services. And we have a number of smaller facilities in more remote locations, like Fort Wainwright in Alaska has a small hospital that offers obstetrical services and basic community hospital type services. So unfortunately, the answer is it depends on the community and what the requirement was to support the operational force in that community that has determined the size of the hospitals that we have.
The governor of New York has publicly asked for the Corps of Engineers to start constructing facilities. What could the Corps of Engineers realistically do?
Sir, as a doc, I'm not going to be able to answer that question for the Corps of Engineers. I'd have to.
Yeah, I mean, well, one thing I just, to the first question, point out, some of those hospitals that we do have, as the doctor kind of alluded to, is the way they're configured. A lot of neonatal, pediatric care beds in those hospitals out of that group of beds. Our doctors are unsurprisingly trained highly in traumatic injuries and dealing with traumatic injuries. And so we have a much younger population that we're dealing with treating in our hospitals. And so all of these kind of factor into what is that capability we have for a potential outbreak that generally has been more devastating to older persons who require a different type of attention than we normally do. So that's all being looked at, is how we can take the type of services we normally provide, or the type of skills that we have, and see what we can do. With regard to the question about the governor's comment, aware of the governor's comments, we've not received an RFA or a request to actually do any construction. That would be something that we would look at. At this time, I think there are some other options out there that we've seen private companies that are able to do some of the construction. There are other facilities, but we have not been asked to take a look at that yet. But we're standing by to look at RFAs as they come in and work with the White House on deciding how we best support those. Jeff?
Former Vice President Joe Biden floated the idea of the military building these tent hospitals with 500 beds. Is that one of the options that is being considered right now?
So we do have tent hospitals. They are deployable hospitals, and much as was just mentioned there, the challenge is they're designed to take care of trauma patients and combat casualties. And so, we have a variety of capabilities, much like our fixed facility hospitals. Our deployable hospitals vary in size, and the specific capabilities are tailored to whatever the mission is. So we have supported humanitarian operations, as you're well aware, in the past. We've supported relief efforts during natural disasters. What we're trying to be very careful of is not overpromising. We want to be factual about what we have. Our fixed facilities are designed to the force that we have. They're not 1,000-bed medical centers all over the United States. They're, for the most part, small community hospitals. Our deployable hospitals range in size and range in capabilities, and are very much focused and designed to take care of those in combat. So as those are useful, if we're asked to deploy them, we have great colleagues. I'm very proud to serve with them. And as Mr. Hoffman said, I think, they'll deliver excellent care if asked to do so. But the colleagues that we have in uniform primarily are focused on the specific military needs that we have.
And what is being done to make sure that troops in Afghanistan, Iraq, and elsewhere have enough tests for coronavirus?
So I'm not aware of any, in fact, I was on the phone with a CENTCOM surgeon over the weekend. I'm not aware of any lack of test. I believe there's been some concern about the fact that the equipment to run the test, that specific machine, is not in Afghanistan, and that's true. We have a relatively small footprint in Afghanistan. We have now 13 labs that are up and running with that machine around the world. The closest one to Afghanistan that's a military lab is our lab in Germany. There are also other nations in the Middle East that have this specific type of equipment. So what we do with any lab that we can't perform in a deployed environment is we fly it or ship it to the nearest lab that can perform it. That doesn't mean that they're not getting tested. I mean, we're doing the swabs. We're just not running the test itself in Afghanistan.
And to be clear, I had this conversation with General McKenzie when he was here on Friday and asked him that specific question. And I think CENTCOM has put out a statement on this as well. We're not aware of any individual in Afghanistan, despite some reporting out there otherwise, that has indicated an inability to get tested. We're actually pretty confident that they're able to get tested, be swabbed in country, the sample sent to Lunchstall to be tested, and those test results are reported back to the individual. A couple things on the first question, though, just point out, talking about tents and tent hospitals is once again the limiting factor being personnel. So even if we are able to build tents for hospitals, we still need the doctors, we need the nurses, we need the orderlies, we need the equipment and all of that in there. And as the doctor mentioned, the general mentioned, those individuals from our system would come from existing hospitals or the reserves. And as you heard General Abrams discuss, I think it was on Thursday, how he called up those doctors who were assigned to him, but were not yet forward deployed. He called up those doctors. They went over to help over in U.S. Forces Korea. In many cases, they came from domestic military facilities here, and that's similar to what would happen with a hospital like that. And then the other thing I would just ask is you take a look at this in the framework of the civilian society and how many beds and hospitals are available on the civilian side versus on DoD. We have a surge capacity. We have a capability. That number is, when you look at what DoD can do compared to what is existing in the civilian side, I don't know if you have the percentage, but it was a 2 or 3% of the hospital beds in the country are DoD beds. So, Barbara?
Dr. Friedrichs, a couple of follow-ups. As you think about this and plan, what is the latest information you have about what the threat volume is essentially that you're planning against? What does the data tell you now about how many Americans, including military, might need hospitalization? Also, can you tell us how many ventilators are in military inventory? And also, my very other quick question, you mentioned, I think that the secretary and the deputy are no longer, within eyeball range of each other. What's your recommendation to the chairman, the vice chairman, the nuclear forces, special ops, the short string forces that cannot afford to be at other than full strength?
So we can spend the next hour going through all the details of that. I'll see if I could give an abbreviated response. So, so from a data standpoint, the good news is now that we're getting accurate data from Italy and from Korea and from here in the United States, I think we're getting a much clearer picture. CDC is doing an excellent job of updating that data so that we understand how widespread this is. And as you and others have reported, or your organizations have reported, this disease is very easily transmitted. And so that, as Dr. Fauci's commented on repeatedly, one of the big concerns on our part is not so much the active duty force contracting the illness, because it does not appear to make most younger people that sick. It's the active duty force contracting the illness and then spreading it to someone else. So we're really looking at this from two lenses. Of those who contract it, how do we minimize the risk of them spreading it to others? And also, how do we ensure that we're prepared to take care of our own beneficiaries, or if asked, take care of other patients as part of a whole of government response?
How many Americans?
How many Americans do I think will get infected?
That's a question for the CDC.
Yeah, I think the
They're doing the
CDC's
modeling.
I'm asking against the scenarios that you plan. You're planning, so you must have an idea of what you're planning against.
We're going to leave the predicted modeling to the CDC. We're going to speak with one voice from the government on that.
Ventilators, and can you talk about the short notice forces, Chairman, Vice?
So I'll start with here in the building. My recommendation has been, much as I shared with you all during one of our last sessions, that people practice social distancing and where they can avoid face-to-face meetings or getting within 6 feet of each other, that they do so. And I've provided that advice for the last couple of weeks now. It's the same advice that CDC has been providing. So we've put that out to the whole workforce, not just to the chairman and the secretary, but to everybody, that we want to practice that social distancing, because that is one of the very unsexy but incredibly effective ways to minimize the spread and protect each other from getting sick. So that's not unique to the senior leaders, that's to everybody here in the building. As far as the special forces or other units, the operational advice that we've given to the services across the board is to look at those missions and identify what that right risk balance is between the medical risk and the operational requirements. And so different units have come up with different solutions to that to mitigate the risk to force while preserving mission capabilities. It's not a one-size-fits-all. It very much depends on what that specific unit's mission is and how best to support it going forward. But as we've looked at the plans, I think they're all solid plans, at least the ones that I've seen, and they involve everything from doing shift work or having certain people work together for 2 weeks in a location and then work from home, trading teams in and out, much as commercial companies are doing, so that you don't have everybody in one place at one time. Kind of common sense things to minimize the risk that an entire crew or an entire unit might be impacted at one time if someone gets sick.
And we're looking to have additional briefings this week with some of the different combatant commanders. I believe, and don't hold me to this, but we're attempting to have the STRATCOM commander connect with you guys potentially tomorrow as well. So I think you'll be able to get into some of those questions, Barbara, on how we're.
In the U.S. military?
So right now it's a number that we're not prepared to give out. So we're going to work on.
To ask why that is?
Because the number deals with our deployable medical capability. Which is a number that we're not prepared to give out. So we can get back to you on that, and we're working through it. So, all right, I'm going to try something tricky here, and we're going to try to go with somebody who's on the line and see if I can do this. Matthew Cox from military.com.
Thank you, Mr. Hoffman. Can you hear me okay?
Yep.
Could you maybe provide an update on how the recent travel restrictions are affecting shipping dates for basic training, boot camp for the services, as well as any deployment delays, cancellation updates?
So on specific instances, I would refer you to the services, because as the guidance was given, gives a lot of flexibility to the service secretaries and the combatant commanders to make waivers. But the way the guidance was given was with the ability of those individuals to issue waivers based on mission essential necessity. So the commanders have that ability to determine that if a certain deployment or if a certain rotation or a certain training is mission essential, they have the ability to move forward with that. We are taking a look at the training programs, given the size of those programs and the impact that a major delay on training could have. So we're looking at that and may have some updates on that in the near future. But for the most part, we believe that the commanders at the 4-star level all the way down to the 1-star level have the authority to minimize any disruptions to their forces, and that any individual who is in that pipeline and is looking for guidance on what to do, we've given the instruction, and we've tried to be as transparent and thorough in this as possible and instructing them to reach out to their supervisor and their chain of command to get some guidance.
Just as a quick follow, is there any update on Defender Europe? I know that the deployments were halted as of, I guess, March, in the past couple of days. There's like 6,000 on the ground over there right now, but there was supposed to be 20,000. Is there any updates to that as far as more troops are going to be sent or not?
No, I don't have any update for you on that. I would direct you to Europe, our EUCOM. They have the lead on making the determinations. At the time we made the announcement, they did indicate that there was likely some additional forces that would be flowed forward to that exercise. I don't have an update on the numbers of it, but we are looking to, although the main exercise may be somewhat constrained, to look at individual pieces of that exercise and continue with them to get as much benefit out of them as possible. Right, Tara?
Thank you.
Thank you. If the Guard is activated, and let's say a Guardsman is a doctor full-time in a local hospital where there's that need, what will be the policy decision? Will that member of the military still be called up and taken away from that local civilian hospital, or would they be left to remain at the civilian hospital?
So I think that's exactly one of the calculations, if you will, that have to be made in making a decision to do that. Look, I've been wearing this uniform now for 30-some-odd years. I've done whatever it was that the country asked me to do, and I think that anyone wearing this uniform would say the same thing. Fully recognize that as those decisions are made, senior leaders are going to balance, if we take someone from here and send them over there, what's the impact? Is the benefit greater over here than it is over there? From the military side, we are here to deter and defend and support our civil colleagues, but that is one of the key considerations going forward.
So I can just say as a reservist that part of the tracking that you do is you have to keep your command updated about what your civilian employment is. And when there's a crisis, there's not a rush to deploy a bunch of JAGs, so we don't usually have the same situation. Nobody wants to get a bunch of lawyers out there at the heart of a crisis, so it's not the same way, but that is something that's being looked at, is trying to get visibility down to the individual level of how are those medical providers being used in their local communities, so that if we do have to make a decision, as the doctor said, that it's something that balances what is going on in the local community and that we're not disrupting them.
And then, may I just, a quick follow-up? You mentioned that there was a surge capability for building field hospitals. Can you give us a sense of what those numbers were? Could the military put up a 500-bed hospital in one of these affected areas in a rapid amount of time?
So we have different deployable hospital capability ranging from 25 beds up to much larger than that. I think the largest capability that you've all seen is the hospital ship, which has hundreds of beds on it. And then the question becomes, what do they need? The challenge is, as we mentioned before, if we build a 200-bed or a 25-bed trauma hospital to take care of people with coronavirus, that's not really a great solution to the coronavirus challenge. And so what we're working through as we participate in discussions is, here's what we have, here's what it does very well, which is trauma care and acute care and emergency care. And we have not been tasked to provide those to any specific location, but those are the types of medical capabilities that we have. We don't have any 500-bed hospitals designed for infectious disease outbreaks. That does not exist in the inventory.
Yeah. And then the doctor mentioned the comfort, and I'm sure many of you have been on the comfort of the Mercy and seen how it's configured. You have litters that are stacked 4 to the ceiling with individuals. You have open bay rooms because they're intended for trauma and for dealing with people who've suffered some sort of trauma, not for an infectious disease environment. There are some beds for that, but it's a much smaller number. So I just want to clarify on all these conversations, the Department of Defense is ready, willing, and able to support civilian authorities to the greatest extent possible at the direction of the President. We just want to make sure that the conversation that's being had is informed by the facts of what is possible and what is not, and what those trade-offs are. We're engaged in these conversations across the government right now and how we can best support, and we'll continue to be a part of those and then follow the guidance set out by the Secretary and by the President. Lara?
So 2 questions. First of all, can you just tell us what the chain of command is on DoD-wide guidelines? Is it the Deputy Secretary of Defense who's in charge, and does it go down to PNR? How does that work exactly? And then my second question is, there's been mounting concern about federal workers who are sick, who are still coming in to work. So what are your policies on disclosures, and how do you ensure that people who are sick aren't coming in?
So on the first one, let me just make sure I have this correct. So you're asking, how are we promulgating guidance within the department?
Who's in charge?
So the Secretary's in charge. On some issues, he's delegated that responsibility to the Deputy Secretary. So I think we saw one of the memos last week came out was from the Deputy Secretary. P&R has the overall look at things affecting the workforce, civilian contractors,
Force health
and
protection.
Force Health Protection, the Pentagon Reservation, WHS reports them. But then you additionally have the services that have the responsibility for their personnel. So it's a big building. It's a big organization, and we have a lot of different people, but it all runs up to the Secretary of Defense making decisions based on the guidance he got. And I'll tell you, this morning we had a 2-hour VTC. Everybody, we're not even in the 3 rooms anymore. We're in a bunch of different rooms calling in to this, and we went through a lot of those decisions with the Secretary and looking at the different policies that are being evaluated, and he was being briefed out on all of them and teeing up different decisions he may make in the next few days.
And then the second question on the federal workers who are sick still coming in?
Yeah, so, we've put out very clear guidance that if you're sick, you should not come into work. If you see someone who's sick, send them home, and, if they look like or sound like they need help, get medical help for them. So as you may be aware, we have a small clinic downstairs here in the building, and then there's a variety of other military medical facilities around the D.C. area where folks can go for care depending on what they need. But this really starts with the individual, and I think it is not about policy at this point. It's about a shared commitment to minimizing the impact of this outbreak. And each of us individually has a responsibility. If you're sick, or if you live with someone who's sick, stay home. That's common sense, it's good medicine, and that's the message that we're sharing with everybody.
Would you mandate that people stay home? I mean, some cities and states have.
So I've got 2 people in my office who I have personally sent home because they came in and I said, you should not be here, go home. But I got a lot of work to do. I said, I don't care, it can wait. The sun will come up tomorrow. I'm very confident. I would rather that we minimize this outbreak than try and get the next report done on time. And that's an important distinction right now. This is recognizing that the priority is minimizing the spread of this outbreak. As the Secretary has said, our first commitment is to protecting the health of our service members and their families. That starts with our responsibility to them and their responsibility to stay home if they're sick.
Okay.
If I may, encouraging telework is different than mandating telework, obviously.
That's in the chain. That's the chain and risk assessment that we go through every day. So we have meetings every single day where we look at what are the numbers, what's the risk to the reservation, what's the risk to the workforce, and we make changes. So as you saw last week, we went from social distancing to on Monday to Wednesday, I think we banned international travel. To Friday, we banned domestic travel. Today, restricted. Today, the buffet is shut down. There's different levels in the risk that tolerance that you go through, and we'll continue to work our way up that as needed, while still trying to maintain the ability of the Department of Defense to do those strategic essential missions. I'm going to go to the phone again, so we'll try this. Dan Lamoth from the Washington Post.
Nothing at this time, thank you.
Okay, all right, so I'll do another phone one since Dan's question was cleared. Nick Schifrin, PBS.
Hey guys, thank you so much for doing this. In terms of the secretary and the deputy secretary, I talk to NSC and state all the time. Neither of them have made that distinction of separating the top official from his or her deputy. So could you just explain a little bit why you've done that and why you've taken that specific task? And then coming back to Afghanistan and Iraq, I understand there's no lack of tests, although the labs are being utilized elsewhere. Have there been any positives, any updates on either quarantining within the war zones or any kind of positives there? Thanks.
So I'll take your last question first, if I may. The short answer is no. We've not had any positive tests in Afghanistan. And thus far, we've not received any reports of anyone who needs care who's not able to receive it. And then I think from the standpoint of your question about social distancing, we've been very transparent and very proactive in implementing the CDC guidelines. My deputy's working from home this week. That's not because I'm special. It's the right thing to do. It's what commercial companies are doing. It's what nonprofits are doing. It's the right thing to do. So I don't think that we're doing anything particularly unusual. We're just implementing the CDC guidance.
Yeah, and I think you have to look at each department and each agency on what the missions that they have and what meetings or operations they have ongoing at any certain time, and the resources available to make those measures take place. And so at the Department of Defense, we're set up so that our commanders and our leaders can do their jobs from anywhere in the world at any time. And so we're able to take advantage of that, probably to an extent that even major companies and others aren't able to. So we're going to continue to do what we need to protect the leadership and protect the workforce, so that we will have that ability as this goes on to help the civilian government respond. Jennifer.
And have there been any positive cases in the Pentagon reservation, any positive tests? And also, can you clarify whether the government is preparing for a national quarantine and whether the U.S. military has been asked to prepare for that?
So the Pentagon question, I think we answered that on Saturday, but
yeah. So we've had one contractor, not in this building, but in one of the other buildings within the Pentagon complex, who was identified. He said he wasn't feeling well, went in, was tested, and he was positive. And coworkers have been appropriately asked to stay home. None of them are sick at this point in time. That was 5 or 6 days ago, and he's doing fine, is the last report that I heard.
And then we have the one Marine who is down at Fort Belvoir. I think those are the two that we've mentioned is kind of in the reservation area. I think your other question was about the Instagram or text message hubbub that went on last night about a national quarantine and planning. Not familiar with anything on that. I think the White House put out a statement that was untrue and is not something that's under consideration at this time, so I'll direct you to them.
Okay, and just one quick follow-up. In terms of the Navy ships, you have one case on board the USS Boxer. You have the USS Carney in South Africa that has pulled into port there, and an ambassador, a U.S. ambassador who was at Mar-a-Lago on March 7th, visited that ship and is seen in Twitter pictures on board that ship. When are you going to either stop, or is it appropriate to stop port calls and stop visitors from stepping onto ships that are now vulnerable with regards to the U.S. Navy?
So I don't have an update for you on what the Navy's position is with the ships that are deployed or at sea. I have confidence that the Navy will look at that risk ladder and decide at a point when it's best to cease having onboard visitors. But I do know they've taken steps already with regard to the 14 days at sea between ports to limit any potential spread and allow them to evaluate whether anybody on the ship has come into contact at their last port visit or their last contact with others. So we'll continue to look at what they're going to do, but I'd refer you to the Navy on what they may change up with that policy. I haven't seen any changes recently. Courtney.
General, 2 quick follow-ups. You said there have been no positive tests to Iraq and Afghanistan. Can you say how many service members or civilians have been tested?
Well, yes, I can. So 495 total tests have been done as of yesterday morning, and I don't have the breakdown by active duty versus family members versus retirees. But in the 13 labs that we have in DOD with the capability to do those tests, we've done 495 tests. And then of the... Globally, yeah. Globally. Right. And then, and again, there's a lag in this data. So that's, as of yesterday morning, the update that we received. That was Friday's data. Part of that is because we're collecting data. We've, as I mentioned in previous sessions, we have a lab in Germany. We have a lab in Korea that's running the test. And so want to make sure we get their data in before we say, here's how many we ran on a particular day. So this was Friday's data. How many service members have tested positive? I'm tracking 15 service members as of 5 o'clock this morning. As we've mentioned before, that will continue to change.
I'm sorry, I meant specifically to Iraq and Afghanistan, though. You said there were no...
None in Iraq or Afghanistan.
None have been tested? How many have been tested there?
I don't know the numbers that have been tested there, but none have been positive.
You said 18 at the start.
Yeah. So this is why I said at 5 o'clock in the morning, it was 15. This was updated after I got my update. This is the 5 o'clock morning update. This came out at 7 o'clock in the morning, and it was 18. So
sorry.
And then, okay. And then one more thing for you, Dr. General.
And with those numbers, we'll try to, every time we give you a number, we'll give you a timestamp of when it's updated as of, so you guys can be on board with that.
Yeah, but and the reason I went with the 15, in case you're wondering about that, is I've got the details on the 15. I don't have the details on the 18. I've been in meetings since I got to, so, yeah.
And then I just want to be clear on the hospital ships. Is there any role the hospital ships can play in an outbreak? Because it sounds as if maybe it wouldn't be bringing people on, but could equipment or personnel be taken from the hospital ships and brought to?
So, we have supported our nation in a number of ways, and as military medics, one of the things the hospital ship is really good at is providing the sort of care it's designed for. So if, for example, a community has a large outbreak and there is a need for emergency room support or trauma support, hospital ship's perfectly designed to do that. Whether that's the right capability to get to the right place, hard to get the hospital ship to St. Louis. But along the coast, it is an option to use. And I want to go back to something I said earlier. I would hate for anyone to misperceive my comments as saying that we're not willing to help. Obviously, if the option is a surgeon taking care of you or no one taking care of you, you want a surgeon taking care of you, and we're all in to help. That's been the message from the Secretary from day one in supporting the whole of government response. What I personally would also feel uncomfortable with is if we say the hospital ship is designed to take care of highly contagious infectious disease patients. As Mr. Hoffman pointed out, when you stack people 4 deep in litters, that doesn't really limit the spread of anything. And so it's being honest about the capabilities and trying to be as transparent as we can about the capabilities and what they're designed to do.
I think that one of the things that's been hard in the past 24, 48 hours is that there's a lot of information out there, specifically on social media, about the military's, that mixes up what the military's capabilities are versus what they're actually maybe intention to do. And you answered Jennifer's question on that, Jonathan, but there's other things beyond just the idea of enforcing a mandatory quarantine. One of them was the military, potentially the National Guard, being used to enforce nighttime curfew, something like that. I know that may not be something that's been asked for at this point, but is there even a discussion at this point about the military being used for more of that kind of law enforcement? It wouldn't be unheard of. We saw it after Katrina and other natural disasters. So, is there even a discussion at this point about?
Well, just to clarify on the military part, whether it's National Guard or DOD Title 10 versus Title 32. So
I guess both, if you wouldn't mind addressing both.
Well, I think the governors have the ability to call up the National Guard as they see fit, and that's happened in a couple places to assist with that. And I think we saw today the governor of Maryland activated 1,000 guardsmen to assist with their response. So you'll continue to see that. There are a lot of things, as the general said. We have plans about how to plan, and so we have a lot of things that we can look at doing, and those things are being looked at. We're having requests come in that we'll look at. But as of right now, we'll come out to you as much as we can, and we'll be out in public and as transparent about it, coming to you guys when we have an announcement on something that's being decided. But I can't get into every rumor or speculation about what the military could do or might have been asked to do, or somebody, this weekend, or what somebody on some sort of text chain said they heard from their friend who worked at this place that saw a guy that said this thing. We can't be responding to all of that. But we're going to try to be as transparent as we can about the things that we are doing. And you guys have been good about whenever you hear something coming to us, and we'll get back to you and let you know as soon as we can whether something is fact or fiction. And we're going to get that out there. We're going to be doing briefings here as much as we can. I'm going to try to have combatant commanders or the service chiefs in here at least once, if not twice a day this week. We're going to be doing briefings and trying to get information to you guys as much as we can. One last thing just on the ships that you mentioned. The ships don't have people on them. So we can get you a ship. Right now that ship has a bunch of merchant mariners on it who operate the ship. There aren't 1,000 or 1,200 medical professionals with the ship waiting. They have to come from somewhere else. So that gets back to that staffing issue. So the ship is great, but the personnel aren't on it right now. They're not sitting there waiting to be deployed. They're in a hospital in Lackland or they're somewhere else. And a lot of times that is also the hospital ships. We partner with civilian groups that'll go out with us to do some of the humanitarian missions we do, like we saw the Comfort do throughout South America this last 6 months. All right, we're going to do one more, and then we got to go.
Okay, thank you so much. How ready is the Pentagon to build hospital beds if asked? What are the surge capabilities? How fast, could that be spun up? And is there a ballpark figure of how many beds could be built or provided?
I think on the first question on to build beds, I don't think we have an estimate on building hospitals, constructing hospitals, pouring foundation and concrete and things like that. I don't think we would have a number for you on that. That's not a request we've had before, and that we would be have on the records for how to do that, or the numbers about what we would be able to do. We do have the numbers on the tent and the field hospitals and things like that, and how quickly we can do that. And we're looking into how fast we can deploy those.
Yeah, and again, I think the good news right now is as our country as a whole is responding to this outbreak, we have not seen huge demand signals coming to the DoD yet saying that we've got a significant gap. I was here all weekend and I did not receive anything specifically that says we need this number of beds in this location. What we do have are these tailorable packages, and some of them can move very quickly. They can move by airplane. Others are much larger, like the ship that takes a few days to get underway and you have to bring the crew to it. What we have tried to be very clear about is if folks need help, let us know what it is. Work through the White House, through the Department of Health and Human Service, that's the lead for this. And then we can offer, here's what we can do to meet that requirement with the capabilities that we have and how quickly it can move.
And just finally, we've got to go because the general obviously has a lot of important things to be doing. He's here 14 hours a day, every day, working on this, so I want to get him back to his office. But the solution to coronavirus is going to be a whole government approach, and DoD is going to be a part of that. And so we'll keep you guys updated on how we're going to play a role in that and what we're going to do. Thank you, guys.
From 5 years to 93 years. With the increase in cases, many individuals are asking whether this is the surge that we have been anticipating or predicting. Although it's difficult to predict, I suggest that we can expect several more weeks of significant activity, and then hopefully things will stabilize if we all take a part in avoiding the spread. Again, we encourage you to take care of yourselves, your families, and your loved ones. Thank you.
Judy, thank you. And I think we'll hear a little bit more as well on the testing front. Not only did you touch upon it, but Pat will touch upon that in a few moments. I mentioned that effective today, we were calling up the National Guard, and the list of potential roles the National Guard could play under the outstanding leadership of General Beale is a long one, and I can't sit here today and give you an exact recipe of what they will be doing, but I promise you they will be doing a lot. With that, we'd love to ask General Beale to say a few words.
Good afternoon. First and foremost, it's an honor and privilege to serve as the Adjutant General. Since 1636, the state militia has responded to the needs of the community during times of uncertainty. Today's modern Army and Air National Guard is a community-based organization that has a footprint in nearly every county within the state. Whether it's military operations overseas, to serve weather events like Hurricanes Katrina, Irene, Superstorm Sandy, the New Jersey National Guard is a vital part of your first responder cohort. Over the next few days, weeks, or months, we ask that you support our 8,100 citizen airmen and soldiers as we move about through your community in support of the state's COVID-19 response. We will be working closely with the Office of Emergency Management to assist fellow residents as we change from our civilian attire and put on our uniforms to serve this state. We will simultaneously be supporting the veterans in our long-term care facilities as well as the veterans community across the state. Please know that we are monitoring the current situation and are monitoring best practices.
Today, I can share some new updates relating to...
All right, everybody, welcome back to News Now on Fox 10 Extra. Pilar Arias taking over for Mike Page for the rest of the show. We are listening in Boston, where the mayor is speaking now about coronavirus. Let's listen in.
Abundance of caution. It's about protecting the worker and preventing the spread of the coronavirus. Effective tomorrow, Tuesday, March 17th, we are suspending all regular activity on construction sites in the city of Boston. All sites should maintain the crews they need to help keep their sites safe and secure. And here's what I mean by safe and secure. All sites need to be safe from anyone on a site or is near the site. Materials need to be secured down to keep them from blowing away in the wind or any other issue that might happen. And securing measures should be taken to prevent any trespassing. All of this work will need to be done by Monday, March 23rd, so it allows the opportunity to finish a lot of this work this week. After the sites have been made safe, skeleton crews will be permitted for the remainder of the suspension to ensure construction sites remain safe and secure. I encourage smaller, especially construction on wood frame, to have security on their projects to protect their building from fires and other potential safety issues. The only work that we're anticipating right now moving forward in the city will be emergency work. That work will need to be approved by the City of Boston's Special Service Department. We're going to prioritize that work and keep our neighborhoods safe. The work that we're talking about generally is emergency street repairs and utility hookup work. I want to remind Boston employers that we're in a robust construction market. Boston is home to a talented, hardworking construction workforce. And when we get back to work as usual, employers need to bring these workers back. And the right thing that we need to do right now is lay them off and not fire them. This is something that we're going to be monitoring literally week to week, and hopefully in the next couple of weeks we'll be able to change the policy. But right now, out of an abundance of caution for the workers on the job site and to prevent spreading the virus, we want to make sure those workers are safe. I also have an update on the Boston Public Library system. All branches of the Boston Public Library system will be closed as of today at 6 p.m. That includes Central Library. During this time, we're expanding automatic renewals and allowing people to keep their books and other materials for 15 weeks instead of the usual 3 weeks. We are waiving all late fees until May 1st. We have pushed back library card expiration dates. If your card is due for renewal, you'll have until October to renew it. We're increasing the limits on accrued fines if your account is blocked. So basically what we're doing is we're lifting a lot of these fines. If you cannot get onto your system, you'll be able to get onto your system. Use online library services will not be suspended for patrons during this period. We know how important library resources are to the people of Boston, especially while our schools are closed. In the coming days and weeks, we'll increase our online service, including ebooks, downloadable movies, audiobooks, and other information resources. As part of our school closure plan, we are distributing Chromebooks to every student who needs them, as we will be encouraging them to use them in the BPL's vast collection of resources during this time, so they'll be able to use them for that. This is a difficult decision because a lot of people use the library as a place to go to get their information, and we're not taking this closure lightly. It was a situation that we decided that we had to do again for the safety of workers in gathering spaces. I also have an update for our BCYF community centers. All BCYF pools are closed. BCYF gyms and fitness centers are closed. And as of on Wednesday, all Boston Center for Youth and Family Programming will be suspended. Only select centers will be open for youth meal distribution throughout the Boston Public School closure. So we're taking that very, very seriously. We're also going to be working with our street workers to make sure that we're continuing working in our street. For a list of meal distribution locations, If you're a parent in the school system, you should know by now, but in case you don't know, go to boston.gov/coronavirus. boston.gov/coronavirus. As we deal with the immediate businesses of keeping people healthy and safe in Boston, we've also been preparing for our long-term recovery efforts. There is no doubt that the coronavirus will have long-term impacts on our community. That's why we're also developing a comprehensive plan to help local families recover in the weeks and months ahead. Today, I'm announcing a new fund, the Boston Resiliency Fund. This effort, in a partnership between the City of Boston and several of Boston's leading institutions, we've been overwhelmed by support. This fund will coordinate fundraising and philanthropic efforts to help Boston families who are most impacted, with a focus on child care and seniors. The money raised will go directly to local organizations and nonprofits that support Boston's families. Our main objectives are food access, technology to support at-home learning for our students, and support for our healthcare workers and first responders, including child care. Our healthcare workers are crucial to our recovery efforts. We need to make sure that they can stay in their jobs and do their job. One of the biggest needs is child care, and we're using this fund to help meet that need. As the situation develops, we'll continue to identify the greatest needs and make sure that we're supporting the people who need it the most. In the face of challenges like this one, Boston and the people of our city show their true colors. Every day, I've seen people help organizing, stepping up, and doing the right thing. I've seen incredible acts of kindness and generosity. This fund is a perfect example of that. We have an initial goal of $20 million, and I'm confident that we'll reach that goal. Already, some of Boston's leading institutions and companies have committed to the fund in the past 72 hours. Those who have contributed $1 million or more include Jeff Layden from Vertex Pharmaceuticals, Ann Koblansky at Partners Healthcare, Jack Connors, Liberty Mutual, Bain Capital, the Gross Family Foundation, Mass Mutual statewide, and John and Cindy Fish. I would also like to thank the folks that have been helping us create this fund and set this fund up. Stacia McNaught from Vertex, Sharon McNally from Camp Harborview, the Shaw Family Foundation, and the Boston Foundation, and many members of the team here at City Hall. We're going to continue to share updates in the coming days and weeks ahead. For now, if you'd like to donate, please go to boston.gov/Boston Resiliency Fund. That's boston.gov/Boston Resiliency Fund. Every dollar we raise will make our city more resilient and will help our communities recover faster. Every dollar we raise will ensure that families have access to nutrition and nutritious food. It will help ensure that every student has access to quality educational material while they're learning from home. It will ensure that our hardworking first responders and medical professionals have access to the child care they need right now. This is one of the best ways that you can help our fellow Bostonians get through this. Boston is a strong and resilient city, full of strong and resilient people. We look out for one another. And when a challenge arises, we rise to that occasion together. I want to thank all of our generous partners who have already contributed to the fund. And thank you to the people of Boston for your continued patience, understanding, and support during these very important times. As a reminder, for more information about closures and resources to the city, we're asking people to go to boston.gov/coronavirus. Again, I want to remind everyone, if they feel sick or have questions about testing, call your doctor or 311 for information. We will have increased staffing starting this afternoon on our 311 call center. This is a citywide effort, and everyone's doing their part. I want to thank the people of Boston and all of our first responders and medical staff, all of our educators, and everyone who's making a difference. And I know that there's a lot of decisions that are being second-guessed and triple-guessed, but every decision that we're making here in the city of Boston is to make sure that we ensure people's safety and we prevent the spread of the coronavirus. With that, I'll take any questions you have. The question is, I'm just going to repeat the question as that's it is, but cutting service on the MBTA, will that increase ridership on the buses and trains that still run? I think the best way to answer that is by looking at Boston today. Many people are working from home or they're not working, and I think that the DMBT, I'm expecting is seeing a decrease in ridership across the board, and I think over the next couple of weeks we're going to see a larger decrease of ridership. This is a critical time for us right now to prevent the spread. I know the numbers have gone up in Boston, and they've gone up the last 7 days every day, but I think if we can prevent the spread from happening and try and level the virus off, we'll be in a better position long term. I'm not sure. I'm going to ask Marty Martinez to come up here and address the questions he can address. From the Chief of Health and Human Services, Marty Martinez.
We know statewide as of this morning there's been about 1,000 people that have been tested. We don't necessarily have the Boston specific numbers of who's been tested, but we know that's happening. We know the state's working to grow its capacity every single day, and we believe that they'll be able to start to get to 1,000 in short order, that they'll have 1,000 a day. The private firms are already on, so people can also get tested through their primary care physician. And as a reminder, to reiterate the mayor's point, if people are not feeling well, we don't want you to go to the hospital. We don't want you to go to the ER. We don't want you to call 911. We do want you to call your primary care provider. It's the best way to get a test, by calling your primary care provider.
And I know, just so I'll come back to a second, sorry. And I also know the state's working really hard to get more tests, and that's their priority right now, and we're going to continue to work with the state, hand in hand. This is a time for us to come together. This is going to be a question for Marty.
Sorry. So the State Department of Public Health has been following the CDC's guidelines. Those were loosened on Friday. Those guidelines used to be pretty restrictive. You had to be, it had to be out of travel or contact with someone who had tested positive. That has since been expanded to a variety of other measures. For now, most people in categories can get tested. You still have to have some sort of risk factor. There still has to be some level of connection to either someone who tested positive or someone else who is at risk for exposure. But again, if you call your primary care provider, they're following the state guidelines, and they have been expanded, which is why the state's gone from, I think, had 475 tests on Sunday to now over 1,000 as of today. So the guidelines have gotten broader, and more people will get tested in short order. Yeah. Yeah, I mean, I think that as far as the testing and the amount of testing, I think people would like to see more tests, clearly. There's no question about that. I think I made a comment yesterday that I'd like to see the CDC come down with more tests, but we're being told that this week we're going to drastically increase the number of tests that are going to be happening, so hopefully we can get caught up on that. When I say we, I'm saying collectively, but the city does not do testing. We don't have the ability to institute testing either. Well, I think the question is, what can, with all the hourly workers going out of work, what can the city do? We're working right now with our economic development office to see exactly how we can be assistance. I think ultimately it's going to be, there's a piece of legislation coming down from the federal government that's going to have some recovery options for salaried and workers. The State House, I know the governor filed legislation today dealing with unemployment and some other opportunities. So I think that we're asking for quick action on all of these efforts, both on a nationwide effort in Congress. And I know that the state is pretty focused on this right now. Great question. Thank you for asking me that. The question was, are we prepared to handle the schools being out tomorrow, and our families prepared for it? I think that's really one of the things that we tried to hold out on is closing schools because it was important that families had the opportunity to go to work and not have to make arrangements. And, you know, we gave them several days beforehand, which I know clearly is not enough for a lot of families. I would say one thing. I would ask families to be very cautious that not having large gatherings of young people together. I mean, that defeats the purpose of kind of keeping the spread contained. Also, if you have older relatives taking care of your kids, be cautious of that as well, because that's something that you know, we want to keep people healthy. And I think that, you know, again, I don't know what the percentage of workers that are going to be home, that are home right now. by the end of this week, I think the vast majority of employees that work for companies in the city and the state will be working from home or home. No, that's not the way it's set up right now. What we're doing, let me just get that page here for you. It's just so I get it correctly, I don't want to say the wrong thing. The money that's going to go to organizations, nonprofits that support Boston's families, our main objective right now, and we're focused right now, is on food access and making sure that we have, through the different food pantries around the city, to make sure they work through the Greater Boston Food Bank and assisting them to make sure we have enough food on hand. Technology to support our at-home learning for our students, so we purchased additional Chromebooks to make sure that we're able to do that, any other costs that come with that. Supports for our healthcare workers and first responders, including childcare. We're working right now with Mass General Hospital and our team here at City Hall to come up with a policy and a procedure on how do we create child care opportunities for first responders and for nurses and doctors. That's where we're beginning with this. This is not a fund that can be applied to pay rent and mortgage and bills. That's not the intent of this fund. The intent of this fund is to support basically some nonprofits and support in very specific areas. A lot of that other stuff goes back to a question asked earlier with unemployment, things like that. Those relief efforts will have to happen at a national level, state level, and in some cases city level. Oh, it's massive, massive. I don't have a number. Tens of thousands. I mean, we're in the middle of a boom right now, and you know, this is a decision that today's a difficult decision to make, just like all the other decisions we made on the day we made the decision, they were difficult, and then a few days go by and you realize it really wasn't that difficult. And it's something that, you know, construction is at the core of our economy here in Boston. Something, clearly I come out of the trades. I was a construction worker myself. This is something that is very personal to me and to a lot of us. So that's why, you know, out of abundance of caution, we're looking at, you know, 14 days potentially, and then we'll revisit it, and hopefully they can be the first workers back to work. But again, 14 days from now, if we're in a different situation, we'll be worrying about some other things. Well, I think what we have to do is practice community distancing. I think that, you know, I've seen people walking today and people walking, a lot of them by themselves, and if you go for a walk, that's fine. Stay out of large gatherings. You know, as Chief Martinez talked about, the number in Boston is 33, the number in the state is somewhere in the 160 mark. If we can try and isolate that when we get a real number on the tests, when all the tests are in, if we get a real number and we understand what we're dealing with here, if we can do the best of keeping to ourselves and spending some time together, that's probably the smartest thing we can do to prevent the spread of the virus. You look at some other countries around the world, and they got to it too late. And what they've done now in Italy, for all intents and purposes, the entire country shut down. I would love us not to get to that point, and if we can somehow level this off, but by working closely together, not working physically closely together, but working closely together with each other to prevent that, the spread, and that would be the best thing we could do.
Is the state being transparent enough with this testing results? Should the state be giving us daily breakdowns?
I mean, again, I think it comes down to a magnitude of capability and capacity. I mean, this is something that, as we said, a month ago, none of us were talking about the coronavirus, and a month later, we're testing people and figuring it out. And I think as time goes on, the transparency and all of the information that we need is going to be there. Certainly, I'd like the information immediately, and we get as quickly as possible. But again, I think this is a time for us to be patient with each other and moving forward. And it's not the time, in my opinion, to be pointing fingers at each other. You know, the community, the public wants information, and they want it. And I think as quickly as we get the information, we should get it out to people. You know, that's why I'm trying to do daily briefings to people to get as much information as possible. And that's what we're going to continue to do here.
All right, everybody, we've been listening in on the Boston, Massachusetts mayor talking about the changes they are making in the city in regards or in response to the coronavirus. I want to show you the stock market, Dow Jones Industrial, big board one more time here as we wrap up News Now on Fox 10 Extra. So what are we hearing? The steeper selling in the U.S. equity markets resuming this afternoon after the Federal Reserve took emergency action to combat the economic harm caused by the new coronavirus update. You can always find the latest on coronavirusnow.com. Have a great day. We'll see you tomorrow. All right, everybody, welcome to News Now, whether you are watching us on YouTube or on coronavirusnow.com. Appreciate each and every one of you being here. Pilar Arias, I am your News Now host with your top of the hour coronavirus update. Here is a live look at the numbers from Johns Hopkins University. They've essentially been tracking every case possible across the globe. They've kind of been the benchmark. They update their numbers every 30 minutes. The numbers that they are reporting versus the numbers that the CDC are reporting completely different from each other, and that's because the CDC hasn't provided an update on the coronavirus numbers, the cases, since Friday. So when the CDC does their daily update, I'll provide you the latest right here. So I'm going to focus in on the United States. Let's take a look here. They are confirming 4,138 coronavirus cases in the U.S., 71 deaths. That's about double, almost double of what we had on Friday. 17 people have contracted the virus and have recovered. So that's the little bit of good news there, that people do contract the virus and they do recover. So, but again, the Johns Hopkins University map that's tracking all the coronavirus cases worldwide, they are tallying at 4,138 cases. We do have a live picture now of the White House briefing. It's not expected to start for about another 29 minutes. When it does, though, we will bring it to you right here on Fox News Now, the Coronavirus Task Force. And it looks like they have an attention, like a bunch of different signs on those seats. I don't know if they're making everybody sit like a chair apart from each other there, social distancing. You're seeing some elbow bumps there. You're seeing everybody kind of standing up around the room, not necessarily sitting down just yet. So that may be their version of social distancing there. We also still have a live news conference happening in Trenton, New Jersey. So there's lots of coronavirus related content, lots of things to get to today. But again, my name is Pilar Arias. I want to actually say hello to you and say happy Monday. I'm one of 3 Fox News Now hosts. You got me and Mike Page, at least until Thursday when Christy Larson returns. But we're doing your top of the hour coronavirus updates. We're bringing you all the live news conferences anywhere, everywhere that we can. We've got cities talking, we've got counties talking, we've got states talking. You can find it all right here. Fox News Now is a part of our huge coronavirusnow.com effort. So we are providing you the latest whenever we can. I want to take one more look here at the stock market before I take you to some top stories related to the coronavirus. Currently down about 2,000 points. Another circuit breaker kicked in this morning. It's just not, it has not been a great day for stocks. It has not been a great week and a half for stocks. The sharp sell-off coming after the Fed at an emergency meeting last night cut its benchmark interest rate by 100 basis points to near zero and announced a $700 billion asset purchase program. The Fed's action, part of a coordinated effort by central banks around the world. Looking at stocks, airlines remained at the center of the storm after United Airlines said its March revenue is expected to be $1.5 billion less than a year ago, and that it would reduce the flight capacity by 50% in April and May. You're seeing a lot of airlines have great deals right now. One in particular, I noticed last week that Southwest Airlines launched a huge sale that was supposed to end on Thursday, and they have continued that sale. It's still going on. And that's because so few people are traveling. People are trying to do what they can to stop this epidemic, stop the spread of the virus. There's a lot of social distancing happening. There's a lot of voluntary quarantines happening. Schools have been canceled. Libraries have been closed. Tons of events across the country have been canceled, and that includes Major League Baseball. They have suspended opening day indefinitely. So as soon as we get any update there, we'll bring it to you right here on News Now. All right, so I do want to tell you some top stories, or at least show you them from across the country in relations to the coronavirus. First, with coronavirus spreading in the U.S. during cold and flu season, many are left wondering what the differences are. Fox's Alicia Turner tells us the symptoms of coronavirus and the flu and how to spot the differences.
like a heavier cough, they're actually having the shortness of breath just from maybe like walking here to the door, they get short of breath.
The heavy cough, shortness of breath, and other flu-like symptoms. This is what you need to look for if you suspect having the coronavirus. Right now, COVID-19 is the reason travel has been suspended, major events canceled, and people are staying at home. Doctors say these are smart moves in order to stop the rapid spread.
I would say, like, if you keep your hands washed, make sure that, you stay away from anyone that is sick, running a fever. If you yourself are running a fever, sick, stay at home, don't go out.
In North Carolina, there have been multiple confirmed cases of the coronavirus.
And with fever and cough.
Crystal Lane is a nurse practitioner at Better Med in Charlotte. She says work has been busy with teaching people differences in flu and coronavirus.
With the flu, what we've seen so far are patients present with like high fevers, body aches, chills. Sometimes they have coughing, sometimes they don't, sometimes they have sore throat, sometimes they don't. But the coronavirus seems to be more attacking like the respiratory system.
Healthcare workers are also taking precautions, wearing masks and keeping hand sanitizer nearby.
Alicia Turner, Fox News.
All right, Alicia, thanks so much for that update there. Again, everyone, my name is Pilar Arias. The intensive care unit at a children's hospital in North Philadelphia is temporarily closed to new admissions. This after one of the doctors there tested presumptive positive for coronavirus. Fox's Lauren Dugan has more.
St. Christopher's Hospital for Children in North Philadelphia welcomes sick kids with weak immune systems. It's full of doctors and nurses trying to make them better, but a doctor who tested presumptive positive for COVID-19 may be putting them in danger.
Wow. Scary.
To close something, that important is kind of crazy.
Now St. Christopher's Hospital has closed their intensive care unit to new patients, but continues to treat kids already admitted. An alert on their website and this letter to families says the doctor with coronavirus worked in the ICU last Monday, Tuesday, and Wednesday, then started to feel symptoms that Wednesday, March 11th. Officials do not believe the doctor picked up the virus at the hospital, but now people worry who was exposed.
Hopefully no other doctors exposed, but there's a big chance.
Francisco Ponce says he wears gloves everywhere just to be safe.
I live in Jersey, so I cross the bridge. When I cross the bridge, I pay cash, so not to be handling cash, directly, I use gloves.
I was thinking today, if I don't protect myself, I'm gonna bring it home, and I don't want to give it to my kids or grandkids.
We found Barbara Montanez also wearing gloves in her car.
It's not only about ourselves. We can't think about only ourselves.
As a mother and grandmother of 4, she expects a children's hospital to be a safe place.
And finding out the doctor is contagious with that virus, your child could be in risk.
All right, everyone, we're going to head to Colorado next here on News Now and also on coronavirusnow.com, where a school committed to serving kids food during closure turns their yellow buses into a meal delivery service. Again, this is in Denver, Colorado.
Part of our thing, though, was making sure that our kids didn't feel a lot of the pain from what's about to happen here.
The coronavirus pandemic is closing schools, but for Pinnacle Charter in Federal Heights, 80% of their 2,000 students depend on free or reduced lunch. So without school in session, how will these children get the meals they need?
We're going to use our transportation system to actually get these meals out to the kids and try to meet those kids where they are.
Starting tomorrow morning, Pinnacle is deploying school buses out to 12 of their centrally located bus stops in North Denver, where bus drivers will hand out breakfast and lunch bags to students. It's every day this week from 8 to 9:30 a.m.
Our bus drivers know these kids. They see them every single day. They know all of their names.
Pinnacle has their cafeteria lunch service team preparing the meals. They're made up of items that won't spoil. School leaders say employees will take safety measures to cut down on the potential spread of COVID-19.
But they'll have hand sanitizer. They'll be using rubber gloves, which is why it's going to be really a stop, grab your bags, and move along and go.
Pinnacle will also offer a drive-up option at their school located off West 84th Ave. Their goal, to make sure no child goes hungry during these trying times.
Just because the kids aren't in our building doesn't mean that they're not our responsibility.
All right, everybody, we are going to come right back here to Arizona. Our very own Matt Galka has this next top story. Not everyone is loading up on toilet paper and hand sanitizer right now as a result of the coronavirus outbreak. Matter of fact, some people are stocking up on guns and ammunition.
If you can't buy toilet paper, I guess you buy guns and ammo.
Although the guns and ammo might not help when nature calls. Guns Etc. owner Ron Sega says he hasn't seen sales like this since the 8 years former President Barack Obama was in office.
He was the best gun salesman there ever was. So yeah, that was the scare for 8 years. We're going to take your stuff away from you.
Now, a different kind of fear. Coronavirus uncertainty has led to a spike of guns and ammo sales at his store.
He sold upwards of 40 to 50 guns yesterday alone.
That is a big uptick from a typical day before the virus impacted the country.
Last 3 years, 3 or 4.
Andrew Weiner isn't a first-time buyer, but wanted to beat the rush.
Kind of a normal purchase. I got a bachelor party for myself coming up, and I'm pretty sure we're going shooting, so I want to buy before everybody else panic buys it.
And even though sales are good, it still doesn't all make sense to the people buying and selling.
What scares me about all of it, though, if this is the reaction to something like this, what are we going to do as a people when something actually happens? And I'm not saying this isn't a real thing. Don't get me wrong on that, but what?
People are concerned, probably should be, but to panic to go buy guns and ammo and toilet paper, I don't know, but that's for them to decide.
We are now getting word that this news conference at the White House with the coronavirus task force could be starting any moment. You see a bunch of people getting prepared there. So again, we are getting word that this could happen within the next 4 minutes. It was originally scheduled to be at 12:30 Arizona time, 3:30 Eastern. Now we are hearing it could be 3:15 Eastern, which would make it less than 4 minutes away at this point. As soon as it starts, I'll bring it to you live right here on Fox News Now. Meanwhile, though, I do have one more top story related to the coronavirus for you. There's plenty of uncertainty in the Democratic primary election process. 4 states will be holding primaries tomorrow, including us right here in Arizona. And there's a big complicating factor, the coronavirus pandemic. Fox News correspondent Ellison Barber has more from Columbus, Ohio.
2 states, Georgia and Louisiana, decided to postpone their primary elections, but the 4 states voting on Tuesday say their primaries will proceed as planned. 577 delegates are up for grabs in Arizona, Florida, Illinois, and Ohio. In Franklin County, Ohio, election officials say in-person early voting turnout is about 80% higher than it was this time in 2016. As schools and restaurants lock their doors, people avoid each other, poll workers are getting trained, and election officials are preparing to distribute bags filled with gloves, hand sanitizer, and disinfectant wipes to every polling location.
This is a requirement.
Ohio Secretary of State Frank LaRose is assuring voters and poll workers this election is going to be safe.
Mass gatherings are not going to be permitted. Voting location is very different from that. It's a neighborhood gathering. It's a place where people will walk into, conduct their business, and walk out.
LaRose says they successfully relocated polling locations in senior residential facilities, and poll workers are going to have the supplies and the training to follow hygienic guidelines established by the Ohio Department of Health and the CDC.
But if there are lines, then the poll workers have been taught to, go outside and encourage everybody to maintain. We sort of say 2 arms length is the easiest way to describe it. When you go into the voting booths, having them next to one another may not be ideal, but also in many cases there are screens there, and so there's an opportunity for some separation. Again, what we're talking about is for healthy people. It's safe to vote and it's safe to be a poll worker, and that's the recommendation. But if you have a concern, if you're not feeling well or whatever else, then you should take advantage of the vote by mail and the early voting opportunities.
The deadline for mail-in ballots in Ohio was Saturday at noon. I asked Secretary LaRose if he would consider extending that deadline or getting rid of it so people could request mail-in ballots through Election Day. He said that would be an extreme step and logistically challenging, but it's something his staff is evaluating. Reporting in Columbus, Ohio, I'm Ellison Barber, Fox News.
All the rest of us, to all Americans, but most especially to those hardworking people whose efforts are going to get our country through this challenge, I have one message. The Senate stands with you. We stand with American workers and families. We stand with American businesses. And we stand with the public health experts and the heroic frontline medical professionals, whom our nation seems poised to lean on as heavily as we have at any point in recent memory. The Senate is committed to meeting these uncertain times with bold and bipartisan solutions. That's what we did a little more than a week ago when the Senate passed billions of dollars in emergency funding for health and small businesses with an overwhelming bipartisan vote and put it on the President's desk. That's what we're going to keep doing this week, particularly if the House of Representatives can actually complete its work and transmit a finished product of its relief over to us. Senate Republicans are absolutely convinced that the House's bill can only be the beginning, just the beginning, of Congress' efforts to secure our economy and support American families. This is a unique challenge, Unlike in any other tough circumstances, our short-term goal is not simply to bring economic activity right back to normal starting tomorrow. Instead, our task is to secure the historically strong foundation of our nation's economy and support Americans during this period when public health may require that some normal activities simply be scaled back. I've spoken with countless colleagues and committee chairmen over the last several days. We agree there are three major areas where the Senate must continue to develop bold and bipartisan action. Number one, we'll need to take further steps to assist individual Americans and families with financial challenges in the weeks and months ahead. Number two, we will need further significant actions to secure our nation's economy, particularly Main Street small businesses, and safeguard our historically strong economic foundation through this period. And number three, we'll need further steps to ready our healthcare system and support our nation's medical professionals. The Senate majority is already working toward next steps on all three of those fronts. I hope further bold action can be just as bipartisan and collaborative as the process by which we passed the first set of additional funds. We must work with each other in the bipartisan spirit this moment demands, and with the administration and the House to deliver results for our country. Now, Mr. President, on one other important matter. Late last night, several critical authorities that law enforcement uses to keep Americans safe lapsed into expiration. Barring Senate action, these important tools, which help protect the homeland from terrorists and counter foreign intelligence activities on U.S. soil, will remain offline. Fortunately, in the weeks leading up to this deadline, the Attorney General engaged in extensive bipartisan talks with members of the House of both parties to try to reach a solution. The resulting legislation, which the House passed last week by large margins within each party, strikes a key balance. It reauthorizes the tools which our national security requires, while also imposing a number of new reforms which basic accountability demands. So, Mr. President, we can't let the relative success of these tools at preserving the safety and security of our country mislead us to believe they are unnecessary. It's just the opposite. Terrorist organizations still search constantly for opportunities to strike on American soil. Hostile foreign intelligence services, whether Chinese, Russian, or Iranian, still seek to conduct operations within our borders, to recruit assets and agents among our population. These threats will not wait around if the United States delays restocking our toolbox. And so the Senate should not wait to act. I sincerely hope that even our colleagues who may wish to vote against the House bill will not make us prolong this brief lapse in authorities, and that we'll be able to get these tools back online this week.
That's been Senator Mitch McConnell on the Senate floor there talking about the coronavirus bill. As soon as a vote happens, we'll bring it to you right here on News Now and also on coronavirusnow.com. I'm going to take you out to the White House. This task force briefing, everyone, it's about seconds away now. We got a 2-minute warning about 1 minute ago, so I'm going to bring up the audio here. Again, this is live at the White House, coronavirus task force briefing.
Just as popular as there's just fewer of us. We're wearing you out. I've been in it for the long run. It's a marathon.
Thank you very much. Thank you. So I'm glad to see that you're practicing social distancing. That looks very nice. That's very good. I want to thank everybody for being here today. This morning I spoke with the leaders of the G7 nations, and they really had a good meeting. I think it was a very, very productive meeting. I also spoke with our nation's governors. And this afternoon, we're announcing new guidelines for every American to follow over the next 15 days as we combat the virus. Each and every one of us has a critical role to play in stopping the spread and transmission of the virus. We did this today. This was done by a lot of very talented people, some of whom are standing with me, and that's available. And Dr. Birx will be speaking about that in just a few minutes. It's important for the young and healthy people to understand that while they may experience milder symptoms, they can easily spread this virus, and they will spread it indeed, putting countless others in harm's way. We especially worry about our senior citizens. The White House Task Force meets every day and continually updates guidelines based on the fast-evolving situation that this has become all over the world. It's all over the world. It's incredible what's happened in such a short period of time. On the guidelines of the task force, the new modeling conducted by Dr. Birx, and our consultation with governors, we've made the decision to further toughen the guidelines and blunt the infection now. We'd much rather be ahead of the curve than behind it, and that's what we are. Therefore, my administration is recommending that all Americans, including the young and healthy, work to engage in schooling from home when possible, avoid gathering in groups of more than 10 people, avoid discretionary travel, and avoid eating and drinking at bars, restaurants, and public food courts. If everyone makes this change or these critical changes and sacrifices now, we will rally together as one nation, and we will defeat the virus, and we're going to have a big celebration all together. With several weeks of focused action, we can turn the corner and turn it quickly. A lot of progress has been made. I'm also pleased to report today that a vaccine candidate has begun the phase 1 clinical trial. This is one of the fastest vaccine development launches in history, not even close. We're also racing to develop antiviral therapies and other treatments, and we've had some promising results, early results, but promising.
to reduce the severity and the duration of the symptoms. And I have to say that our government is prepared to do whatever it takes. Whatever it takes, we're doing. We're doing it in every way. And with that, I'd like to just introduce Dr. Birx, who's going to discuss some of the things that we strongly recommend. Thank you.
Thank you, Mr. President. I think you know over the last months we've taken very bold action to stop the virus from coming to our shores. And because of that, we gained time to really get together and understand the progress across the globe of what has worked and what hasn't worked. We now need to appeal to every single American so that they can have their role in stopping the spread of this virus. We've talked about things before about washing your hands, but we really want to focus on if you are sick, no matter who you are, please stay home. If someone in your household is diagnosed with this virus, the entire household should quarantine in the house to prevent spread of the virus to others. The reason we're taking these strong and bold steps is because we know there is virus spread before you develop symptoms, and then we know that there's a large group, we don't know the precise percent yet, that actually is asymptomatic or has such mild cases that they continue to spread the virus. If your children are sick, please keep them home. Now to our older population or those with pre-existing medical conditions, everyone in the household needs to focus on protecting them. Everyone in the household. I want to speak particularly to our largest generation now, our millennials. I have the mom of two wonderful millennial young women who are bright and hardworking, and I will tell you what I told to them. They are the core group that will stop this virus. They are the group that communicates successfully, independent of picking up a phone. They intuitively know how to contact each other without being in large social gatherings. We're asking all of them to hold their gatherings to under 10 people, not just in bars and restaurants, but in homes. We really want people to be separated at this time. To be able to address this virus comprehensively that we cannot see, for which we don't have a vaccine or a therapeutic. The only thing we have right now is the amazing ingenuity and compassion of the American people. We're appealing to all Americans to take these steps, to protect each other, and to ensure that the virus doesn't spread. These guidelines are very specific, they're very detailed. They will only work if every American takes this together to heart and responds as one nation and one people to stop the spread of this virus. Thank you.
Thank you very much, Dr. Birx. So just to connect with what I mentioned to you in previous discussions in this room, and Dr. Birx said it very well, that in order to be able to contain and curtail this epidemic to not reach its maximum capability, we have a two-pillar approach, one of which I believe has been very effective in preventing the substantial seeding, and namely the travel restrictions that we've discussed many times in this room. The other, equally, if not more important, is when you have infection in your own country, which we do. And, you know, I could read the numbers, but they're really essentially what we've seen yesterday, incremental increases both globally as well as in the United States, with the curve doing that. So therefore, the kinds of things that we do are containment and mitigation. What we're mentioning now, the guidelines, when you look at them carefully, I believe if the people in the United States take them seriously, because they were based on some rather serious consideration back and forth. Some may look at them and say they're going to be really inconvenient for people. Some will look and say, well, maybe we've gone a little bit too far. They were well thought out. And the thing that I want to reemphasize, and I'll say it over and over again, when you're dealing with an emerging infectious diseases outbreak, you are always behind where you think you are if you think that today reflects where you really are. That's not word speak. It means if you think you're here, you're really here because you're only getting the results. Therefore, it will always seem that the best way to address it would to be doing something that looks like it might be an overreaction. It isn't an overreaction. It's a reaction that we feel is commensurate, which is actually going on in reality. So take a look at the guidelines, read them carefully, and we hope that the people of the United States will take them very seriously because they will fail if people don't adhere to them. We have to have, as a whole country, cooperate and collaborate to make sure these get done. Thank you.
Okay, go ahead.
Mr. President, a lot of people are concerned about how long all of this might last. Do you have any kind of estimate that if Americans really were to band together and do what the White House is suggesting, how quickly you could turn this corner?
My favorite question, I ask it all the time. How many times, Anthony? I think I ask him that question every day, and I speak to Deborah, I speak to a lot of them. I get the opinion. So it seems to me that if we do a really good job, we'll not only hold the death down to a level that is much lower than the other way, had we not done a good job. But people are talking about July, August, something like that. So it could be right in that period of time where it washes through. Other people don't like that term, but where it washes through.
So is this the new normal until the height of the summer?
We'll see what happens, but they think August, could be July, could be longer than that. But I've asked that question many, many times. Yes.
That being said, Mr. President, Americans today and looking forward are living with so much anxiety and so much fear facing uncertainty right now. I'm curious, how are you talking to your own family about this? How are you talking to your youngest son? Do you empathize with this sense of anxiety? People are really scared.
Yeah. No, I think they are very scared. I think they see that we're doing a very professional job. We've been working with the governors and frankly, the mayors, local government at every level. We have FEMA totally involved. FEMA's been, usually we see FEMA for the hurricanes and the tornadoes. Now we have FEMA involved in this. They've been doing a fantastic job locally, working with people that they know because they work, like as an example, in California, in the state of Washington. They work with them a lot on other things, and they're very familiar, so they're working on it. What you can do, and all you can do, is professional, totally competent. We have the best people in the world. We have really the greatest experts in the world. And someday soon, hopefully it'll end and we'll be back to where it was. But this came up, it came up so suddenly. Look, you were surprised. We were all surprised. We heard about it. We heard about reports from China that something was happening, and all of a sudden, we did make a good decision. We closed our borders to China very quickly, very rapidly. That was a otherwise, we'd be in a very, as Tony has said numerous times, we'd be in a very bad position, much worse than we would be right now. You look at what's happening in other countries. Italy's having a very hard time. But I think that what we do, and I've spoken actually with my son. He says, "How bad is this?" It's bad. It's bad. But we're going to be hopefully a best case, not a worst case, and that's what we're working for. Yes.
You can clear up some confusion on two key fronts. One is about your own test. The other is about containment efforts. Is the administration considering more aggressive containment options, like a quarantine, a national curfew, restricting?
Well, we have that very much. Yeah, we have that very much, and we've been pretty aggressive. We were early with Europe, but we were very, very early with China and other places, and fortunately we were. And as far as containment here, we're coming out with strong suggestions. And, it's becoming a little bit automatic. You look at people, they're not doing certain things. For instance, they're obviously not, I wouldn't say the restaurant business is booming, and bars and grills and all. People are self-containing to a large extent. We look forward to the day when we can get back to normal.
To be specific,
what's your second question?
Are you considering instituting a nationwide lockdown, a nationwide quarantine? The NSC knocked that down, but there's still some questions about how it all came
At this point, not nationwide, but well, there are some places in our nation that are not very affected at all. But we may look at certain areas, certain hot spots, as they call them. We'll be looking at that, but at this moment, no, we're not.
The second question is, you said you had your coronavirus test Friday night. the White House doctor's office put out a statement around midnight Friday saying that no test was indicated. So when exactly was your test administered?
Well, I had my test. I was late Friday night, and the reason I did it was because I had no symptoms whatsoever. So the doctor said, you have no symptoms, so we don't see any reason. But when I did the press conference on Friday, everybody was going crazy. Did you do the test? Did you do the test? So very late on Friday night, I did the test. And he may have put out, or the doctor may have put out something at I don't know what time the letter went out. Maybe it was put out by somebody else. But the results came back, I believe, the following day. And we tested negative.
But the question is, how could the White House doctor's office say a test wasn't indicated, implying that you hadn't had one when in fact you had?
Well, I told them that, and I went totally by what they said, the doctors, more than one. They said you don't have any of the symptoms. They checked what you're supposed to check, and that I didn't have symptoms. But I did a test late on Friday night, and it came back probably 24 hours later or something. They sent it to the labs, came back later. Yeah, please.
Mr. President, you had a teleconference with the nation's governors today. Yeah. And in that teleconference, you told them if they need things like respirators or masks to try to get it on their own. What did you mean by that, and what will the federal government do to help?
If they can get them faster by getting them on their own, in other words, go through a supply chain that they may have, because the governors, during normal times, the governors buy a lot of things, not necessarily through federal government. If they're able to get ventilators, respirators, if they're able to get certain things without having to go through the longer process of federal government. We have stockpiles now, and we're ordering tremendous numbers of ventilators, respirators, masks, and they're ordered, and they're coming, and we have quite a few at this point. I think, Mike, we have a lot. But if they can get them directly, it's always going to be faster if they can get them directly if they need them. And I've given them authorization to order directly. Go ahead, please.
Mr. President, one of the big weaknesses in our healthcare system is surge capacity for medical facilities, and I wanted to ask what precautions, what planning is being done to get China was able to build hospitals in a matter of days. Are you prepared to use the Corps of Engineers or FEMA to start building surge capacity that we may need in a couple of weeks?
Well, first of all, we hope we don't get there, and that's what we're doing, and that's why we're taking a very strict look at this. But we also are looking at areas, and not only looking, we're expanding certain areas. We're taking over buildings that aren't used. We're doing a lot in that regard. We hope we don't have to get there, but we are doing a lot in that regard.
Mr. President, could you clarify something? These guidelines say stay home if you're sick. Yesterday, the Vice President said no one should worry about losing a paycheck if they stay home when they're sick. But the House bill exempts companies of 500 employees or more from the paid sick leave requirement, and that's 54% of the American workplace. Why is it a good idea to only require small businesses to provide paid sick leave?
Well, we're looking at that, and we may be expanding that. We are looking at that. We want fairness. We want it for everybody. No, we're looking at that through the Senate, because as you know, the Senate is now digesting that bill. So we may very well be adding something on that. Okay? Good question.
Two questions here, Mr. President. One, going off of what he was asking, how many ventilators and how many ICU beds do we have right now, and will it be enough?
I could get back to you with that number. We've ordered a lot. We have quite a few, but it may not be enough, and if it's not enough, we will have it by the time we need it. Hopefully, we won't need them.
And you'll give us the exact number?
Yeah, we'll be able to give you.
They have not given us an exact
number.
We
can give you a number. If it's important, we'll give you a number. Go ahead.
Okay. And yesterday, you said that this was under tremendous control. Do you want to revisit that statement if we are going to be experiencing this until July or August, 5 more months ahead of
when I'm talking about control, I'm saying we are doing a very good job within the confines of what we're dealing with. We're doing a very good job. There's been a tremendous amount of the way they're working together. They're working hand in hand. I think they're doing really a great job. And from that standpoint, that's what I was referring to. Yes,
you're not saying it's under control, right?
I'm not referring to it, meaning the. Yeah, if you're talking about the virus, no, that's not under control for any place in the world. I think I read. No, I didn't. I was talking about what we're doing is under control, but I'm not talking about the virus. Yes, please.
The stock market took another hit today. Is the U.S. economy heading into a recession?
Well, it may be. We're not thinking in terms of recession. We're thinking in terms of the virus. Once we stop, I think there's a tremendous pent-up demand, both in terms of the stock market and in terms of the economy. And once this goes away, once it goes through and we're done with it, I think you're going to see a tremendous surge.
Are you looking at any domestic travel restrictions? I know that's been on the table before, but is that firming up at all?
We're not really. We hope we don't have to, Steve. We think that hopefully we won't have to do that, but it's certainly something that we talk about every day. We haven't made that decision.
Mr. President, can I ask you, doctors and nurses in this country are telling us across the board that they're terrified of this virus, of the fact that they might get it, of the fact that they might take it home to their families. What can you say to assure healthcare providers in this country that the federal government is doing something today to ensure that they get personal protective equipment to protect themselves and their families?
Well, I think the federal government is doing everything that we can possibly do. We made some very good early decisions by keeping people out, by keeping countries out, certain countries where the infection was very immense. I notice a lot of people are talking about South Korea because they've done a good job on one side, but on the other side, tremendous problems at the beginning. They had tremendous problems and great numbers of death. I think that we've done a fantastic job from just about every standpoint. With that being said, you look, no matter where you look, this is something, it's an invisible enemy. And but we are speaking all the time, not only with the people, but also the professional people, the nurses, the doctors. They have been doing a fantastic job. We are also working very much on getting them the kind of equipment that they need. And for the most part, they either have it or they will be getting it. But remember this. We want the governors, we want the mayors, we want them locally from a local standpoint because it can go quicker. We want them to work. And we had a great talk with the governors today. I think it was a really great talk. There's a tremendous coordination. There's a tremendous spirit that we have together with the governors. And that's pretty much, for the most part, bipartisan. Yeah.
Mr. President, you told John that you think this could wash through, as you said, July, August. You just told Steve when he asked you about a possibility of recession, you said it may be. I'm curious, if there is a recession, when do you think that might hit?
Well, I don't number one, determine recession. I just say this. We have an invisible enemy. We have a problem that a month ago nobody ever thought about. Nobody in the, I've read about it. I read about many years ago, 1917, 1918. I've seen all of the different problems similar to this that we've had. This is a bad one. This is a very bad one. This is bad in the sense that it's so contagious. It's just so contagious, sort of record-setting type contagion. And the good part is the young people they do very well, and healthy people do very well. Very, very bad for older people, especially older people with problems. My focus is really on getting rid of this problem, this virus problem. Once we do that, everything else is going to fall into place. Yes, please.
A lot of rumors last night that you were going to put in a national curfew or some kind of, texting.
I've been reading. I've been watching.
Right, exactly. Me too. Your people were saying this is a foreign disinformation campaign. Is that what's going on? Are people messing with us on the internet?
Well, I don't know. I mean, that I can't tell you if they are or not. And, I think a lot of the media actually has been very fair. I think people are pulling together on this. I really think the media has been very fair. I think it could be that you have some foreign groups that are playing games, but it doesn't matter. We haven't really determined to do that at all, and hopefully we won't have to. That's a very big step. It's a step we can take, but we have not decided to do it. Jennifer, go.
Mr. President, two things, one on airlines and one on Jeff Bezos. Can you talk a little bit specifically about what you'd like to do to help the airlines, first of all? And then second of all, we heard that Jeff Bezos has been in contact with the White House daily. Can you say what he's been asking for or proposing?
Well, I've heard that's true. I don't know that for a fact, but I know that some of my people have, as I understand it, been dealing with them or with him, and that's nice. We've had tremendous support from a lot of people that can help, and I believe he was one of them. As far as the airlines are concerned, the airlines, we're going to back the airlines 100%. It's not their fault. It's nobody's fault unless you go to the original source, but it's nobody's fault. And we're going to be in a position to help the airlines very much. We've told the airlines we're going to help them.
They want $25 billion.
Well, we're going to be helping. We're going to be backstopping the airlines. We're going to be helping them very much, John. It's very important.
What do you do about the stock market, sir?
$25 billion for the passenger carriers and $4 billion for cargo?
We're going to be looking at it very strongly. We have to back the airlines. It's not their fault. In fact, they were having a record season. Everybody was. They were having record seasons, and then this came out. And it came out from nowhere. So not their fault, but we're going to be backing the airline, yeah.
The stocks continue to fall today. Would the White House support negative rates?
Best thing I can do for the stock market is we have to get through this crisis. That's what I can do. That's the best thing we can do. That's what I think about. Once this virus is gone, I think you're going to have a stock market like nobody's ever seen before.
People be voting tomorrow, Mr. President?
Mr. President, the other day you said you don't take
He'll be back in a second. He'll be back in a second. I think the question that I think maybe John asked about until July, the guidelines are a 15-day trial guideline to be reconsidering. It isn't that these guidelines are now going to be in effect until July. What the president was saying is that the trajectory of the outbreak may go till then. Make sure we don't think that these are solid in stone till July.
Yeah. But that would be the outside number. Yeah.
Mr. President,
you've been criticized.
Hold on 1 second, please. Go ahead.
To follow up, Senate Republicans, do you want Senate Republicans to change the package that passed the House last week, even though you
I think they may make it even better. Look, they're working together very well with the House. They're working very much in unison, like the question before. They're working to only enhance it and make it better and make it fair for everybody, and that's what we're looking to do. So we may go back and forth with the House a little bit, but both will be in a very positive fashion. Please.
Yeah, Mr. President, these new guidelines say avoid social gatherings in groups of more than 10 people. The CDC's recommendations yesterday were for people to avoid gatherings of more than 50 people. What's evolved in you and your team's thinking in just the past 24 hours? And also, what exactly do you need to see in a stimulus?
Well, let me just have the professionals answer that. Would you like to do that?
Great. Thank you, and thank you for that question. So we have been working on models day and night around the globe to really predict, because some countries in our very early stage, like the United States, we've been working with groups in the United Kingdom. So we had new information coming out from a model, and what had the biggest impact in the model is social distancing, small groups, not going in public in large groups. But the most important thing was if one person in the household became infected, the whole household self-quarantined for 14 days, because that stops 100% of the transmission outside of the household. And as we talked about early on, it's silent. We had another silent epidemic, HIV. And I just want to recognize the HIV epidemic was solved by the community, the HIV advocates and activists who stood up when no one was listening and got everyone's attention. We're asking that same sense of community to come together and stand up against this virus. And if everybody in America does what we ask for over the next 15 days, we will see a dramatic difference, and we won't have to worry about the ventilators, and we won't have to worry about the ICU beds, because we won't have our elderly and our people at the greatest risk having to be hospitalized.
Dr. Burks, can we ask you to comment on the Doctor?
Go ahead. Yes, Mike, please.
Thank you, Mr. President. Very productive call today with governors. We talked about the new rollout of testing that we described yesterday, and drive-through and community-based testing. And I know how grateful the President is for the efforts that governors are making, and now with the Admiral and the United States Public Health Service as well as FEMA, we made great progress today in coordinating those efforts. But the other issue that was raised with the President today was personal protective equipment. And the reason I mentioned testing is because one of the recommendations that we have for states is that these remote testing sites make a priority of two groups. One would be people over the age of 65 that have symptoms. We don't want them to go to hospitals or emergency rooms. We want them to go to a remote site in a parking lot or at a isolated community location. But the other category is our healthcare workers. We want to make sure that our healthcare workers have the opportunity
to be tested, and using that new high-throughput test that the President arranged with our major commercial labs, we'll be able to do that much more expeditiously. So we're putting a real priority on our extraordinary healthcare workers that are at this very hour coming alongside people that are struggling with the coronavirus and people that are concerned that they may have been exposed. The other piece is we're grateful that the legislation passed by the House of Representatives includes liability protection for N95 masks produced by companies like 3M in Minnesota, by Honeywell. Literally tens of millions of masks are produced every year for industrial purposes, for construction. But the health experts say they can be used just as readily to protect healthcare workers from respiratory ailments. 3M and other companies were not able to sell those to hospitals, but the President negotiated with the Democratic leadership of the House and Senate. We've added a provision to the bill that will literally, from one company alone, add another 30 million masks per month back to the marketplace. We're strengthening the supply chain, and healthcare workers around America can be absolutely certain that the President and our entire team are going to continue to put the health of America first and put first our healthcare workers across this country that are meeting the needs of the people of our country.
Mr. Vice President, how many test kits have been sent out and how many people can actually be tested?
I think the Admiral can answer that. And you might want to talk about the roving also.
So thank you very much for that. As we talked about yesterday, we're really entering a new phase of testing. At first, we were at the initial phase where the CDC-developed test was only available in public health laboratories in the CDC. Works very well for a few thousand tests per day after it gets running. We're now moving into a phase that the big commercial laboratories with high-throughput screening have availability. So as we talked about last week, because of the historic efforts of the FDA, a Roche test and, as the President predicted, a Thermo Fisher test were both produced last week under an emergency use authorization. 1.9 million of those tests will be sequentially into the ecosystem this week. From the information we have right now, 1 million tests are available with all the reagents, everything ready to go, primarily at the reference labs called Quest, LabCorp, and a couple others. Now, it doesn't matter if they're not in your neighborhood, because every day when people get tests, a little white box goes out in front, it gets shipped by an incredible distribution system. The test resulted and it's electronically reported. So these are available to people nationwide. We expect more and more than 1 million coming on board this week as the reagents come up and as people with the testing capacity validate that in their own hospitals and other places. And in the future, we expect at least 2 million next week and at least 5 million the week thereafter. There are also a whole growth of what's called laboratory determined testing or laboratory-derived testing, where individual laboratories, because of the regulatory deregulation of the FDA, can develop their own tests and start using them. So if you're a CLIA-certified lab with complexity, you can do that. So the point is, testing is now entering sort of what we normally do in the healthcare system, where big labs in a high-throughput basis receive these through normal channels. So that part of it is really underway.
Do you know how many Americans have actually been tested? Do you have a number?
There is a number. I don't have that number because I've been working on setting up this distribution system. So this is where we are. The state and public health laboratories in the CDC are published every day on the CDC website. The CDC gets feeds from LabCorp and Quest, and they get that on a daily basis. What is not being received right now, and Ambassador Birx is fixing, is that these homegrown tests in highly complex labs don't necessarily get reported in the system. However, as we move forward, particularly in the commercial phase of where we are right now, we expect about 80 to 85% of the tests to flow right into the CDC. We know them. That's not good enough for Ambassador Birx. She wants 100, and we'll work on that.
Sir, are you
So I think just to put it a different way, a lot of testing has been going on, and I don't believe anybody's been able to do what we're doing and what we will be doing.
And let me just say that we talked about the drive-through testing yesterday. I want it to be clear to everybody, this is just another tool for states and local public health systems and healthcare systems to use. It's not replacing testing that goes on in a doctor's office or in a hospital, or if you go to your doctor and wants to get tested in that office. This is just another tool that we're helping the states to have. And again, as we talked about, this is modeled on the FEMA-based points of distribution system optimized for testing. We expect this week, we now have gear, people being shipped right now today that will be in over 12 states with multiple sites, many of states having multiple sites, to start augmenting the local capacity and really providing the state and the local people what they need as another way for people to get tested.
So this has never been done before. That's never been done, and certainly not on a level like that. And I will say that I think I can speak for the professionals that if you don't have the symptoms, if your doctor doesn't think you need it, don't get the test. Don't get the test. I think that's very important. Not everybody should run out and get the test. That's right. But we're able to handle tremendous numbers of people. John?
Mr. President, earlier today, Governor Cuomo of New York said that he believes that hospital capacity soon will be overwhelmed and implored you to call on the Army Corps of Engineers to build temporary facilities to house patients. Is that something
we're looking into? It. We've heard that. We've heard it from really two places. There are two places that have specifically, New York being one, and we are looking into it very strongly. Yeah. Steve, go ahead, please.
Sir, how have you changed your own behavior to take account of this virus? Are you washing your hands more?
Oh, I've always washed my hands a lot. I wash my hands a lot, probably, maybe if anything more, certainly not less.
What was it like taking the test?
It's not something I want to do every day, I can tell you that. It's, it's a little bit of good doctors in the White House, but it's a test. It's a test. It's a medical test. Nothing pleasant about it.
You said that in a tweet that Governor Cuomo should be doing more.
Well, I think he can do more.
What specifically
but I think
should he be doing?
I think he can do more, and it's an area of the country that's very hot right now. I think New Rochelle, and a place I know very well. I grew up right near New Rochelle. I think it's an area that has to be tamped down even more because it's a hotbed. There's no question about it. So I think they can look at doing it. But we're getting along very well. We've had a very in fact, I noticed you made some statements just now that the relationship with the federal government has been good. The federal government has done everything they've wanted us to do. But we can, I think it's very important that all of the governors get along very well with us and that we get along with the governors. And I think that's happening.
I have the President. The Defense Secretary and the Assistant Defense Secretary have decided to separate and be in a bubble to avoid the spread of the disease and to protect the chain of command. Is that something you and the Vice President should be doing? And has there been any talk about having to have a 25th Amendment?
Well, we haven't thought of it, but I will say this: that we're very careful. We're very careful with being together. Even the people behind me they've been very strongly tested. I've been very strongly tested, and we have to be very careful. But everybody should be vigilant. We have to be vigilant. Yeah,
Thank you, Mr. President. Two simple questions for you, Mr. President.
Go ahead, please.
Two simple questions for you, Mr. President.
Hold it before you.
Okay, I don't know if this is a question for you or for Dr. Birx, but Dr. Birx said that it is the millennials who are going to lead us through this, and that now is the time to look out for the older people in our home. Older might be a state of mind, not necessarily an age. So for those millennials of us who have parents who are in their 50s, 60s, 70s, what is older? What should we tell them at this point?
Well, if I was Dr. Fauci, I would tell you there's a physiologic age and a numerical age. So older people with pre-existing conditions. And what do we mean by that? Significant heart disease, significant kidney disease, significant lung disease, any immunosuppression, any recent treatment for cancer, any of those pieces in any household. Now, why do I think the millennials are the key? Because they're the ones that are out and about. And they're the most likely to be in social gatherings. And they're the most likely to be the least symptomatic. And I think we've always heard about the greatest generation. We're protecting the greatest generation right now. and the children of the greatest generation. And I think the millennials can help us tremendously by having, plus they need to communicate with each other. Public health people like myself don't always come out with compelling and exciting messages that a 25 to 35-year-old may find interesting and something they will take to heart. But millennials can speak to one another about how important it is in this moment to protect all of the people. Now, you could be 40 and have a significant medical condition and be of substantial risk. You could be 30 and having come through Hodgkin's disease or non-Hodgkin's lymphoma and be of a significant risk. So there are risk groups in every age group, but there's more millennials now than any other cohort, and they can help us at this moment.
Mr. President, thank you very much. Thank you very much, Mr. President. You already talked. Mr. President, the other day you said that you were not responsible for the testing shortfall. Very simple question. Does the buck stop with you? And on a scale of 1 to 10, how would you rate your response to this crisis?
I'd rate it a 10. I think we've done a great job. And it started with the fact that we kept a very highly infected country, despite all of even the professionals saying, no, it's too early to do that. We were very, very early with respect to China. And we would have a whole different situation in this country if we didn't do that. I would rate it I would rate ourselves and the professionals. I think the professionals have done a fantastic job. As far as the testing, you heard the Admiral. I think the testing that we've done, we really took over an obsolete system, or put it maybe in a different way, a system that wasn't meant to do anything like this. We took it over, and we're doing something that's never been done in this country. And I think that we are doing very well. We took the system, we worked with the system we had, and we broke down the system purposely. We broke it down in order to do what we're doing now. And within a short period of time, and even now, we're testing tremendous numbers of people. And ultimately, you're saying it will be what? It will be up to how many people will we be able to test?
We certainly expect with the high throughput testing that that's no longer a barrier. The barrier is actually doing the test on a person. And I'm sure, as the president would inform you, in order to do the test, a healthcare provider needs to dress in full personal protective equipment. And there's a swab that's put in the back of the nose all the way to the back of the throat. It's called a nasopharyngeal swab, which is then put in media. The next person who has to get tested, that healthcare provider has to change all the personal protective equipment. When you put that in, it's highly likely a person coughs or sneezes, so you're at risk. So that's what we're trying to fix now by the mobile platforms, by all the things we're doing, is to enable sort of high throughput of this swabbing. And we're doing some technological things, too, that might be breakthroughs to make it much, much faster. But we certainly expect that from thousands of people per day, we will be at the tens of thousands of people per day this week, according to those who are.
But does the buck stop with you, Mr. President? Does the buck stop with you?
Yeah, normally, but I think when you hear this has never been done before in this country. If you look back, take a look at some of the things that took place in 09 or 11 or whatever it may have been. They never did. Nobody's ever done anything like what we're doing. Now, I will also say, Admiral, I think we can say that we're also getting this ready for the future, so that when we have a future problem, if and when, and hopefully we don't have anything like this, but if there is, we're going to be we're going to be starting off from a much higher plateau, because we were at a very, very low base. We had a system that was not meant for this. It was a smaller system. It was meant for a much different purpose. And for that purpose, it was fine, but not for this purpose. So we broke down the system, and now we have something that's going to be, and is very special, and is ready for future problems. I think we can say that very strongly. Yeah. Go ahead, please.
Thank you, Mr. President. How close are you to shutting down America's northern border with Canada? And could you also speak to the fact about the elections that are supposed to be taking place tomorrow? Is it your advice that those states postpone those elections?
Well, I'd leave that up to the states. It's a big thing, postponing an election. I think, to me, that really goes to the heart of what we're all about. I think postponing an election is a very tough thing. I know they're doing, because they've been in touch with us, they're doing it very carefully. They're spreading people out at great distances, as you can see. And I think they'll do it very safely. I hope they do it very safely. But I think postponing elections is it's not a very good thing. They have lots of room in a lot of the electoral places, and I think that they will do it very well. But I think postponing is unnecessary.
On the northern border, sir, how close are you to shutting?
We think about it. We think about it. If we don't have to do it, that'll be good. We have very strong emergency powers when it comes to something like this, both on the southern and the northern borders, and we are talking about different things, but we'll see. Right now, we have not decided to do that. Steve?
Can we get Dr. Fauci to talk about the vaccine trial today and whether the timetable for a vaccine is it possible to accelerate, or is it still 12 to 18 months?
So, thank you for that question. The vaccine candidate that was given the first injections for the first person took place today. You might recall when we first started, I said it would be 2 to 3 months, and if we did that, that would be the fastest we've ever gone from obtaining the sequence to being able to do a phase 1 trial. This has been now 65 days, which I believe is the record. What it is, it's a trial of 45 normal individuals between the ages of 18 and 55. The trial is taking place in Seattle. There will be 2 injections, one at 0 day, first one, then 28 days. There will be 3 separate doses, 25 milligrams, 100 milligrams, 250 milligrams, and the individuals will be followed for 1 year, both for safety and whether it induces the kind of response that we predict would be protective. And that's exactly what I've been telling this group over and over again. So it's happened. The first injection was today.
Sir, the market just closed down 3,000, almost 13%. Your response to the market close, sir?
Is pregnancy an underlying condition?
Thank you.
Dr. Fauci, is there guidance for someone who may have felt sick but then feels better, so you had symptoms but you no longer do, your fever's gone away? How long would you stay home after that point? That's not clear from the guidelines.
Well, if you are positive for the infection, if you have coronavirus, it is less how you feel than whether or not you're still shedding virus. So the general issue about letting people out of a facility, who, for example, a hospital or whatever, who have been infected, you need 2 negative cultures, the same way that was just described, 24 hours apart.
Yeah, no, the market will take care of itself. The market will be very strong as soon as we get rid of the virus. Yes.
Could you clarify about pregnant women? Is that an underlying? Because the UK said today that pregnancy was one of those underlying conditions. Do we say that too?
There's very little data in pregnant women. I think about a week ago, I said the reports that came in from China, from the Chinese CDC, of the 9 women who were documented to be pregnant and have coronavirus in their last trimester, delivered healthy children, and they themselves were healthy and recovered. That is our total sample size, and we will be getting more data from countries. While countries are in the midst of this crisis, like Italy, I try not to bother them frequently to get us their data. We try to get it just weekly from the countries that are in the midst of responding to the epidemic, so that their focus is on their individuals in their country.
Mr. President, any comment on what people like Devin Nunes, the governor of Oklahoma, have been saying, encouraging people to go out to restaurants, which goes directly against what this advice in your guidelines says?
No, I haven't heard that. I haven't heard that from Devin or anybody else.
Should they stop saying that?
Well, I'll have to see what they said. But
They encourage people to go to restaurants if they felt okay with their families.
I would disagree with it, but right now we don't have an order one way or the other. We don't have an order, but I think it's probably better that you don't, especially in certain areas. Oklahoma doesn't have a tremendous problem. Oklahoma, you said the governor of Oklahoma.
Oklahoma, Devin Nunes is another.
Yeah, well, I hadn't heard that.
So should they be doing that, or should they not be doing
Well,
that?
let's adverse to what the professionals are saying. That's, you know.
And what you're saying in your guidelines,
Yeah.
that people shouldn't
No,
be
it's
going to
adverse,
restaurants.
but I'll take a look at it. Absolutely.
I don't know who would be best to answer this question, maybe Secretary Hayes or Dr. Fauci. School districts across the country are closing down, yet for the most part daycare centers remain open, and considering that children can sometimes be asymptomatic carriers and go home to older individuals, are there any recommendations about daycare centers?
I'd prefer if one of our medical professionals discuss that, given that's a clinical recommendation.
That's a good question, John. In the original guidelines as they were presented, it was schools, not daycare. I think it's very important. We should probably, if we have not discussed that, go back and discuss that in some detail about whether or not that's equivalent to school. It's a good question.
A question about the sort of underlying public health strategy behind some of these guidelines. Telling people to avoid restaurants and bars is a different thing than saying that bars and restaurants should shut down over the next 15 days. So why was it seen as being imprudent or not necessary to take that additional step, offer that additional guidance?
Doc, you want to answer that?
Well, I think we have to say the data that has been coming out, and I'm sure you're all up to date on how long the virus lives on hard surfaces. And that has been our concern over the last 2 weeks.
No, I'm sorry. Go ahead.
Okay.
Go ahead. I just wanted to read. There's an answer to this.
Oh, yeah. Go ahead, Tony. He was my mentor, so I'm going to have to let him speak.
The small print here, it's really small print. In states with evidence of community transmission, bars, restaurants, food courts, gyms, and other indoor and outdoor venues where groups of people congregate should be closed.
So, Mr. President, are you telling governors in those states then to close all their restaurants?
Well, we haven't said that yet.
Why
We're
not?
recommending, but we're recommending things. No, we haven't gone to that step yet. That could happen, but we haven't gone there yet. Please.
So on the election, you're saying it's a bad thing to postpone it, but if you've got the 10-person maximum, guideline, in a practical sense, can you have rallies? Can you primaries surely gather more than 10
Well, people? hopefully this will pass through, and hopefully that we'll have everybody will be going to restaurants and flying and being on cruise ships and all of these different things that we do, and it will very, very hopefully be in a fairly quick period of time. But we're taking a tough stance. We may make certain other decisions. We may enhance those decisions. We're going to find out. As per the question that you were asking, some of those decisions may be had. So how about one more?
On the cyber attack on HHS,
Yeah.
is there any reason to believe that they were trying to hack into the system and gather information from the system? And also, is there any reason, so were they trying to hack to get information, and also do you have any reason to think that it could have been Iran, Russia? Do you have any reason to believe it was a foreign actor?
So in the previous 24 hours, we saw a great deal of enhanced activity with relation to the HHS computer systems and website. Fortunately, we have extremely strong barriers. We had no penetration into our networks. We had no degradation of the functioning of our networks. We had no limitation of our capacity for people to telework. We've taken very strong defensive actions. The source of this enhanced activity remains under investigation, so I wouldn't want to speculate on the source of it, but there was no data breach or no degradation in terms of our ability to function and serve our important mission here. Thank you.
Mr. Vice President, have you been
what are you
tested
looking
yet?
for in another stimulus package, sir? Could you speak to that?
One thing Mike just said, it's very important to get out that this is for the next, what we're talking about, much of what we're talking about is for the next 15 days. Mike, go ahead.
Mr. Vice President, have you been tested?
I've not been tested yet. I'm in regular consultation with the White House physician, and he said I've not been exposed to anyone for any period of time that had the coronavirus, and that my wife and I have no symptoms. But we're checking our temperature regularly every day, and we'll continue to follow guidance, which I think may be a good place to land at the end of the day. And that is, as we expand testing rapidly around the country through the new public-private partnership that the President facilitated, we want the test to be available for people who have symptoms, people who have symptoms and are in vulnerable populations, and our healthcare workers, to make sure that they can have the peace of mind that they're doing their jobs and they're properly protected. And so our best counsel, the counsel of the experts, is if you have a question, call your doctor, call your healthcare provider, ask whether or not you should be tested, and that's what my family's doing as well. Let me just emphasize one more point, if I can. The President asked the task force to continuously review the data and the information that we have, not only in this country, but from around the world, to give the best guidance to state leadership and local healthcare leadership and all of the American people about how to keep themselves, their family, and their community safe. This guidance for the next 15 days is what our experts say is the best opportunity we have to lower the infection rate over the entire course of the coronavirus. Just as the president did by suspending travel from China, just as he did with travel advisories and screening from Italy and South Korea, just as we've done with Europe and at midnight tonight with the UK and Ireland. We'll continue to take very decisive steps to lower the spread of the coronavirus. But we want every American to know, and we would ask all of you in the media to spread the word of the American people that this is advice on behalf of the President of the United States to every American, what you can do over the next 15 days to prevent the spread of the coronavirus. And we're calling on every American to do your part, because together we'll get through this and we'll find our way forward.
Mr. President,
just one more, Steve. Go ahead.
Mr. President, what do you think of this?
G7 video conference today. What was the upshot of that? And are you still going to be able to meet at Camp David? I think
well, it looks like it.
And are you confident in their responses, as you are with
I'm
Europe?
very confident in there. They're in a position that some of them are in a rough position, if you look at a couple of them, and some are heading toward pretty rough territory. We had a very good conference. It was a teleconference. Everybody was on the phone, every leader, and almost 100% was devoted to the subject that we're talking about today. And they are working very hard. And they're very concerned, obviously, but they're working very hard. But I would say just about all of it was, Steve, all of it was devoted to what we're talking about.
Hold that summit at Camp David?
I think so. I mean, so far it seems we didn't even discuss that. Still a ways off, but it was a very good discussion, and they have. There's a great camaraderie. There's a great togetherness. I think I can say that very, very strongly. Thank you all very much. Thank you. Thank you very much.
For the airlines, Mr. President, do you consider this to be a bailout?
All right, everybody, again, we've been hearing from the president, the vice president, and other health officials, including Dr. Fauci, there at the White House. Due to the news conference, we didn't have your top-of-the-hour coronavirus update from Fox News Now on coronavirusnow.com. Here's the latest from Johns Hopkins University. They are reporting 4,200 confirmed cases of COVID-19. That's the coronavirus right here in the United States, 73 deaths. That's a lot more than we saw on Friday, the last time we were updating you with these numbers. Now, of course, Johns Hopkins University tracking all the numbers worldwide as best they can, providing the updates every 30 minutes. The CDC, on the other hand, the Centers for Disease Control and Prevention, only providing updates Monday through Friday at 4 p.m. Eastern. They say the numbers close out at 4 p.m. the day prior to reporting. So as of right now, the CDC is only reporting 3,487 cases of the coronavirus and 68 total deaths. So there's some discrepancies, and that's to be understood with this fluid situation. The cities, the counties, the states, they're all reporting numbers at different times, and everybody's just trying to keep tabs as best they can. Meanwhile, not a good day for the stock market at all. This is how the Dow Jones Industrial Big Board closed out. Nearly 3,000 points, nearly 13% down. Nothing but red on the big board today. That's what we call it. The New York Stock Exchange just had its closing bell. It's not one of those days that you want to stand there and clap in front of the nation when the stock market did such a very bad job today. And a lot of people are just worried about the 401ks, the economic future. President Trump even just said during that news conference that we might be headed towards an economic recession, a world recession. But he says the stock market will, quote unquote, take care of itself. So we have been having lots of news conferences happening live. New York City Mayor Bill de Blasio is speaking now. We are waiting for the governor of Massachusetts to come out and talk about the coronavirus. So I have been recording on them. I want to take you out to the situations that are unfolding first. But since Bill de Blasio is still talking live, let's head to that live news conference right here on Fox News Now.
Stay home as much as you can. That guidance might get a lot sharper at any point. I have been asked repeatedly, are we considering travel restrictions? Are we considering curfews? We are considering everything is the answer. Every option, every tool is on the table. We will decide in turn when we want to employ each. But right now, the answer is simple. Stay home to the maximum extent possible. protect yourself, protect your family. In general, the simple rule is when in doubt, stay home. If you're not sure you should do something, stay home. We're going to talk about some things that, if you're healthy, are still appropriate to do, like getting food and medicine. But again, the simple guidance to all New Yorkers is, if you're not sure you need to do.
All right, everyone, I'm going to interrupt Mayor Bill de Blasio in New York City, and that's because the mayor of San Francisco, California, is speaking about the coronavirus latest, and we just got word that there may be some mandatory shelters in place happening in certain counties in the Bay Area. So we're going to go to San Francisco, California, live now.
Breed, city agencies, businesses, schools, the healthcare system, and individuals are stepping up to do their part. All San Franciscans, please do your part. Abide by the new health order. If you do have to go out, practice social distancing. Stay 6 feet apart from others and wash your hands frequently. Check in on your neighbors. Do not leave children who are out of school with elderly relatives, if at all possible. Do not go to emergency rooms unless you have a true emergency. Take care of yourself and your loved ones, and make a plan for how you will manage the changes that are upon us. I know this is a lot to take in, and I and the department are committed to providing all San Franciscans with as much information and guidance as we can to help you do your part. Today's decision was reached collectively, and the entire region is acting as one. We will be developing more detailed information as soon as it is available. And again, please stay up to date by visiting the department's website or SF.gov. And today, if you haven't already, sign up for the text alert service. Text COVID-19 SF to 888-777. That's COVID-19 SF to 888-777. I know today's order is a radical step. It has to be. We need to act now, all of us, to protect the public health. Thank you.
Thank you, Dr. Colfax. And before we open it up to questions, I want to introduce President of the Board of Supervisors, Norman Yee.
Thank you, Mayor Bree. I want to thank you for your leadership, and I want to thank the leadership of all 6 counties coming together to fight this pandemic as a joint effort, because it can't be isolated. I want to also acknowledge my colleagues. As you see there, almost every one of them are here. Supervisor Safai, Supervisor Walton, Supervisor Mandelman, Supervisor Stephanie, Supervisor Peskin, Supervisor Marv, Supervisor Ronan, Supervisor Preston. We're here standing together with the mayor, and I want to thank all of them working in unity with the mayor's office to respond to this. I want to thank the mayor once again to be aggressive about this effort. This is not a game at all. I want our seniors in particular and people that are most vulnerable to take this seriously. We could give orders, but if you don't follow it, it's useless. You all must do your part. We all must do our part. That's what we need to do. Now, the mayor has rolled out many initiatives already to the press, to the public, saying these are some of the things that we're going to do as a city to help the small businesses, to help people that are residents in San Francisco. Those are great ideas that were generated by all of us standing behind me. And I want to say two other things. Those ideas are not the only ideas, and we will continue to find other policies that can help our population in San Francisco while we are all sitting and being impacted by this one way or another, whether it's economic, whether it's emotional, and so forth. So on Tuesday, we're going to continue that discussion to see what else we could do, what other ideas we could come up with, and I'm happy that we will take that initiative to work together. The other thing I want to say is that during this emergency, it's so important that the Board of Supervisors membership, my colleagues, are well informed. So, because as you know, many of the residents come to our offices for information, and we need to communicate back one way, both ways, to the Department of Emergency Management, or EOC, to make sure that there's strong links, strong communication that goes on between us, and we're going to work on that also. So I want to thank once again Mayor Bree for your leadership in this. Thank you.
Thank you, President Yee, and thank you to all the members of the Board of Supervisors for joining us here today. As I said from the very beginning, the priority in making these decisions is public health. I know this has been very, very difficult for so many people, and we will continue to do everything we can with a number of initiatives to mitigate the impacts on our especially very vulnerable community, not just the vulnerable communities of people that we know are at risk of contracting the coronavirus, but also the people who we know might be suffering financially. We got a lot of work to do. We will be continuing to do that every single day and provide initiatives that we know we can actually deliver for the people of San Francisco. So I thank you all again for being here. I thank you for your patience and cooperation. This order will go into effect at midnight tonight. And again, I want to say, do not panic. The grocery stores will remain open. The gas stations will remain open. The banks will remain open. The pharmacies will remain open. There's no need to rush out to do things at these particular locations because they will be available to you. And so at this time, we'll open it up to questions. But again, our goal is to try and mitigate the impacts, as we have said time and time again, provide essential services to the public to the fullest extent possible, provide mitigation around the economic impacts on what we know impact people's lives on a regular basis, especially those who sadly have already been laid off because of the lack of business for various restaurants and other places, and we know there's more to do. But I will say that I'm really proud of the leadership here in San Francisco because we are ahead of the curve in comparison to so many other cities throughout this state, throughout this country. They are not even close to doing many of the things that we have already put in place in San Francisco. There will be more to come, and I thank you again for your cooperation, and thank you to all the public health officials and others who have really stepped up and provided the most meaningful support during a very difficult time. And so with that, I'm happy to open it up for questions. Christian.
Question about enforcement. What is enforcement going to look like?
Yeah.
San Francisco police, sheriff's deputies, Department of Public Health workers going around making sure businesses aren't open. What is that going to be?
I'm going to let Chief Scott answer some questions around enforcement.
Thank you, Mayor Breed, and I again also want to thank Mayor Breed for her leadership. So enforcement, we're going to take a compassionate, common sense approach. We're looking for, number one, education. The mayor has been very clear to all of her leadership team that we need to get the information out to the public about what this is all about. Don't panic. We're going to have frequently asked questions that will be published to the public. We're looking for voluntary compliance. We're asking the public to voluntarily comply. Now, this order by law is enforceable as a misdemeanor or failure to comply with it, but that is an absolute last resort. And I want to be clear about that. This is not about, a criminal justice approach to a public health issue. This is about educating the public. This is about social distancing and practicing those safe protocols, and we will be a part of that education process. If we do get called to those situations, we're going to try to educate the public and point out why we are doing this. and we were asking for voluntary compliance. Yes, by law, enforcement is an option, but that is not our desire. That is not what we intend to do. We intend to adhere to the spirit of what this is all about and keeping people safe and keeping this virus from spreading. So we will do our part. Thank you.
I'm sorry. We're not putting a ban on food delivery.
Homeless again. Homeless, young listeners, too many people. How do you do it?
So we are still working with the governor's office to not only make sure that we have places for people who are homeless to self-quarantine, but we also know that in this challenging time that the homeless, along with our other vulnerable populations, fit into a vulnerable population. And our goal is to provide some additional resources that we are working on now. We do have locations just in case there is someone who is diagnosed and may not need hospital service but may need to self-quarantine. It is something that we are continuously working on, and we'll provide more information about that when we have all the details.
How about media coverage impacts? Are we essential, and also flying to the airports? What about travel?
Dr. Colfax, you want to?
So under this order, all but essential travel will be restricted. And your first question was about the media's role, an absolutely essential role to communicate effective information, the accurate information, and to push back against rumors. And again, I know this is a radical step, but also essential services will continue. So ensure that people understand that they will be able to support themselves and their families, get the vital resources that they need during this time, and that this is an evidence-based intervention in terms of making sure that people stay at home as much as possible to prevent the spread of the virus. This is an evidence-based, science-based intervention. Thank you.
Flights, will people be allowed to go on flights?
So at this time, in compliance with the order, people who leave the county during this time would not be, except for essential travel, again, essential travel, would be out of compliance coming back between now and April 7th. People who are currently out of the county would be able to return at this time, but really going forward until April 7th, essential travel is only allowed under the order. Thank you.
When it comes to overall, does the city know how many healthcare workers are currently under quarantine? And are there concerns San Francisco based to not having enough healthcare workers there in hospitals?
Yeah. So as I said, protecting healthcare workers and first responders is one of our top 3 priorities at the health department. I don't have the numbers to share with you in terms of the number of healthcare workers who are quarantined, but we do know that they are at high risk for exposure, which is why we're working with everyone across the city, hospital systems across the city, to prepare for the potential for a substantial portion of the workforce to have to be under isolation or quarantine. One of the key things that we're working on is ensuring that there is adequate personal protective equipment in keeping with World Health Organization and CDC guidelines, so that we can keep the workers as safe as possible so that they can care for the people who are most vulnerable to this disease.
At this point, as you see it, though, do you think it's possible San Francisco may not have enough healthcare workers in the near future?
We are more prepared than any other jurisdiction that I'm aware of. We have a robust healthcare system, and everybody is stepping up.
What about tourist visitors?
That will be posted on the frequently asked questions.
What services in City Hall are going to continue and what are going to be restricted?
Essential services will be continued. Essential city services will be continued both at City Hall and across the city.
But presumably there will be a fact sheet to tell people.
We will be, that will be provided, absolutely.
Are you short personal protective equipment right now as you face this, or are you going to need
every local jurisdiction needs more personal protective equipment. I cannot emphasize how important that is, given the escalating response and the need to protect our healthcare workforce. We have asked at the federal level for more visibility in terms of what is actually available. All local jurisdictions that I have talked to and I'm aware of are working under a short supply. This is a key gap in our ability to collectively respond to the epidemic, and we have been working locally and regionally and at the state level to advocate for developing more up-to-date guidelines with regard to what is the necessary protective equipment, and also to make sure that we have a clear sense of what is available going forward. Personal protective equipment is a vital part to this response, and I want to ensure that we are able to keep our healthcare workers protected with the best evidence possible so that they can do their job.
I know you said restaurants closed except for delivery. Not to quibble or to get too far into the weeds here. What does that include? Takeout? When people come in and get takeout, what about coffee shops, those kinds of businesses?
Under the order, takeout will continue, and coffee takeout, as long as the social distancing is maintained under the order, that would be permissible.
Janitorial services in the big buildings are essential work?
We will post the essential activities on our website with frequently asked questions. I will say that cleaning is especially important for all of us during this period of time. So frontline workers include the courageous janitors who are doing the work of cleaning and keeping us all protected.
What is the plan for those folks who do not have cell phones? You send out a text alert number. How do you get in touch with those who are not as connected as everyone else?
So we have a campaign that will be on radio and TV and print media. We are today switching all of those messages as we speak, and those you'll be hearing and seeing and be able to read those as of today.
Any flyers in other languages?
Yes. Yes. So all of that is out. You can either go to sf72.org or sfdph.org, and you will find all of that material ready to print and share.
And I just want to add that also there have been a lot of nonprofits that we've partnered with to distribute information in various languages all over the city, so that information has already been going out. Thank you.
Doctor, you can't even get hand cleaner. What are you doing to work with the supply chain with the public where they can access what they need?
Thank you for your question, but Greg, it's not just about hand sanitizer. Regular soap works just as well, so I'll let Dr. Colfax answer the details about the supplies.
So I would just reinforce what the mayor is saying about soap and washing your hands is one of the key interventions, if not one of the most effective interventions we can do to reduce risk. Hand sanitizer, we're working with all of our supply chain operators locally to ensure that we have as much available as possible. We work with what we have, and we're trying to get more. Thank you.
On Friday, the president announced that there's supposed to be a national website where people can input their symptoms and be taken directed to the closest testing site to them. There's been talk that he sort of over-exaggerated what that website would be, and it's now supposed to be a pilot program that actually just includes the San Francisco Bay Area. Has the city been in communication at all in terms of how this website will work?
So we have been in very preliminary conversations with the company. I don't have specifics to share at this point, but they are working with us and a couple of other counties to try to develop a pilot. I would emphasize that this is a pilot intervention as we understand it at this time, and we want to make sure that given the national limitation of test kit availability, which has really hobbled our local ability to respond, that those tests are reserved for the people who need the test the most.
Is there a timeline when that should go on?
I don't have, if I could give that to you, I would. I don't have that timeline. That hasn't been established yet.
And just to be honest, we can't sit back and wait for the federal government to do anything. Unfortunately, they've not been as proactive as they should in recognizing that this is a crisis throughout the entire world. As you know, I sent a letter to the Vice President 2 weeks ago around the lack of support for test kits, around protective equipment, around their very terrible response in dealing with this. But sadly, now is not the time to point point fingers. It's the time for us to come together and to provide as many resources as we can here locally in order to protect public health, and we hope that people will cooperate with us.
Reaching out regional-wide, because if bars and restaurants are closed here in San Francisco, somebody can drive out of Daly City or Orange County or to the East Bay. If you could talk more about what's being done to coordinate a region-wide effort, are you in communication with supervisors in other counties? What's being done?
So the public health officers for the counties that I listed are all in constant communication and are the ones who put forth this specific directive. And so they are definitely in touch. From my perspective, I'll let Dr. Colfax talk specifically about what that entails. But we, as mayors, as leaders of the city, we are in constant contact along with the governor's office in order to provide coordinated responses for the suggestions or the mandates that are coming down from public health officers. So there is a coordination that is happening around the region as a result of this particular situation, and we're working together, and we're working directly as well with the governor's office, who's been very supportive in our efforts. And so I'll let Dr. Colfax talk about the public health officers and their coordination and response.
So thank you, and I think it's really key to emphasize how important this regional response is. From the data that we're receiving from other countries, we know that our regional approach must be taken, particularly with regard for social distancing, for it to have an optimal impact. Over the weekend, the health officers from the nearby counties came together, shared data information about what we were doing, and made a commitment to working regionally and collaborating and really working lockstep towards this order. While the order released today is specific to San Francisco, the order reflects the concepts that are being implemented and executed across all 6 counties, and the timing of the order and the effect of the order, the date and time that the order is effective is consistent across the 6 counties.
Any main change related to the transportation, so car keeps running, buses keep running? Or?
There'll be a press availability with the director of MTA, Jeff Tumlin, at 3 o'clock today to provide details on Muni and our transportation system here. We unfortunately can't speak on behalf of BART.
Well, the first thing is if we are practicing the social distance requirements, the likelihood of somebody being stopped is very, very extremely low, unless they're doing something else. And if they're called in as a disaster service worker, they would need to have the regular credentials on them, but that's easily explainable. As I said, you know, we're taking a very common sense, compassionate approach to this. We understand that certain things have to happen, and we have to have essential services in our city, and our officers will be very thoughtful about that. But if social distancing is being practiced, there's really no reason to stop anybody. Thank you.
So thank you all again. I just want to express that I know we said that a lot of this information is online, and we also realize that not everyone has access to the internet, and so 311 is also a tool. And I want to reiterate that this is not the time to panic. If people have questions, they have concerns, they can call 311. They can look at the Department of Public Health website for any questions or any other concerns. We are here to provide as much information as we possibly can to help every resident of the city get through this very difficult situation, which is something that, again, we have experienced, maybe not in this magnitude, but we have had challenges before, and we have become a more resilient city as a result of those challenges. We will emerge stronger and better because of this. Please cooperate with the order. Please continue to work with us to comply so that we can get through this sooner rather than later. Thank you all so much for being here today.
All right, everybody, and we are keeping our coverage going. Taking out to a live news conference now in New York City.
Happen with lightning speed. I want to thank our educators who are stepping up to meet this challenge. I especially want to thank 4 groups of workers who are the unsung heroes today, who today are at the front line helping kids in those schools that are providing the breakfasts and lunches on a to-go basis. I want to thank our school custodians, including those from Local 891, our school cleaners, including those from Local 32BJ, our school food workers, including those from DC 37, and the firemen who keep, and this is meaning the folks who run these systems in the building, the firemen who keep the boilers and systems running, including those from Local 94. All of you, want to thank you all for what you're doing, for your commitment to your city, to your fellow New Yorkers, and to the children of our city. Thank you, because you're allowing all of them to have food they need today. So there's a number of actions we're taking today, some of which were announced last night, others of which are new, all contained in an executive order. I'm going to summarize very broadly. Obviously, it will be made public immediately. But the business closures related to restaurants, bars, cafes, now adding other businesses consistent with the state's actions, and we are obviously staying in close contact with the state and agree with the actions that the state has taken. The postponing of elective surgeries, and again, that is both in our public hospitals and in our voluntary hospitals. And we've set a 96-hour window for all those to be shut down, obviously with the allowable exception of something that is life and death or something that goes from optional to mandatory because of the nature of the health condition of the individual. Because we need to avoid public gatherings to the maximum extent possible, we're suspending for the time being city council hearings. We're suspending ULURP rules in terms of the land use process. That means that anything that was going to go through the land use process will simply be frozen in place. It does not mean there'll be an alternative decision-making. It means that that application will just have to hold until we are able to get back to normal. We are suspending visits to inmates at Department of Corrections facilities. And that starts Wednesday officially, but my understanding is there are no visits scheduled for today or tomorrow, so that's effectively means there will be no visits from this point on. Obviously, we're going to encourage alternatives, more phone calls, potentially video conferencing, et cetera. We are suspending procurement rules to allow for faster procurement. And as I noted yesterday, we are officially canceling the special election for Borough President in Queens. So all of this is included in the executive order, which I will now sign. This executive order takes effect immediately. As you heard, and again, we're in agreement with the state on all these actions, speeding up the closing on the restaurants, bars, cafes to 8 p.m. tonight, and again, they will be able to be open going forward for takeout and delivery under certain hours conditions. Other businesses that will be closed, movie theaters, other types of theaters, museums and cultural centers, concert venues, nightclubs, and commercial gyms. Obviously, we continue to say to all private business that it is crucial to allow telecommunications telecommuting wherever humanly possible. So that is something I want to continue to emphasize. We've gotten a lot of cooperation from the business community. We want that to be as deep as possible. Anybody who can telecommute should. Also want to note there are a host of public recreation centers, youth programs, after-school programs. These are all going to be shut down for inside activities. We are trying right now to determine if we can re-engineer some of those programs for outdoor activities with appropriate social distancing. Very, very concerned about our young people and what's going to happen to them over weeks and months potentially. I think they have to have some kind of outlets, some kind of recreation. We're trying to see if we can figure out a model for doing that outdoors with proper supervision and proper social distancing, but we do not have that locked down now. To working people in this city and obviously to business owners, including small business owners, everyone is immediately hurting very deeply. There's a lot of fear, there's a lot of confusion. Immediately we are seeing working people with much less money in their pockets and tremendous fear about what's going to happen next. There should be at least a little sense of relief that the House of Representatives acted on Friday, but it is not enough. We need more. Obviously need action on a consistent, ongoing basis from the federal government. And we will be fighting for that and working closely with our federal delegation, our senators, and our Congress members to achieve a much greater stimulus and relief package that really allows people the comfort of knowing that they will have some continuity in their lives. They'll be able to afford the basics no matter what their employment situation. They'll be able to stay in their homes and afford food, medicine, all the basics that we have to achieve that. We can only achieve that with federal support. This is going to be very, very tough for all of us. There's no question about it. There's going to be a lot of sacrifice here, a lot of pain. I hate to say it, but it's true. Lives will continue to be lost. Our job is to try to help people in every way, reduce to the maximum extent possible the number of lives that will be lost in this crisis, help people get through it, help people get back on their feet, make sure people are getting the right information so they can make the right choices. And this is something that will evolve and change probably pretty much every hour of every day. And we will be constantly giving you updates. The overall numbers are sobering. As of this hour, and everyone knows that these numbers can change at any moment, as of this hour, 463 confirmed cases in New York City. The borough breakout, again, lags behind. It has not yet been fully cross-referenced with the newest number, which that 463 number is from 11 a.m., so we do not have an exact cross-reference. The last best information we have from earlier this morning, based on a smaller number of cases, was here's the borough breakout: 118 in Queens, 111 in Manhattan, 62 in Brooklyn, 34 in the Bronx, 19 in Staten Island. I am very, very sorry to say that we now have 2 additional deaths, or a total of 7 people have passed away. The first is a 56-year-old man from the Bronx who worked as an investigator for the city government. This is something we are feeling all personally. One of our colleagues in public service has been lost. Investigator, Department of Correction. We have checked the logbooks for his work in recent days, and to the best of our knowledge, he did not visit the inside of a jail facility. He worked with one fellow employee closely. That individual is self-quarantined. So to our Department of Correction colleague who we've lost, our condolences to his family. Our hearts are with them, our prayers are with them, and we will do all we can to help them in this incredibly difficult time. We've also lost an 89-year-old man who returned from Italy about a week ago, and we grieve also with his family and loved ones as well. We see consistently that we keep losing people overwhelmingly in those same categories of those who are older, particularly much older, and those who are vulnerable because of pre-existing disease. Now, what we are going to do to expand our capacity. We understand that this curve is moving rapidly. We're going to have to radically expand our healthcare facilities in New York City and capacity. Again, this is going to be a war basis in New York City. I do not believe the United States government is on a wartime basis right now. I think it's painfully evident. If they were, we would already have immense support from federal agencies on the ground right now. I do see a beginning of federal support, but nowhere near what it should be at this point. So we will do it ourselves to the maximum extent possible, and I've ordered all my colleagues to identify all spaces that can be converted immediately to medical use. We're going to start with those that are most obvious, that already are engaged in healthcare and either being underutilized or not utilized, and then we are going to go much farther. So I think you have to think of this in a wartime worldview. You have to think of this as something where you're going to see a massive mobilization to save lives, to help people through their suffering with this disease. A lot of people who are hospitalized, the vast majority of people who are hospitalized will survive, but they'll go through a very difficult experience. Again, basically, the numbers keep holding. About 80% of everyone who gets this disease does not require hospitalization, has a fairly mild experience. 20% have a much more serious experience. Overwhelmingly, those folks need hospitalization. The ones who end up with the most serious problems in the ICU, and there is the category where we see ourselves losing people, particularly among the older folks with the pre-existing conditions. What that says to us with this kind of steep increase in number of cases is we're going to need massive medical capacity on a scale we have never seen in the history of New York City before. So we are going to be constantly building out medical facilities and creating them where they have never existed before, and retrofitting facilities that have nothing to do with healthcare. We will turn them into hospitals so long as we can get the equipment and the personnel. We will keep building our capacity to meet the demand. We've had a lot of conversations internally about how we're going to achieve this. The personnel are the single most crucial element. Thank God we're in a city with a vast number of healthcare personnel, but still nowhere near what we might eventually need. So we're going to find many ways to take people who are in other appropriate parts of the health profession, help them maximize their ability to serve, look for folks who may have retired recently who could come back, students who could be appropriately credentialed to be brought in. I predict in this, if it continues to be a situation where our area and others like Washington State are disproportionately suffering in the context of the whole nation, that we're going to ask the federal government to send in healthcare workers from other places to help. Clearly, we're going to ask for the military's medical units to come in, which are very effective, and that's a substantial amount of military personnel. We're going to need all of that to get through this, and we'll have more to say on it as we go along. Facilities that we are immediately bringing online, and this is a combination of some public facilities, some private, that we will in this instance, working with their owners, we will put them into public service, and obviously we will compensate for it. And we're going to work the same with the voluntary hospitals to maximize their capacity. But I can report 4 new facilities being brought online immediately. The Kohler facility on Roosevelt Island, an H&H facility that was empty. It is being immediately brought back online, 350 beds. It will be ready in approximately a week's time. There is a recently built nursing home in Brooklyn that had not yet been occupied. And again, we'll get you more details as the announcements are ready and final notifications and confirmations are achieved. but this is very likely coming online in the next 2 weeks. 600 beds. The Westchester Square Hospital in the Bronx has an available approximately 150 beds, and we believe, again, likely to come online in the next 2 weeks or so. The North Central Bronx Hospital, part of H&H, has 2 floors that are vacant with 120 beds. This will be activated immediately within a week's time or so. That gives us somewhere in the neighborhood of 1,200, 1,300 beds that we can immediately say will be activated. Then when it comes to existing health and hospitals facilities and voluntary hospital facilities, a 3-pronged strategy. Discharging patients on an expedited basis, obviously in a manner that is still healthy and appropriate. Canceling the elective surgeries as is ordered in my executive order under our state of emergency. And building additional capacity within hospital buildings. The example Dr. Katz gave, turning a cafeteria into an ICU, turning a parking lot into an ICU with a tent. Those 3 strategies between our existing health and hospitals and the voluntary hospitals, we believe will net us an additional 7,000 new usable beds, meaning new because they will be available for the cause of fighting coronavirus. So with that estimate, 7,000 beds capacity plus the 1,300 almost that we will bring into play from the other 4 new locations, that will take us to 8,200, 8,300, and then we're going to keep going rapidly from there. But this will be a race against time to create these facilities, to get them up and running, to find the personnel and the equipment we need.
All right, folks, we are listening live right here in New York City on the coronavirus briefing. This is the Mayor Bill de Blasio there in New York City. I just want to run the latest numbers here that we are getting. Close to 4,300 cases now confirmed in the United States, 74 total deaths so far in the U.S. We are continuing to follow this here for you live on Fox News Now.
Need to keep in that kind of location rather than sending them home. We're getting additional hotel space immediately. We have identified and are acquiring space in 5 smaller hotels that will amount to 250 hotel rooms, but we'll be building out from that rapidly. In terms of tents for medical use, the kinds of tents that can be used to set up a medical facility or an ICU, our emergency management team has already acquired 11 such tents, with another 10 to 20 coming in the coming days, and are working out the distribution of those tents between public and private facilities. We now have, as a result of the President's state of emergency, again, the real time here, everyone, is just staggering. We had the President's state of emergency just a few days ago, the congressional vote, the House vote just a few days ago. Everything is really moving fast. But when the President signed the state of emergency, that put FEMA into play. And this is crucial. We need FEMA to be part of the solution. Our Commissioner for Emergency Management, Deanne Criswell, was a former senior official at FEMA, understands exactly what capacity and resources they bring. So this is a very important dynamic to have FEMA involved, and they have immediately gotten to work with us. We will be standing up 5 drive-through testing facilities across New York City. Details are coming together about where they will be in the city. I want to emphasize, and I can't say this strongly enough, and I'm sure my health colleagues will say it even more strongly, these facilities will be for priority testing, not for anyone, not for whoever walks up, and that's not said with any lack of respect for anyone. It is clear we need to test on a priority basis the folks in greatest need. We have to protect our healthcare professionals. There are specific categories that we need to focus on. Testing will be based on priority and reservation, and we will have details on that soon as they're up and running. But there will be 5 drive-through testing centers set up in New York City. And again, thank you to FEMA for working with our Office of Emergency Management and our Health Department to do that. Just some other items I mentioned in our correction system that we will be suspending visits. I want to emphasize this is also the kind of decision that should never be made lightly. For those who are incarcerated, it's something they will be lacking and missing greatly. We will come up with alternatives, as I said, more phone calls, hopefully video conferencing. But it was absolutely necessary to protect the health of all those who are incarcerated, and obviously, very importantly, our correction officers who we are depending on greatly at this moment. They have a very tough job. Their job is crucial. We need to protect their health and well-being. That was a driving factor as well in making that decision. We are announcing a new emergency rule from our Department of Consumer and Worker Protection. I mentioned a few days ago specific actions that were being taken to delineate products that were becoming scarce and to institute anti-price gouging measures. We are taking a much deeper step now. An emergency rule banning price gouging on supplies needed to treat or prevent coronavirus. I'm going to list them for you. And so for all the folks out there who sell these items, we are deadly serious. You need to not only not price gouge, you need to understand you have an obligation to your fellow New Yorkers to make sure that people can get these crucial supplies. It is not time for profiteering. It is time to be a good citizen and help your fellow New Yorker. The items are thermometers, sanitizing wipes and/or baby wipes, paper towels, latex gloves, face masks, fever reducers, cough suppressants, zinc oxide supplements, facial tissue, toilet paper, rubbing alcohol, and aloe vera. And apparently, I did not know this, rubbing alcohol and aloe vera can be mixed together to create a version of hand sanitizer. So those two make the list. Retailers cannot increase the price of these items by more than 10%. That is the rule, and every time there is a violation, there'll be a $350 fine per instance, and that means it can add up very, very quickly if someone is violating that rule. In terms of supply chain, we have been studying carefully. I've asked our emergency management commissioner to constantly reassess the supply chain and update me at this moment. The good news is on food and basic household goods that you would find in a supermarket, there has been actually a very intensive resupply in recent days. That's the good news. The bad news is stuff is being snapped up really, really quickly. I remind people, we are going to work to ensure that the supply chain remains strong. We need our federal government to do that in a way that's far beyond what we can do. But while this is all proceeding, we need our fellow New Yorkers to look out for each other. If you're someone who's bought a lot of everything, God bless you. But if there's someone in your life, someone older, someone with one of those pre-existing conditions, someone who has a disability that keeps them from getting out and getting supplies they need, either help them by getting what they need for them or share your supply enough to help them out. I know we are in a society where people have been taught too much just to look out for themselves. We're going to enter an entirely different human reality and societal reality. We're going into something that people in this generation have not experienced before, but in previous generations they knew way too well. And everyone's going to have to figure out how to work together and share. So if you have an overabundance and you see someone who doesn't have anything, please help them out. Few other points, one related to that. We're very concerned about isolated New Yorkers, for the folks who have to stay home because they're vulnerable, for the folks who are in isolation for medical reasons. We want to help them out and communicate constantly with them. And this is whether it's someone who is a confirmed patient with coronavirus or just experiencing sickness but not yet confirmed, and certainly for folks who have to be very, very careful and stay in to the maximum extent. We are going to create what is being called an isolation app. Department of Information Technology and Telecommunications has put this together. It will be up quickly. It will provide guidance in 9 languages. It will ask if individuals need anything, and they'll get real-time responses. And also will give us good information on what challenges people are facing, where we're having particular problems across the city, et cetera. Finishing up, obviously now with the action on restaurants, bars, cafes that serve food, a crucial issue will be food deliveries. I got the question the other day whether we would suspend enforcement on e-bikes in terms of deliveries. The answer is yes, we are suspending that enforcement for the duration of this crisis. Okay, a few more things, and then we will start to take your questions. We're gonna, all of us up here, especially the health professionals, we're gonna repeat ourselves a lot over the next weeks and probably months. So let's begin with the most important point, which is stay home as much as you can. That guidance might get a lot sharper at any point. I have been asked repeatedly, are we considering travel restrictions? Are we considering curfews? We are considering everything is the answer. Every option, every tool is on the table. We will decide in turn when we want to employ each. But right now, the answer is simple. Stay home to the maximum extent possible. Protect yourself, protect your family. In general, the simple rule is when in doubt, stay home. If you're not sure you should do something, stay home. We're going to talk about some things that if you're healthy are still appropriate to do, like getting food and medicine. But again, the simple guidance to all New Yorkers is if you're not sure you need to do it, stay home. If you have any option, then you don't have to go out, stay home. Limit your time outside your home or your apartment. When you go out, be mindful of social distancing and try and distance as best you can. Those are some very simple rules. For folks who are sick, it's a stronger version of stay home. Stay home, don't even think about going out. Try as best you can to get the people in your life to get that food for you, get those medicines for you. Obviously, there'll be deliveries. Do not accidentally put someone else in harm's way. If you must go out, if you're someone who is sick and there is literally no other way to get food or medicine, you can't find anyone else who will do it for you, you must go out. You should be out for as little time as possible. You should keep your distance. You should help people around you know to keep their distance. If you are sick with the symptoms, again, I'm keep using simple layman's terms. The doctors will always feel free to improve upon them. But cold and flu-like symptoms, our guidance has changed in the last few days. We are saying stay home for 3 to 4 days. If you're getting better after that time, that's fantastic. Stay home until you're well. If you're not getting better, call your doctor and act accordingly. Crucial piece of information. Do not go, now that this crisis has advanced, do not go to the emergency room unless it is actually an emergency. If you are in an absolute dangerous situation health-wise right now, that's what the emergency room is still for. Otherwise, if you're just worried that you might be getting sick, I want to tell you more and more what you're going to see at emergency rooms. You're seeing it now all over the country as you will see officials of that healthcare facility outside screening and turning away people who do not need emergency care. So the better way to do this is to not go unless you absolutely have to. We cannot overwhelm our healthcare facilities. We have to make sure the folks who need help the most are getting the care. Finally, just trying to give some examples for the many, many New Yorkers who are not in those particularly vulnerable categories. You're not over 50 with the serious pre-existing conditions. You're not over 70. You're a healthy New Yorker and you're trying to figure out what to do. So when in doubt, you still stay home. But we understand that people need to stay healthy. We understand that people under any circumstance, if they have the ability to get a little fresh air and exercise, that's actually quite important to their health. We understand that people need groceries, they need medicines. In these instances, it's okay to take a walk, but practice social distancing. It's okay to go jogging, but practice social distancing. It's okay to walk your dog, but practice social distancing. If you don't need to go get groceries because someone else can get them for you, that's great. If you can get a delivery instead of going out, that's great. But I understand that there's so many people who are healthy who are trying to figure out what to do. Some basic, simple things like getting some exercise or getting some fresh air. I've spoken with all of our key health officials on this. Everyone agrees that's acceptable if you keep it limited and you practice social distancing. That's where we are today. That could change tonight, that could change tomorrow, but that's where we are right now. So everyone understands that this is going to be a very difficult few months. It will definitely get worse. It will get a lot worse before it gets better. I don't take any joy in saying that, but people expect our leaders to talk straight with them. It will get a lot worse before it gets better. We understand that so many people are going to be affected by this. But again, the answer is not fear. The answer is not panic. The answer is not, I'm going to sit around and hope that someone else will save me or the government will take care of everything. The answer is for all of us to work together and support each other. The answer is for us to believe in each other, support each other, look out for each other, and understand that everyone has a role to play. Everyone has a chance to do something really important for their fellow New Yorker and for someone in need. Everyone has a chance to exercise personal responsibility, listen to the guidance and abide by it, but also listen to the idea that even your city government, your federal government doesn't reach into every nook and cranny of our lives, but people do. Our family does, our neighbors do, the people on our block do. And we saw this after Sandy. The people were helping each other before any government agency could arrive. And I was very moved by it when I went through neighborhoods in Brooklyn and Staten Island and saw the amazing things people were doing to support each other. We're going to need that again now, that we're going to do everything we can as your city government. Everything we could possibly imagine to do, we will expend every resource. We'll do things that have never been seen before in the history of New York City. But in the end, New Yorkers will play a crucial role in helping us get through this crisis and in helping us overcome this crisis. And I have absolute faith in my fellow New Yorkers that you are more than up to the challenge. Few words in Spanish. A partir de esta noche, estamos cerrando algunos negocios en la ciudad de Nueva York. Todos los neoyorquinos tienen la responsabilidad personal de tomar precauciones, ser inteligentes y proteger a los más vulnerables. Los próximos meses serán dolorosos, pero juntos superaremos esta crisis. Okay, we covered a lot there. Let us open up now to your questions. My colleagues will join in as we go along. Rich.
So, I just looked it up, Mr. Mayor. Anthony Fauci is 79 years old.
Yes, he is.
So, did he give you any sense of if he is fearful about himself? Or?
No, he's been quite clear about that. He said, he was asked, has he been tested? He said, no, I'm not sick. I think he's exactly what we should be looking to as a role model. Amazing story. I was looking it up the other day. Here's a kid who grew up in Brooklyn. His family had a pharmacy. He used to deliver the prescriptions to people's homes in Brooklyn. And boy, when he talks, you know where he's from. And what an admirable guy and someone we should be proud of. But he was quite clear. People need to take common sense precautions. especially those in greatest need. But right now, I think, look, Dr. Fauci's in the same situation we are in. We have to, all of us, have to serve the public. We are not going to be able to look at things the same way everyone else does on one level. We are supposed to put ourselves in harm's way, not to be reckless, obviously, but we're supposed to stay at our post no matter what, just like our first responders, our health workers. So this is a situation where public servants are in a very different category than everyone else. We are supposed to do everything within our power. A number of us may get sick. That's the price of admission. We're asking everyday New Yorkers to really be cautious and careful, but we are holding ourselves to a different standard, a higher standard, because we signed up for putting ourselves in harm's way, and that's fine. No one has a problem with that.
Given your own guidance that you just gave to New Yorkers about stay home to the maximum extent possible, you received a lot of criticism for going to the gym today. Do you want to explain your thoughts
Sure.
on that? And then if Dr. Barbeau or a medical professional wants to weigh in on how safe that was.
Absolutely. I knew in advance that it was a very socially distanced situation. There was almost no one there. I had heard that information prior. I suspected that we were all going to be about to close them down, and this would be the last chance to get some exercise. I got no exercise whatsoever over the weekend. I was in this building a huge percentage of the time. I need exercise to be able to stay healthy and make decisions. I'm going to figure out some new way to do it going forward. I did not for a moment think there was anything problematic because I knew the dynamics. And again, I have to stay healthy so I can make the decisions for the people of this city.
Too, you've asked people to make sacrifices. You're not the only person in New York that needs exercise to stay healthy. People have found other ways to adapt.
Right.
Do you think it was irresponsible for you?
No, you can ask 100 different ways. I'm very comfortable with what I did. They're all closing down today anyway.
Could a medical professional perhaps?
Sure.
Yes. I'm a practicing doctor. I support the mayor's decision to get exercise today.
I know some people who have already been laid off from their jobs. What steps should people in that situation do right away?
When they've been laid off? Look, this is something, you know, that obviously there's actions being taken on unemployment insurance, for example. But we're going to need something much deeper than that from the federal level. We're going to need direct income replacement. So I used the example earlier today about the New Deal, and it's a very different physical reality. But just play it out in your mind for a moment. Remember, as soon as the New Deal, as soon as the Great Depression hit, a previously prosperous country with very low unemployment went in short order to 25% unemployment. My grandparents were among them. And the stories I heard, they had a small business in the garment district, and it was wiped out very quickly. And the stories I heard from them, from my grandfather, about the ways people came together to help each other and support each other were very, very powerful. Just everyday people helping each other survive. But then very soon after, once Franklin Roosevelt became president, these miraculous things started to happen, like massive numbers of government jobs. Now, coronavirus is different because we can't create massive employment when people can't gather, obviously, but the notion is the same. The federal government did something unheard of. There was no precedent whatsoever for it. It was night and day from what had been known a year earlier even. And they created a massive infusion of money into people's pockets through government-created jobs, and it saved America, literally. Saved America from falling apart. Right now, I'm asking this administration, this Congress, to create today's version of that. Replace people's incomes, not just unemployment insurance, which is nowhere near what people made, but replace their incomes to the maximum extent possible. I'm sure it may not be exactly the amount that everyone makes, but it has to be enough for people to afford the rent, food, medicine, the basics. If we don't do that, you're going to see a tremendous amount of pain and a danger of a further collapse in this country. Let's be blunt. They have the money. They just did, $1.5 trillion, $1.5 trillion tax break for the wealthy a few years ago, endless expenditures on the military with very little assessment of whether that's the best use of money. endless wars that are getting us nowhere. There's money. It's going to the wrong place. It should be going to the American people in a time of crisis. So I take to heart what Senator Schumer said right here on Saturday, that this bill is going to be followed by another bill. That next one needs to get to direct income replacement. Yeah.
Mayor, have any higher-up-ranking Department of Health officials threatened to resign in recent weeks over disagreements with you and your staff about the handling?
No.
Is there any truth whatsoever to these? I mean, there's been press accounts of...
I don't know about the multiple press accounts. If someone wants to bring me specifics, I know nothing about that. I know people have had serious conversations trying to make decisions together. I know when someone comes up to me and says, I want to resign. That has not happened.
Mayor, on the expansion of hospital capacity, can you...
Just a little louder.
The expansion of the hospital beds, are there other facilities that you're looking at? Are you looking at expanding it beyond healthcare facilities to
Yes.
armories and, other...
Anything and everything, but it will be, look, anything healthcare related, obviously, Aaron, is better because there's certain advantages to a facility that was built for something like that. But we're going to look at anything and everything. Again, it will be very much related to the extent of the mobilization we can achieve, depending on the personnel available, the equipment available, and the federal presence. If the military will come in a big way with their medical capacity, that would help immensely. If we're able to get, if we get to this point, healthcare professionals from other parts of the country brought in on a systematic basis. So again, I don't understand what the federal government is doing. I cannot believe what I'm seeing. It should be a full national mobilization. Look, I've had my differences with certain decisions our military have made over the years, but I come from an Army family. I would trust the Pentagon right now a hell of a lot more than the White House to figure out how to sort out this crisis and address it. I wish the president would just call up the Secretary of Defense and say, you take over, I don't know how to do this. But if we could put this on a war footing, and you have states in the union that have very little presence of coronavirus, we need healthcare professionals here. So those are my thoughts about the expansion. If we have the personnel, if we don't have the personnel, you can only expand so much. If we don't have the equipment, you can only expand so much. But if we have those things, we can keep expanding constantly into any and all types of appropriate buildings and creating what we need. It's never going to be perfect, but it's, again, these are battlefield conditions.
And what kind of response, if any, have you gotten to these requests for military assistance?
Nothing to speak of. The FEMA, different from the military, obviously, FEMA is actually now truly engaged. And I'm saying some of this is obviously strong opinion, and other things I'm reporting to you are updates. And my colleagues can jump in at any point and put more sharpness to it. But FEMA is now here. That is really good. That's really helpful. And we're engaging the Veterans Administration, and that's really helpful, but we have some more work to do to get to specifics. There's no military presence at this moment. There should be. We're one of the epicenters. I mean, I don't check the morning state facts against each state, but I'm looking at my health colleagues. I believe we are still the leading state in terms of cases. Right. What do you got to do to get prioritized around here? This should be where, I think Washington State's gone through a horrible experience, absolutely horrible. But in terms of sheer number of cases, this should be where the first aid goes, and I don't see it. Anyone else? I'm going to keep moving this way. Go.
Mindful of what you said about everything being on the table, including potentially curfew, quarantine-like measures, is there a threshold or a trigger for doing that?
It's a constant conversation of what we think makes sense to do, all things considered. This is how all the decisions have to be made. We have to factor, it's not one thing, it's everything. And what it means. Obviously, look, who wants to compromise the employment of everyone who works at bars and restaurants and cafes? That was not a lightly taken decision, but it was at least somewhat mitigated by the notion we could do takeout and delivery, keep a certain amount of them employed. And obviously, a lot of people depend on them for their food, and that's their reality. So that was where we struck, a balance of how you figure out how to do something in a sensible manner. We're going to be looking at all of this. If you do a curfew, if you do travel restrictions, there are real ramifications. So we have to process that and come to a decision quickly, but each in real time. Go ahead.
Mr. Mayor, you announced the new rule on price gouging.
Yes.
A couple things.
what should New Yorkers do if they see price gouging?
Call 311.
Okay. The second thing is, I've already.
And I'm sorry to interrupt. Call 311 and be specific.
Okay.
I really urge people, a lot of times New Yorkers come up to me with a complaint or they call WNYC, whatever it is, they're very fair. I always say, please get us all the information you can get. If you go into a store and you say, you know, a store price gouged me, I want to know the name, the address, what item it was, take down the price. If you can't take a photo, whatever they can get, the more the better.
And then, do you know how many fines the city's issued in recent days on price gouging?
I don't, but we can get that to you.
I'm already hearing from New Yorkers that they think, who are cash strapped at this point, that they think 10% is just too much of a markup. Would you consider lowering it?
I think we assume some variation is normal in a free enterprise economy, and 10% on its surface doesn't, seem to me necessarily unfair. Your point is well taken, though. I think 10% is also consistent with the current legal guidance. But we'll reassess that in light of the emergency to see if we can go even farther.
Question for Dr. Barbeau.
Sure.
Dr. Barbeau, off of Sally's question, there have been multiple reports that there's a toxic relationship between you and the mayor, that there's a logjam in getting out new guidance because the mayor is micromanaging the process. Can you speak to those reports?
I think it's been clear from the beginning that we are, and the mayor has been very clear, we all wear the same uniform, we're all on the same team, and we share the same goal of slowing the spread of COVID-19 and reducing the potential harm to New Yorkers. My team and I have been working 24/7 since this began, and nothing has changed, nor will anything change going into the future.
Mr. Mayor, just a couple of questions. Just Dr. Barbeau, has she threatened to resign?
I just answered the question like a minute ago. You called on me. You said, Mr. Mayor. I don't understand your question. I was asked the question, has anyone resigned? No. Has anyone threatened to resign? No. Do you want to ask her if she's resigned or threatened to resign? Feel free. But ask her, don't ask me. I'm confused by your question.
I have no intentions of resigning. I'm very honored to have this position at this time in history, and I am honored to be working with the mayor closely, along with my colleagues, to again ensure that we have one goal, which is to slow the spread of COVID-19 and reduce the harm to New Yorkers. No.
Guys, you can print what the hell you want in the middle of a crisis, but when we tell you it's false and we confirm to you it's false, it would be really, really nice if you would acknowledge it. This is a crisis. This is not personalities and games. This is a crisis. It did not happen. It just didn't. It's like the day a few months ago where someone said I had a lunch with Eric Adams and we came up with a grand plan. We had not even seen each other in person for months, and yet it still went in the paper. I don't know what you guys think are the right standards, but I would hope you would raise them a bit in the middle of a crisis. We have been discussing decisions every single day. Does everyone agree on everything all the time? No. Are there different factors? Does health think the same way as education? Guess what? No, they have different imperatives and we have to make sense of them, for example. But no one threatened to resign, period. What else? Go ahead.
There was you talked about over the weekend how you wanted to see the models and the paperwork, and I've heard you've asked very detailed questions about those things. Can you talk a little bit about how you take advice from people like Dr. Barbeau and Dr. Katz?
The same way I take advice from the police commissioner, the school's chancellor, every other leader of every agency. And if you think that a responsible elected official is supposed to just take whatever people say, period, and implement it without any discussion, without considering the impact on all the different pieces of the equation, guess what, my friend? If I ask 5 different agency heads what they want to do about the same situation, I will get 5 different answers. It doesn't mean there's anything wrong with that. Did Richard Carranza want to close schools? Of course not. Of course not. If he said, oh, geez, yeah, shut them down, no big deal, I would not think that's a very devoted educator. He hated it. I hated it. But we had to think about the health considerations first while balancing all the other pieces of the equation. And there were public safety elements. I I'm going to try to articulate how this works, but I'm also going to beseech you guys, you better start searching for truth. Not scandal, not headlines, not clicks. Truth. This is a crisis. Real decision makers have to factor in everything, because the ramifications of people's lives are that great. Unfortunately, on Sunday, I had to do something which is really going to take away the chance for kids to get educated as well as they might have. It's going to take away a chance for a lot of kids to get meals. We're going to try our damnedest to find an alternative. There are many, many other points. These things are not easy.
Circling back to the question from Friday about the potential of reopening health enrollment, I've spoken with a number of New Yorkers that are concerned, especially with the potential loss of jobs and the various factors that might go into healthcare in this crisis, COVID-19 or otherwise. Have you had that conversation with the governor about reopening the healthcare enrollment period?
I have not, amidst all the other things. It's a great question. I will guarantee you get an answer very quickly.
Hi,
And everyone, we're doing first round. For anyone who hasn't gone, we're going to go one round through, and then we'll see if we do any other, depending on how long that takes. Go ahead.
Senator Zelma Myrie today called to suspend the detainment of people on technical parole violations, to release elderly, sick, and those facing imminent release from prisons, to suspend arrests for low-level offenses, and basically things like that. Currently, there is video conferencing and video visitations.
All right, everybody, since this is a pre-recorded news conference from New York City with the Mayor Bill de Blasio, we're going to head on over to Detroit, Michigan now. They are having a live news conference, as well as Kentucky, a state coronavirus briefing. But again, we're heading on over to Detroit, Michigan next, right here on News Now.
Various business interruptions. But I want to say again, go on our website and fill out your poverty exemption form. An individual who makes less than $22,000 or a family of four making less than $32,000, go to the city website and sign up for the HP TAP exemption and the pays bill, because it will cut your tax payments next year. The sooner that you go fill it out, the lower your payment is going into next year. And so we had a lot of folks who were filling it out this year because they thought there was a foreclosure deadline coming up. The foreclosure deadline is gone, which is a good thing, but you still don't want to get that bill next year. And so those exemptions remain in place. One last thing that I hope the people of this city will do, as we are now sitting at home being socially distanced from our neighbors, but you got something in the mail, and it's your census form. And our future for the next decade is going to be determined by whether we fill this out. I filled mine out yesterday. It took less than 10 minutes to do. But if you think about what it means, Dr. Vitti and the Detroit Public Schools are continuing the school lunch program with their grab and go program during the period of time schools are out. That school lunch funding comes on a population basis based on the census. We've got folks in this town on Medicaid who have their health care to take care of them. That Medicaid money is allocated based on the census. Arthur Jemison just sent housing folks out to make sure every homeless person is being cared for during this crisis. Those homeless funds are allocated by the census for the welfare of our children and our most vulnerable for the next decade. Please take 10 minutes. It is really important. It's going to matter to the people who need it most for the next 10 years, and you're sitting in the house anyway. Take the time, do it online or mail it in, but it is census time, and the truth is, whatever cities fill out their census form in the highest percentage get most of the money. In 2010, Detroit had the lowest return rate in America. And we probably lost $300 million in the last decade. How much would that have meant to us? We can't afford for our children and our most vulnerable to lose that again this decade. And with that, I'd like to turn it over to the leader of our housing and revitalization team, what they have done in a very short period of time. They showed me the new beds that they've opened to make sure we have enough space to be able to separate those with symptoms from those that are not. It's been great work, so I'll turn this over to Arthur Jemison.
Thanks, Mayor. I can answer any questions you have, but I want to thank my director, Donald Rencher of HRD, his homelessness solutions team member, Tara Windsor. Tara Defoe's been working with us on some other projects, crucially, and of course, the health team member who's embedded with us, David Bowser, who are out there right now at the site at Cass community participating in the temperature checks. So we've got teams out there. We've been working for the last 3 or 4 days to identify additional shelter capacity that would allow us to create a situation where people, if they were exhibiting fever or other symptoms, would be able to be separated. And so now we've had a series of webinars with each of the shelter providers, and so again, teams are out there today and tomorrow trying to make sure that people, if they do need particular and new attention, that we can get that to them. If they need to be separated or isolated, that we have places they can go to where they can get medical attention as necessary. And we think that's an important part of making sure people who come to shelter, that shelter can be a real option for them, and people who have been in shelter can know that the people who need additional attention are able to get it. I can talk in more detail and answer questions about it, but it's been a 3 or 4 day effort. We've got, it's going to continue over this week, not just with the additional capacity, but trying to add even more capacity, so if we have more need, we have the ability to respond to it. But again, I'm happy to answer any questions you guys might have about our response in shelters today.
Mr. Jemison,
Before we do, let Denise speak, and then we'll take all the questions. Go ahead.
Okay, thank you. So our role at the Detroit Health Department is to protect the safety and well-being of all of our residents, particularly, most importantly, our most vulnerable, which is our homeless population. And I'm really pleased with the plan that the mayor had briefly indicated, as well as Arthur Jemison, and working closely with the health department. So these individuals will have a better opportunity to practice both the precautions that the mayor and I have been speaking about over the last several weeks. The center will have access to water, so individuals can wash their hands, resources to manage their symptoms, and better yet, get the care that they need. So as we continue to deal with COVID-19 and all of its implications, this is yet another intentional step that we can take to ensure that all residents are protected. We know nothing stops Detroit, so let's continue caring for each other by washing our hands, covering our coughs, avoiding large crowds, practicing social distancing, and of course, staying home when we are sick. Now, this advice may sound redundant, but it's the best defense that we have now. Again, thank you, Mayor Duggan and Arthur Jemison, for your leadership. Let's continue to work together as we slow the spread of COVID-19. And now we'll open it up for questions.
Arthur, Emil has something he wants to ask you.
Sure, evidently.
Mr. Jemison, do you know how many homeless there are in Detroit, and how many are in shelters, and how many may still be on the streets for whatever reason?
Sure. We estimate that there's approximately 2,200 people. That's on the basis of the pit count trajectory over the last 5 years. We estimate that there's probably about 1,000 people in shelter today, maybe 1,200, and so that's the basis we've been working from in our estimates.
And what measures can be taken to reach the other 1,000 who may not be in a shelter because there's no room, or because they just don't want to do it?
So what we've been doing is, and sort of part of the approach we rolled out today means that at every one of the touch points, not just the shelters, but also street teams, there's a street outreach portion of the work that cities contractors do, where they go to places that homeless individuals congregate. And so what we're trying to do now is go to shelters, because that's the first place and people were in the closest contact and not outdoors. We're hoping to later this week expand so that we're able to have street teams and other points of entry go out and engage with people in the places they're located. So I think later this week we would expect that that part to launch. But we wanted to start with people who were in shelter today, because again they're in close quarters often, and we wanted to make sure that we started there. I mean, again, this is we're learning this along with lots of other major cities around the country about how to do this. And the first step we thought was, let's go into shelters, get some diagnostic information, and if necessary, isolate some individuals so they can get more attention.
Mayor, we saw out in California they have a shelter in place for a number of areas up in the Northern California region. Is there, under any circumstances, that could lead to something of that nature happening in Southeast Michigan or in Detroit, like a mandatory shelter in place type scenario?
Sorry, with respect to homeless individuals or with respect to?
In general, for the mayor in general.
Okay, I guess I could speak a little bit to homeless individuals, and then obviously so I think what we have to get a better understanding of what's going on, and I think we want to let data drive our response. If we find out that there's very few or almost no people with fevers in any of our shelters, that might require one response. If we identify one place that has a few people, that might require a different one. I don't want to presuppose what the answer would be. I think we got to go on the basis of evidence that we get, but we're now in the evidence gathering process, at least as it pertains to homelessness.
Yeah. So we'll see. We're about 4 or 5 weeks behind California, and we're evaluating that. But the other point I make is there is a shelter bed today for everybody who wants one. So we have people who choose for a number of reasons not to use them, but those resources are there, and if you know somebody, there is a bed open tonight for everybody. Any other questions? Good.
More on the shelters. If you were to identify somebody in the shelter, you're already concerned about beds. Mm-hmm. What kind of things can you do to mitigate the spread inside of the shelter? And then what happens to that person or persons if they've been identified? Okay.
So if we were to find someone tonight who has a fever, we've got a place that we can take them where there's currently has medical staff where they can be isolated and separated from other people who might have been in that shelter tonight. That's number one. Number two, we're going to be there's going to be a fever check for everybody in that shelter that person might have been. And there's going to be personal protection equipment for people who are at that shelter, so they might be able to, for example, the most important thing to do is to say, hey, if there's a new person who hasn't been in the shelter, wasn't there earlier, we can make sure that they don't have a fever now. And of course, I want to just repeat the things that everybody up here says all the time. We've spent the first webinar going through every detail of a health protocol related to hand washing, wiping down surfaces, all the things you've heard the mayor and Director Fair talk about every day. They've been doing those things for at least a week on the basis of health notices that we've been sending them. So we expect them to continue to do that now with additional PPE and with the benefit of having the sort of testing and the capacity to isolate, which they didn't have before.
All right.
Before you go, can we get the correct spelling of both of your names and your titles, please, for people back in the station?
Arthur Jemison, Jemison.
All right, everybody, sounds like they're wrapping things up there in Detroit, Michigan. We're going to head on over to Iowa now. Let me confirm exactly where this is before I take you there. Live here on News Now and coronavirusnow.com. It appears that this is Governor Kim Reynolds holding a newser in Johnston, Iowa. We're going to listen in live.
We do. Do we offer that plan? Yeah, we do have plans. There are some plans throughout public health preparedness that are actually considered confidential, and I believe this falls under that.
Governor, can you talk about testing? We're hearing from some Iowans that it's taking them a while to get their results if they have COVID-19 or not. Kind of what's the process? How long does it take?
Yeah, I don't know if I don't know about the number of tests today, so maybe Dr. Badati or Sarah can address that. But within 24 hours, the tests that are going into the state hygienic lab, we're able to provide those results. Well, I should just let you, I don't want to miss, within 24 hours. And as I said in my remarks, we're adding a second shift so that we can almost double the capacity that we'll have to test. And if the need arises, we'll be able to add even more. So the turnaround time is relatively quickly there. Once we go to some of the national lab availability, that's taking a little bit longer to get the results back, but today on the conference call with the Vice President and the President, they did address that, and as we're expanding the number of kits and the capacity to do the testing, they also are reducing the time that it takes to get them back. They mentioned 48 hours. I don't think they're there yet, but that's a goal, and they want it to be reduced to even a quicker turnaround time than that, and so I know that's the goal, and every day I think they're having their capacity is growing, and we're making great strides from that perspective too. We know it's really important because the sooner we can get the results back, then we need to take the precautionary steps. Is there anything that they need to be doing in the interim when we're testing? If you're sick and been tested, self-isolate and stay home. I mean, I feel like a broken record, but again, I mean, they need to, if you have any of the symptoms, you call the doctor, you go through the assessment. He makes the determination if you should get a test or not, or come in. If it's determined that you do need to test, then you would need to stay home until we find out what the results are, and then they'll start the additional assessments that they do from that.
Are you planning drive-through testing in New Jersey?
We are. That's a priority of mine. We're working on it. There are 10 states that are doing that right now, so we are hoping that we will be able to stand that up. What I learned on the call today, though, is a lot of the drive-through tests are really focused on public health officials, first responders, EMS, our essential services that we need to make sure that we have the workforce in order to take care of Iowans, and then Iowans 65 and older. So there are some parameters in the way that they're standing up the drive-through, but I still think this is something I'm hoping that we're able to move on. And it was, I know, a topic of conversation at the healthcare meeting too. So everybody's looking at it, and hopefully we'll be moving to a couple of those drive-through test opportunities
The state
soon.
auditor has already ordered his employees to work from home starting at least by tomorrow. Are you close to doing a statewide policy?
Every one of the agencies have already implemented that. They're way ahead of that. They're already, Dr. Garcia, would you like to kind of give an update on what you've done? And this is reflective of what we're seeing in some of the other agencies as well.
Certainly. So we thought, being the Health and Human Services Agency, that we should probably set a good example here. We went from being an agency without a telecommuting policy to standing one up. Today, we deployed 500 employees to a work-from-home status, focusing on Dallas County and the surrounding Polk counties. Areas, offices, and by the end of the week, we should be up to 2,500 of our employees. Obviously, we do have some individuals who are in direct care roles who don't have an option to telecommute.
And thank you, Director Garcia. And that's reflective of what we're seeing across our state agencies. So they've already implemented those practices, and we'll continue again, like we do throughout the day, continue to reassess how we're delivering services and meeting the expectations of Iowans.
Daycare providers are about to be inundated, and I've also heard that some daycares are actually trying to close down temporarily. What should people be doing? What should these providers be doing to keep their facilities safe? And what advice do you have for parents out there as they are struggling to find care for their children?
Well, I want to talk again about the collaboration between agencies and why it's so important, and why we are kind of co-locating here at the CEOC so that we can have coordinated conversations in regards to issues just like that. And I want to thank the Iowa Department of Public Health, the Department of Education, and the Department of Human Services. I don't care which one of you want to take that. Maybe Kelly, do you want to step up again? And they'll walk through some of the steps that they've already taken in regards to your question.
So I think we have two categories of children here. Children who are not school age and already in care, where their providers may be making the decision to close. We did send out guidance over the weekend in partnership with Department of Education around how best to make that decision. And then we have children who are school age but are affected by school closures, and their before school and after care might have also closed around the school closure as well. And we're working on both issues. So it's important to us because there are risks and benefits to every decision in this time, but the need for childcare during this time doesn't go away. And so we're working with individual providers, we're working with superintendents to stand up alternative sites, particularly, as the governor mentioned, for employees of hospitals, first responders, other essential workers during this time who really can't afford to be away from work. And our goal around that is to really ensure that providers are still able to operate safe childcare settings. Sending children to grandma and grandpa is not a good idea at the moment. And so we'd like to really make sure that we continue to lay eyes on children and really, I mean, again, a broken record, but having parents and providers in childcare settings really hold true to not sending a child if they are ill, and doing scans at the doorway when children are dropped off, really making sure that, of course, hand washing and pristine hygiene at the centers is at the core of their mission. We do that during cold and flu season. We're ramping up our technical assistance on the regulatory side to make sure that childcare providers are staying true to that model. We've also asked the Department of Corrections to help us in our supply of hand sanitizer and cleaning products, and that will be key in this effort. So I think there's a question there about health safety, which Dr. Padati and I have been having extensive conversations around. And then there's a broader impact around economic and child welfare issues. So if children, again, the need for care does not go away, it just gets pushed to a different place. And I know that we've seen, I myself don't have a Facebook account, but we've seen that some individuals are standing up alternative child care sites on Facebook. Again, parents still have a need for care. So it would be our preference, strong preference, that in this time we step in and provide that space, that we social distance as much as possible in those settings, that we provide technical assistance around good hygiene practices, that we hold true to not admitting children who are ill, and we ask parents to keep children home if they have the ability to do that.
The mayor of Miami is testing positive for COVID-19 but has shown absolutely no symptoms. This is perhaps a question for Dr. Padati. So how are we, if we're looking at symptoms and staying home for symptoms, I mean, how can we say that people aren't spreading this disease just like he might have been if he wasn't in quarantine?
Yeah, again, a great question, and overall, I would say it's an example of a place where we do continue to learn more about this illness. I would also say that it's always really important still to think about the person, about the patient and their symptoms and how they feel. You know, tests are great. Sometimes we get false positive tests. Sometimes we get false negative tests. It's really important to think about the person. And I can tell you I was on the phone with CDC as recently as an hour ago, who's reiterated the same thing, that we're going to continue to learn more. We're going to continue to investigate these things. But we really think people are spreading when they're contagious. So again, you know, taking those cues of if you don't feel well, and this I know is hard, but if you don't feel well, even with a mild illness, right? So if it's just a cold for me, it could make somebody else in one of those more vulnerable populations really, really sick. So even if I don't feel super sick, it's important that I sort of isolate myself and stay away from others and keep an eye on how I'm feeling, regardless of whether it's COVID-19 or flu or anything else.
This is that, you know, and I understand that people who are at home and who are watching TV, who are reading newspapers, who are scared, you know, what do you say to their fears that what example that is?
Yeah, again, I think that's exactly why it's important to remember there's a couple of really good things you can do, and I know they sound simple, but if we think about what we know about viruses like this and this virus, it's somebody who's sick for the most part, who's coughing, right, or sneezing, or droplets are going on to somebody within close contact. And so the more we can do to keep those people away from others and, you know, not allow those opportunities for transmission, the better. And again, the data that we've seen so far is supporting that, you know, this is how we see people, you know, getting sick with this. And I also think, again, going back to the idea that for most people, for about 80% of people, we do think this is a mild illness. And again, I know this is hard, and I know, sometimes we'll say things like, well, it's just a cold, I still feel well enough to go to work. But what we're saying is, even if you feel mildly ill, even if it's, a sore throat or, a mild fever or a cough, we want you to stay away from other people, stay home, stay isolated, and pay attention to those signs of how you feel, regardless of what's making you sick.
We see over the weekend that people, despite, raising alarm about not gathering in large spaces, people are going to bars and doing all these things. Tomorrow's St. Patrick's Day. Iowa doesn't have a ban on bars and those sorts of settings. What's your message to Iowans about, it's okay, I can go because I'm young?
Nope, I would say just the opposite. It's the same message I've given throughout this press conference. If you're not feeling well, stay home. If you have a cold, a cough, a fever, any respiratory, anything that Dr. Badati just walked through, you should not be in public. You should stay home. Practice social distancing, so don't cram yourself into some of those venues. You have a role to play in helping us mitigate the spread and to bend the curve. We all have a role to play in this, and one of the biggest things that we can do is to practice those simple guidelines. There'll be another St. Patty's Day next year. So just if you're sick, stay home, practice social distancing, wash your hands, cough in your sleeve. If you're not feeling well, call the doctor. They'll go through the assessment. They'll route you and give you the proper recommendations that you need to move forward. And that's, if we all do that, this isn't going to end tomorrow, and we're going to continue to see the numbers rise for a while. But it really will help us bend the curve. It will help us prevent the healthcare system from completely being overburdened and taxed, and it will allow us to serve the most vulnerable Iowans who needs our healthcare professionals serving them. So especially if you're 80 or older and you have underlying conditions, the statistics are scary, and so we need to keep that into consideration. I want to have, and then we'll take questions, but I want to be sure too, because this is another question that we can continue to get, and it's about unemployment and what we've done at the state today, I believe, and I have Director Townsend with me who can give you an update on what they've been able to do from the state perspective in coordination, I think, with the federal government as well. And then I do have Director Dunn is with us today, and I want to thank her. When we talk about telecommuting from home and being able to stand up in the manner in which we've been able to do, she's played a vital role in making that happen, and I really appreciate her really helping us implement a work-from-home strategies in a really relatively short period of time. So with that, I'd like Director Townsend to address unemployment.
Yeah. Thank you, Governor Reynolds. Part of alleviating the fear and concerns that we see in our communities with regard to staying home from work were alleviated this morning when the governor announced the initiatives that we have undertaken at Workforce Development to ease the process for filing unemployment claims, to broaden the eligibility group, and to also have a corresponding break for employers who will not be charged for those unemployment claims for individuals that have to take work off because of
3 p.m. here in Phoenix, Arizona, 6 p.m. Eastern. Pilar Arias here, your News Now host, also on coronavirusnow.com with your top of the hour coronavirus update. We're going to head to the Johns Hopkins University map. They are doing their best to stay on top of all cases globally. As you can see here, 181,305 confirmed cases of the coronavirus. China, Italy hit hard, Spain as well. And coronavirus cases continue to grow here in the U.S. So far, worldwide, more than 7,000 people have died from the coronavirus. I want to show you our U.S. situation. You can click here by all the different countries. They even go in order of the cases. So far, we're at China, Italy, Iran, Spain, South Korea, Germany, France, and then the U.S. The U.S. has 4,392 confirmed cases of the coronavirus, 75 deaths. That death toll, unfortunately, has just kept climbing today. We're staying on top of all things coronavirus related for you right here on Fox News Now. We're going to return to Iowa, but I do want to let you know that we are on standby for an update right here in Maricopa County, Arizona, the Phoenix area, with our very own Governor Doug Ducey, that's State Lab. So again, we are waiting for a coronavirus update right here in Arizona, and I'll bring it to you as soon as it begins right here on News Now, also on coronavirusnow.com.
It was community spread. We're still assessing. Yeah, we're still assessing that.
We can follow up afterwards.
Thanks, guys.
Thank
Really
you.
appreciate it.
Thank you.
Somehow you can read the paper. They locked.
Good afternoon. I want to thank everyone for being here today. We want to give you the latest update on where we are with COVID-19. Just a couple of hours ago, new guidelines were announced by the White House and federal health officials. I will be working with Dr. Kara Christ and the Arizona Department of Health Services to ensure Arizona complies and updates our guidance to reflect these new recommendations. We will be working with county health officials, community leaders, and the private sector to implement these guidelines and to spread the word. We've already updated our guidance based on the CDC recommendation that large events and mass gatherings be canceled. Many already have, and the private sector and community organizations continue to be responsible partners in this effort. On these decisions, we aren't guessing. My decisions are being guided by data, facts, and science in consultation with subject matter experts. When the CDC makes new recommendations, Arizona will apply its guidance. Yesterday, in coordination with Superintendent of Public Instruction, Kathy Hoffman, we announced a 2-week school closure to address staffing shortages and prioritize Arizona children. Superintendent Hoffman is here today. I'm grateful for her partnership and her leadership. We worked together through the weekend, and she's been an incredible advocate for Arizona schools, teachers, and students. Arizona is lucky to have her steady leadership during this crisis. As we made clear yesterday, it's important for families and parents to know that while this will address operational issues, closing schools will not stop the spread of COVID-19. The safest place for children at this time is at home. They should not be cared for by elderly adults or those with underlying health conditions. For those who can't stay home, we're grateful for the partnership of so many nonprofits and other community members and the faith-based organizations who are stepping up to assist during this difficult time for these families in need. We have formed partnerships with the Boys and Girls Club, the YMCA, and more to come. I'm going to hand it over to Superintendent Hoffman to talk more about her efforts with our schools and education community. Superintendent Hoffman.
Thank you, Governor Duthie. I also appreciate your partnership and your leadership. Good afternoon. Today I'd like to provide an update to families and educators across the state regarding statewide school closures for all public and private preschool through 12th grade schools. I want to first recognize that these are unprecedented circumstances and that they place a heavy burden on every Arizonan. Our state leaders are committed to supporting our kids, families, and school communities through this difficult time. Together, we will get through this. I want to highlight a few resources educators and schools can find on our website that will be continually updated as information is changing. The first, a top concern of mine, is guidance related to school meals. The Arizona Department of Education's Health and Nutrition Services team is working with district and charter leaders on steps they can take to ensure schools who qualify offer food in a similar manner as the summer food service programs. While our department works to provide a comprehensive list of schools offering meal service for all children under 18 years of age, please contact your local school officials to inquire about programs offered in your area. I know that many educators, parents, and students are wondering about statewide testing and the potential for makeup days in the summer. While we continue to take this one day at a time, we have been working with assessment vendors to extend the testing window as needed. We are also in communication with our federal partners in the event we need to secure a waiver for statewide testing. In the coming days and weeks, we will provide additional guidance to schools around testing, instructional time, and other critical matters. I also want to speak directly to educators and school staff. Each one of you has stepped up to serve Arizona's children, and for that, you will forever have my gratitude. Now more than ever, Arizona's children and families need you. Today, we are calling on school leaders to provide safe and responsible ways for teachers and other school staff to continue serving our students in creative ways. I urge schools to be as flexible as possible during this time, and I want to assure you that the Arizona Department of Education has no interest in being punitive in any way towards schools, teachers, or students. I know that many logistical questions remain to be answered. Please know that my team, alongside Governor Ducey and Dr. Christ, are committed to keeping you as up-to-date as possible. Please visit our website at azed.gov for a running list of resources for families and guidance for school leaders. Finally, I'd like to take this opportunity to remind all of us that in these difficult times, Arizona students are looking for comfort, guidance, and reassurance that everything's going to be okay. I encourage every adult to approach this scary situation with kindness and compassion towards others. It's our job to set an example of patience and goodwill. Arizona has proven to be a strong, resilient community, and together we will meet the needs of our families and our children. Thank you.
Thank you, Superintendent Hoffman. Next, we are working with our Secretary of State, Katie Hobbs, and county election officials to adjust for the presidential preference election. I'm grateful to have Secretary Hobbs here, and her partnership and leadership have been very important in ensuring that democracy goes on. Through DEMA and ADOT, we've made sure that election officials have the equipment and support they need for the polling places to function tomorrow. Our election leaders have been working overtime to ensure that voting is safe. Let's hear more from Secretary Hobbs on her work to prepare for tomorrow. Secretary Hobbs.
Thank you, Governor Ducey, and thank you also for your partnership, Dr. Christ. We understand the apprehension that voters have right now. My office has been in consultation with election officials across the state, health experts, and leaders from the Democratic Party who agree that the election should move forward tomorrow. This decision was not made lightly, and what it all comes down to is that we have no guarantee that there will be a safer time to hold this election in the near future, and elections do not end on Election Day. There are thousands of workers in communities across the state that must continue the job of counting the ballots in the days following the election. The longer we wait, the more difficult and dangerous this will become. My message to voters is stay informed and make a decision that is right for you. Some counties are offering emergency voting today, curbside voting at Election Day voting locations, and ballot drop-off locations, including drive-up drop boxes. Contact your county election officials to learn more about options available in your county. Our office is constantly monitoring the situation and will quickly communicate to the public any new developments. Since some voting sites in the state have been relocated or consolidated, all in-person voters and those dropping off early ballots should verify voting site information with their county election officials. Contact information for those trusted sources and additional information is available at arizona.vote. Arizona.vote is also where voters can find the most current updates related to recommendations and guidelines. As a reminder, only the Democratic Party is participating in this presidential preference election, so only registered Democrats who are registered by the deadline of February 18, 2020 are going to be able to participate. Our democracy has risen to challenges in the past, and it must continue to do so.
Thank you very much, Secretary Hobbs. Now to the work of our health professionals. As of 9 a.m. this morning, Arizona has 18 confirmed COVID-19 cases. Our health professionals, led by Dr. Kara Christ, have been working around the clock to address the disease and provide additional testing. Today, both Banner Health and Sonora Quest opened their first patient-friendly testing site to increase the speed and availability of testing, with more on the way. More partners like LabCorp, TGen, and Mayo Clinic are also conducting testing for patients in Arizona. I met with all of these labs earlier today for a full briefing on their work. We're grateful that the private sector is stepping up during a time of need and providing additional options for testing for Arizonans. Our team will continue to explore ways that additional testing options are made available across the state. At this time, I'm going to let Dr. Kara Christ share some more on this topic. Dr. Christ.
Thank you, Governor Ducey, for your leadership and making the health and safety of our communities the top priority of your administration. I'm grateful for the partnership we have in working with DEMA Deputy Director Wendy Smith-Reeve and community stakeholders, including Superintendent Kathy Hoffman, Secretary of State Katie Hobbs, and private sector lab partners. My team has been working nonstop in response to COVID-19 to ensure we keep our communities and families safe. We are constantly monitoring local, national, and global activities so that we can make data-driven decisions that protect our communities while having as minimal of an impact on Arizonans' daily lives as possible. So I want to provide the latest information about the spread of COVID-19 in Arizona. To date, we have 18 cases. There are 8 cases in Maricopa County, 5 cases in Pinal County, 1 case in Graham County, and 4 cases in Pima County. We have community spread of COVID-19 in Arizona, and we are expecting more cases. There is a heightened level of risk of COVID-19 now that we have community spread. Our goal is to mitigate the spread of the disease and lessen the impact on people at the highest risk for serious complications. People at highest risk for COVID-19 are older adults and people with serious medical conditions like heart disease, diabetes, or lung disease. My team has been working tirelessly to ensure Arizona complies with the new guidance provided by federal officials earlier today. Federal officials are now advising the following, and we're working to review any updated guidance from the Centers for Disease Control and Prevention. If someone in your household has tested positive for COVID-19, keep the entire household at home. Do not go to work, do not go to school, and contact your medical provider. Employers should develop protocols to work from home when possible. For those workers in our healthcare industry and pharmaceutical and food supply, your continued service is very important. We need this community to maintain their normal work schedule and follow CDC guidance to protect your health while you are at work. Everyone should avoid social gatherings in groups of more than 10 people. That includes avoiding eating or drinking at bars and restaurants, using drive-through or pickup options instead. And they recommended avoiding discretionary travel, shopping trips, and social visits. We are currently reviewing this as this comes down, and we'll develop Arizona guidance to go with that. We encourage people, particularly high-risk individuals, to have supplies on hand, such as extra prescription medications, over-the-counter medications, and other household items and groceries. Take everyday precautions, such as avoiding people who are sick, washing your hands often, and cleaning and disinfecting those high-touch areas in your house, like doorknobs, light switches, toilets, faucets, and phones. Stay away from crowds, and have a plan if you get sick to call your healthcare provider and identify who else can care for you if your caregiver gets ill. There are a lot of questions about getting tested for COVID-19, and I want to provide you with the latest information about testing in Arizona. There are now several private laboratories that can test for COVID-19. These labs include LabCorp, Quest or Sonora Quest, Arup, Mayo Clinic, and TGen. I want to thank each of these labs for working to get private testing implemented so we can test more people in Arizona. People should work with their healthcare provider if they are symptomatic, and all tests must be ordered by a healthcare provider. Please call ahead before going to see your provider so that they can give you instructions on how to keep other patients safe. In collaboration with Banner, we are planning to open collection sites. We appreciate Banner leaning forward to provide this valuable service to Arizonans. More sites and more information will be available this week, and we will notify the public of the locations of those sites and where those services are available. We know that other healthcare and laboratory partners are in the beginning stages of implementing screening locations. We're working with other sites to continue standing up additional alternate screening locations throughout the state. In order to provide support for this, I have issued a standing order that will allow symptomatic Arizonans to receive screening at these sites. And the Arizona State Public Health Laboratory will also continue to test those high priority samples that are sent from our county public health partners. As of today, the Arizona State Public Health Lab has tested 200 people. The lab has ruled out 125 people, and there are 63 samples pending. You may notice that the data on our website has recently been updated related to this. While positive cases across all labs will be reported on our website, more detailed information about the number of people tested, pending, and ruled out is only available at this time from our state public health lab. Of the 18 cases we have in Arizona, 12 have been confirmed by the state public health lab, and 6 have been confirmed by private labs. This information is updated on our website every morning at 9 a.m. To stop the spread of COVID-19 and protect our most vulnerable community members, we ask everyone to routinely implement infection prevention practices. And I know you've heard this from me before, but it bears repeating. The best way to prevent the spread of respiratory viruses are to do the following. Wash your hands often with soap and water for at least 20 seconds. If soap and water are not available, use an alcohol-based hand sanitizer. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick. Stay home when you are sick. Cover your cough or sneeze with a tissue, then immediately throw that tissue in the trash. Clean and disinfect frequently touched objects and surfaces. If you need to see a healthcare provider, it's a good option to consider telemedicine. In closing, I urge everyone to find reputable sources for information about COVID-19. We have a dedicated website that is updated daily, and you can find the most up-to-date information about the disease at azhealth.gov. The CDC also provides current updates about the latest information, and we are partnering with the Arizona Poison Control System to offer a COVID-19 hotline for the public and for medical providers who have questions. This hotline can be contacted at 1-844-542-8201. We will continue to provide the public with the most up-to-date information and advice on how to keep yourself and your loved ones safe. But now I'd like to introduce Chief Clinical Officer, Dr. Marjorie Bessel from Banner Health.
Thank you. As the largest employer in the state of Arizona, Banner Health is positioned to help all of those that reside in Arizona to get through this event in the best and healthiest way possible. There are a number of things that all of you can do to assist all of this, in addition to the tips that you heard from Dr. Christ. At Banner Health, we are partnering very closely with Dr. Christ and her entire team. We've been working with public health since the beginning of this event to make sure that we are providing timely and evidence-based guidelines for the care of those that reside in our state. We follow CDC guidelines throughout every event, and in this event, that is no exception to our usual and customary processes. Like you heard from Dr. Christ, we continue to regularly look at the CDC site and update our processes to remain within guidelines that are best positioned for us to take the best care of those that reside in the state of Arizona. We are happy to partner with both the state as well as other federal resources to provide testing to the state of Arizona. As you heard from Dr. Christ, we will be having more information about that and make that publicly available later this week when we're ready to do so. In the meantime, there are some things that you can do out in the community that can absolutely assist us as the largest healthcare provider in the state be positioned to be able to continue to care for those that reside in our state. As you heard from Dr. Christ, please follow social distancing and other great hygiene around hand hygiene and respiratory etiquette to keep yourself as safe as possible. We have already implored for those that work for us to not come to work ill. It is incredibly important at this time to not go to the workplace if you are feeling ill. We have daily reminders and electronic checking mechanisms for our employees to make sure that they are not coming to work ill nor staying in the workplace ill. This will help us at Banner Health continue to keep our healthcare workers healthy so they can be here to serve you. In addition to that, for those that feel that they might have symptoms and feel like they might need medical care, we ask for you to call ahead of time. If you have a primary care physician, please call ahead of time. If you have access to other points of care, please call ahead of time. Work with your healthcare provider to determine whether or not you need to come on site for assessment and then possible testing. If you must come to the site for assessment or possible testing, we ask you to mask yourself immediately upon arrival. Masking yourself if you are a symptomatic individual who might ultimately then turn out to be positive for COVID-19 will help prevent the spread of the disease to our healthcare workers. Our healthcare workers' safety is of primary importance so that they can maintain being at work and able to take care of those of you who might need their care. If you mask yourself immediately upon arrival, the spread of disease to our healthcare workers will be minimized. At all of our entrance sites, there is signage to remind you to put a mask on if you are symptomatic, as well as masks available for you to put on. In addition to that, I would like to close by saying that our partnership with the Department of Health Services, those in the state and those at the federal level, is of very significance to the Banner Health system. We look forward to continuing to follow the CDC guidelines, update them frequently, put our processes into place to be in compliance with those guidelines. If you have additional questions, you can go to our bannerhealth.com website, which will help guide you to find information about the symptoms, possible treatment options, and ultimately collection sites that we will be announcing later this week. Thank you.
I'm Dr. Jeffrey Trent. I'm the President and Research Director of TGen, and I want to thank Governor Ducey, the leadership of Dr. Christ for their effort and all of us at Arizona getting access to testing for the coronavirus. I'm joined in the room today by Dr. David Ingenthaler, the former state epidemiologist, the head of TGen North, which is our division in Flagstaff that is set up in 6 weeks for FDA approval and CLIA testing our specific test around COVID-19. That gets joined to all of the other partnering testing groups mentioned today. We've been fortunate with our partner, the Arizona Department of Health Services, to participate as well beginning last week in some population screening, something that we believe is critical as well going forward. That has been joined by funding from nonprofits, Flynn Foundation, Piper, the NARBA Institute as well. Last week and this week we've been testing at the level of about 200 capacity per day. Next week by the end of next week, that'll change to about 1,000 a day. And again, those are in line with the other groups that are working on this today. This is, of course, as needed and in direct support of the state's response. I want to thank again the governor for his leadership, and thank you very much.
Thank you, doctors, and thank you to Banner and TGen as well for being here. As you can see, we're working on several fronts to address the impact of COVID-19 on Arizona. And this situation is constantly evolving, as we've seen just this afternoon. We're focused on this 24/7. We've got a great team. here at DHS and with all of our partners. I hope you can also see that this is bipartisan. It's actually nonpartisan. We're relying on the medical experts, both here in Arizona, at the CDC, and at the NIH. We're going to continue to be guided by the facts. We're going to be transparent, we're going to be timely, and we're going to act with urgency. What we've seen is that Arizonans have acted responsibly through this, and they continue to act responsibly. Now, tomorrow is St. Patrick's Day. If you're thinking of going out to a crowded bar to celebrate, our advice is don't. Social distancing or personal distancing is one of the greatest measures you can take to stay safe, and that's hard to do in a crowded bar. We appreciate the work being done by the Arizona media to get the facts out and the latest information to the public. It's really important, and we couldn't do it without your work and professionalism. We also need people to donate blood. Our food banks need your help. I encourage Arizonans to contact the Red Cross and their local food banks to help on these fronts. And I especially want to thank those who are holding our communities and state together right now. Community leaders, nonprofits, our faith-based community, law enforcement officials, doctors, nurses, and our grocery store workers who have been working around the clock to meet demand. And finally, I want to reassure Arizonans, we will get through this, and we're going to get through this together. There's a lot of work to do, and as you can see today, we have people from across the state dedicated to getting this done together in a partnership. It's going to take all of us. With that, we'll open it up for some questions.
Let's start over here, Dennis. Yeah, you're talking about the elections moving forward, and you're urging people not to go out on St. Patty's Day. Yet, thousands of people could be going out to the polls tomorrow. Why not spend this and extend this like your home state of Ohio has chosen? How can that be safe? And you worry that these disenfranchised voters who are scared to come out and vote tomorrow?
Well, first I want to say we are putting out guidance on best practices. This practice of social distancing or personal distancing is important. And I'm going to turn it over to the Secretary, but I think she said it well, that we have no guarantee that there will be a time in the future when it will be safer than tomorrow, and that democracy must go on.
Thank you. And I think it's important to keep in mind about the social distancing guidelines that they apply to social situations. And our intent at polling places tomorrow is to get people in and out. There's one thing on the ballot and one thing only. And the polling place workers, we've been working across the state to make sure that they have what they need to implement the guidelines, and that they are going to work with if there's people in line, to social distance and make sure that those things are being maintained.
So we have been providing guidance and talking about having hand sanitizer or hand washing stations at the polling places so people can take that personal protective step. We've also talked about trying to social distance people while they were in line to make sure that there's more space in between them. They are offering other ballot options for drop-off so that people don't have to go in, and then just making sure that they are wiping down and disinfecting the areas at a certain cadence. So we have been providing technical guidance on that.
Yeah, my question for Dr. Chris. You mentioned the screening locations. If he goes to a screening location and they do prefer to get tested, and does the health department now have the test to kind of meet that if that demand does jump?
So these test collection sites are actually going to be done with our partners. So for instance, the one that we're partnering with Banner Health on, that would go through Sonora Quest Laboratories. Because we are trying to keep the capacity in the commercial laboratories. So it's going to depend on each individual entity and how they're running their their alternate testing site. Some will be for their specific patients if you're dealing with a specific healthcare provider. Others are going to open it up, and then that's when they'll be able to show up, look at a consent form that they will attest to the fact that they have symptoms, that they will isolate themselves until they get their diagnosis, and then they will be tested under my standing order.
Dr. Chris, this will probably go to you. Why is Arizona still using such strict guidelines for the state labs to test? We know Colorado has tested 758, New Mexico 583. Why does Arizona still have such strict guidelines?
So we are sticking with those 3 tiers of testing at the Arizona State Lab. We are looking potentially at expanding them, but since we've got such support from our commercial laboratories, we believe that that will be able to pick that up.
But the laboratories, most of them, it has like a 5-day turnaround. State labs can get them out quicker.
It just depends. They've got the same turnaround that we do, but they have shipping and handling. So it depends on when our state lab gets our specimen to determine whether it's a same day, next day, or the day after turnaround.
And last question, the CDC updated their guidelines a week ago for state labs. So when will Arizona update theirs to the CDC recommendation?
So we are working with our partners on that. It depends on the availability of the testing reagents and us, because we are that high risk population. That's what we are testing. So we want to make sure we've got the capacity to test those while our commercial labs are testing the population.
JJ, question for Dr. Chris. DHS website does not have coronavirus information in Spanish. Why is that, and what are you guys doing to communicate with people who speak to them?
We are working on trying to get it translated to Spanish. This has been a rapidly evolving situation, and so things update almost daily. We are working on getting a lot of our hard materials translated into Spanish, and working on getting Spanish in our social media, and then working on getting that webpage.
Are you worried that delay will lead to greater spreading?
It's just, there's a lot to keep up with, and so we are translating as quickly as we can.
Okay, and then you talked all about, and we're going to get it out too, we talked about hospital bed capacity as cases ramp up. How much flex is there in capacity with
Yeah, absolutely. So there are, we are working with our healthcare partners to expand potential bed availability and looking at the ICU capacity around the state. With the declaration, the National Emergency Declaration issued by President Trump, that opens up certain authorities in addition to the public health declaration of emergency that Governor Ducey, that allows us to waive specific licensing rules so that we can increase capacity and ensure that we can get patients into alternate sites as needed.
As we have learned from other countries and other states, one of the most scarce resources that can emerge out of this type of event is our staffing. So protecting and keeping our healthcare workers safe is of primary importance. I want to reiterate my comments that I made earlier, because all of you that are out there can help us keep our healthcare workers safe, both at Banner Health as well as the other healthcare organizations within the state. If you feel that you are sick and you might need to be evaluated and therefore tested, we ask that you please call ahead of time. That way we can help triage you appropriately, and perhaps you don't need to come on site for ongoing care or direction of care. If you do come on site, please immediately mask yourself if you're symptomatic, so that we reduce the risk of spread to our healthcare workers. By taking those steps, we can absolutely keep our healthcare workers safer and more available to take care of those who are going to need us as the COVID-19 situation continues to emerge. Thank you.
You had a question real quick, Dr. Chris. What guidance do you have for gyms? Should they be closing down at this point? There's some sort of sanitation procedures they could follow.
So we are encouraging right now that gatherings over 50 be limited. With a gym, it is possible to social distance, so that would be on the individual to take a look at what are their current health risks and what are their risks for serious complication. But then also, if the gym that they go to, can they social distance? Is there things to wipe the bars down? Can you stay away from potentially other sick individuals? And again, we're reviewing that new CDC guidance to see how that will impact businesses like gyms and restaurants.
These test collection sites, are people going to need a doctor's order to go to them? And is it ever going to be practical to test everybody in Arizona?
So for symptomatic patients, they won't need to have specifically an order from their own physician because we've issued a statewide standing order. So if, for example, the testing collection sites that Banner will be standing up, they are using my standing order, so I am the ordering physician. So they'll Yes, that's a wider. If you're coughing, fever, shortness of breath, you could, yes, you could use yourself. Yes. Yes, so this will expand the availability to more Arizonans.
Mark, you have a question?
Yeah, this is Dr. Chris for you, and I do have one for the superintendent. Dr. Chris, has there been any consideration, if you get slammed with patients, to reopen any of the St. Luke's hospitals here in the valley, the one in Century, the one in Phoenix that have been closed recently, to supply the bed space? I don't know if it's still equipped or what, but has there been any thought to that?
So yes, I believe our local public health partners are working with to identify if St. Luke's would be a good site for an alternate care setting. As well, we've had other physicians who have identified a potential location where alternate sites could be posted to. So we are looking at that around the state.
And Superintendent, today the President mentioned that the social distancing scenario that we now find ourselves in could last through August. So are you now considering the possibility that the school year might not end until technically the start of the next school year? And what does that mean for you?
Well, as the governor mentioned, the situation is constantly evolving minute to minute, hour to hour, as you all know. And so the way we're planning is we just had a stakeholder meeting with education leaders, and we said, what do we need to address today? What are the most urgent, pressing matters for schools today? What does that look like if we're closed for 2 weeks? And what does that look like if we're closed for the rest of the school year? So we are thinking about it in the most immediate, short-term, and long-term way.
No solution.
Well, depends on which issue. So for example, for meals, we already have solutions rolling out because meals were a very high concern. One issue that's another high concern is teacher pay or staff pay for our hourly workers. That's an issue that we're partnering with the governor's office and the legislature on, and we're hoping to have recommendations out as early as today.
Superintendent, what is the worst case scenario if, say, the CDC recommends closure of 20 weeks? As far as schools go, would we be able to get a waiver for students not having to stay out? What is the worst case scenario plan?
Well, we're still working on the plan, but if we get to that point where we're closed for the rest of the school year, then we will be working with the federal government and on things like testing waivers and not having to make up school days. Those are some of the various solutions that we're looking at. And we'll continue to be in close communication with our school leaders on what works best for their communities. We're also grateful for the partnership of different entities and organizations for providing online resources that previously cost schools money, but now they're offering for free.
Governor Ducey, you're telling people not to go out and party tomorrow. Under what scenario would you recommend the closure of bars and restaurants and businesses?
What we're doing is making every decision that we can that we believe is in the best interest of public health in the state of Arizona. We're doing it with with guidance from the Centers for Disease Control and Prevention and the National Institute of Health as they update their guidance. Those discussions, along with the discussions, I was able to meet with doctors today and providers today. Those inform our decisions, and we're going to continue to make decisions as this unfolds over the course of time to protect public health in the state of Arizona. So we're not at that point. But we do think that the guidance that is out there, and I would encourage everyone to go to azhealth.gov so they can see the guidance specific for the state and citizens of Arizona. We will be following CDC guidance.
Governor, a couple of things. Number one, you talked about how responsible Arizonans have been. I do all the family shopping. Not only are we out of sanitizer and toilet paper, but cat food and everything else. You know, how responsible are people when they're hoarding things? You cannot find canned soup, you can't find cat food, you can't find paper towels. How do we prevent hoarding?
Dr. Christ and I are accessible every day. We're communicating what the situation is in Arizona, what the facts are, and what is necessary. With all that said, the fear that's out there is very real. I think you've heard from federal authorities, Health and Human Services, and I want to say it from the podium as well. The supply chain for Arizona and for the United States of America will be protected. We are in coordination and communication with the leaders of our largest grocery chains, and they will be replenished. So I would encourage people to buy what they need. So that their neighbor can have toilet paper and necessary things for their food pantry as well. It was Dr. Christ that mentioned the situation of prescription drugs for someone with underlying health conditions. That would be maybe one situation where someone would stock up. In these other situations, I have high confidence in our grocery stores, in our manufacturers, that they will be able to more than keep up, but we've got to buy on a consistent basis.
One of your latest things also came out of some press conference about flexibility, things like unemployment. Right now, you have to be laid off, out actively looking for work, things like that. We have a lot of people whose businesses have closed, who have virus, and we don't want them out looking for work. What do you plan to do? What do you plan to ask the legislature to do as far as unemployment?
Well, this is an evolving situation. We understand that the social safety net is going to be stretched, and we're going to be part of the people leading that stretching of how we can help people that have lost their job through whatever's going to happen as a result of COVID-19 and some of the guidance and decisions that will have to be made around that. But that's evolving. We're going to work with the legislature and the federal government to advocate on behalf of all Arizonans.
I know I want to touch back on the social distancing about the guidelines. Usually you're following CDC guidelines, but then you have states like Massachusetts who have been going to restaurants and going to bars. And as you mentioned again, tomorrow is a huge day for some people, especially college students. Do you think that maybe you will try to ban that to stop the spread of COVID-19?
Our circumstances in Arizona today are different. It's a big country with 320 million people. I'm focusing every day on what's the best decision for the state of Arizona. Along the way, we've made emergency declarations. We've put out executive orders. We've made the decision to shut schools. As things are necessary or needed, as we have the data, the facts, and the science, we'll make decisions. This is where we are today, and it will change.
So I may turn that over to our partners. It's going to depend right now based on your insurance, what type of insurance you have. And we do know that they've waived copays and that it should be considered an out-of-network, like if it is out-of-network, it should be covered by your insurance carrier. For those that are identified as high risk by public health, those tests are free here. But we're continuing to get more information on the pricing because we don't know if the state were to step in, how much that would be. So.
That raises an interesting question. If I just quickly follow Ryan's question, I understand waiving the copays, and that's great if people have insurance on Medicare, that's fine. There are people in Arizona, there are a million people without insurance, without access, without anything else. What about them?
So we are still exploring that cost. We have been told by the federal government that the tests are free, so we are looking into what mechanisms and how we do that. So we're continuously trying to identify that.
Can you just clarify, we keep talking about bars. What about movie theaters, parks, malls, places where people would go? Are we recommending scaling back on that? Even public places like the court?
So what we're recommending on right now with the guidance that was released yesterday is mass gatherings over 50 people. So that would include potentially malls, festivals, parades, concerts, those types of things. As we're looking into what the CDC recommended today, we'll be making more tweaking to that guidance to identify, are there ways to social distance in restaurants? Italy had some interesting social distancing there. So how do we establish that? But we're still looking at that guidance. There are still possibilities that they could stay in business because you still can do drive-through, you can do pickup. There are ways to social distance without shutting down like the restaurants.
Thank you, everyone. Usually know how to reach the additional question. No green beer, Governor?
All right, everyone, it appears we have wrapped up here in Phoenix, Arizona. I'm going to take you out live now to St. Paul, Minnesota, here on Fox News Now, also live streaming on coronavirusnow.com.
The waiting week for unemployment insurance that will allow workers to take advantage of those benefits right away after they need to take advantage of UI. It also ensures that we make unemployment insurance benefits available to anyone whose health or the health of their loved ones is affected by this crisis. And it clarifies that you can access unemployment benefits if you are quarantined or self-isolated as a result of COVID-19. So the workers who are affected by today's executive order to close down those businesses the governor mentioned, you may be eligible for UI, you probably are eligible for UI, and you should go to uimn.org and apply. The EO also addresses the issue of childcare, which I know is on the minds of so many Minnesotans right now. I know my wife Mary and I are thinking about this a lot for our 2-year-old twins as our childcare situation has shifted drastically, and that's true for so many Minnesotans. So if you are a parent who is experiencing childcare challenges due to the closure or cancellation of childcare facilities, you are eligible to receive unemployment benefits while you are away from work. So again, please do go and apply. The order also addresses the needs of businesses, as the governor mentioned, who pay the taxes that make this whole system run. We don't want those businesses to be adversely affected by this crisis. So we are suspending the employer surcharge for employers to pay into that unemployment system for the duration of this executive order. So this will provide some fast relief to businesses who need it most during this time. Now, I want to make a very important point to everyone who is going to be looking at applying for unemployment insurance benefits in the coming days. It is critical that you use our website. I've mentioned it before, and I'll mention it again. It's uimn.org. Our call centers are simply not set up to handle the call volume that we expect could come in based on this executive order, and we need to reserve those call lines for folks who don't have access to the internet or don't speak the languages that are available on our public website interface, those ESL applicants. So please, again, if you are applying for unemployment insurance, go to the website uimn.org to do so. We're also expanding the hours that our website will be available. It is currently able to accept applications Monday through Friday from 6 a.m. to 8 p.m. We're working right now to add Sunday hours. And I would just say this, we would ask for everyone's patience as the team scrambles to do everything we can to make this system work in these trying times. We have a great team in place that's working very, very hard, and we'd appreciate everyone's patience as we make these developments. Now, we know unemployment insurance alone isn't the only tool that's going to be needed during this crisis. It is a start. We are continuing to look at other solutions at the federal and state level. One that I did want to point out today is the federal government's Small Business Administration disaster loan program, which we're continuing to get more guidance on by the hour from the federal government. We are working closely with the SBA and the business community and local partners to ensure that Minnesota businesses are eligible for that program. It will provide loans at a low interest rate for businesses that experience economic injury as a result of this crisis. We'll have additional guidance on that in the coming days, and we believe that funding will be available within the next couple of weeks, so more to come from us there. Lastly, I'll just say this, these are unprecedented times, and I think you're seeing today an unprecedented response, and we would just ask the business community, many of whom we've spoken with over the past few days, to continue to collaborate with us, to be creative, to look for solutions. We have been impressed and inspired by the civic backbone and call to action that I think our business community and our workers have felt during this times of crisis. It really is a chance for all of us to come together and ensure that our economy can weather this time and make Minnesota better for everyone in the future. So with that, I want to bring up one of those business leaders who's here to join us today, one of Minnesota's most well-known restaurateurs, Andrew Zimmern. Andrew?
Thank you, and thank you, Governor Walz. We're in a crisis. The restaurant and the food industry is in the same place. Like others around the world, we are realizing that we need to take drastic measures to prevent the spread of the novel coronavirus and flatten the curve. Those measures will mean a greater percentage of people will survive this viral pandemic. Reducing gathering spots will help with containment, and hopefully real plans and real leadership, like the ones taken by our governor, civic leaders, will also restore confidence in our markets and institutions and ultimately get us back on our feet sooner. We cannot pretend that this real world crisis is not happening. Restaurants and bars are closing all around the country, some by mandate, some by choice. Service industry workers are losing their jobs. Small business owners are facing bankruptcy. Paid leave is being taken seriously in our industry for the first time. And in a state, like all the others, with food security issues, closings of restaurants and schools means a loss of access and meals for many Minnesotans. And still, these closures are the right thing to do in the interest of the public health. The hard choices now speeds resolution further downstream. Additionally, I feel we need to ultimately address the needs of hundreds of thousands of restaurant, hospitality, and leisure entertainment workers here in Minnesota. Traditionally, these industries employ the largest percentages of single parents, returning citizens, transient workers, and immigrants, especially new immigrants. Young people most often find their first job in the hospitality industry. Paid leave, health insurance, and saving plans have been historically lacking in our industry. Crisis organizations like Second Harvest here in Minnesota are struggling to deal with the waves of fear gripping this vital and beloved industry. Right now, many can't pay staff, rent, property, and other taxes, and of course, can't do that at all when there is no business. Fall off has been anywhere from 50 to 90% for restaurants, and that was over a week ago. Restaurants everywhere, including here at home in this state, have seen resources evaporate over the last month because hospitality folks all want to help. We all got into this business because of the magic that we know that happens when people share food with each other at our tables. Nobody wants to close, but we know that we must. Food people understand the greater good. We were first responders to 9/11, Katrina, and every disaster since. We always have been. So every restaurateur, chef, server wants to be the last one out the door. But the reality is that the public health needs to come first. That being said, I know that our food community stands ready to help. If we need to turn our restaurants into community food centers via public and private partnerships, we're ready for that. And I can speak for my organization that we will do everything that we can to facilitate any help for any and all Minnesotans whenever our civic leaders call upon us to do so. My heart breaks as I read letter after letter from chefs and restaurateurs across our state and country expressing the same ideas. We do need everyone to help. We need government bailouts of our industry, beginning with eviction protection, rent and tax alleviation, assistance for those without paid leave or health insurance. Help with loans for businesses and individuals should be on the table precisely because these restaurants employ so many, but also because they are small, consumer-facing businesses without cash reserves. We need to make sure that when this pandemic is finally over, and it will be over, that we have restaurants that can reopen. The harsh reality is that most won't. The food world is the vital cultural fabric holding us all together. I have spent 30 years preaching that message. What does a Minnesota without restaurants, food service, and a hospitality industry look like? We need to bathe this industry in dignity and respect as we close our doors and provide all our assistance when the time comes as we reopen them. Thank you very much. And at this time, I'd like to introduce my colleague, Stephanie Shimp.
By the way, everybody, if you recognized who that was or you didn't, that was Andrew Zimmern, celebrity chef, speaking there in St. Paul, Minnesota.
Tell you that even the great University of Minnesota didn't teach a course in how to respond to coronavirus or a pandemic. We are relieved. Thank you, Governor. We are relieved to be here with you and to stand with you in this time of crisis and to know that we can keep our employees safe. We spent all weekend formulating plans, talking about whether or not we would go to takeout or to delivery. How can we both keep our employees safe and our guests safe, but do what's right for the community? And this is one of those times when we can do more by doing less. And it's really hard for someone like me in hospitality to say, stay home. But this is a time to cook meals at home and to be with your family and to do everything we can to help those in healthcare and to flatten the curve and to keep the hospital beds open for those who really need it. We hope to be here as an industry when all of this passes, and we'll be stronger than ever. And our restaurant community knows how to band together, and we know we can get through this if we all just stay home. Thank you, Governor, for doing this, and especially in light of St. Patrick's Day tomorrow, I encourage all of you, if you can do this today, tonight, do it now. The sooner we can all stay home, the better it will be for all of us. And now, John Puckett from Punch.
Thank you, Stephanie. The human dimensions of this are something I want to talk about, that we've been so sad as a company. My background is my wife and I started Caribou Coffee here about 30 years ago and built that company to about 100 stores. And then the last 20 years, I've been building Punch Pizza with my business partner who founded it. Today, we were on a phone call with our employees, and we had to let over 400 people know that we're having to temporarily close our company through no fault of their own. This is a virus that's an unseen enemy that's rapidly growing, and for the good of our community and the safety of our employees, it's better that we all hunker down and protect our vital healthcare resources so more damage doesn't happen in our community. We are going to reopen. We're going to have a bright future, but the next 2 to 3 to 4 months are going to be very difficult, and we were very frank with our employees and management team about that. The restaurant business is a business that we spend 40 cents on the dollar on labor. We employ a lot of people per dollar of sales, I think more than any other industry. But we're really going to be affected. And I really thank the governor for taking leadership on this. We have a lot of employees listening to this tonight and are reading about it tomorrow. And getting immediate unemployment insurance will really help them make the rent payments, make sure their family has food. And it's just a really terrible tragedy that we're all going through. We made the decision to close over the weekend after we had a couple of false, it ended up being false reports, but potential contacts of our employees with the person that initially was thought to have the coronavirus. It turned out not to be true. And we didn't think it was possible to continue operation with increasing virus spread in a tight restaurant environment. So for the sake of the public, we think it's in the best interest of all that, again, we stop operation and we make sure that the health professionals can do their job and not get overwhelmed.
I want to thank all three of you on behalf of Minnesota. This representation that you just heard of people who have poured their entire lives into creating not just an industry, as they said, a social fabric that sets Minnesota apart, and to hear them speak about putting the greater good and protecting our incredible healthcare assets, that's what Minnesota is asking for. That's what Minnesota needs. Your leadership at this critical time will not be forgotten. It sets an example for so many. And for those of you listening, I think the magnitude is starting to come home. 900,000 students were sent home. Several 100,000 of your neighbors were just laid off. An entire industry has been shut down in the face of this, all for the greater good. And as we triage this, and as we bend this curve, and as we keep our neighbors safe, I do think it's important. We're getting through this, and we're coming out the other end, and there's an opportunity here for us to do what Minnesota does, come together. These industries are going to need to be protected. These industries are going to need to, as we talk about it, ways that we can get together, and it's going to take public-private partnerships, if you heard, and it's going to take political will and political collaboration. And I hope that we all are seeing this. That's exactly what's happening in Minnesota. I met earlier today with all of the leadership in the House and Senate, and there is a sense of camaraderie and spirit and oneness about getting this right that I'm not sure, maybe some of us who were serving or saw the time after 9/11 where this country came together and can see a lot of good. We can do that in this. I would echo the message that Stephanie put out. Do this as quickly as possible. I'm not naive, and I send a message to Minnesotans. Please don't go out for one more time to crowd the bars before they close. We've thought about everything. Don't make a rush if you can on the liquor stores, whatever it might be, to create situations. Do these things in an orderly manner. Understand that this is a short-term time that we're asking you to sacrifice for the greater good. Understand where folks are at on the other end of this, where our neighbors are going through. And so we get an opportunity here to implement this now in an orderly fashion, bend this curve, keep these precious resources in the hospitals ready to function, and get on the other side of that. With that, Tom? Yeah, for every time we do something, and there's every question, I want to ask just, for the press, I think to think about how we talked about this, there has not been changing plans, there is evolving plans. At this point in time, listening to Commissioner Malcolm's and the health department's best laid plans, I think the one that comes to mind is people are saying, why is Mall of America still open? Where can people congregate? This information coming out is coming out almost hourly that we have. We're asking people to do things, and again, you can shop in the grocery store and keep the social distancing there. You can do some of these things, but I keep, and will keep reiterating this, I think it is altogether possible, and no, it is probable, that there will be additional executive orders. I would forecast for you, we're already thinking and measures around transit that are starting to happen, and how we clean our buses, how we clean our trains. We are talking with Met Council this afternoon. So these are things as they come. They are the best science and data of where transmission is most possible. We don't have the capacity. We are not answering every question. And the guidance that my team is getting and that I'm getting talking to other governors is, you're better off to move on this and then figure out what got missed, but do the best you can to mitigate that. And we're trying to strike that balance. I cannot announce this closing without having in place the ability to do the UI and provide some assistance to these businesses. But there are a lot of other things that we're going to have to do behind it. So they're not wrong. I would just say this, there's a potential for those things still coming. Esme. Yeah. Thank you, Teddy. Yeah, I'm sorry. For those of you out there listening, because of the audio setup we hear, the question was from Tom Hauser, and it was getting folks texting in, and rightfully so, saying things like, what about other businesses? What about the Mall of America? Where other people congregate? That's not wrong, and we're not attempting to answer every single question at the time. My answer I gave said, based on the best data of the transmission vectors of where they're at right now, these are the places that we're dealing with. We are trying to balance that, of course, always safety first, and then thinking about the economic impact, and then the mitigation things in place, not just to mitigate the spread, but to mitigate the hardships that would be caused by this. We can't put people on the streets, and as I think Andrew so clearly articulated, this is an industry that these businesses are providing the best they can with healthcare, but that's very difficult. These are folks, and many times it's their first jobs. Many of us did this type of work when we were in college. We have to make sure, and then there's the professional and the single parents. So I'm not going to tell you that this fixes all that in the beginning, and I'm certainly not going to tell you that this is not the last time we're standing here, as further mitigation is needed. Esme. I'll have Commissioner Grove answer. The question was from Esme Murphy, was about explaining a little more on the unemployment insurance, the numbers involved with that, and a clarification on parents who do not have daycare and need to stay home for that, their eligibility. So Commissioner Grove.
Thanks, Esme. I would say we don't know the projections of how many people are going to apply for unemployment insurance. We know that many people, at least some people, have paid leave available to them, sick leave. Those programs will probably pay you more than unemployment insurance, which pays you roughly half of your wages, up to a max of $740 per week. So it's impossible to predict right now, but we know that hundreds of thousands of workers are affected by this. And so, again, I want to reiterate that for those who do apply, please do so via the website, uimn.org. And yes, your question about parents who have to take off work for childcare, I mean, the core tenet of unemployment insurance is to help those who have to leave work for no fault of their own. And if there was ever a time when there is a condition in the market that is no fault of anyone's own, it is a global pandemic. And so if you are faced with having to leave work to take care of a child because of these announcements thus far, we strongly encourage you to apply for UI, and the executive order gives us a lane there to help those parents. It is, and we would ask for some patience. We will move processing time as quickly as we can. Usually within a week or so, we get you an account and we're up and running, but we'll continue to speed up processing as fast as we can.
There are folks who are concerned even beyond restaurants.
That's right. The question was the supply chain and the food supply to make sure that there is enough food, both raw materials if we're doing takeout, and then I assume in grocery stores is the question. I think we heard yesterday in the president's announcement that he had been on, especially with representatives of the largest grocery stores, of making sure that those, I think he mentioned Kroger and a few others out there. What we're doing is with the Minnesota Department of Health monitoring to make sure what that supply chain looks like, what the food supply looking coming in, and stretching how far back we have. A lot of industries now are just on time delivery, which we're finding out is a wonderful model for manufacturing. It is a terrible model for ventilators. It is also a terrible model if we don't have food supply in there. At this point in time, we have no reason to believe that we can't get that, but one of the things that we're thinking about is critical industries and things that need to stay in business. It's not just the grocery stores, it's the truck drivers who drive the groceries there. It's the freezer materials where they're stored, where they pick them up at a distribution center. It's the mechanics that work on the truck so that the trucks can pick it up from that distribution center and deliver it. So at this point in time, we have confidence in that system, but I think it's really important to keep in mind of thinking what those critical industries are. This is, and I'm going to reiterate again, this is why it's critical to have a plan in place. And I would also say, I think what governors are asking for, we spent an hour on the phone with the president and the vice president this morning, the 50 governors. We're really looking for that guidance from the federal government to provide a clear-cut set of protocols that are going to be in place so that we can ensure we're going to get there. Some of you have heard the comment that was made this morning, and it was disheartening to me that when we were talking about ventilators, the president's response was we should just go procure those locally. That's not possible. In terms of, we're thinking creatively, and I would forecast to you, we're thinking about, and Commissioner Malcolm is getting an inventory of every single ventilator. And there might be one at a nurse's or a medical training facility at the University of Minnesota or Hennepin County College. Those are things we're thinking of. But when it comes to food, at this point in time, the supply chain is there, it's solid, and we believe that. Well, I will say it again. The question was about over-purchasing of materials, about planning for the future. There's several mixed messages we get from people. The first thing I would say is that it's human nature to think about this. I think we tell people to plan for emergencies, and I don't think they see this as necessarily a negative. They're going out. What I would ask people to recognize is we have a lot of folks who don't have the capacity to store up a lot, and they're buying it week to week. And when we create a run on these situations, it throws that delivery system out of balance. There will be more coming in, but if everybody's just sitting there waiting to take it, and I think what I would tell people is take what's appropriate that you need and understand those who have enough at home right now or have stored enough there. Our food shelves at Second Harvest Heartland and others are really going to be hurting. Now might be the time to maybe donate a little of that if you got that so that people can find it. So I would just ask people, be judicious. Don't over-purchase that. Understand the system is solid. It's not as if another delivery is not going to come, but if we take it all at once, it leaves people short. I'll go here and then I come back to you. Certainly. The question is, and the question was about why the distance learning is not starting till the 30th. This was to give time for the schools to prepare what they needed to do, to look and see how they were going to. And I was talking to teachers yesterday in the Rochester schools, and most of you would recognize they have a unique situation because they're going to have a bulk of healthcare providers because of the concentration of the Mayo Clinic, Olmsted County Medical Center. But a lot of schools are trying to figure out how do they work plans together. Teachers are getting together and say, we will do the science units for the 4th and 5th graders. We'll do that on Zoom, figure out how to get there. I would also like to use this as a time of what they're trying to do is to figure out where the gaps are in terms of delivery of broadband and different ability to get it there with laptops. That's what the inventory that came to me today was saying. Do you have a laptop? Do you have access to care? This will give them time to say, if I say no and I'm living in a neighborhood where we need a hotspot, we'll be getting them there. And I want to give a shout out to a lot of our internet providers. One example I saw with Comcast, they're upping everybody's speed up to the top. They're allowing people to, if their bills aren't paid for the next 60 days, they're allowing them to call in and get access if they have a child at home. Our private businesses are stepping up to deliver at. This period of time was to allow them to put that all in order to meet the standards and move forward. It is a prep period. It's like what many of us do during late July and early August. We start prepping for 3 or 4 weeks to get that delivery of classroom material. Now they're just switching it over to e-learning. I promised I'd come to Peter. The question was to our health system CEOs here, and I'll let them decide if all three or if one wants to answer, is what they're requesting from us in terms of support for the industry on the side from the legislature and what they can anticipate some of their needs might be. So, thank you.
Maybe I'll start and just with an appreciation for the governor and the commissioners on their leadership and for our colleagues. That the best way for us, the question we're asked all the time is, do we have adequate supplies, rooms, staff, equipment to take care of people? the best way to do that for all of us to do it together and flatten this curve. So let me just emphasize that. In terms of what we're looking for, we know that there will be extra expenses in training and equipment and potentially facility changes. We don't know what all of those will be yet, but we have a partnership where we're collaborating all together in that and trying to raise what that will be for the future and for our needs economically. But just as the governor said, our first goal is to make sure we provide the best and safest health care for those who need it. You can help us do that by doing all we can to actually adhere to good hygiene practice and flatten that curve for us. And we're so grateful for everybody stepping up and backing these things and for the leadership of the governor and these commissioners. Thank you.
Peter, I'll follow up. This time, those are being worked out right now. I'm going to speak a little bit out of order and candidly because these are unprecedented times. The number I'm thinking is somewhere around $150 million, and we will work out what those would look like in terms of, and that's as we're starting to anticipate what that curve looks like. I want to use Commissioner Fran's quote on this time is, a question mark times a question mark is a question mark, and that is the space we're in. But in the essence of as much transparency and as much information as possible, please use that judiciously, that's a number that's being talked about now, and each one of these institutions is kind of submitting or thinking about what they need, I think if that's fair to say. And here's what I would tell Minnesotans. This is not going to be X amount of dollars. This is when it's going to be done, and this is when everything's back to normal. It's not that simple. And I heard the president today talking about July and August. And so I think we understand we certainly don't want to set unrealistic expectations, but I also want to realize that the business of democracy and the accountability of taxpayer dollars does not stop in a crisis. We simply don't have that answer, and as soon as we get it, we'll get it to you. Yeah, absolutely right. And maybe if Commissioner Harrington, and these are still discussions going on, the question was about some of the decisions happening both here in Minnesota and across the country of county jails and other detention facilities releasing nonviolent offenders, folks who maybe were picked up because they missed bail or they had a parole violation for a nonviolent offender, of trying to get them out of that concentration. What I can tell you at this time, those are conversations we're having. I spoke to Sheriff Hutchinson last evening. He spoke to Commissioner Harrington, and we were speaking this morning on this very issue. Nothing from the administration has been decided yet, other than every single thing that can slow the spread of this disease and bend this curve that doesn't put public safety at risk, we are exploring. Is that fair to say? So.
We have been having this conversation with Commissioner Schnell of the Department of Corrections. We've also had it with the local counties because we have many of our workhouses and juvenile detention centers that are actually run by the county that are separate from the Department of Corrections. And so we're having a conversation with the county sheriffs, 79 of which have jails and need to have some understanding of what they're doing. And we're talking to them about visitors, about virtual contact with lawyers. We're also having that conversation with the county workhouses, and we're having that conversation with the Department of Corrections. So all of those have been talked about in terms of the general tenor of what do we need to do in terms of public safety. And in fact, I would add in there that we're also having that conversation with the judiciary, because the judiciary has a primary role in making the decision about who gets released, who gets sentenced, and what methods we're going to be using. So we're also starting to have that conversation with them also.
The question was around other sites where we know people gather and sites where there is, of course, close contact, such as dental offices. I think the other example was hairdressers and the like. Just to reiterate something that the governor said earlier, In getting today's order out about bars, restaurants, other entertainment venues, places where people gather, mostly for fun and enjoyment, not for essential services, that was our priority today. Because of St. Patrick's Day certainly being just an amplifier of that effect, but seeing that people weren't picking up the suggestions to do more voluntary social distancing, we felt compelled to move earlier, faster, as fast as we could on these announcements today. I can't speak directly to what more might be coming by way of guidance, but certainly the social distancing guidance applies to all of those environments, certainly. But when we know that there are services that require hands-on care in the healthcare setting and dental care settings, there's a pragmatic consideration that social distancing isn't possible in every encounter, but where, as much as it can be done, it should be done. In terms of today's 19 cases, I believe when I left the office, I did not have any information on characterizing those cases other than the demographics. But again, I think, just to reiterate again, another reason why the speed of moving on these enhanced community mitigation measures today is, as we are seeing the demographics of the cases, a significant number are in younger people who may not have severe illness themselves, but are in a position to spread the illness to those at higher risk. And those are the very folks who are still congregating in these social settings that we really wanted to get the message out strongly and quickly that for the good of the community, as has been discussed, they need to stop. So I can't tell you what number of cases are community spread, but I'll tell you quite honestly, I think as the numbers continue to grow, as the epidemic matures, and again, we're all trying to slow down and even out that spread, I expect that the majority of the cases are going to start to be community spread. That's just what we expect to see from here on. And that, again, was part of why the acceleration of these measures. I think the question is, what about the risk of people who are asymptomatic being able to transmit the virus? And in the case of what I was just talking about, younger folks who may have the disease and have a very mild illness and are still walking around the community because they don't feel that bad. They still may be in a position, they're not totally asymptomatic, but it's not severe enough that they're staying at home. We're still learning about the transmission potential for people who are completely asymptomatic, and we don't think that's a very high percentage, but it's not zero. So again, I just want to mention the information on this is evolving so fast. I think the CDC's guidance late last night was informed by new information coming in from the United States. So we're just going to have to keep on this and keep evolving our guidance daily and even more frequently as the information becomes more clear.
No, this is the beginning of it, and I think the question that came earlier about schools planning, that actually ends on the 27th. I think the expectation here is that these will, of course, be re-upped. This is to set the parameters, if you will, set the level, understand what we're at, be able to move and changes in that, and I think most of us understand there will probably be a further extension. And I would segue that back to Tom's question about folks asking about these other scenarios. I'm actually encouraged that people are thinking about these scenarios. And there's actually a cottage industry on Twitter poking holes in the logic of, well, why did you do this and you forgot this? We can't encompass it all, but if people are thinking about this, what I would tell you is, if it is a close proximity and you're worried about that, and you're worried someone there might be sick, those are the things we need to avoid. I mean, we're getting to that point now that if it seems like it's not a good idea, it's probably not a good idea. And again, as long as people keep thinking about that, but what I can assure you is we are trying to think through all these scenarios. We have not forgotten or thought that we did this without giving any thought to dentist's offices, the dental hygienist saying they're put in that position. It's just going to be ever evolving. And the date on this is just to set that parameter, and it looks like that's what most folks are doing. And then I would just forecast right now, I don't see a situation in anywhere around the world where there wouldn't be an extension on these dates. Yeah, and we spoke, the Lieutenant Governor was speaking with Chief Executive Benjamin from up at Mille Lacs. They have made the decision they will be closing all of their facilities. This situation of our sovereign nations, we are in close proximity or close communications with them about what they're going to do. They have the ability to make the decisions themselves. They have their own healthcare systems. We are coordinating and giving as much information as we can. I think what you'll probably see is those decisions are made by those sovereign leadership in each of the nations, that they will probably move in that direction, and we are in close contact with them. So I think what you're starting to see already, at least at Mille Lacs, I know that tonight that order is going. I cannot speak to the others at this time. I haven't been updated on, but they're right, because I heard somebody tell me they drove by and these things were packed. And I would go back to this again. I understand the human nature part of this. I think one of the things that there's a belief, and I think there'll be time, and there should be time to critique how this happened, of folks not believing in the severity of this, of not believing how important it was, and they didn't understand quite that much. I feel like that's starting to drift away, and I think you'll see a cascade, as you heard some of our restaurateurs talk about. John, others were already making this decision on their own. I think the same will hold true in the indigenous nations.
All right, we got to wrap there today.
Thank you all, and thanks to everyone. Thanks, folks.
Thank you, Governor.
Well done.
All right, everybody, good afternoon or evening, depending on where you're watching News Now from, whether you are watching on our YouTube page or you're watching on coronavirusnow.com. My name is Pilar Arias, 426 here in Phoenix, Arizona, 726 on the East Coast. Again, Johns Hopkins University reporting 4,464 cases here in the United States, 78 deaths. Unfortunately, 17 people have contracted the COVID-19 virus and have recovered. We're going to head on over to Houston, Texas next, where they had about a 48-minute long news conference on the coronavirus update there. Again, Harris County, Texas, Houston, Texas, coming up next.
Our fire chief, Fire Marshal Lori Christensen, Public Health Department Director Dr. Shaw. We've got several council members here, Cassick Statham, Jerry Davis, and other city officials. I know we've all been watching the news, the updates from other jurisdictions, from the from the government, the federal government, from the CDC, the president. We are all watching the evolution of this virus and its spread. I know a lot of folks are scared, and it's a difficult time. It's an uncertain time, but we've had tough times before, and we are known for nothing if not being able to get through tough times together. As an update, our Emergency Operations Center here at TransStar is now activated to level 1, the highest level of activation, highest level of readiness to ensure that we can respond to this crisis. We have 8 cases right now in Harris County, several across the region, and we continue to update those numbers as they come in. The reality is we're at a pivotal point right now. The decisions we make, the decisions you make to go out in groups or to stay home will very much determine whether people live or die. Whether we flatten the curve sufficiently to allow our healthcare workers to address an influx of cases, or whether our healthcare system and thereby our community at large are overwhelmed. Simply put, the decisions all of us, including our healthy residents, make could affect whether somebody lives or dies. Yesterday, the CDC announced that any gatherings of more than 50 people should be canceled. We heard from different jurisdictions with varying degrees of regulations This morning, the president announced gatherings of 10 people, then the CDC said 10 people as well. Fundamentally, what we're seeing is sharper and sharper recommendations. We issued recommendations last week, but we saw too many people still doing things in crowds when they didn't need to. I saw folks on social media. I saw folks in person. All of us are working to issue stronger, more aggressive policies because the reality is that the situation is becoming more and more serious. But we're at a turning point. We can address this. We can make a difference right now, and that's what we're all working on doing. This is about more than just the rodeo. Conferences, weddings, religious gatherings, festivals, parades, other types of assemblies all need to recognize that gatherings of any kind should not be happening. And so we've worked with Mayor Turner, and he and I are united on requirements for our community, recommendations and requirements. I am ordering that in Harris County, and that means unincorporated areas as well as all the cities within Harris County, that starting tomorrow at 8 a.m. and for 15 days until extended or otherwise revised, 3 things. First, restaurants must offer only delivery, pickup, and drive-through service and close for sit-down meals. Second, all bars and clubs must close. Finally, unless you need to go out, stay home and stay away from crowds. This is not going to be solved by any one action. It will take all of us, including young people, healthy people, my fellow millennials, everyone, making sure we play our part. Unless you need to go out to pick up food, buy medicine, groceries, necessities, go for a run or a bike ride, play in your yard, you should not be going into any kind of crowd. No matter where you are, if it's picking up food at a restaurant, picking up groceries, whatever you absolutely need to do, if you see a crowd, you should not be part of it. I want to thank the leading restaurateurs. I spoke with the Houston chapter of the Texas Restaurant Association earlier today. We've got some business leaders here behind us as well with Houston First, with the association, and I appreciate their input. I appreciate the work that they do and the conversations that we had throughout the day. I expressed to them directly, and I expressed to the community, to the restaurant owner who may not have a job tomorrow, or soon to the senior who is seeing their 401k in trouble. I know this is very difficult. It's a difficult time, and that's why we're taking extraordinary measures. We are at a pivot point with the trajectory of the virus. History will say that we prioritized human life. It will say that if we erred on the side of action. But again, that action needs to be on each and every member of the community. It can't just be your government. So I encourage our residents to support these businesses by continuing to order from them. We thank everyone in the community for your cooperation, and we want everyone to recognize that this doesn't work unless we all buy in. As additional notes, the food supply is strong, as Mayor Turner pointed out earlier today with the different grocery store leaders. Grocery stores are not only open, they're hiring. They are adjusting hours, they're supporting online operations, and more. But people don't need to hoard. The county and the city continue working together to prepare for spikes, to develop testing. We continue to provide essential services, and the county is not shutting down, neither is the city. Your actions will save lives, and we are taking additional steps to also support the broader impacts of these measures. On price gouging, we know that Harris County is full of great people who come together during times of disaster like these, but there are also some who take advantage of these difficult times. And so I want to thank our county attorney's office for working aggressively to pursue folks who are trying to take advantage of others through price gouging. There are folks offering fake coronavirus treatments, fraudulent tests, exorbitantly priced hand sanitizer. All of those, our Harris County Attorney's Office, Vince Ryan and his team will be investigating. And so I encourage any resident who finds evidence of this kind of behavior to report it. You can go to readyharris.org, and tomorrow we will make a hotline available. We are also already beginning to band together, as we always do. And so we need volunteers. As you've seen, the food bank needs volunteers as it provides food to children who are out of school and rely on those school meals, as well as other volunteers will need for other work. And so we encourage folks to also go to readyharris.org, where you'll find the link to Volunteer Houston. And so we're leveraging the platform of Volunteer Houston to connect folks who want to volunteer with the nonprofits in the community who need volunteers, and we're all coordinating on that. CenterPoint has agreed to provide flexibility with making natural gas payments, and so I want to thank CenterPoint for that. I am also very appreciative of the mayor's step to postpone any water shutoffs until after this time. And so I am sending a letter to the municipal utility districts and the public utility districts to be flexible with their water shutoffs and take that leadership from the city of Houston. We've spoken and sent that information to them already. As you all know, there are distribution sites for children, as I mentioned, for food that HISD stood up. The other school districts are working on. The map and information is also on readyharris.org. And I know folks will ask about testing. We're still working very closely with Mayor Turner, with the hospital system, and our public health and healthcare departments to sort out testing as quickly as we can. There are there are important obstacles on supply chains, and we are working through those, and that is our #1 priority right now. So we will, I'll hear also from Dr. Shah, from the mayor, and Dr. Peirce, but I do want to repeat my remarks in Spanish before we do that very briefly. Seguimos viendo las noticias, los cambios realmente a diario de las regulaciones a través del país, a través de las localidades en cuanto a lo que está sucediendo con la situación del coronavirus, y es muy preocupante, pero hemos pasado por tiempos difíciles juntos muchas veces y sabemos que como comunidad podemos trabajar juntos y salir adelante, y es lo que tenemos que hacer el día de hoy. El Centro de Operaciones de Emergencia aquí en TransStar está en nivel 1 de activación, es el nivel más alto de preparación para responder a un desastre, una emergencia como esta. Estamos en un punto crucial en nuestra reacción contra este virus. Las decisiones que tomemos el día de hoy y estos días determinarán vidas y decisiones de vida o muerte para muchas personas en la comunidad.
Friendly reminder, everybody, I do understand that they are speaking Spanish here at this coronavirus news conference in Houston, Texas, but they are talking about Harris County as a whole, where there are a lot of Spanish-speaking people living in the community. So they're trying to make sure that everybody gets the information that they need out in the Texas area, Harris County, Houston, Texas area. So thanks for your patience and understanding while I continue to play out this news conference.
Saludables, los jóvenes, que las decisiones que ustedes tomen de salir y estar con otras personas puede afectar la vida o muerte de un residente de este condado. Y por eso tenemos que trabajar todos juntos. Hemos visto los cambios, CDC, el gobierno federal, primero dijo 50 personas, de 50 personas no se deben reunir. Esta mañana han dicho que más de 10, hemos visto distintas comunidades. La realidad es que no deberíamos estar en ningún tipo de grupo. Aunque sea una boda, conferencia, grupo religioso, festival, desfile, cualquier tipo de asamblea, de grupo, debe cancelarse, no deben estarse llevando a cabo. Es nuestra decisión y nuestra responsabilidad en este momento. Hemos dado recomendaciones la semana pasada, pero hemos todos visto muchas personas que aún están por fuera, muchas están haciendo caso, pero demasiadas todavía vimos en grupos. Entonces, el día de hoy he trabajado con el alcalde Sylvester Turner y juntos estamos unidos en requerimientos para nuestra comunidad. Son 3 cosas. Hoy estoy ordenando que en el condado Harris, y eso incluye las áreas no incorporadas del condado, así como todas las ciudades dentro del condado Harris. 3 cosas. por los próximos 15 días, empezando mañana a las 8 de la mañana. Todos los restaurantes deben ofrecer simplemente servicios de recoger la comida, de delivery, enviar la comida a la casa o pasar en el drive-thru, en el carro. No se permitirá tener comida o el comer dentro del restaurante sentados. Todos los bares y clubes deben cerrar, número 2. Y número 3, a menos de que usted deba salir, tiene que permanecer en casa y siempre debe estar alejado de cualquier grupo, de cualquier asamblea, grupo de gente. Necesitamos que se quede en casa. Puede salir a comprar comida, a comprar medicina, a la tienda, lo que necesite, pues, necesidades. Puede salir a montar bicicleta, caminar, jugar en la yarda, pero no debe estar en ningún tipo de grupo, por más que usted sea saludable, porque puede resultar con el virus y contagiar una persona vulnerable que pueda morir o sufrir o inundar nuestro sistema de salud dado al virus. Abuso de los precios, muchas personas.
Extend that through the end of April. And we will further suspend all proclamation presentations at City Hall on Tuesdays, which is normally at 1:30. That will be suspended through the end of April as well. And all of our meetings will be limited to 50 persons. Let me just start off, also add, none of these decisions that we're having to make are easy decisions. They're simply not easy, especially when you recognize that when you're making a decision, you're impacting people's livelihood and possibly people who will be either laid off or lose their jobs as a result of the decisions that are being made. I will tell you that it is important for all of our governmental entities in Houston, Harris County, surrounding region, and quite frankly across the country, to act as much in concert with one another, because our boundaries are very porous. People are traveling from one destination to another. Last night, of course, when the CDC issued their new guidelines limiting or recommending that the limit be 50, it did change things. And so we started making adjustments, trying to get a read from where the CDC was and where people were on the federal level. And then, of course, just today, those guidelines shifted from 50 down to 10. So things are very fluid and things are constantly changing. I will tell you that as it relates to the largest cities, for example, in the United States, New York, Chicago, D.C., they have already taken action in terms of closing or suspending business with restaurants and bars and clubs already. Houston, of course, will be the fourth city of the top 4 in doing that. And the period of suspension for us, as the judge announced, will be 15 days. And the goal is very direct, and that is to slow down the progression of this coronavirus, COVID-19, so that it doesn't overwhelm our healthcare system, to flatten the curve. That is the goal. And these are tough decisions that have to be made. But from what we are getting from all of the medical experts and people that are advising, that if we don't take definitive action now, all of us will pay a much greater cost down the road. And that's the focus, that's the goal. They're not easy decisions. We certainly recognize that we will be impacting people's lives, people's businesses. So that's simply the consequences of what we're having to do based on what the facts and the science and what's being presented to us. So we'll continue to work very diligently to get this situation under control, and we just encourage people to continue to do their part in minimizing being a part of large gatherings, groups, and in large part, people are already doing that already. But what we did notice for example, over the weekend, that in a number of these places, there were huge crowds and people were not respecting social distancing. And that's an important part of this situation. I know Dr. Shaw and Dr. Purse will talk on testing. I know you're anxious to hear about that. So let me just pause and yield to Dr. Shaw.
Thank you, Mayor. Thank you, Judge Algo. Thank you both for your leadership in very difficult times. My name is Dr. Umair Shah. I'm the Executive Director of Harris County Public Health and Local Health Authority for Harris County. I just want to start by thanking Dr. Peirce, Mr. Williams at the City of Houston. As both the Judge and Mayor have stated, this is a very challenging situation for all of us as a community. We recognize that that challenge of what's happening in our community really means that we have to make difficult decisions. As we've said all along, as the situation continues to evolve, as it continues to change, that our response will also need to change alongside with it. Dr. Peirce and I had a call with a number of local health authorities from across this area earlier this afternoon, and we continue to be lock in step in terms of our commitment to our community. And we recognize that that means that difficult recommendations are challenging for all of us. All of us that are up here, we dine in restaurants. All of us that are up here, we go to a number of establishments that are going to be impacted by these changes, and we recognize what that means to us. We recognize what that means to our community, and we do not take these decisions lightly. As the Mayor has mentioned just now, and just dovetailing on what the Judge said earlier, we recognize that all of these attempts are everything we can do to help slow the transmission of this virus in our community. And that is absolutely critical to what we are trying to do. That surge of increase in numbers is what we are avoiding. We're doing everything we can to get us there from that avoidance standpoint. We want to do everything we can to delay the progression, to delay the number of individuals that are exposed, delay the number of individuals that are become cases, and eventually delay the numbers of people who are hospitalized or have to present to our healthcare system. I think it's absolutely important to remember that initially our discussions with our community were about, please watch what's happening in the situation, make sure you use personal hygiene, and you do everything you can to help those in your own family, yourself, as well as your coworkers, everybody around you, and your community as a whole. Those recommendations have not changed. We still want people to wash their hands. We still want people to cover their cough. We still want people to avoid other situations where they may be sick and they may be exposing others. But what we are doing today is a continuation from the conversation from last week about gathering. It's the concept of gatherings. And while the focus may be on restaurants, bars, etc., what we are really wanting our community to hear us loud and clear is that gatherings as a whole, regardless of where they are, can put our community at risk. And we want you to do everything you can to help us as a community to get past this as best we can. We also recognize that there are those individuals who are more at risk because they are going in gatherings or because they are being exposed. The elderly, above the age of 60, those with underlying health and medical conditions, those who may be immunocompromised with an immune system issue or challenge, and those who in many ways, pregnant women and those who have weakened immune systems, or in other words, that they are at risk for some reason. We want to do everything we can to protect those people. But in order to protect those people, we have to also take steps for all of us who are healthy and all of us who are doing the things in our everyday lives. And so while we have to practice those personal hygiene, those activities are absolutely critical. Social distancing is what is going to help us get through this situation. Social distancing means that we have to do what we're doing up here, our best, to try not to be as closely connected with each other. And that's very difficult for all of us, especially because our human instinct is to be around each other. So we know this is difficult for all of us. We know this is difficult for our community, but we absolutely feel this is the right decision. Let me just close before I turn it over to Dr. Peirce that we also recognize that at the end of the day, we have gone through a number of emergencies in the past, and in order to be able to get through any emergency, we have to work together. There's a limit to what we in government, what we in the response community can do. We can only do it when all of us as a community work together. Thank you.
Dr. Pearce. Yeah.
Thank you, my good colleague, Dr. Shaw, Judge Hidalgo, Mayor Turner. So to put this in perspective, as we've said before and as Judge Hidalgo mentioned, we are doing this to save lives. So while in Houston and the Houston region our numbers remain small, and while so far we have had no deaths, I want to point your attention to the fact that in Italy yesterday they reported 349 deaths in one day related to this virus. Across all of Europe, I believe it's over 500 deaths in one day. We are doing these very drastic measures in order to prevent that from occurring in our community. These are, we understand, as everyone up here has said, these are aggressive, but there is absolutely a very real reason why we're doing that. One of the next steps that we'll be engaging in was going to be testing across the region. There are going to be basically sort of two testing sites, if you will. Those are going to be supported by local government and our colleagues in the Texas Medical Center and the hospital community. That is ongoing in preparations. Our rate-limiting step so far has been getting adequate amount of personal protective equipment. Yesterday, we got help from the federal government. That personal protective equipment and some other supplies we need is en route. And once that is in place, we have a plan. We have done some dry runs on those plans. We think that they're ready to go, but we still have to get the personal protective equipment and some of the other testing supplies in place. It's not quite here yet, but we are hoping that by the end of this week that will be up and running. Concurrently, there are some independent testing efforts that are going on by some medical groups across the community. We applaud those efforts. They are all small and being run, and I anticipate and look forward to more of those because this is a huge community, and we will be working together, although maybe through different business models, we'll be working together really to do the same thing. I want to once again remind the community that even though you may be scared, if you are without symptoms, if you don't have fever and a cough or any other symptoms, you do not need to be tested. And in fact, if you were to get yourself tested when you don't need to be tested, you're almost certainly going to get a negative result, and there would be a chance that that would be a false negative because you can have virus on Monday with no symptoms, get tested, get your result Tuesday or Wednesday. When you start to have a little bit of fever, your test result will come back negative because you weren't symptomatic enough. And you would think, oh, this fever that I have can't possibly be from coronavirus, when in fact it is. So you really need to wait until you have symptoms. And through all of these testing procedures, there will be medical professionals to help assess your situation to see whether or not you should be tested. And if the answer is no, please accept that answer and go about your way, and hopefully you will remain healthy and without symptoms. Should you develop symptoms, you may want to then return. But the one thing we don't want are huge crowds overwhelming this testing system, because in a population regionally of about 5 million people, we are not going to be able to test 5 million people all on the same day. And so we absolutely need to prioritize that, and prioritization schemes will come out so that we can be successful in identifying the cases appropriately so that we can then inform the people who are at risk of infecting others that they need to self-quarantine at home and not spread the virus. And remember, anyone who is infected with the virus, the people they are most likely to secondarily infect are going to be the people most important to them. That's going to be their family, their neighbors, their coworkers, and other loved ones. So it is really important that we all are wise and patient and strategic about the testing. It is also equally important that people abide by the advice given by Mayor Turner and Judge Hidalgo in terms of social distancing and abiding by the recommendations in terms of staying away from gatherings. Again, you've heard this before, but if we work together, we absolutely can be successful. And hopefully we won't have days like Italy had yesterday, where Italy alone had 349 deaths recorded. Thank you.
Thank you so much. I will take questions now. Yeah.
Judge, I actually have a question for you just here. Can someone explain how the city and county will enforce this closure and what the penalties are for violators?
So let me have Chief Christensen answer that question.
Good Good afternoon, Laurie Christensen, Harris County Fire Marshal. We're working closely with the mayor's office and the judge's office to ensure that we're consistent. I know Chief West is here from HFD. What's going to happen is the judge talked about a hotline that's going to be set up tomorrow. Our office already has a complaint system in place. Many people have used it when you see an overcrowding or you see an unsafe location. So what's going to happen with this test bank? They will contact our office, we'll prioritize those, and we will be going out and working with the community. I want to make it very clear. Our goal here is compliance. We want to help educate the community. We're going to go out. If we see a restaurant or a bar that's open, we're going to make sure they understand this order is in place. And you heard our leaders say this order is in place for their protection. And we're going to make sure they understand that. We will issue an occupant load for staffing level only if it's a restaurant, because obviously they can still do curbside and the drive-throughs. But bars, we will issue a 0 occupant load, and we will make everybody leave that establishment. Now, let me be clear. If for some reason we need to take enforcement actions because we cannot obtain compliance, we will do that. But our goal is to obtain compliance through working together.
Are you in contact with other counties? Excuse me. Are they doing the same thing? Because how would it work if, we're doing it in Harris County, you drive down the street, you're in Fort Bend County and everything's
so I will speak for the fire marshal side, and then obviously I definitely wanted to let our leaders speak. From the fire marshal side, yes, sir. I work very closely with our local county fire marshals and our city fire marshals, all 34 cities here in Harris County, and we are working on a consistency plan. So to answer your question, I can't speak for those leaders in those counties, but what I can tell you is the fire marshals group, again, we're working on a compliance and working with our community. And I believe the mayor...
Yeah, just to answer the question, so obviously we can't seal our borders, right? And that's part of what we recognize and why we can't issue any sort of travel ban or that kind of thing. And so, we obviously have been in touch with neighboring counties. As you guys saw, Dallas made a similar decision. I haven't heard the latest from our immediately neighboring counties. Everybody's, got their heads down trying to figure out what's best for their community. And so, we'll see what they decide. I do believe, and based on the conversations we've had in other areas, this will be is set up to be successful as long as the community works hand in hand with us. That's really what this is going to be about, is we sat down, thought about what are the steps we need to take that best practices dictate, learning, what we've learned from communities that are farther along than we are, and that is what we're doing right now.
And what I would add, Dallas has already made the decision. Austin is looking at making that decision later on today. So other cities are looking at doing the same thing. I think what we all recognize is that it's important for us to operate in unanimity as much as possible. Take, for example, if we didn't take any action, and let's say Dallas has already moved, then you have a lot of people who are not in college. Schools are out, spring break time. People simply then leave one jurisdiction and then come to another. And what we have seen in the city of Houston, in Harris County, in Fort Bend, for example, is that we've had a lot of cases positive based on people traveling from one jurisdiction to another. And now you have a situation in which New York, Chicago, LA have taken very definitive steps. Those are the top 3 largest cities in the country. We are number 4. And the reality is that if we could close off our boundaries, if we could stop people from coming into our region, that would be one thing. And then I will tell you, yesterday we were at a different position. I know when we were asked the question, and when I was asked yesterday, was very reluctant even to move on our restaurants, bars, and clubs. Same thing with the judge, very reluctant. But you had the CDC made its pronouncement last night, and that was an abrupt shift down to 50. And then the president made even reduced the number even 10. And in his pronouncement today was saying to restrict people from eating establishments and other institutions. So everybody is trying to operate in concert. That's the only way really that you're really going to hold down this virus, slow down this progression, is that if we operate in concert. And these decisions are not made easily. I mean, we've been talking with the the Restaurant Association today, And it's not an easy decision, because when you make a decision, and a decision that may cause someone to be laid off, that's not a tough call. So,
I don't mean to be a smart aleck or anything.
yeah, that's okay.
What about this? I mean, should we be doing these? You know, I mean, you figure there's about 50 people here. I mean, should you do like some sort of online feed kind of thing?
Yeah. No, I'm with you. So this is they remembered as the last one of these. So we just are setting up the feed. We've been working really hard on getting this worked out and out to you guys. But yes, we are working on an online feed for the press. We want to keep the press safe as well. And listen, all of us, I mean, we are, it's 6 feet. And we don't want to see those crowds. I went to, for a run yesterday, and I saw crowds at restaurants. A lot of people complying, yes, but still too many. The crowd coming out of a museum, we can't have that. You should not be in a place unless, you got to be very spaced out. And if, shop online, exercise at home or out in the park.
All right, everybody, good afternoon or evening, depending on where you're watching News Now from. Also a part of coronavirusnow.com. Pilar Arias here with you. Top of the hour coronavirus update, 5 p.m. Arizona time, 8 p.m. Eastern, Johns Hopkins University latest. The website appears to be up and running quite smoothly today. They have been providing updates. These numbers have been changing. Currently, so far in the United States, 4,464 confirmed cases of the coronavirus, 78 deaths, unfortunately. Total number, 17 people have contracted the virus and recovered. There's about 10 minutes left on this Harris County, Texas, Houston news conference in regards to the coronavirus, so we're going to listen in there. And then we've got plenty more news conferences from across the country that we're going to get to as we wrap up our final 2 hours of coronavirus-only related coverage right here on News Now and coronavirusnow.com. Again, we're returning to Houston, Texas.
And I saw crowds at restaurants. A lot of people complying, yes, but still too many. The crowd coming out of a museum, we can't have that. You should not be in a place unless, you got to be very spaced out. And if, shop online, exercise at home or out in the park. But we shouldn't have crowds, and we're absolutely, working on that, certainly in our own, practicing what we preach. Yeah. So the analysis we had, and Mayor, if you'd like to add something too, was, the minute we start itemizing, you lose the main message. And so that's why I would like folks to take away those 3 messages and for you guys to help us spread it. And it's about, restaurants with only takeout, delivery, and drive-through. Bars and clubs are closed. That's number 2. And then finally, you should not stay home unless necessary, and certainly do not be in any crowd. And so I think that speaks for itself. We're already seeing theaters and museums and gyms and all of that close. And yeah, I mean, you should not be in a class with a group of people. You should not be doing that. But we did not want to dilute the message, and the numbers keep changing. One day it's 250, the other day 50, the other day 10. So the fundamental point is, you should not be in any kind of gathering. And yeah, you can go to the grocery store, you can go to the park if it's, sparsely populated, and go pick up your food from the restaurant. Please patronize those restaurants. We need folks to support the businesses, but we don't want to see crowds. We don't want to see people out in groups or a house party. Yeah. Right, so I'd watch a movie at home. I mean, I think they released Frozen online in Disney Plus 2 months early. Seriously, watch it at home. This is not, and we're seeing the theaters closed. So the fact that we're not itemizing it doesn't mean it should not be happening. We don't want to see crowds. We obviously. I would encourage folks to stay away from any kind of crowd, whether that is a theater, whether that is a gym, whether that is a wedding, whatever it is. You should not be in a group, and certainly regardless of whether you're young or you're at a at-risk community. Yeah.
Let me just say, this is not a lockdown. Okay. Let me be very, very clear. This is not a lockdown. What we are attempting to do is to be very measured at what we need to do to slow the progression of this virus so that it doesn't overwhelm our healthcare delivery system. And let me just say this. Neither should people expect government to tell them what to do on every single thing before they do what's right. Government shouldn't have to tell you what to do. And a lot of people are looking for government to tell them to be responsible. So this is not a city or county lockdown. These are very measured steps based on what we are seeing that are needed at this time to slow the progression. But if you are going someplace and you see that you can't have social distancing, then you need to step out of there, okay? So people still need to act responsibly, and individual judgment is always good. But these are very measured steps, because every time we take a step, there are going to be impacts on people. So we don't want to go and I don't think people should look to government to tell them every single thing that they should or should not do. We are taking some very measured steps. People still need to exercise their own judgment and be responsible.
What about mass transit? Anything with mass transit, anything different like with mass transit?
Well, I think, and Metro, for example, is working on helping with the social distancing, but we also recognize people need to utilize mass transit, because there are a lot of people that don't have cars or trucks, and so they need to use it. And that's why I'm saying, there are some things that simply will have to take place because people need to get from point A to point B. And we're mindful of that, and we're very sensitive to that.
I think I have a question for the fire marshal.
Yes, sir.
That ignore these guidelines, what's the punishment? It's a civil punishment, isn't it? Not criminal. Wouldn't be a criminal violation.
That's right. It'd be a citation. It would be a citation. That is correct. Yeah. So it's it could be up to $2,000. But what I'll say is also it could be it can be enhanced like anything else can. It depends on the environment and that patron and not necessarily the patron, but the business owner and how they want to work with the law enforcement officials that show up. Now, it could be the fire marshal's office. It could be the sheriff's office. We work very closely with our sheriff's department and whoever shows up. So as long as they comply, again, our goal is not to issue citations. If we can get compliance, just like they've been saying, let's work together. We do this during hurricanes. We do this during events. Let's work together. Let's get people out of there. If we show up and you're doing it, we're going to talk to you about it. But if you comply, we're going to try not to issue those citations if possible.
Yeah, so for obviously we recognize the human impact of these decisions, and that is why these decisions are tough ones, and we're putting on the balance, and it's going to hurt right now. It's going to be very, very painful, but it will be a lot worse for the community, for the economy, for our residents if we don't act right now. And so we recognize the impact. The things we're working on, as I mentioned, price gouging, our county attorney is working on that. We are working with the school districts and the food bank to ensure that the kids have their food provided to them. I've seen a lot of our JPs who are not pursuing evictions, and so of course they're each making their individual decisions. We are working on the volunteer, trying to compile volunteer support. We are asking the municipal utility districts and the public utility districts to take the step the city did to not shut off water during this time. We are continuing to explore what more we can do. Look, we've got all the best people from around the county looking at this question. What can we do? And to the extent there is something we can do, we will do it. And unfortunately, some of it does fall to the federal government. And that's where we're watching very closely what comes out of there, to what extent they can help us with unemployment insurance, to what extent they can help us with the different areas that impact folks who will find themselves without the same kind of job, childcare. All of those issues are tough, and be assured that we are doing everything we possibly can, and as we always do at the county, pushing the envelope as far as it can go, to where we are doing and being creative about the steps that we can take. So, stay tuned on that.
And let me encourage people: take out, pick up, delivery. Take out, pick up, delivery. In talking with Cameron earlier, that's Cameron, president of the Houston Restaurant Association, and I certainly want to acknowledge them because we're talking a lot about compliance. But let me say to you, the restaurants in our city, in our region, in the county, they want to be partners. They want to be partners. And one of the things that they did ask for example, is pick up, take out, delivery. That's important. And so, that's one way we can be supportive. And then on the federal level, the bill that's making its way through would provide assistance, for example, to those businesses, I think with less than, I want to say 500 employees. So that would be a big, big plus.
And maybe the Restaurant Association could tell us, have they estimated the economic impact on that industry of this latest order? Anybody know?
We don't have an official number. We know it's going to have a large economic impact. But to us, this is an international health crisis. So we're working with the mayor. We're working with Judge Hidalgo to
Large is $20 million, $10 million?
we don't have an official number right now.
Yeah, right. No, and honestly, this is the question everybody's struggling with. And again, we're all trying to run down, but the calculus we have made is the worst case scenario pales in comparison with the impact of this in terms of economy. Let me add, and then I'll wrap. The other thing we're pursuing is SBA loans through the federal government, seeing as we have a disaster declaration for, qualifying businesses. So we're trying to look at that. So anyway, we'll answer questions one-on-one. Thank you guys so much.
Metro Rail will run normally too, Mayor. Are they cleaning them more?
All right, everybody, just got word. We're actually going to head to Capitol Hill here next, and that's because we're going to head on over to the House floor. It is live. We're hearing that they're having to shore up some of the loose ends, tie up some loose ends, so to speak, on the coronavirus-related bill coming from Capitol Hill. Remember, the House approved it. It was headed to the Senate. So it appears that they're just tying up some loose ends to before this can go for a vote. So we're going to listen in live on the House floor. I also want to let you know that Honolulu, Hawaii is also having their own coronavirus update live right now. I have been reporting on it since the beginning, so that will be coming up next here on News Now. But again, we're going to head on over to the House floor. We are hearing this is coronavirus bill related.
Resolution 891, the House stands adjourned until 9 a.m. on Thursday, March 19th, 2020.
All right, so whatever they did, it was extremely quick. I'm going to let you know right now, our executive producer is letting me know that they were trying to pass the revamped coronavirus bill with technical corrections, hoping to do so via unanimous consent without objections. Otherwise, must come back to re-vote. So again, we just got word from Chad Pergram. The House approves retooled coronavirus bill via unanimous consent. The measure contained technical corrections to the original version okayed in the wee hours of Saturday morning. But again, the House has approved the retooled coronavirus bill via unanimous consent. That means no one in the chamber verbally shouted, "I object." There had been threats that GOPers may do so earlier that would have stalled the bill, requiring the entire House to come back to Washington to vote on the measure again. But yet again, the retooled coronavirus bill passes with unanimous consent. I'm going to head on over to the report out of Honolulu, Hawaii, next, right here on News Now, also live streaming on coronavirusnow.com.
However, during this health emergency, as we are recommending actions to initiate social distancing, some of these provisions are just not workable. We want government to continue to work as much as possible during this time, but the Sunshine Law provision makes it impossible. The proclamation allows administrative hearings and public meetings to be conducted through remote technology and telecommunication tools. All reasonable measures will be taken to ensure public participation that is consistent with the recommendations of social distancing practice as advised by the CDC. The emergency proclamation also waives the 1-week waiting period for unemployment insurance. We do know that COVID-19 epidemic impacts our workers all across the state. We will be eliminating the 1-week waiting period because we know that many in our community will be not working during much of this slowdown. The supplemental emergency proclamation waives the 1-week waiting period for applicants who are unemployed as a result of COVID-19. Just want to remind the community that doing our parts also recognizes that if we go out and hoard toilet paper and other necessities, it really makes it difficult for others in our community to continue to be able to participate. We are suggesting that people should use restraint. There has been no interruption of supply lines. Matson and all shippers to the islands continue to operate under normal conditions. This supplemental proclamation specifically addresses hoarding, and we do know that we can take action if we do believe that it is getting out of hand. Also want to note that under my first emergency proclamation, price gouging is illegal. Sellers may not take unfair advantage of consumers during an emergency or disaster by greatly increasing prices on essential consumer goods. And certainly I would ask the community's help if you identify situations where you believe that merchants are gouging the community. Please call the Office of Consumer Protection. The health of our community is our #1 priority, and this supplemental proclamation, we are ensuring that the resources necessary to fight the spread of COVID-19 in our community is available. I'd like to introduce the Director of the Hawaii Emergency Management Agency, Ken Hara, who will become Incident Commander dealing with the COVID-19 situation.
Thank you, Governor Ige. I wanted to start by saying the National Guard is not taking over. I'm taking over as the Incident Commander, as the Administrator of the Hawaii Emergency Management Agency, or HAEMA. The decision to transition me as the Incident Commander follows President Trump's emergency declaration. We'll align all of our activities with the National Response Framework, as we do for all disasters. Yesterday, FEMA provided an incident management assistance team to assist the State Emergency Operations Center. Region 9 Director, Mr. Bob Fenton, will be the Federal Coordinating Officer. From today, all federal requests and coordination will go through HAEMA and then to FEMA Region 9. HAEMA will work closely on emergency management, medical health and care stakeholders, and I will consult closely with Dr. Bruce Anderson and his Department of Health team for all health and medical decisions. Thank you.
We have been very fortunate that our healthcare, the private sector healthcare providers in our community have really been committed to working with us to keep our community safe. I do know that access to testing has been an issue of concern in our community. We are committed to providing testing for COVID-19 to all of those who are appropriately candidates for testing. I am proud of our private sector partners who have established more than 40 testing centers all across the state so that those who are ill and believe that they have been exposed to COVID-19 can go to a community testing center and determine if the conditions are met and request to be tested for COVID-19. I'd like to introduce Hilton Ratho, Executive Director of the Healthcare Association of Hawaii, who represents all private hospitals and long-term care facilities who have been instrumental in organizing the private sector response to COVID-19. Hilton.
Thank you, Governor. We understand the public is very concerned, and our physicians, hospitals, urgent care centers, and community clinics across the state, Healthcare Association members and non-members alike, have been working together on this unprecedented effort. As the Governor said, screening sites are for patients who meet screening criteria for COVID-19, and a physician's order is required to collect a specimen for screening. For screening, individuals will be asked, do you have a fever, cough, or hard time breathing? Have you come in contact with anyone who is sick or who has COVID-19? Or have you been in a country or area where there is COVID-19? If an individual meets these criteria, a specimen will be collected both from the back of their nose and their throat. Also, if an individual meets criteria, and this is very important, they're requested to self-isolate until their test results come back, which generally takes 3 to 4 days or could take even longer. The Department of Health has published on their website today a list of 42 sites across the state of Hawaii that can screen for COVID-19. The list will be updated as additional sites become available. This list is fluid as more organizations are working to stand up screening sites. There are 21 hospital emergency rooms across the state that can screen for COVID-19. In addition, there are 11 screening clinics, 6 urgent care centers, 2 community clinics, and 2 federally qualified health centers that can all screen for COVID-19. These sites are distributed across the state. There are 27 sites on Oahu, 4 on Kauai, 6 in Maui County, and 5 on Hawaii Island. We will continue to monitor these sites and provide additional resources as the need becomes available, becomes necessary, and we really appreciate the collaboration of the Governor, the Department of Health, and the National Guard as we all work together. Thank you.
I just really wanted to conclude this press conference by just again encouraging all the community to realize that we need to work together to get through this. And certainly I'm proud to be governor of the state of Hawaii because we learned a long time ago that when we work together, we can do great things. We are asking those who are sick and may have symptoms to see if they should be tested for COVID-19 and then proceed as appropriate. For those who are not sick, we are asking you not to tie up resources by requesting to get tested when unnecessary.
All right, everybody, this news conference in Honolulu, Hawaii, still going on live, but so was a news conference with Mayor Garcetti in Los Angeles, California. Our neighbors very close to us here in Phoenix, Arizona. I understand that News Now, as well as streaming on Coronavirus Now, is not just nationwide, but worldwide. But again, since I am already recording this news conference in Honolulu, Hawaii, we're going to head on over to Los Angeles live right now.
While you practice safe social distancing and you help our city flatten the curve. Taken together, these temporary closures and restrictions announced last night will prevent large gatherings and strengthen our work to slow the spread of COVID-19. But I also want to reassure Angelenos about their public safety during this crisis. Crime is down this year, in the past week down even further. That said, Chief Moore and I had discussions, and Chief Moore has asked half of our detectives to go now and work on the streets of Los Angeles to help supplement our patrol officers. 50% of those detectives are now out on the streets and making sure that any challenges that arise in our neighborhoods at grocery stores or folks that want to make sure students and their children are safe when they're picking up the lunches that they need, that they will feel secure in this city, and our officers will be there to assist them. We know all Angelenos have had to make huge changes and sacrifices during this period. Those who are older, those who are younger, those who work, and those who go to school. Today was the first day that our LAUSD schools were closed, and a change in routine like this can be very confusing for both the children and parents, and it puts a strain on our families, our teachers, and our communities. And I want to thank all the LAUSD employees who have stepped up to volunteer to help, and I know the district will be announcing more about that tonight. But we're working to make sure the whole family is taken care of during this crisis. We understand that earlier today that we learned that LA clarified their plan around the 60 grab-and-go centers for meals to make sure children can continue to get the nutrition that they need during this crisis. And the district will clarify details on this in an announcement later tonight. But if you're looking for the closest place to feed your children, you can go right now to achieve.lausd.net, and those locations are now up and live. Schools are closed. Many workplaces are shut down for remote work or altogether. And in the last few days, we've heard from people across our city who worry deeply about how they will cope, what they will do without the sources of income upon which they rely each month. We hear you, we see you, and we are here for you. That's why last night, and I wanted to reiterate this today, we ordered a moratorium on evictions of residential tenants during this local emergency for people unable to pay rent as a result of this health crisis. I also want to reiterate and remind people that no water, power, or gas will be cut off for you during this period. No one will be evicted, and rents can be deferred. There's been also a tremendous amount of disinformation. I think everybody listening knows what I'm talking about. If I got one text, I got 100 from friends saying that they knew somebody who absolutely was going to confirm that the entire country was about to go into a state of martial law, or that, again, the port was being closed down, the city was going to cease to function, etc. We will have to make decisions in days ahead, but we will never do those in a secret way. I will always talk to you about what's coming the next day and the day after that, listen to our public health officials at the national and local and state levels to inform those decisions, so there will be no surprises. But I can certainly tell you, and I think many of you have checked this online, that those rumors about a national lockdown are not true today. And that's important for all of us to push back the misinformation, the fraud that many people are trying to exercise, financial fraud, testing fraud, and other things. As always, please check with official sources, lacity.org, lacounty.gov, of course, state website at ca.gov, and with our Centers for Disease Control. I want to also add a note on testing, and I thank the county, Supervisor Barger and Dr. Ferrer, for their update today on the new cases and many elements of this. But this is a question that comes up a lot. Why can't I get a test? We can go through in future days, and you can certainly read plenty on why this nation was unprepared and did not have enough tests, and the heroic work that's being done here locally with private sector, with laboratories, led by LA County and our state and our governor to ensure that we have more tests, more testing labs, and more testing capability. That is arriving more every day and in the coming weeks. In the meantime, though, people are saying, I have symptoms, what should I do, and why can't I get a test? Those tests and the lab capacity to process them is being focused on 3 sets of individuals. First, our healthcare workers and first responders, who are at greatest risk, and we need to be out there in the field to help us with this crisis. Second, those who are the most vulnerable, our seniors and those with pre-existing conditions. And third, people with severe symptoms. When you don't fit into one of those three, it's unlikely today that a test is available. So what should you do? The advice is clear. Stay home, self-isolate, and make sure you're not coming into contact with other people. If you have extreme symptoms, that's the time to visit a hospital. Stay in close touch with your doctor, and we hope there will be tests not only for those who are symptomatic, but asymptomatic coming in greater numbers in the next couple days and certainly in the week ahead. On food distribution, I hope some of you joined us earlier today as I joined together with the heads of our grocery chains in a supply center. It was in Paramount, where we saw the actual evidence of all the food that is there, and to encourage people to not panic buy and not to hoard. That panic buying and hoarding comes at an expense. Those who need food are not getting it, and it is causing our workers that are out there in our grocery stores to be under higher risk than they should be. So please, buy food for a week, don't buy it for a month or even for multiple months. The food will continue to come, and we hope that you could see that today with your very own eyes as well. There is no need to stockpile. Water will continue to flow, as I mentioned. Toilet paper and paper towels will be replenished quickly, and in a matter of a few weeks, we're told that's when hand sanitizer and other things will be there. So do your best to share with one another in the meantime. I'll say it one last time, hoarding is hurting our community, and your behavior can cost someone their life. Finally, as we undertake efforts to slow the spread of this virus, I've heard from Angelenos who are eager to help, to do what we always do, reach out a helping hand to neighbors and folks around. You don't have to wait for any official government instructions. Certainly check on seniors you know who live in your building or your neighborhood. See if you can help them get food if they're unable to go out or they're self-isolating. And look for those folks who are the most vulnerable. For people who are quarantined, check in with them. Call them on the phone. Look for ways that you can video conference, play a game virtually, or other things. Let's make sure that we don't have social isolation while we have geographic isolation from one another. And to answer the call that we have out there for folks who want to go further, I mentioned last night our LA COVID-19 Crisis Fund, which is out there to support families, healthcare workers, unhoused neighbors, and to build our capacity to respond to this crisis with real-time research. I encourage you again to give what you can, and you can go to this fund at coronavirus.lacity.org. That's coronavirus.lacity.org. We raised tens of thousands of dollars in the first day. We want to continue that money coming if you have the means to do that, and we will make sure that money gets to the people that need it most and for the effort that our frontline workers need for equipment and other things. We've seen the leadership of our philanthropic community and the generosity of our corporate giving. But it is time now to elevate our efforts, and that's why I've asked Matthew Johnson, our former president of our police commission, to serve as the chief of COVID-19 philanthropic and private sector community emergency response. Whether that's donations, whether it's technical assistance, or whether it's research, Matt will help us oversee this throughout Los Angeles, mobilizing our business community to lead a process that ensures our city's corporate and philanthropic giving is strategic, well-informed, and effective in slowing the spread of COVID-19. As individuals, as communities, as a city, everybody's doing their part. And thank you from the bottom of my heart for your courage in these tough days. Thank you from the bottom of my heart for your loving of your fellow Angelenos during these tough days. We can and we will stop the spread of COVID-19 in Los Angeles. And while we have still challenging days ahead of us, I believe more than at the beginning of this crisis in the strength of this city, in our ability to come together and to help one another, and we are all first responders in this effort. So thank you for your work to save lives in this critical period. Maintain that distance, make the right decisions, reach out to those in need, and we will get through this stronger than ever before. With that, I'm going to turn to questions from the media that are going to come over speakerphone. We're trying to do best practices here at City Hall, and I'm happy to answer those questions, and then I'll be giving some remarks as well in Spanish. We'll take questions.
Thank you, sir. All right, the mayor, they're answering really, I think, a lot of questions that the average person has. There's one here. There's going to be a pause on evictions. They did some parking enforcement relief, not all parking enforcement relief, the meter spots in front of
Sounds like the
businesses.
meters are still going. Yeah.
Right, to clear those metered spots. They said crime is down. They will not turn off the water or power, so giving some people a break where I have trouble paying their bills.
And eviction, too, a hold on evictions as well. This, of course, after his decision last night to essentially shut down all gyms, restaurants, dine-in restaurants, as well as...
All right, everybody. So that was our sister station, Fox 11 Los Angeles, KTTV, providing coverage. They just showed Los Angeles Mayor Eric Garcetti's news conference there, as well as you heard him that he's going to be taking questions from the media via speakerphone because they are also practicing social distancing. They're not having news reporters show up at their conferences, news conferences. So I just wanted to let you know that was the latest there. This is the latest from Johns Hopkins University, tracking every single COVID-19 case in the world. I was going to say in the U.S., in the country, but no, worldwide, globally. As of right now, though, this is the situation in the United States. 4,645 is what Johns Hopkins University is reporting, 85 deaths. I'm going to take you back out to Honolulu, Hawaii now. I have been recording on this news conference. You might see a little blip in the record, and that's because I accidentally pulled up Los Angeles at the same time I was doing the record. But other than that, we'll be in Honolulu, Hawaii for their coronavirus update.
Unnecessary. This really is an all-community effort. Well, we need to work together to keep our community healthy and safety. So we want to encourage people, when you are sick, to stay at home. Don't go to work. When your children are sick, keep them at home so that they cannot infect others. Most importantly, practice good hygiene, wash your hands frequently, use hand sanitizers, and help us keep our community healthy and safe. Any questions?
Are you going to talk about the Kualoa case?
We don't have the details on those cases today, so we will be providing information as we get them on that case later on.
You mentioned the community being on the edge of community spread. Do you have anything that you could elaborate on that?
Well, I do think that case at Kualoa was one of them, where an individual was infected and other family members were infected by the virus as well.
So you're confirming then that that person and family members all in that household, because I know there's a lot of people living in that house, are infected now as part of community spread?
No, we will be providing additional information as we get it. Certainly, I don't want to speculate. I know that you've talked to many individuals involved with that case that I have not had the opportunity.
So talk a little bit about what, if any, of the National Guard resources are being used at this point, and then what is the next step in doing that?
Sure. We have a limited number of National Guard people who have been activated. They're really involved with supporting the Emergency Operations Center. The proclamation stands up the Emergency Operations Center as consistent with the federal presidential proclamation. So there are planners and organizers that are part of that to support the Emergency Operations Center. We also have stood up several National Guards people to serve as liaisons to the Department of Health. We do know that the Director of Health and much of the department will still be critical partners as we move forward. And so a number of the Guards people will be serving as liaisons to coordinate activities, ensure that the appropriate information is shared. As you know, and Ken Howard talked about the FEMA IMAT team showing up, so part of that support would be to integrate county, state, federal action so that everyone is aligned to keep our community safe.
Governor, the Waikiki businesses are offering to come IRAs. At the same time, President Trump is saying limit gatherings to 10 or more. What should local residents do in terms of opportunities to help businesses at the same time?
Well, I mean, I do think that, we encourage people to judge social distancing is very important. We are encouraging our businesses to look at what practices they need to implement to allow for social distancing within their business operations. As we had said last week, the Department of Health had issued guidance that events of 100 or more should be rescheduled or considered for postponing. As you know, the CDC issued new guidelines at about events of 50 or more, and we're in the process of evaluating that recommendation, and we'll be coming out with a more specific recommendation later on.
Are there any plans to provide any relief for service workers, particularly tipped workers who are going to be losing a lot of that revenue, especially maybe like suspending the tip credit, for example? Or...
No, I mean, we're looking at a wide range of actions that we can take to help our community. Obviously, the most obvious one is unemployment insurance, but we are looking at the other safety net programs to provide support for our community, and we will be making announcements as those decisions are made.
Governor, legislative leaders had suggested maybe more temperatures taken at the airport. Anyone coming in from the mainland, is that something that you're considering?
We're looking at all of the activities and actions that we can take. We do know, and I hear it, and I share the concerns of many. A lot of the instances and the positive COVID-19 results came from visitors. So certainly we're looking at how and what actions we can take to try to identify those who may be ill. We're also looking, and I know that cruise ships, and although a lot of the large cruise ship lines have shut down, we do know that there are smaller cruise ships and others that remain a concern of our community, and certainly it's a concern of mine. So we're looking at what actions we have, what state authority we have that we can exercise to better screen those who are on ships and those who are on airplanes.
So there's a boat scheduled to dock in Hilo on March 20th. You folks are going to send some mitigation, quarantine.
No, I mean, we're evaluating what we can do and see what kind of screening or what screening the industry is doing. They are required now to have physicians on the craft. We're looking at what we can do to further screen people getting off of the ships.
Yeah. So let's follow on to what the governor was talking about. So this morning, I contacted both the deputy directors of the Department of Transportation for airports and harbors. And we're going to start working together on formulating a plan to look at screening people at both the cruise line passengers as they get off and also at the airports. So that's work in progress. We'll have both combination of the National Guard planners, Hawaii Emergency Management planners, and those from the Department of Transportation. So that call was made this morning. To your question about the cruise line, my understanding is the Cruise Line Association is temporarily banning all cruise liner ships from coming to Hawaii for 30 days. So I don't know if that's still a valid schedule or not. Okay, thank you.
Governor, any comment on reports or appetizer about the session going on break?
No, I mean, I have had discussions with the legislative leaders, and we've talked about a lot of different options. I know that they are concerned, and they're working through one of the reasons for including in the emergency proclamation waiver of sunshine and other provisions is to really look at how we can conduct business in an environment where social distancing is important. We recognize that public participation is a key part of legislating, and certainly the suspension of the session allows both House and Senate to look at how they operate and think about what changes they can implement to be able to conduct the people's work in a method that allows everyone to understand what decisions are being made in a way that allows us to complete the session. You know, we obviously understand how important it is for the legislature to complete its session. So I certainly support.
Focus on street sweeping around encampments, ensuring emergency access, keeping colored curbs clear.
Is working with House and Senate leadership about how we can continue to conduct the people's business in a way that keeps our communities safe.
With other cities already taking curfew measures, how close is the state doing anything like that?
Well, I mean, I think we are looking at all the options. You know, the focus really is on how to keep our community safe. We do know that social distancing is the one tried and true parameter that allows us to flatten the curve and spread out the incidence of infection so that our healthcare system doesn't get overwhelmed and that we can conduct as much of our activities as normally as possible. We know that the family lives here in the islands will be impacted by COVID-19 for months, at least 2 months at a minimum. And so certainly we are looking at what actions we can take to keep COVID-19 out of our community, to identify it if it does come into our community, and really take action to spread the curve so that we can handle it within the resources that we have.
The Kualoa Ranch is the first community spread one, right? I mean, aren't you concerned? I'm sure you're concerned, but how is this?
I don't know exactly what is the Kualoa Ranch. We do have a case that we believe is community spread. So we have not had that opportunity to talk about that. You know, I think we'll provide that information when we have facts to provide. As we assured you, we would not participate in rumors, and we have not had the opportunity to get all the information and facts on those positive cases that just arrived.
On when that information will be provided?
Well, we'll keep you posted, and we'll let you know.
Aside from social distancing, what other measures can you take? I know we're talking about actions here, but when can we expect to hear about possibly screening people at cruise lines at the end of the week? Or?
Well, I mean, we are working to get that done.
Yeah, like I just mentioned, right now there's a reprieve for 30 days. And just this morning I talked to the Deputy Director of Transportation for Harbors. So we're going to start this planning effort. So there'll be a plan in place before those 30 days are up. Okay, sure.
Measures against hoarding. What could be done about that?
In consultation with the Attorney General, we could order the people to stop right now. I mean, worst case is to try to have that enforced, you know, with local law enforcement, and then if need be, with the National Guard.
Are you hearing a lot of reports of price increases?
We've heard some reports. That's why we asked that they contact the Consumer Protection and report it.
You want to get details?
Correct.
To clarify on the further screenings, in the past you guys have said that the reason that you were unable to do that was because the federal government had not allowed us to do so, the extra screenings at airports as well as the cruise lines. It's frustrating for you that, you know, now that we've been asking for this to happen for months, and then now that we have confirmed cases here and potential community spread, now they're considering expanding that?
Well, it's not the federal government that's considering, it's us. And now with this, we're aligning the national response framework. Worst comes to worst, we can try to find an area off of the airport to do, you know, because the airport is controlled by federal authorities. So that's why we're in the initial planning stages, so I'm working closely with airports and harbors.
So the state does have the capability and did have the capability to do these temperature screenings?
I don't know that now. Like I said, I started the coordination this morning.
Governor, what is the significance of having
I think, for the most part, this started and was initiated as a public health matter, and that's why Dr. Anderson was the incident commander and really drove all of the activities. I would say the majority of issues were really public health decisions that needed to be made. The president's proclamation really says that this is an emergency similar to natural disasters and those kinds of emergencies. And the president said he wants to deal with it in that same vein. So he asked all of the states to stand up their emergency operations center. He asked us to appoint, as the incident commander, the director of Hawaii Emergency Management Agency to lead point, because all of the communication lines are already established between HIEMA, FEMA as the federal region coordinator, and FEMA will be the point of contact for access to all of federal resources, just as it is in a natural disaster. So the reason for that is, the flow of funds are already defined, the flow of communications. There's already a process that county, state agencies understand, so that when they have a need, they can already initiate the request, and we can evaluate it at the state level, determine whether we can support the requests. If it's beyond the capacity of the state to support, then we forward it to the federal government. So it is a process and structure that has worked and survived the test of time. It's a way that we know how to identify needs that we have here at the county or the state level. And most importantly, it's a way for us to systemically request assistance from the federal government in the language that they understand and can respond to. Ken, I don't know if you wanted to add anything else.
No, I think the governor hit it exactly right on the head. The expertise is there, the construct is there, and now that FEMA is the main point of contact, it just logically makes sense for us to go and adopt that same national response framework. Earlier, as we talked about advanced planning. So the Hawaii Emergency Management Agency and Department of Health have been planning for sort of the worst case scenario, but really we've been siloed. So within the next 24 hours, we're only going to get those planners together and nest both plans. My comment to them was, we need to move and act at the pace of an unprecedented crisis. We need to make assumptions that we got widespread community spread of the virus, the COVID virus. If we keep waiting to react to certain situations, we'll be too far behind the power curve. So we're going to plan for the worst case, but hope for the best. So we got these planners working nearly 24/7 now to come up with a comprehensive plan from worst case, if we do need to quarantine certain neighborhoods, or the best case, just try to monitor and to mitigate the spread, hoping that there's no huge cluster. I think that if we keep reacting, it'll be just really bad for the state. But I want to make sure that everyone's not panicking. There's a lot of misinformation going on in social media, right? I think some of you saw that Hawaii Island, there was a mandatory quarantine. That is not the case. If we go to that, it'll be the absolute last resort. We are very concerned about the civil liberties of the people of Hawaii. So that will be the last decision. So I want to let people know, do not panic. Go back to don't hoard, because everyone needs these critical supplies. Mayor Caldwell made an important point yesterday by saying, by hoarding, the people that can only afford 1 to 2 days worth of supply and food are the ones that suffer, because when you go to those shelves, they're all empty. So let's please take care of everyone. Let's keep this aloha spirit alive. And I also want to ask you, the media, right, to help us. You're an important part. The governor talked about the whole of community approach. If you can help us to share facts and not jump into rumors and come to us for validation, we want to partner with you. It's important that the people know what the facts are so they don't panic. Thank you.
Governor, making the decision to suspend the Sunshine Law, did you get an indication from boards or commissions in your departments that they have the capacity capacity to either video conference or meet remotely?
No, certainly that's part of the planning that we're doing now, trying to think about what's the best way to facilitate those kinds of meetings. You know, we do have assets all throughout state government. You know, our university campuses are all interconnected by video conferencing. And so there are other assets in our community that don't get access by boards and commissions on a regular basis. So we are looking at all of those opportunities as ways that we can ensure that our boards can continue to meet, that we can get quorum, that we can provide public sunshine to the process so that the public's right to know and be involved with decision making can continue in a way that doesn't require them to all show up at a conference room where we have people exceeding the 50 individuals or more that CDC is recommending, or the 100 individuals that we talk about at this time. You know, we are in the process of evaluating those guidelines, and certainly we'd be inclined to move toward the CDC recommendations.
Ken, you talked about the worst case scenarios of the teams. Is this DMAT? Is this the team that's there to do the worst case scenario? Is that what you're activating or putting together?
Well, the DMAT is just a small, you know, medical assistance team. I'm talking everything, right? It could be National Guard, it could be federal assistance. That would be, you know, this is an international crisis right now. We believe that we'll be able to mitigate that spike. You know, Dr. Anderson talked about if this thing gets out of control, that huge spike, you know, that's where it'll exceed our resources and capability. But we think with the measures now that we have, the social distancing, we cannot stop stressing that, and the hygiene will help the spread. And if you're sick, stay home. And that way we can flatten that curve so we never exceed the resources within the state. That's what we're trying to do.
General, are there lessons learned from your...
Yeah.
General, are there lessons learned from your agency from the fall facility that will help you prepare for this?
Well, help me to prepare for this. I think trying to prevent fear, right, and then having the community to have trust in the Hawaii Emergency Management Agency and FEMA is important. So, you know, it was very unfortunate what happened. I'm intimately familiar, right, because, you know, that was part of my life for 2018. But I think we really bounced back following the Kauai floods, the Kilauea volcano eruption, Hurricane Lane, and Hurricane was Olivia, right? Hawaii Emergency Management Agency, regardless of initially how low their morale was, every single one performed at 110%. Everyone was there for multiple hours, and they proved that they can function, and they're highly qualified and experienced for major disasters. So we need the trust of the people, and that's why I need your help to ensure that we keep that trust. I'm not saying give us a buy, right? If we mess up, let us know and report it. But if it's something, don't try to go in the got you and be looking for that something bad. Help us to pass factual information so that we can keep the public calm. That's what I'm asking. Thank you. Sure.
Men and women, are they on a different status right now, or is it more people?
So there's a combination. We got our full-timers. Those are the ones we first surged to help with the planning effort that the governor talked about. So we embedded, besides standing up additional planners within the Hawaii National Guard, we also plussed up the Hawaii Emergency Management Agency. We're going to have a tiered approach. The first thing we need now is the next round of call-ups is going to be for that command and control. So we have the structure in place as we bring units and capabilities on.
Are people on standby, or are they being told?
The entire Guard is on standby. The one challenge I have is, you know, I really want to use my medical assets, but they're also employed, right? They work at Queens and hospitals and clinics. So it's really a small percentage that I can tap into. Right now, my numbers when we did a query is about 47 between MDs, physician assistants, and then EMT qualified personnel. So all of these could help with surveillance and testing.
Seeing that we saw people in other countries being treated in gymnasiums, can we get an update, perhaps this is for Dr. Anderson or Hilton Rayfield? What is our medical bed capacity, and where will the folks who do not have permanent lodging, whether they're in trips or housed
So we are updating all our stats. We are reaching out to all of our hospitals. We will have information later today, which we will be able to share. We just wanted to make sure that we had the most current information. So we've been collecting statistics, latest information. We do know, for example, how many isolation beds we have across the state. We're finalizing our numbers on the total number of ventilators, both the ones we have in hospitals, in other sites, and also in backup. We are making sure we understand exactly how many ICU beds and critical care beds are. So we expect to have all of that information compiled and ready so that we understand exactly what our capacity is. And we're monitoring census on a daily basis. We do that anyway. That happens regardless of what's going on. We monitor census. We look at who's on divert. But we're collecting as much additional information as necessary to figure out, okay, what, if we do have to surge in a particular area, what resources do we have to move around? So we're focusing on all those activities right now.
All right, everybody, good evening. Thank you so much for watching News Now, whether it's on YouTube or on coronavirusnow.com. Pilar Arias here with your top of the hour coronavirus update. It is 6 p.m. Arizona time, 9 p.m. Eastern. So this is our second to last update. Johns Hopkins University tracking every COVID-19 case that they can worldwide. Currently reporting right here in the U.S., we stand at 4,661 cases of the coronavirus, 85 total deaths. Unfortunately, that death toll has pretty much doubled since what we were reporting Friday evening. It's absolutely sad there. Total people who have contracted the virus and have recovered is on the top right-hand side of your screen. It is in green. 17 that we know of. Now, unfortunately, they even break down the deaths by the state. So most of them, 48 in the state of Washington, 7 in California, 10 in New York, 5 in Florida, 3 in Louisiana, 2 in New Jersey, 1 in Colorado, 1 in Georgia, 1 in Indiana, 1 in Kansas, and 1 in Kentucky. So this has pretty much impacted every single state, every district, every area, every corner of the United States. It is a global pandemic, an epidemic, and we're going to continue to follow it all for you, the developments right here on News Now, also on coronavirusnow.com. About 6 minutes left in that Honolulu news conference. I'm going to take you back there, and then we've got plenty of other news conferences from across the country to wrap up our final hour of streaming for the evening. But a friendly reminder, please like, share, subscribe. Let your friends, your family, your coworkers, your neighbors, everybody you know about what we're doing right here, especially while people are sheltering in place, while they are under self-quarantine, mandated quarantine. They can count on our stream 12 hours a day. You've got me and Mike Page through Wednesday evening, and then Thursday, Friday, we are back to full strength with your News Now host trio, me, Mike, and Christy. We've got all of your coronavirus-related coverage right here.
On all those activities right now.
President Trump did say today that it would be up to the states to acquire additional ventilators. What is our current stock supply in that regard, and what do you make, or what is your reaction to the president's guidance on that today?
Well, as I just said, we are cataloging every single ventilator we have in the state, and we'll have that information later today.
I did want to, we did have a conference call with the president and vice president this morning, and they said what they would want us to do is access our normal supply chains as the first request. So they're not saying that that they're not going to make equipment or supplies available, but they would want us to access normal acquisitions on a local level first and then escalate it as appropriate. And, you know, we talked about the reason for embracing the the national response model, and that's basically what it is. You know, that we ought to meet our needs locally. As we are unable because of shortages, then we escalate. Counties can escalate to the state. If the state has the assets, we provide it. If the state does not have sufficient assets, then we escalate to the federal government. And on the conference call this morning, they just wanted to emphasize that we should source locally first. You know, they didn't want to see all of the states trying to be prepared and ask for more than what they need. You know, it's that hoarding mentality at the national scale. You know, if everyone requested, you know, ventilators, whether they needed it or not, in anticipation of a shortage, then clearly we would not have sufficient resources. And on the homeless, the mayor is setting up a location to deal with homeless individuals who may become infected.
Governor, with so many people expected to be laid off, are there any plans in the works to be able to move those resources? And since there's going to be needed workforce to do other things in dealing with coronavirus, are there any plans to kind of be able to use some of those people who are being unemployed to do other kinds of work?
I mean, I do think that we're talking amongst the visitor industry, for example, and everywhere to talk about what social distancing means. You know, if you look at a bus and the transit system, obviously, you know, there are a lot of people on the bus. Can you operate with social distancing by reducing the number of passengers on the bus? Well, you can, but that would mean you would need a lot more buses. Well, lots of tour buses are out of work with tour buses. So we are having those kinds of brainstorming sessions to really think about what assets are in our community that have been idle because of COVID-19. Can we redeploy them to help plug the gaps in different areas so that we can keep our community safe by social distancing in every aspect of our lives, at the same time, you know, keep people employed and people being able to be functional and earn a living. I mean, I think that we are all working through that, thinking about how we can be self-reliant, thinking about how we can come together as a community, find the assets that are available to us, and really solve the challenges that the COVID-19 situation presents to us as a community. You know, I think we are considering all options to increase social distancing, you know, to avoid gatherings where it can be a source of spreading infection. So, I mean, we're not at that point. Are we considering it? Absolutely. I mean, you know, we are looking at all actions that can help us flatten that curve and ensure that our healthcare facilities don't get overwhelmed, so that anyone who needs care can get appropriate level of care.
Governor, to follow up on Dan's question about the push-pull, you have some restaurants and some theaters opening and some closing during this time because they're trying to figure out how to handle this. And I was wondering if you can give any advice on that, as I know you've been pushing to flatten the curve. What do you tell people?
Well, I mean, I do think that, you know, we are open, you know, there should be conversations in our community about what kinds of things we can do. You know, social distancing talks about trying to keep even healthy people 6 feet apart, right? I mean, that's the whole notion of we don't want to have an opportunity where we have a gathering of people and they're too close. So if there is a COVID-infected individual, that they can make a lot of people sick. I mean, that's, you know, we just want to ensure that we don't create those opportunities. And clearly, there could be ways that theaters could operate. There could be ways that restaurants could operate in different ways that allows their businesses to continue.
Any other questions? Thank you all for coming today.
Thank you.
We'll let you know if we have any updates.
All right, everyone, that was the latest in Honolulu, Hawaii. Here is a live look at Times Square in New York City. And folks, even when I was there at 6 o'clock in the morning to get tickets for a Broadway show that had standing room only tickets, it was the Book of Mormon at the time when I was there, the summer of 2011. Even that early in the morning, I did not witness Times Square this empty. This, they're saying, is a result of the coronavirus outbreak, social distancing. Nobody wants to be in public anymore. Nobody wants to be in crowds anymore. So it's currently 9:08 p.m. there in New York City. very scarce crowd, barren crowd, however you'd like to refer to it, a lot less people than there probably would be there, especially the evening before St. Patrick's Day. A lot of festivities canceled, dialed down, lots of changes happening as a result of COVID-19. Coming up next here on News Now, also on coronavirusnow.com, we're going to head on over to Philadelphia, Pennsylvania, where they held their coronavirus update this morning.
The latest data on the spread of COVID-19, we are announcing new restrictions on business activity in the city of Philadelphia. In addition, non-essential city government operations will be halted for at least 2 weeks. Managing Director Brian Abernathy will give details on all of this shortly. These changes will disrupt life in Philadelphia, and we do not make these changes lightly. We are well aware of the potentially devastating effect they will have on the businesses and workers in our city. Our administration is actively developing grant and loan programs aimed at business and job preservation. Our Acting Commerce Director, Sylvie Gallier-Howard, will speak about that shortly. For now, I urge all businesses and residents to observe these restrictions so that the threat of this virus can quickly be eliminated. And before I turn it over to Dr. Farley for more of the details, I want to say to everyone, let's be calm, but be sensible. Look out for each other. Look out for your elderly neighbors. Although you're not supposed to have physical contact, you could perhaps order groceries if necessary, or do things to help us all out. Our children that need to be fed are being fed, and we are doing everything we can do to flatten that curve so that we can get back to normal. And it might be a while, but we'll go on from here. So I want to bring up Dr. Farley first. He will update you on the latest cases.
I'm going to take a square here first. So welcome and thank you for coming today. First, I want to update you on the latest case counts information we have for Philadelphia and the region. As of 7:30 this morning, the state of Pennsylvania was reporting a total of 63 cumulative cases of coronavirus infection in the state, of which in the Philadelphia region there were 24 in Montgomery County, 7 in Delaware County, and 4 in Bucks County. In Philadelphia, since the last time we spoke yesterday at 1 p.m., we have 1 new case that's been reported, which brings us to a total of 9 cases in Philadelphia. The 1 new case is a male who is in his 20s and had international travel to an area that was heavily affected. The health department is now identified 104 contacts of people who were known cases. They're either being monitored at home or in the process of reaching them to do that. Then an update on the availability and our recommendations around testing for this virus. In the last 24 hours, we have received 88 test results, so that is a large increase from the number of test results we've received in the past. All of those are negative except for the 1 positive that I mentioned a minute ago. The national laboratories, LabCorp and Quest, have greatly increased their testing capacity and their throughput. And so I made a recommendation yesterday, and I want to emphasize it even more today. We want doctors to test more people. If most of those people are negative, that is fine. We need to test more people who don't have this infection so that we can identify the few people who have this infection who are missing right now. So now when I say test more people, I'm talking about testing people who have symptoms. They should not be testing people who are perfectly healthy. But the symptoms can be quite variable, and if a doctor has any suspicion at all, we recommend that doctor test for this infection. The public needs to understand that as part of that, if we are testing more people, that just because someone is tested does not mean they have the infection. We're hearing many people who are worried about someone having been tested, and the vast majority of people, probably well over 95% of the people who are tested, will be negative. Now, as far as the availability of sites to collect the sample, there are several healthcare providers in the city who are setting up rapid and drive-through testing sites. We will give you more information about that in the future, but it's increasingly available to physicians around the city. And the city is working for several options about similar rapid and drive-through testing sites. And as far as new guidance and recommendations, you probably heard that as of last night, the Centers for Disease Control recommended canceling all public gatherings and all meetings with 50 or more people. We had previously strongly recommended canceling gatherings of 250 or more, and considering canceling gatherings of less than 250, we are going to be consistent with the CDC guidelines today and recommend that people cancel gatherings of more than 50 people. If people feel that they have to hold meetings of less than that, there are a series of risk reduction steps which we included in our recommendations around the 250 meeting rule, which we will be recirculating. And they involve excluding people who are ill, excluding people who are vulnerable, having distance between people, and using hand sanitizer as we did here. I want to remind the public that if people have questions about this, we have a 24/7 hotline that they can call to get those questions answered, 1-800-722-7112. That's 1-800-722-7112. And then reminder what everyone can do to stay safe. Stay away from other people. Particularly wash your hands before you touch people, after you touch people. Don't shake hands, don't hug. If you are sick with a fever or dry cough, stay away from people. Contact your physician about getting a test. Let me say, this is a rough patch for everybody here, where there's going to be a period of time when many of us are going to be at home in our homes or apartments, away physically from other people. But there are still, thankfully, plenty of opportunities for people to stay in touch with others and to help others. And I think that's what we ought to be redirecting our energies to. So use this opportunity to call your relatives, including that relative you may have had an argument with and haven't been on speaking terms for a while. Call your friends, call your neighbors, see how everyone's doing. Connect by Skype, do Google Hangouts. There's an awful lot we can do electronically these days without a physical connection to help people out, and this is the time to do it. Thank you very much. Now I'm going to turn it over to Managing Director Brian Abernathy.
Thank you, Dr. Farley. The following changes on commercial activity are effective today, Monday, March 16th at 5 p.m., and will last through at least March 27th. Only essential commercial establishments should remain open. To allow for essential goods to be accessible to the public, the City of Philadelphia designates the following businesses as essential: supermarkets and grocery stores, big box stores, pharmacies, discount stores, mini markets and non-specialized food stores, daycare centers, hardware stores, gas stations, banks, post offices, laundromats and dry cleaners, veterinary clinics for domestic pets, and pet stores. Also deemed essential are commercial establishments that sell any of the following: frozen food products, non-specialized stores of computers, telecommunications equipment, audio and video consumer electronics, household appliances, IT and telecommunication equipment, hardware, paint and flat glass, electrical plumbing and heating material, automotive fuel, domestic fuel, sanitary equipment, personal hygiene products and medication not requiring medical prescription, medical and orthopedic equipment, optics and photography equipment, and soaps and detergents. Food establishments, meaning restaurants and bars, may only accommodate online and phone orders for delivery and pickup and cannot allow dine-in service for the duration of these restrictions. As the mayor said, today we are halting all non-essential city government operations in order to reduce the spread of the COVID-19 virus in Philadelphia. This means that all city government buildings will be closed to the public effective tomorrow, Tuesday, March 17th. Staff members are still expected to report to work on Tuesday, March 17th, unless otherwise instructed by their supervisor. Individual department heads are currently determining what operations are essential, and city workers should consult with their supervisors on their status. Essential operations will include public safety, health and human services, utilities, sanitation, and finance and payroll. I want to thank all of our dedicated city staff for their support during this time, and want to also specifically mention the folks who came together in a very short period of time to make sure that our children were fed today. We were able to distribute over 2,000 meals, and that was done because of partnerships with our city departments and our outside stakeholders. And I'm proud of the safety net that we've been able to put in place for the workers who are going to be impacted by these commercial activity restrictions. And with that, I'm going to turn it over to our Acting Director of Commerce, Sylvie Gallier-Howard, to say a few words.
Thank you, Brian. Good afternoon. I'm Sylvie Gallier-Howard, Acting Director of Commerce for the City of Philadelphia. As my colleagues have said, we recognize businesses in Philadelphia and around the country are especially impacted by the spread of COVID-19 in Philadelphia. We also know that our small businesses, which are the backbone of the city's economy, are particularly vulnerable. Today, I want to share that the city, along with our partners at PIDC, will launch a program to support Philadelphia businesses, help maintain payroll obligations, and preserve jobs impacted by the spread of COVID-19. The program, which is still being developed, will be a tiered program that aims to provide targeted supports for small businesses. The program will include a mix of new grants and zero-interest loans for Philadelphia businesses that make under $5 million in annual revenue. In addition, PIDC will continue to offer its existing lending programs for small and mid-sized businesses on flexible terms to provide working capital, fund contract receivables, refinance high-interest debt, and meet other needs. We recognize the critical need to support businesses and workers during this unprecedented time. This new program will provide needed support to our city's businesses, help them reopen once the COVID-19 closures cease, and retain or rehire employees as they recover. More details about the program, including how businesses can apply, will be announced in the coming days. I also want to reiterate that we are still exploring additional relief options available to businesses of all sizes that are being made available through the state and federal governments as well as other sources. Right now, we are circulating a short online survey to gather more feedback from the business community. It has been posted to our website, phila.gov/commerce, and on our social media accounts at PHL Commerce. And I encourage everyone to send that around and have businesses fill that out. If businesses have questions during this difficult time, the Commerce Department's Office of Business Services is available to answer them. They can be reached through the Business Services Hotline, 215-683-2100, and email business@phila.gov. And again, that will continue even as we have closures, so please do not hesitate to reach out. Thank you.
At this point, Council President Clark wanted to provide an update on City Council operations.
Thank you, Brian. Good afternoon. Just basically, I want to thank the mayor and his team for being proactive to this approach. The simple reality is anything that we can do to minimize any spread of this very, very aggressive virus is clearly something that we need to do. Last week, we talked about the suspension of council sessions and public hearings. For this particular week, we will extend that for an additional week. It will overlap into the budget hearing process. We believe that we will be in a position to have discussions by remote fashion. There is one thing in particular that we are in the process of establishing. There is an ordinance, a transfer ordinance for emergency authorization to make sure that the managing director's office has the appropriate revenue to do what it needs to do to fight this virus. We will be in a position to do that remotely, allowing some levels of access from the public as required by certain statutes. So we're going to do whatever we need to do. We're asking people to follow the signs, follow the recommendations of the city. The city's website is real clear in terms of what you should not do. Working together, continuing to be in a unified front, continuing to have the messaging that's coming out here today. We will figure out we will get through this. Just want to thank my colleagues who are here today to continue to support. So, Mayor, your team, guys, thank you so much for taking the leadership and moving this forward. Thank you.
Thank you, sir, and thank you again for your partnership throughout this crisis. The President Judge, I.D. Fox, also wanted to provide an update on the court's operations.
Thank you, and thank you, Mr. Mayor, for inviting us here today as another branch of government. I am President Judge and Chair of the Administrative Governing Board for the 1st Judicial District. In response to this crisis, I filed a petition with the State Supreme Court requesting that they provide me with authorization to declare a judicial emergency under the Rule of Judicial Administration 1925B. Right before coming down here today, I did receive an order from the Supreme Court granting that emergency power. I will enter an order shortly. As such, the 1st Judicial District and the courts and related offices, with the exception of certain services that we deem essential, will be closed from tomorrow until April 1st unless otherwise ordered by the court. Jury and non-jury, both criminal and civil, as well as preliminary hearings are suspended and will be rescheduled at a later date. Jurors do not need to report for jury duty. All civil pretrial conferences, case management conferences, diversion programs, discovery lists, and trials are canceled or postponed. All criminal trials, pretrial conferences, diversion programs are also canceled pending further order of the court. Prior to this date, we had postponed all sheriff sales in the month of March. We've also suspended the issuance and the enforcement of writs of possession to avoid evictions. We have previously canceled our Thursday mortgage conciliation program as well as our tax programs. The following essential court services will remain available. Preliminary arraignments and emergency protection from abuse orders will continue on a 24/7 basis. Non-emergency protection from abuse petitions secured at family court will resume upon the reopening of our courts. Juvenile detention hearings and shelter hearings will continue as required under the law. An emergency judge will be available from 9 a.m. to 5 p.m. for civil emergency filings. Those must be filed in the Stout Center in person. We operate in an e-filing system, but we are requiring emergency civil motions to be filed over the counter in person at the Stout Center. Those emergencies will be limited to health and medical emergencies, public safety, and emergency guardianship appointments. During non-business hours, the court will continue to, as we always have, to have a designated emergency judge available for the City Hall operator. All pretrial services in adult probation and parole department client interviews will be suspended for the next 2 weeks. Gagnon 1 hearings and EMU supervision will continue. Municipal court will continue to hear video bench warrants hearings for individuals incarcerated in the Philadelphia prison system. In addition, early bail review will continue. Traffic division will remain open to retrieve impounded vehicles 3 days per week and will update the public through press releases as to what days. We will be contacting parties who are scheduled to appear to court during this period to inform them of any rescheduling changes. We will continue to reevaluate all closures moving forward and will alert the public to any change. Again, thank you. We thank our partners in government for their cooperation and assistance. Thank you.
Thank you, Judge. And before I take questions, I do just want to say thank you again to all of our partners in this. To watch the city come together in this crisis has been something that's been truly amazing to watch. The amount of work that has happened at our Emergency Operations Center, the hours that our staff has put in, both leadership and frontline staff, we have been able to prepare ourselves for both the public health crisis, but also to make sure that our vulnerable citizens are protected, to make sure that those who may not be with a job are fed and provided assistance, and that our core functions, whether that's through the court or through the legislative process, are being maintained to the best of our ability as we, again, try to stop the spread of this illness. It is going to take all of us to continue that work. This is not going to end overnight, and it's something that we will continue to work together as partners, both private sector and public sector, nonprofit and for-profit, in order to bring Philadelphia both through the crisis and then figuring out how to rebuild afterwards. And for that, I thank them. And we're happy to take your questions.
Do these have the closure of non-essential businesses, the authority of law, and what we can do if someone decides they're simply not going to close that you know about?
And the question is do these closures have law behind it, and what will we do to enforce? Yes, they do. The mayor has broad authority over these closures, and we'll have both health and L&I inspectors prepared to enforce should businesses open. Sure.
I want to just get one phone number in here. If residents see a restaurant or a bar where people are dining inside after this rule goes into effect, they can call the health department and we will send an inspector out to enforce the rule. The number is 215-685-7495. That's 215-685-7495. If you see a restaurant that is open and people are dining inside, we'll send an inspector out. It's the same line we have when people have a complaint about a restaurant under ordinary circumstances.
Dr. Farley.
I can't imagine. The question was, will we arrest someone who kept their business open? I can't imagine we're getting to that point. Again, I think between our health inspectors and our L&I inspectors, we will be able to manage through this fairly well. Ma'am?
Yeah.
Many of the restaurateurs that I've talked to personally are in favor of this. We're thinking about doing it themselves, and we gave them some motivation to do it, and they've expressed that they're happy with that. So I'm sure there'll still be some people who may violate it, and we have a number, and we'll go out and enforce.
I just have a question for Dr. Farley. It's in terms of social distancing, it's a hot word that we're hearing right now. What exactly are some do's and don'ts of social distancing, and how can people best practice them?
Yeah, so the rules we put in our meeting policy are, try to stay at least an arm's length away from people, up to 6 feet, okay? If you're sick, you should not be in a gathering. Wash your hands frequently or use hand sanitizers frequently. And those are the key additional guidelines there.
And I'm getting a lot of tweets from people concerned about SEPTA.
Right now, SEPTA is operating normally. We've been a reduction in ridership just anecdotally, and it is a major lifeline for people to get to work. So we'll have to make that decision as we, this is a situation that has no playbook. It's hour by hour. Things change in an hour that were totally different just 60 minutes before. So we will continue to monitor that and see what we have to do to adjust, but that is a major way for people to get to work.
And I would actually like to add on SEPTA, it's also a significant transportation source to get to healthcare, to get to anything. And I think for SEPTA to shut down would have a significant impact on our ability to provide healthcare going forward. So the question is, will trash be picked up, and will rec centers still be open for kids to get food? Yes, trash will continue to be picked up. Sanitation is considered an essential service. And yes, our recreation centers, those that have been designated, will continue to be open not just for food for children, but may also provide food for adults and the community as well. The question is, how will we know it's safe to reopen businesses?
So we're going to be monitoring the outbreak, the number of cases that come per day. You'll be able to see that as well. When we start to see the number go down, that's a sign that things are moving in the right direction. These are social distancing approaches. At the same time, we're going to be doing our case containment approaches. We interview cases, we interview the contacts. We think that that is a long-term going to be the way to continue to solve this problem, even if we have cases in the future. In the future, we may be able to continue that and not require the social distancing to stay ahead of this. So I can't say when, but I can say that if you follow that case count, that'll be the best indication.
You said on Thursday or Friday that your case count was difficult because there was a lag in your testing in Philadelphia, which is why you had no case at the time. Is your testing, is Philadelphia able to test properly so that you can measure how many cases are active?
We know we need to test more people, but the testing capacity is improving every day. As you saw, 88 tests today. I think over the weekend we were at 15, 20 tests a day. So as the number of tests increases, we'll have increasing confidence that we're not missing cases. Right now, we don't know for sure.
Dr. Mark, have you been able to model, the New York Times reported last week on some modeling that the CDC had done that actually listed potential death rates and how many people would be sick, how many would go to the hospital. Have you been able to do that in a city with a population of 1.5 million people that happen to be quite poor?
No, I've done some very rough informal calculations myself. Those models are based upon worst case scenario. If this virus is released throughout the community and that the majority of people who come in contact with it get infected. I don't think we're going to hit the worst case scenario. The actions we're taking today are to prevent us from hitting that worst case scenario. So I would not look at those models as predicting the future so much as just something internal for planning.
What are your rough numbers? What is your rough numbers show you?
I can't give you that here now. Again, I am optimistic that we can contain this with the actions we have today.
Nina. So the worker should absolutely file for unemployment. I believe the governor made an announcement on unemployment today, and we're continuing to work with the state to streamline unemployment benefits, SNAP benefits, and TANF, and we'll continue to advocate on behalf of those workers at both the state and federal levels to make sure that this crisis isn't just about those who may be infected by Corona-19. It's also about those folks who may lose their jobs as a result of us taking action to contain the infection. Certainly, we've increased our social safety net around food access, and we are exploring other options, whether that's around individual assistance or additional housing support. As you heard Judge Fox mention, evictions will be suspended. We're continuing to work with all of our partners in order to be able to make sure that our workers are protected going forward.
And then just one more thing on that. I've had some initial discussions with our restaurant industry. They are interested in trying to get together to see what they can do to pool some money or to find some resources to keep their people paid as long as possible.
Yeah, so we know that if this virus were to spread unchecked, that we would overwhelm our healthcare system. The healthcare hospital systems have been planning for that a long time. So one of the key reasons why we're doing the steps today is to try to prevent that from happening. I can tell you that the hospitals have discontinued elective surgeries and other elective procedures and other elective admissions. So currently, the hospitals have more empty beds than they do at any other time, okay, so that they are making capacity available. And there are additional steps that they can take, even to go beyond their typically licensed capacity if need be. So we're working very much on that. We hope we never get to the point of exceeding our capacity. For the moment, we feel comfortable, but it's something that we need to take very, very seriously to prevent us having that point.
General. So we are working on adding additional shelter capacity for those individuals who are currently identified as homeless, as well as a quarantine space for those who may suspect that they have been infected with the virus. That work is ongoing. It hasn't been complete, but it is a top priority to have resolved this week. Again, this is one of our top priorities for this week is to make sure that we have food distribution, housing, and quarantine space for those individuals who are experiencing homelessness. Again, there's a lot happening. We've been able to stand up a lot of services in a very, very short period of time. I'm confident in our team to be able to do that, but I can't do everything overnight. Channel 3 and back. So I can't say why the governor didn't include Philadelphia in his order last night, but I can say that the city has been looking at this for a significant period of time. And again, Philadelphia is the poorest big city in the country. We have significant needs. We wanted to make sure that safety nets were in place for our workers and for those who are suffering poverty. At this point, I feel comfortable that those safety nets are in place or will be in place very shortly. But again, we also need to continue to monitor what the city's posture is every day, hour by hour, day by day, and we will continue to make changes and adjustments as we need to. The question is about changes to the police department and officers on patrol. We always evaluate our deployment strategies around the police department. At this point, there's no deployment strategies or changes to announce. The question was about the officer's funeral for Friday. We are given the CDC's advice last night, we're in ongoing conversations with the officer's family, the FOP, and the police department on what our next steps are. Laura? The question is what is our coordination with the governor's office, and if there's a larger statewide closure that is expected. Our chief of staff speaks with the governor's chief of staff on a regular basis. The mayor speaks with the governor on a regular basis, as early as this morning, or as late as this morning. So they know what our posture is on a continuous basis, and we know what their posture is. We're looking forward to working with Harrisburg as partners. I have no knowledge of a statewide shutdown. I don't think the city has one, so that I would refer back to Harrisburg. Pat? Will ACCT, which is Animal Care and Control Team, stay up and running as the only intake shelter? It will have some operations. Has not been determined exactly what those operations will be yet.
Well, I don't think this is an appropriate time to get into presidential politics and the president. They're trying their best, I think, at this point now to get the test kits out, and if they can do that, that'd be great. But I do think that states and cities are based on their various circumstances, are leading the way. We don't want to dismiss the federal government, because at some point in time there's going to be a huge need to help financially with recovery. Same thing with the state legislature and the governor's office. So we want to maintain good relationships with everyone at this point, so we can utilize all the opportunities to move forward when this is over. Epidemiological, yes. As long as it takes. I mean, again, there's no playbook with this situation, and hopefully what we'll see because of these measures is a flattening of the curve and a kind of calming down of the situation, and we'll go as long as we can. I mean, we're committed to taking care of our citizens and to trying to keep our businesses be able to rebound when this is over, and that's what we're here for, and we're going to need help, certainly from the state and federal government, to do that. Medically speaking? I am not a doctor, and even though I think the doctor here doesn't exactly know.
Yeah. I don't think anyone knows. We've announced this policy effective for 2 weeks, am I right, 14 days, and then we'll evaluate that as the epidemiology unfolds. Yes. They're at isolation at home. We're in contact with them every day to instruct them to look for symptoms. If they have any symptoms at all, especially fever, but other symptoms as well, then we make sure that they're tested. There's no reason to test them if they don't have symptoms, and so we don't do that. We wait to see if they develop symptoms, but we do have that daily contact.
What should people do during this time when they're not working?
As I said earlier, this is a time to get together virtually with your friends, family, and neighbor. There's a lot of opportunities electronically these days to be in touch with people, even if you're not touching people. And people should take that opportunity to do that. You know, human relationships are important to health over the long term, and even over the short term. We can still have those relationships without having to physically be in the same spot. Now's the time to take advantage of that. I don't have any details to say other than that we are working very actively with partners locally, partners at the federal government, to try to have one or more large-scale rapid testing sites available. And so we're optimistic about that, but we don't have anything to announce on that yet.
Question for Dr. Farley or Dr. Abernathy. What recommendations can you, or is it Mr. Abernathy?
Mr. I appreciate the program.
No problem. What recommendations can you make for best precautionary practices for those living with HIV who are not suppressed or other chronic illnesses to ward off this virus?
If people have HIV infection and they're not immunosuppressed, immune systems are in pretty good shape, and so they're no more risk than anybody else. Everybody should take precautions, but the same precautions as anyone else. Keep a distance, wash your hands, and if you are sick, stay away from other people, get tested.
Okay. Great, thank you all. Thank you all. Have a good afternoon.
All right, everybody, we're going to wrap up the stream here on News Now on YouTube as well as on coronavirusnow.com in about 18 minutes, 16, 17, 18 minutes or so. Here's a live look at Times Square in New York City. Pretty much empty, barren, hardly anybody out there, even though it's 9:43 in the evening on a Monday. So we're going to wrap things up in Kentucky. We were showing some of their coronavirus news earlier today. We're going to head to Frankfort, Kentucky.
And the rest, maybe it's time that we learn from them. But practice good mental health. I talked to you a little bit about mine today. When you need that break, when you need that stress relief, go and get it. Our Emergency Operations Center is now at level 3. That helps us prepare for our response. We put out, and it is an order, to close all restaurants and bars to in-person traffic. We can still have drive-through, delivery, and if done right, takeout. Curbside service. We just got to make sure we're not creating lines of people in person that would otherwise frustrate what our goals are. And let me tell you, we need you all to order out. It is important during this time period. These are small businesses. Understand the impact of this order. Let me tell you that this order is mandatory. It's absolutely necessary. It's going to protect our people. I understand it comes with difficulty. So we are waiving the waiting period for unemployment for people that are losing their jobs due to the coronavirus, and we'll waive any work search requirements until the state of emergency is lifted. I know for those that are going to lose their job that is not a lot of comfort. But I want to tell you that we will work every single day to do everything we can to lessen its impact. And I'm going to talk about SBA here in a minute. We're beginning on tomorrow morning. We are closing the state capitol to non-essential personnel. That'll be people who work here. That'll be the media. But please understand that these are steps that we have to take. And even people in that group, if you can work from home, I would now suggest that you do it. It's just one of those important steps we take as we move forward. Okay, some new steps. And again, there are going to be new steps every day. First, we're going to be providing a 3-month extension on driver's license. So anybody who has one that's expiring in the next 3 months, we're going to give that extension. We do not want in-person traffic coming in to those facilities. We are going to, by 5 p.m. tomorrow, close government around the state to in-person services. We are going to pass whatever emergency regulations or the rest that we need to make sure people can get the services that they need. But we have to model the type of behavior that we want to see from other people. We have applied for an SBA Economic Injury Disaster Loan Declaration, and this is to help especially with some of the steps we're taking. The U.S. Small Business Association is offering designated states and territories low-interest federal disaster loans for working capital to small businesses suffering from substantial economic injury as a result of the coronavirus. We have sent our request directly to the SBA, which allows small business and private nonprofit organizations to seek loans from the SBA to help alleviate economic injury caused by the coronavirus. So please know that we are taking all of those steps. All right, here's another big one. With the recommendation from our Secretary of State, who I'm going to ask to step up here now, we are postponing our primary elections by the 35 days allowed under state law. That means they will be moved to June 23rd. Again, a necessary step. We don't want people out there trying to create gatherings where the coronavirus could spread. And just think about the poll worker at your location. We cannot ask people to sit all day long at one of these centers, especially when they are some of the most vulnerable. I think this recommendation by the Secretary of State shows what I've been saying. There are no parties. There's just us against the coronavirus. I'm going to ask Secretary of State Michael Adams to come up now.
Thank you, Governor.
Thank you.
Good afternoon. I'm Michael Adams, Kentucky Secretary of State and Chief Elections Official. State law allows the governor, upon the recommendation of the Secretary of State, to change the location of an election and to delay the time an election occurs. On May 19th, we've got our statewide primary elections for the Democratic and Republican parties. We also have special elections and local option elections in various parts of the state. I made a recommendation in writing today to the governor. It's not something I've done lightly. It's something that was done with feedback from county clerks of both parties around the state, State Board of Elections staff, and others. Most of the powers the governor has in cases of emergency are his sole powers. This is a unique one that actually envisions a role also for me as the Secretary of State. It's sort of a happy coincidence, I think, that you've got a Secretary of State and a governor of differing political parties agreeing jointly that this needs to be delayed for a period of 35 days. This gets a couple of things. Number one, it buys us time. Obviously, the hope is that by June 23rd, the worst will be over and we'll be able to have an election that's as normal as possible. The other possibility is that we won't be back to normal. This will give us time to assess changes that we can make in our election system as to location and potentially even as to method to make sure that we can have a smooth election. If you have any questions, I'll stay till the end. Be happy to answer any that I can. Thank you, Governor.
Thank you. We all ought to thank Secretary Adams and everybody else who is coming together. One team, us, against the coronavirus. That's where we are in this world, and we are going to win by this type of cooperation. Okay, next, I understand that our decision today and other decisions we've made, but specifically with bars and restaurants, is going to cause additional unemployment. I knew it when I made it, and admittedly, it's weighed heavily on me. It's why I needed that extra time today to make sure that that I was healthy and took that moment out to get myself recentered, just like so many people are going to have to. But we want to make sure that those that are in this situation have the tools they need in the coming months. And so I've asked for individuals from the Education Cabinet to be here today to explain the process for applying for unemployment.
Thank you, Governor.
Thank you.
My name is Josh Benton, the Deputy Secretary of the Education and Workforce Development Cabinet. And just to reiterate some of the things that the Governor has mentioned this evening is, we want to encourage, when at all possible, for employers to provide flexibilities to their employees, both with sick leave and opportunities to work from home. But we also recognize that there will be potential job loss as a result of the coronavirus. And so, while we have not yet experienced large-scale job loss as a result of the coronavirus, we want to be prepared for that. But most importantly, we want to serve those Kentuckians who are in the process of experiencing job loss as a result of the coronavirus. So just to overview a couple of processes and to also talk through the executive order that the Governor referenced this morning. The Education and Workforce Development Cabinet will provide unemployment insurance benefits for individuals experiencing job loss and medical quarantine associated with COVID-19. So this means two really different scenarios. One is if someone experiences quarantine and during that process has separation of employment, we will be able to provide unemployment insurance to those individuals. Additionally, if there are fluctuations in the economy that cause employers to lay individuals off, we are going to view both of these situations as temporary job loss situations. So individuals will not have to perform that work search that the Governor referenced earlier. They will either when their time of quarantine ends or when their employer calls them back to work, they will remain on unemployment insurance until those times have come. We worked with the U.S. Department of Labor to secure this flexibility so that in either one of those scenarios, we can be the most accommodating and most supportive to those Kentuckians who are experiencing job loss in either one of those scenarios. Today's executive order is something I also want to address that talks about waiving the 7-day wait period. So typically, we process unemployment insurance benefits much like companies process payroll every 2 weeks. So when someone loses their job as no fault of their own, they can apply or file for unemployment insurance. Under Kentucky law and guidance from the federal government, we have a 1-week waiting period. And during that time, we assess and do due diligence on that claim, and then determine that person to be eligible for benefits. After that 7-day period has ended, then they can request payment on benefits. As the current law stands, they cannot receive benefits for that waiting period. So the executive order today allows individuals who are claiming benefits to do 2 things at the same time. When they experience job loss, they can file for unemployment insurance and request benefits, so that first unemployment insurance benefit is for a full 2-week period. After the initial claim, they will have what's the traditional 26 weeks of unemployment insurance, and again, they can remain unemployed until their quarantine has ended or until their employer calls them back to work. Should also say this is somewhat of a fluid situation. We are hopeful that Congress passes 2-week medical leave as a result of quarantine, but until that happens, we want to make sure that individuals experiencing quarantine and job loss are able to have cash flow during that time. To just prepare for this demand, we've taken some immediate actions. We're increasing staff on our unemployment insurance call center line so that we can provide quality service to individuals experiencing job loss. We have dedicated additional staff also to reviewing and adjudicating claims so that when these are filed, that we can review them in an expedient amount of time.